Like, good evening for everyone, and today it's our first IBQ based revision, and it's a version 2. And today we'll be completing mainly of the preclinical and the basic subjects. Okay, and it will be consisting of anatomy, physiology, biochemistry, pathology, forensic medicine, and few parts of anesthesia and PSM also. Okay, this will be our total subjects which are covering means for the day today. Fine, that is the motive of the session, and the session will be consisting of means like today's session we have a break in between. Yeah, हाँ हिंदी तो बोल सकते हैं कोई ना, but we'll try to be more universal with English. हाँ yeah sure, yeah, it will, these are the basics of the session is to get a good score and get to clear your FMG exam. Okay, that's the basis of these sessions. Fine, and this session, it will be of today's session, it will be of around 4 hour 45 minutes to 5 hour 15 minutes, and there will be a short break in between for 15 minutes. Fine, and if you insist, we'll discuss, yeah, we'll discuss about this in detail also. Fine, and if you have any doubts, you just put up in the comment section or else keep it with you. We'll discuss about your doubts at the end of the session, and without wasting much time, we'll start with our session. Okay, could anyone describe me which type of MRI is this? Is it a T1 weighted MRI or a T2 weighted MRI? Yeah, just look into the circle spaces. Yeah, if you are able to see this image, or if you're able to appreciate this image, it's a T2 weighted MRI image. Yeah, it's a T2 weighted MRI image. And like if you see this recent FMG patterns, you will be able to know that like they will be asking questions like mainly they will be asking at least one number of like n number of questions, but at least minimum one question will be asked from this transfer section of the CNS. Fine. So with the day, we'll progress with this anatomical landmarks of this part. Fine. Yeah. If you see this image, like mainly they'll be asking about the landmarks. If you see these images, could anyone tell me what is this structure which is being represented or marked here? Yeah, this is what? This is the caudate lobe. This is the caudate lobe. So if you see this adjacent to this ventricles, this adjacent to the ventricles, if you'll able to see this type of nucleus, this nucleus which is what? Which is the caudate nucleus, or which is what? This is the caudate lobe. Fine. If there is any damage to this caudate lobe, could anyone tell me in which condition does it result in? If just remember, if any damage to this caudate lobe, it will result into the condition known as chorea. Okay? It will result into this condition known as chorea. And if you come down, you're able to see this lens-shaped nucleus. Could anyone tell me what is the name of this lens-shaped nucleus? It is what? It is the lentiform nucleus. It is the lentiform nucleus. Okay, fine. And this lentiform nucleus, it will be consisting of two parts. Yeah, Lokesh, yeah, Hafiza, yeah, Dilshad, yeah, we're getting it correct. And if you see this lentiform nucleus, it will be made up of two parts. One is this globus pallidus and this putamen. Globus pallidus and the putamen. Just remember. And if you come down, if you are to see, this is the third ventricle, and adjacent to the third ventricle, there will be a structure known as thalamus. Just remember, adjacent to the third ventricle, there will be a thalamus. Yeah, yeah, correct, guys. And if you're able to see, in between this caudate nucleus and this lentiform nucleus, you will be able to appreciate some structure. Like this structure, it is what? It is the internal capsule. It is the internal capsule. Just remember, it is the internal capsule, and there will be two limbs. There will be an anterior limb of the internal capsule, and there will be a posterior limb. Okay, it is the anterior part and it is the posterior part. Just remember. Fine. Just don't forget this image. Just keep a remind about it. Fine. With this understanding, we'll move on to our next part. Okay. If you see this image, this is the sagittal section, and we know in the sagittal section it will cut the body into the right and left. Fine. And like sometimes they will ask you very simple questions, but don't get tricked. Okay. If you see this structure, this is what? This is the cerebellum. And if you see some structure which is be having some kind of belly. Fine. If you see this kind of belly, which will be what? Which will be what? Which will be the pons. And the next to the pons, the structure which is below the pons, which will be what? It will be the medulla. Fine. Could anyone tell me with which foramen, by which foramen medulla, this medulla will be coming out through which foramen? It will be what? It will be by the foramen known as foramen of magnum. Okay? Just remember. Fine. And next, if you see, they will ask sometimes, they will ask one more question. Yeah, above to this pons, it will be a midbrain. Observe. Fine. And above to this pons, there will be a midbrain. Fine. This is the midbrain structures. And there will be one more structure known as corpus callosum. If you see this corpus callosum, it will be consisting of two parts. The anterior part, it will be what? Corpus callosum, it will be consisting of three parts. The anterior part, it is known as genu. This is the genu of corpus callosum, and there will be the posterior part, which is known as the splenium of the corpus callosum, whereas the last part, the part which is joining this genu and the splenium, it will be what? It will be the body of this corpus callosum. Yeah, but to Prakash, it's correct. Yeah, fine. Yeah, like I think so few of you guys, you are just watching this video in a latent part of it, so just click this live button and just be live with us. Fine. And if you move to the next slide, you'll be able to see this CSF flow. We know the CSF, it will be formed from this lateral ventricles, and from the lateral ventricles, it will be flowing to this. If you see this lateral ventricle, from this lateral ventricle, it will come to this third ventricle, and from the third ventricle, it will go to the fourth ventricle, and fourth ventricle, it will start flowing into this central canal of the spinal cord. Fine. From this lateral ventricle to the third ventricle, it will come from this lateral ventricle to the third ventricle by a phenomenon known as phenomenon of Monro. Fine. Monro. And from this third ventricle to the fourth ventricle, it will come by this phenomenon known as, or duct known as aqueduct of Sylvius. Aqueduct of Sylvius. Fine. Next, from the fourth ventricle, it will be flowing into this central canal of the spinal cord, and it will be connecting to the adjacent CSF flow structures. Fine. Yeah, Lokesh. Yeah, there will be two foramens. Like one will be like foramen of Megendi, and there will be Leshka. Just remember. Fine. Leshka and Megendi. And the Lakshka, it will be, just remember, they will sometimes make you to confuse. It will be the lateral most structure. It will be the lateral one. Just remember. Fine. This is all about the CSF flowing structures. And we know if there is any condition, means there might be any tumor which may cause obstruction, and it may lead to this condition known as hydrocephalus. Fine. And this type of obstructive hydrocephalus will be, in this type of obstructive hydrocephalus, there will be enlargement of this proximal structures. Okay, fine. Just remember. Yeah, M for medial and L for lateral. Correct, Lokesh. Fine. With this understanding, we'll move on to our next part. If you see our next part, it will be the circle of Willis. Okay, it will be the circle of Willis. And if you see the circle of Willis, we know it will be the circle of Willis. It will be formed from this, mainly from this artery, which is the internal carotid artery. Okay, and between this posterior cerebral artery. And we know this internal cerebral artery, it will be giving, means our internal carotid artery, it will be giving the branches as this middle cerebral artery and the anterior cerebral artery. Fine. And between this anterior cerebral artery and this anterior cerebral artery and this posterior cerebral artery, there will be two connecting branches. Fine. Yeah, correct, Chaudhary. It will be like the MCA is not a part of the circle of Willis. Fine. And this is the posterior cerebral artery, which will be forming from this basilar artery. Okay, this is the basilar artery. Fine. And these are the small branches which are known as what? Pontine branches. And this basilar artery, it will be formed from this two vertebral arteries. And these two vertebral arteries, it will be coming from this. Yeah, correct. Yeah, Lokesh, you are getting it correct. And these two vertebral arteries, it will be coming from the foramen known as, like it will be passing two foramens. Like it will be coming from this cervical vertebra with a foramen known as foramen transversum, and on the upper aspect, when it's come inside, it will be traveling with the foramen known as foramen of magnum. Like we studied, right? The same foramen which is being passing to this same spinal cord and the medulla, it is the same foramen of magnum in which this vertebral artery too also passes. And this vertebral artery on anterior side, it will be giving a branches known as anterior spinal artery. Whereas in posterior, it will give a branch known as posterior inferior cerebellar artery. Fine. It will give a branches known as posterior inferior cerebellar artery. Fine. And if you see, this is the posterior communicating artery and this is the anterior communicating artery. And ACA will give a, yeah, sure. Like I will tell you, like which are the important questions which can be asked also. Yeah, sure. Yeah, like, and it will give a branches like in the ophthalmic artery. Fine. And just only one thing you need to remember about the circle of Willis. It is what? Which of the following artery won't be forming the circle of Willis? Just remember, MCA won't form the circle of Willis. Fine. And the artery forming will be this ICA, ACA, ACOM, PCOM, and the PCA. Just remember. Fine. Just these are the arteries which will be forming this circle of Willis. Just remember. And and if there is an aneurysm or any of these things, most commonly it will be in and around the circle of Willis. And if there is any rupture, you'll be able to see this different types of foramens. Like there are means like there are few times they don't want to make you answer the questions much easily. So sometimes they will give this type of images. And first we'll start with this foramen, means or this plate, which is known as what? Cribriform plate. If you see this cribriform plate, what is the nerve which is being passed from this cribriform plate? Cranial nerve, which is what? Which is the olfactory nerve. Next one, it is the optic foramen. If you see this one, this is the optic foramen, and we know in the optic foramen there will be passing of this cranial nerve too, which is the optic nerve. Yeah, correct, Lokesh. Yeah, Garo. Yeah, you are getting it correct. Correct, Jamin. And next one, it is the superior orbital fissure. And if you see the superior orbital fissure, the superior orbital fissure mainly supplies the nerve which supplies the eyeball, means which supplies the muscles for the eyeball movement. We know there is this eyeball will be supplied by this nerves of cranial number 3, and then LR6 and SO4 by the mnemonic, means the 6th cranial nerve and the 4th cranial nerve. And the sensory suppliations, yeah, and it also supplies this sensory supply, which is what? Which is the ophthalmic division of the mandibular, ophthalmic division of the trigeminal nerve, which is what? Which is the V1 nerve. Okay, fine. And next one, there are 3 foramens which are inconcurrent. Yeah, correct, Gaurav. Yeah. If there are 3 foramens which are inconcurrent, this are remembered as rows. Fine. There is also one more guy, means one more again known as rows. I just saw. Fine. Yeah, there is also known as rows or rows. Fine. If you see, this is the foramen of rotundum. Okay, and this is the foramen of ovale. And we know that foramen ovale, there is a structures which are passed by, can be remembered by this mnemonics known as male. Fine. And in this 3, the common is that the superior orbital foramen and the foramen of rotundum and ovale, all of this will be having these branches of this trigeminal nerve. Yeah, like S is for, it is the spinosum. Correct. If you see, this is the spinosum. Okay, and all of this they'll be giving this or this transversing this branches of the trigeminal nerve. And V1 it will be from this superior orbital fissure. V2, which is what? Which is the maxillary branch, will be from this foramen of rotundum. Whereas ovale will give these branches of V3, which is what? Which is the mandibular nerve. Okay, remember, like it is a male. So if it is a male, means he will be always also known as man. So just remember, it is also known as male and man. Fine. Next one, we know foramen of spinosum, and it is being repeatedly tested. Like for example, they will give you a case scenario in which there is a recent history of road traffic accident, in which yeah, the other structures, nice rows. The other structure, it's they are the accessory meningeal artery, lesser petrosal nerve, and the emissary veins. Okay, correct rows. Fine. Okay, fine. If you see this spinosum, they will give this typical recent history of road traffic accident, and with this road traffic accident, they will give this foramen, which is being transversing a vascular structure, is being damaged, and this damage lead to which type of hemorrhage? Fine. And we know the spinosum will give rise to which of the, means give passage to which of the following arteries or the veins? Could anyone answer in the comment section? And if you know this artery, you know this will be leading to cause of condition known as extradural hemorrhage. Yeah, correct, Lokesh. There is also like nervous spinosus. Yeah, middle meningeal artery. Yeah, that's what I need to hear. Like, yeah, correct, Lokesh. Correct, Gaurav. It is what? It is the middle meningeal artery. Yeah, we also know about this structure known as styrion, in which also like posterior to it, the middle meningeal artery which passes, and means there is, it also passes through this foramen known as foramen spinosum. If there is any damage to it, it will result into this condition known as extradural hemorrhage. Yeah, it is what? It is a idli shaped hemorrhage. Yeah, fine. We'll study this too. Yeah, extra dural hemorrhage. It is a idli shaped hemorrhage. Yeah, nice, Gaurav. Fine. I think so. You remember this mnemonic. Fine. Next, if you see, this is the internal acoustic canal, or this internal acoustic meatus. And this internal acoustic canal, obviously, like it is aqueous, means like it is a hearing one. Yeah, it is a lens shape too. Yeah, correct. Yeah. If you see this will be giving rise to 2 nerves, like are giving flow to these 2 nerves known as 7th cranial nerve and the 8th cranial nerve. Fine. Internal acoustic canal. And just remember why it's important, because in a case of acoustic schwannoma or vestibular schwannoma, you'll able to see that the one of the sign is what is that compression of this seventh cranial nerve, and it can lead to the cranial nerve palsy also. So just remember this around this internal acoustic canal, there will be, or into the internal acoustic canal, it will be the seventh and eighth nerve which will be passing. Yeah, correct, Rose. It will produces this bilateral ice cream cone appearance, or this ice cream cone appearance on contrast MRI, contrast enhanced MRI. Fine. Next one, if you're able to see, this is what this is this jugular foramen, in which the rest 9, 10 and 11. 11 passes, which is what, which is the accessory nerve, and there are two parts of accessory nerve. One is the cranial part and the spinal part, and the cranial part of this accessory nerve which passes through this jugular foramen. Okay, next one will be this hypoglossal canal, and we know hypoglossal canal will give means give passage to this. Yeah, correct, Gaurav. Will give passage to this nerve, which is what, which is the 12th cranial nerve, which is the hypoglossal nerve. Next, we know this is the foramen of magnum, and we know we already saw that the medulla passes through this, and also the vertebral artery, and also this spinal part of the spinal part of and also the spinal part of accessory. No, fine. Yeah, correct, Rose. Sir, please share blank PDF. Hmm. Okay, exam prep. With this understanding, we'll move on to the next part. And in recent also, there is a trend of asking about this transaction of the CNS, and also they're repeatedly asking about this cadaveric images of this either this thoracic cavity or this abdominal cavity or some part of the pelvis also. Fine. If you see this image, you'll be able to see it is the cadaveric image of this thoracic transection. That is the thorax image, and you will be able to see this structure which is being adjacent to the vertebra. Could anyone tell me? Yeah, correct, Lokesh. What is this structure? And could anyone tell me what is this aorta? Is it ascending aorta, descending aorta? Yeah, Lokesh, correct. Yeah, it is what? It is the descending aorta. Fine. It is the descending aorta. And if the aorta is being descending, means there should be some part in which the aorta must be ascending. So this is what? This is the ascending aorta. This is the ascending aorta. Fine. Next one. And behind this ascending aorta, yeah, Gaurav, yeah, Lokesh, correct, yeah. And if you see this posted to this aorta, there are these trunks which are known as pulmonary trunk, or this main pulmonary artery. Fine. Next one, if you see this muscular structure which is being compressed, and which is at the around the superior level, around the T4 level, because the arch is now like below the T4 level, because if you're able to see, there is no formation of this arch, whereas this aorta which is being already formed, so it will be somewhat near to that level of T4, T5. So it will be what? It will be like, yeah, no, the IVC will be the smaller one. It will be the IVC. Fine. Whereas this one, this compressed one, okay, it will be what? It will be the esophagus. Just remember this. Fine. And the most of this vascular structure, it will be remain closer to the bones. Fine. Because it's over the superior aspect, it will be very small. It's possible sometimes it won't be even visible because it's more superior section, because we know IVC it will end in more inferior aspect even. Fine. And this will be what? This will be the esophagus. Just remember, don't get confused, because the small questions they will ask and will get confused. Fine. With this understanding, we'll move on to the next part. If you see this image, what is the most anterior most chamber of this heart? For azygous means, just remember, it will be mostly they will be giving this. They won't be. It will be a transversion section. It will be difficult to identify. Mostly they will be asking in the diaphragmatic level, or they will be asking in the anterior posterior level, or in the whole body level. They will be asking. Okay, so don't worry, don't get confused. Yeah, correct. It is what? It is the right ventricle. It is the most anterior most chamber. Okay, anterior most chamber. Fine. And we know the posterior most chamber, it will be what? It is the left atrium. Okay, it will be the left atrium. So, and we know this left atrium, it will be around this level, means, or it will be near to the structure known as esophagus. Fine. So, if there is any enlargement of this left atrium, this can present as a dysphagia. So, if there is any left atrial hypertrophy, this can present as esophageal conditions known as like dysphagia. Just remember. Okay, the esophageal dysphagia. And this is what? This is the, yeah, correct side. Yeah, this is what? This is the aorta, which is what? Which is the descending aorta, which will be adjacent to the vertebrae. And if you see this small structure, it is what? It is the inferior vena cava. It will be the inferior vena cava. Fine. With this understanding, we'll move on to the next part. You are sitting in a OPD, they will be giving this question like that a patient is presenting with some complaints or these features of some respiratory difficulties. On chest X-ray, on chest X-ray PA view, you are able to see this kind of appearance. Fine, you are not able to see this costophrenic angle. There is a blunting of this costophrenic angle. Okay, there is a blunting of this costophrenic angle. What is the invest means like no, Lokesh, just look into the image properly. Fine. Yeah, like first, before answering it, just look into the image. Like if it is pneumothorax, it will be a deep sulcus sign. Fine. Okay. Like we get confused, but don't get confused. Fine. If there is any pneumothorax, it will be a deep sulcus sign. But if there is any fluid collection or if there is any pleural effusion, the costophrenic angle will be blunting. Okay. There is a two different terms. If there is any blunting of this costophrenic angle, it will be seen in a case of effusions, whereas the deep sulcus sign it will be seen in a case of pneumothorax. Fine. And if there is in a case of pleural effusion, you'll be able to means you need to do means yeah. If you're able to see some levels, it will be what? It will be a hydropneumothorax. Whereas if you're able to see just a level or just a Ellis curve formation, it will be what? It will be just hydrothorax. Fine. And for this, yeah, correct, Lokesh. And if you're able to just see this Ellis curve, it will be a hydrothorax. Fine. And in the case of hydrothorax, we'll do this procedure, which is known as what? Thoracocentesis. Thoracocentesis. And this thoracocentesis, it will be they'll be asking these questions in a case of thoracocentesis where you will insert this needle in the upper part of the lower rib or this lower part of the upper rib. What will be your answer? We can do it in the fifth ICS. Like mostly we'll do it on the posterior surface, like near to the inferior border of the scapula, which will be around the 8 intercostal space. Yeah, it will be the upper. Yeah, correct, Adarsh. Yeah, Rose. Yeah, Afsal. Yes, yes, Sai. And example of location, yeah, you were getting it correct. It will be what? It will be the upper part of the lower rib. It will be the upper part of the lower rib. Fine. Because we know in the lower part there will be a neurovascular bundles. To avoid damage to it, we'll do in the upper part of the lower rib. Just remember this. Fine. With this understanding, we'll move on to our next part. If you see this image, it's a barium swallow of the esophagus. And this esophagus, you will be able to see some type of constrictions. You know, there are few normal constriction. If you're able to see, there are few normal constrictions and few constrictions of this esophagus which will be formed when there is any abnormalities. And if you're able to see, the first constriction, it will be what? It will be, there will be physiology. The first constriction, it will be what? It will be the constriction at the level of cricopharynx. Fine. Next one will be around the same level. Like one will be at the level of 9 inches and from the incisor, and next one will be at the level of 11 inches from the incisors. And if you see, arch of aorta will be at the level of around the level of L4, which will be forming this second one. Fine. And third one will be by the left. It's not a main bronchus, it is the left. It is the left bronchus, left main bronchus. You can tell it as it's not the main trachea, it is the left main bronchus. Yeah. Yeah, correct, Rose. It's 25 centimeters from the aortic arch. Yeah. Yeah, means like inches you can convert it into the centimeters even. Okay. Fine. Yeah, third one will be at the level of 40 centimeters or 11 inches from the incisors. Fine. Next one will be at the level which is entering into the diaphragm, Okay. Could anyone tell me at which diaphragmatic level the esophagus enters? Means next we'll study that only. Like esophagus will be at the level of T10. Okay. Esophagus will be entering at the level of T10. Okay. Yeah. T8 will be the IVC. Correct example. Yeah. Yeah. If you see this image, the first constriction it will be by this aorta. Next one it will be by this. In this image, if you're able to see, it is the constriction of the aorta. Next one will be the left main bronchus. Okay, and we know this constriction. This is the diaphragmatic constriction. And before this diaphragmatic constriction, if you're able to see, if there is any infringement, we studied the posteriormost heart structure. This what it is, the left atrium. If there is any left atrial hypertrophy, it leads to this compression of the esophagus and can cause some type of constrictions. Okay, fine. Just remember these things. Yeah, correct, Ara sir? Yeah. And next one, if you're able to see, this is the image. This is the image of this diaphragm or cadaveric diaphragm, which is showing these openings. And first one we know, which has been remembered by this mnemonic known as voice of America. First one it will be what? It will be the vena cava opening. Next one will be the esophageal opening. Next one will be the aortic opening. Fine. If you see this vena cava opening, yeah, correct, Adarsh. Yeah. Yeah, Sai, yeah, now you are getting it correct. Yeah, Lokesh, correct. Yeah, Rasar, you are getting it correct. If you see this vena cava opening, it will be at the level of T8. Next one, if you see this esophageal opening, it will be at the level of T10. Next one, this aortic opening, it will be at the level of T12. And if you see this vena cava opening, means we know by the name, the vena cava, it will be passing through this opening, and there will be few more structures. You can remember by this mnemonic known as RIP, or RIP. Fine. I, it's for, it will be for IVC, and RT for, it will be for, it will be the right phrenic nerve. It is the right phrenic nerve. Next one, it is the esophageal opening. Could anyone tell me? Yeah, correct, Rose. Yeah. Could anyone tell me what is the structures along with esophagus which will be forming or passing through this T10 opening? Means which we are expecting in the questions, it will be what? It will be the vagus nerve. So just remember, esophagus will give passage to this nerve known as vagus nerve. Fine, vagus nerve. Okay, don't confuse with azygous. Like yeah, azygous gastric branches of the, yeah, like in aorta means aortic, the branches of this esophagus from this aorta also will get passes through this. Yeah, fine. Yeah, correct, guys. Fine. Next, if you see this aortic opening, in this aortic opening, there will be passage of this aorta, and there also will be passage of this thoracic duct. Okay, there also will be the passage of this thoracic duct. Just remember this one. Fine, and there also will be passage of this azygous vein. Okay, don't confuse with this. Fine. Here the azygous vein will pass, whereas esophageal opening there will be passage of this vagus. Fine. Just remember. Next one, you will able to see this transection of this abdomen. Could anyone tell me what is this structure which is the in green in color? A correct answer, correct Rose. Gallbladder. Fine, it is the gallbladder. And if you see, this is the means this is more superior transection. Like so, if you're able to see, this is the small part of the liver. Okay, it is a small part of the liver. And if you see this image, this is what? This is the stomach. Means you will able to see this airfield structure. And we already studied this is what? This is the vertebra. And you know this adjacent to this vertebra, what is this structure which is being passing? Or what is this structure? A correct Baisra. It is what? It is the aorta, which will be what? Which is the descending aorta. Fine. It is not the ascending aorta, because ascending aorta, it will be from the heart and it will be ascending up and it will just come, it will form the arch and it will come descending. Fine. Yeah, correct Sai. Yeah, correct Rose. Correct Lokesh. Yeah, correct Rashi and Baisla. Fine. And if you see this next image, means there will get confusion, like whether the means like the muscular structure is esophagus or the IVC, but whereas this level the stomach is already being formed, so you will able to see this structure, which is very large in structure, along with easily compressible, it will be what? It will be the inferior vena cava. It will be the inferior vena cava. Just remember. With this understanding, we'll move on to the next part. And recently, they started asking about this landmarks. Means they will give you about a small landmark, and they will ask you what is the vertebral level or what is the disc level. They will be asking. Right? You're able to see, like last time they means like last to last time they asked this question, means they mark this part and they asked what is the disc or the what is the name of the disc level which is being into this superficial landmark. So if if they ask you about this jugular notch, it will be located at around this T2 to T3 vertebra, or it will be at the level of vertebral disc between the T2 to T3. Just remember these things. Okay, fine. Next one, if you see this image, means we know this is what means. We know means about this ilia crust, it will be forming this plane or this line known as tubercular line, and this tubercular line, it will be around this T4, means around this L3 to L4. And we know around this L3 to L4, we also in need of diagnosing some conditions like meningitis. Yeah, correct, Lokesh. Yeah, means in such conditions, achalasia means someone like I couldn't understand your questions. Kindly reframe it and post it up. Yeah, umbilicus is also like it was more superior, like it will be around the L3 and L4. Fine, and constitute this L3 and L4, we know like we will be doing this known as like in case of any meningitis to be diagnosed, we'll do this spinal puncture or this lumbar puncture, and for this we'll use this iliac crust as this landmark, and we'll use this line known as Tophes line, in which we used to withdraw this samples of the CSF and will send for the investigations. Okay, just remember these things. Fine. Next one, as we talked before also, like this is the inferior part of the scapula, and it will be near correspond to this level of T7 vertebra. Fine. Near correspond to the level of T7 vertebra, and here where means like are below this levels we do this pleural effusion. Fine. Yeah, correct, Sai. Yeah, you are getting it correct. Next one, if you see this image, you'll be able to see around the level of means around the level of L3 there is the origin of this artery. Could anyone tell me what is this artery is? Like I think so, guys. Few of you are not in an exact live. Just like click on your live button so that you will be in align with the class. Fine. If you see these structures, we know the abdominal aorta. It will be entering at the level of T12. Once it enters, it will give different types of branches. Fine. And starting from the T12 till it bifurcates at the level of between L4 to L5. Fine. And if you see this initial, the first branches which is be given by this, it will be what? It will be the celiac plexus. And next to it, it will be giving this branch known as superior mesenteric artery. And the superior mesenteric artery, it will be given at the level of L1. So next time there will be marker structure which will be adjacent to this L1, and they will be asking what is the artery which is being lies beneath it. Okay, fine. It is will be what? It is the superior mesenteric artery. Yeah, correct, Rose. Fine. Next one, if you see this L3 means around the border of L3, it will be giving a branches known as inferior mesenteric artery. And we know this inferior mesenteric artery, okay, means this artery will prevent the inferior artery is the correct side. If you see this inferior mesenteric artery, it will prevent this ascent of this kidney in a case of horseshoe kidney. So remember, it will prevent the ascent of horseshoe kidneys. Okay, horseshoe kidneys. So they will ask this way, like they can give you a horseshoe image, and they can mark you the superficial location, and they can ask you. Fine. No, like it's means as we know, like it's not a means it will be at the level of L3 and L4. Like it's not exactly, because based on the location we go along it. So it will be around the L3 and L4. Fine. And next one, if you see this L1 means like L1 level, there will be formation of the superior mesenteric artery, and there is a syndrome known as CAS syndrome, in which the superior mesenteric artery will go and compress. Means this will be originating from this aorta. Fine. This is superior mesenteric artery, and due to this excess excess loss of fat, or a sudden loss in the fat, or in case of any application of hip spica or any femur fracture, will apply some spica. And in case of such things, the superior mesenteric artery goes on and compresses this duodenum. Okay, duodenum, and can cause obstruction even. Okay, and can cause obstruction even. Just remember these things. Okay, fine. These are the quite might be asked, because they can give a history, and they can ask like retrospectively, like what is the name of this like name of the structure which is responsible for it. They can ask you. Fine. Like it is known as CAST syndrome, CAST, because there is also multiple names of this syndrome. One of the name is the CAST syndrome, because of this application of this cast around the hip. Okay, in a case of hip means femur fracture. Fine, we'll apply a cast known as hip spica. Okay, just remember these things. Fine. With this understanding, we'll move on to the next part. Could anyone tell me what is this name of the muscle, or like what is the name of this sign known as? Okay, it is known as what? It is known as swinging of scapula. And we know the swinging of scapula, it's due to the damage to this now known as nerve 2 serratus anterior, are also known as long thoracic nerve. Yeah, correct side. Yeah, correct Rose. Yeah. It is also known as nerve of Bell. Fine. And damage to this structure will result into this condition known as swinging of scapula. Long thoracic nerve, which is lead to this condition known as swinging of scapula. And we know this there is a muscle known as Boxer's muscle, which is the serratus anterior. Fine. And next one, if you're able to see, if there is an adduction, internal rotation, and the extension at the level of elbow, and the internal means like flexion at the level of wrist joint, this will be manifestation of which of the following palsies? Correct size, it will be what? It will be the Erb's palsy. It will be the Erb's palsy. Yeah, also known as, it will be what? It will be the damage to this C5 to C6 of this upper trunk of brachial plexus. It will result to this condition known as Erb's palsy. Okay, fine. Which is also known as policeman tip deformity. Fine. Or waiter's tip deformity. Yeah, correct, Baisa. Yeah, correct. KP Chaudhary, Abdul Malik, Sai, correct. You are getting it correct. Fine. With this understanding, we'll move on to the next part. If you see, now they can mark your muscle and they can ask you what is the muscle which is being responsible, like, or they can show you some borders, or they can ask you what is the border, this, which muscle is making this border. Fine. If you see, like, they can ask you this two muscles. Just remember these two muscles. Rest, if you want, you can remember. Fine. This is what the superior one. It will be what? It is the rhomboid major, and the next one is the rhomboid. First one, the superior one, it is the rhomboid minor, and next one, it is what? It is the rhomboid major. Okay, these are the two muscles you need to remember. And if you want to remember one more, it will be what? It will be the levator scapulae. And all of these muscles, it will be attached to this medial border of the scapula. Fine. All of these muscles, it will be attached to this medial border of the scapula. Next one, like what they will ask you regarding this muscle and this posterior aspect, it will be what? Yeah, correct. Yeah, correct. Arrows. Fine. So they can ask you about this rhomboidal minor and rhomboidal major, and most of these things they will be attached to this medial aspect of this scapula, and they can help in the tilt and the elevation of the scapula. Just remember. Next one, they can ask you, there is a triangle of auscultation. Okay, there is a triangle of auscultation. You can, means, in which um there is no musculature or less musculature over it, so that you can hear this lung sounds very much clearly. So it is known as what? It is known as triangle of auscultation. And this triangle of auscultation, it will be formed by these two muscles, border by these two muscles and the one bone. Okay, it will be what? It will be by this trapezius and the latissimus dorsi. It will be by this trapezius and this latissimus dorsi, and other border, the next border will be found by the scapula. Just remember. So since there is no muscular, less musculature over this, or less tissue over this, it can provide a good window for us to listen. So we can listen over here to get a proper lung sounds. Fine. Just remember this one. Yeah. If you see this images, like they'll be asking about this relation to the humerus. If you see about this relation to the humerus, if there is any, we know the structure which is being passing near to the surgical neck of humerus, it will be what? It is the axillary nerve, and we know this axillary nerve will be supplying this axillary nerve will be supplying these two muscles. What are the two muscles which is being supplied by this axillary muscle? Yeah, correct, Lokesh. It will be what? It is known as what? This is what? This is the regimental bat sign. Yeah, correct, Sashikala. It is the axillary nerve. What are the two muscles? Yeah. Yeah, correct again. Yeah, correct, Sai. It is what? It is the deltoid and the teres minor. And is deltoid and is the teres minor. And just remember, this deltoid, we know it helps in the abduction of the shoulder, and it also produces this counter. You'll be able to see this beautiful counter of the shoulder. Whereas here, due to this paralysis, the delta counter is lost. Yeah, correct, Chaudhary. Yeah, correct, Rose, and correct, Sashikala. Yeah, this counter of this is lost. Fine, and this will be seen in a case of axial nerve damage, and this axial nerve damage will be most common in a case of surgical neck of humerus fracture. Next one, because of this thing, there will be a loss of sensation over this area known as regimental bat sign. Fine. Next one, if you see around this shaft, of this humerus, you will be able to see this one artery and one nerve structure, and this around this midst of fracture, it will be producing to damage to this, which now it will be produce damage to this radial nerve. Yeah, correct, Lokesh, correct, KP Chaudhary, and correct, Rose. Yeah, they will be producing damage to this nerve, which is the radial nerve, and deep to this there will be a profunda brachii artery. And we know if there is any damage to this radial nerve, this will lead to this condition. What is this condition? Radial nerve damage. Yeah, correct, Lokesh. It is what? It is the wrist drop. It is the wrist drop. Right? It is the wrist drop, because we know this most of these extensions of this hands will be supplied by this correct side. It will be supplied by this radial nerve, so it will lead to this wrist drop. Correct, Baishla. Fine. Next one, if you see some more inferiorly, you'll be able to see around the supracondyle, means there will be a condyles. Okay, and on the medial side of the condyle, means there will be one nerve passing, which is what? Which is the ulnar nerve. And we know if there is any damage, to the lateral condyle, means the lateral condyle won't grow. So but the medial condyle tend to grow. So this will be at the level of median, like around the level of medial side. And if there is any damage to this one, which is known as what? Lateral condylar fracture, this will lead to this condition in which lateral condyle won't grow, whereas the medial will tend to grow, and this lead to this kind of palsy. Yeah, correct, Rose. It will lead to this condition known as tardy ulnar nerve palsy. Yeah, ulnar also can lead to, and in ulnar it can lead to different types of things. It can lead to this thing known as Plahan. Okay, Plahan means if just ulnar nerve is being damaged, it will lead to this Plahan, and you need to differentiate this Plahan from this benediction sign. You know this Plahan, it will remain as a claw, means it will remain as a claw as any type. Okay, fine. There will be means if there is any claw hand, means there will be always a claw hand. Fine, yeah, Rose, it is an incomplete Plahan. And whereas in a case of medial nerve palsy, when you tell them to make a wrist, there the formation of, like, it will looks like a claw, but there will be formation of this hand known as benediction hand. So just remember how they are describing in the question. So the description of this question also matters. Yeah, correct RSR, correct Lokesh. Fine. The next one which is will be given is the book test. Okay. Okay, book test. Fine. What's the test? What is the what is the name of this sign known as? Yeah, there is a loss of this adductor function. Yeah, everything you are getting it correct. Could anyone tell me the name of um this sign? Yeah, it is a card test. Yeah, correct. It is known as Fromet sign. Okay, Fromet sign. Okay, just remember it is known as Fromet sign. Okay, and it is, yeah, correct. It is known as what? Fromet sign. It's actually what this is actually what this is the book test. We know that card test. We know this pad and dot. So we'll keep a card in between, and this leads to this adduction. Okay, this will be the card test especially. Correct. Fine. And this sign is known as, especially what I need is this sign. This is known as what? Fromet sign. Fine. Whereas this card test also will be positive in a case of ulnar nerve palsy. Fine. Just remember. And next one, if you see around the supracondylar humerus fracture, already Rose written, like this will lead to this damage to this nerve known as anterior interosseous nerve, like more common than a median nerve. Fine, more common than a median nerve. Fine, just remember these things. And we know in the case of median nerve palsy, this hands will form this known as benediction's hand. Benediction hands. What is this name of this sign known as? Which muscle which is being tested here? Answer in the comment section. Yeah, correct. Yeah, guys. Yeah, yes, you are getting it correct. Yeah, portion pen test. Yeah, correct. Rose, you are writing in a more descriptive manner. Correct. Yeah, Lokesh, you are getting it correct. It is known as what? It is known as pen test. Fine. And in which we are testing about the abductor functions. Okay. And we know, yeah, we know the adductor, it will be supplied by this ulnar nerve, whereas all other muscles of the thumb, it will be supplied by this median nerve. Fine. Just remember these things. Next one, if you see, this is what? This is the pointing index. This will be what? This is the pointing index. This also seen in a case of median nerve damage. And could anyone tell me in which of the following tunnel syndrome will be able to see this median nerve damage? It is what? It is the KP Chaudhary, correct? The correct side. It will be what? It is the carpal tunnel syndrome. It is seen in a case of carpal tunnel syndrome. In which of the following nerve injury will be able to see in a case of in a case of ulnar nerve injury? What are the canals you will remember? What is the name of this canal? Yeah, it is what? It is the, yeah, cubital tunnel syndrome. Then there is also one more canal. There is also damage to this canal known as Guyon's canal. Yeah, correct, guys. It is the Guyon's canal. It is the Guyon's canal. Just remember, it is the Guyon's canal. So these are the two. They can lead to this ulnar. These are the two canal in which this ulnar passes, and it can lead to this ulnar palsy. Okay, just remember. Fine. With this understanding, we'll move on to our next part. Fine. And just remember about these things. Like this can be asked because they will give this typical questions. A patient is presenting you with a features of fall. Okay, fall from a bike or something, and yeah, correct. And they will tell you there is a tenderness. Or after a force injury, there will be a tenderness over this area. What is this area? Correct, guys. It is what? It is the anatomical snuff box. Okay, it is the anatomical snuff box. And if there is any tenderness over this area, yeah, correct. Yeah, correct. Chaudhary, Rose, yeah, will be inside. It will be what? It is the scaphoid fracture. And we know the content of this anatomical snuff box. It will be what? It will be the radial artery. Yeah, Sashikala, correct. And you know, like some questions it can be means if you don't know, also some questions can be answered in exam hall itself. Like they will ask you, they will come and mark this structure because like once upon a time they asked about this flexor tendon, so they can come and mark this structure also. What is this structure which is being responsible? You know, in the medial border of this anatomical snuff box, it will be formed by just one tendon, whereas this lateral border, this two lateral border, it will be formed by these two tendons. Fine, lateral border means you can grasp your hand and you can check. In the medial border, it will be by this one tendon, whereas this lateral border it will be by this two tendons. Fine. And if you see this medial border, it will be by this, yeah, arrows. Yeah, you wrote it exactly correct. It will be what? Like if you see this medial border, it will be found by just one tendon. Just remember, extensor gives two tendons. Like there will be one longest tendon, one brevis tendon. So on a single stand, like on medial border, it will give this extensor pollicis longest tendon, whereas on the lateral border, it will give this extensor pollicis brevis. Whereas this abductor, it will be say as a single, so it will give this single one, which is what, which is the abductor pollicis longus. Fine. Just remember these things, and you'll be able to go with it. Fine. Yeah, correct, KP Chaudhary. Yeah, yeah. There will be radial artery, which is the content characteristic. Fine. With this understanding, we'll move on to the next part, which is this triangle, which is known as what? Femoral triangle. And in the case of femoral triangle, we know these things. Like there is this naval arrangement. Like yeah, from laterally there will be a nerve, then followed by this artery, followed by this vein, and if there is any femoral canal formation, yeah, correct, Sashikala. Yeah, this more medially it will be what? It will be the lymph node. Fine. From yeah, if it is from medial to lateral, it will be the vein formation. Fine. It will be the vein formation. Okay. And next, if you see what they will ask you, like these things, everyone means they will think everyone will know. But what they will ask you is that the medial border of this femoral triangle will be formed from this by this muscle which is known as adductor longus. Could anyone tell me which border of this adductor longus will form this middle border? Medial means like medial border. Medial border of this adductor longus or the lateral border of the adductor longus? Then we just check it out because that is the trap. Okay, fine. We'll think like it's means it will be the lateral border, but remember it is the medial border. Okay, it is the medial border. Okay, and okay, yeah, correct, Rose. Yeah, means you didn't fall into the trap, like you were in place. Fine. If you see this medial border of this adductor longus, it will form this medial border. Fine, not the lateral border. Next one, it is the sartorius. Sartorius from the lateral border means, and this it forms the lateral border of this femoral triangle, but this medial border of the sartorius will be forming. So both of this muscles, medial border will be the forming this medial and the lateral borders. Okay, there will be no lateral part of this muscles. Just remember. Fine. And this base of this femoral triangle, it will be found by this muscles known as iliacus and psoas. Okay, iliacus, psoas, and this pectineus muscles. Okay, iliacus, psoas, and pectineus muscle. Just remember, don't get confused. Fine. This is the trap questions they will be ask you. Fine. Yeah. Sartorius, it is also known as honeymoon muscles. Yeah, it is also known as talus muscle. Correct. Because it helps in the honeymoon muscles, it helps in the abduction of this hip. And next, if you see what they will ask you about in the legs is that what is the medial border? Means they will give you this typical clinical scenario in which a patient is being operated or being harvested for this great saphenous vein graft. Which of the following which might be injured, which can cause pain in later on? Fine. So just remember, it is a great. So remember, if there is any someone great, we'll name them. Okay, and in the name of them, we'll name some places. Fine. So we'll name this part means it will be supplied by this nerve, which is known as what? The same saphenous nerve. Okay, saphenous nerve. Okay, and whereas the superior part, whereas this dorsal aspect, it will be supplied by this superior peroneal nerve, whereas this first web space, just remember this first web space, it will be formed by this, it will be supplied by this deep peroneal nerve, and this lateral aspect, it will be supplied by this nerve, which is known as sural nerve. Okay, it will be supplied by this nerve known as sural nerve. Okay, don't get confused. Yeah, correct, Chaudhary. Yeah, correct, Sai. Yeah, you are getting it correct. You are in track. Yeah, sural nerve. If they ask you in the questions, like the nerve being means the vessel being harvested for a CABG, coronary artery bypass surgery, and now the patient is presenting with complaints over this medial aspect of the leg. Which of the following nerve will be responsible? They will mark this area and they will ask you also even. So this will be the saphenous nerve. Yeah, correct. Great saphenous nerve. It will run along with this great saphenous vein. It will run along with this saphenous nerve, whereas this short saphenous vein, it will run along this sural nerve. Okay, fine. Correct, guys. Next one, if you see, like before they have a trend of asking about these questions about this bones over the foot. Okay, fine. And this is the calcaneum, and this is the talus, and they won't ask any other bones. They will just particularly ask this bone. Could anyone tell me what is this bone? Yeah, guys, it is correct. It is the navicular. Fine, it is the navicular bone. And above this there is a three cuneiforms and one cuboid. Just remember, three cuneiforms and one cuboid. Okay, fine. Yeah, correct. It is what it is, the navicular bone. Fine. Next one, they will ask you about this. They can mark and they will ask you about this reflexes and their nerve roots. If you see this image, this ankle reflex, it will be by this S1 and S2. Then it means it will go numerically. Yeah, correct Arasar, correct Lokesh, correct Chaudhary. You are getting it correct. Next one, if you move on to this from below to above, initially it will be by this S1 and S2. Next one will be by this L3 and L4, which is what? Which is the patellar reflex. Okay. Next one will be this flexor or this biceps reflex will be by this C5 and C6. And whereas this triceps reflex, it will be by this C7 and C8. Okay, triceps. Fine. Yeah, correct, Arasa. And with this, now they started asking about this histological questions. Fine. If you see this histological images, okay, initially means they will give and ask what is this structure or what is this made up of, what is this made up of, and what is this made up of. If you see, there is a formation of uniform deposition of this fibrins, and there is a gene means like properly aligned cells are the properly aligned cells. So yeah, properly aligned chondrocytes. It will be what? It is the which type of cartilage? Could anyone answer in the comment section? Is this which type of cartilage is this? Means it's a cartilage. Okay, there are three types of cartilages. One is elastic cartilage, next one is hyaline cartilage, next one is known as fibrinous cartilage. Fine. Could anyone tell me which type of cartilage is this? Just remember, if there's any more fibrin deposition, it will be what? It is a fibrous cartilage. Okay, fibrous cartilage. Fine. Whereas you can just remember about your school stories. Till means you are in school, like you will be more flooded with some kind of disciplines and everything. But when you completed your 12th, you'll be given more elasticity. So you will try to explore everything in a single. So if you're able to see the single type of cells, right? Single type of cells is having small means you are given much elasticity. So this will be what? This is the elastic cartilages. This is the elastic cartilage image. And if you see later on, you explored many things. Now you just came to a conclusion. Okay. Once you come to a conclusion, you just want to settle down. So you want to get married and you want to settle down. So you'll become a couple. So initially you'll be in like you'll be more disciplined. Then you will be given some spaces, and at last you'll be with your couples or with your friends. Okay, you'll be enjoying. So this will be what? This will be the hyaline cartilages. Okay. And could anyone tell me, the spina is made up of which of the following type of cartilage? Is it a elastic cartilage? Yeah, nests of cells. Yeah, correct. It is. If you see this nest of the family at the fronts of cells, it will be this hyaline cartilages. Spina is made up of which of the following type of cartilages? You can also just do it and answer. Yeah, correct, Rose. It is will be what? It is the elastic cartilage. Fine. And most of this vocal cartilages or this thyroid cartilage, they will be made up of this hyaline cartilage, whereas our epiglottis, this will be made up of this elastic cartilages. Okay, like thyroid is made up of hyaline cartilage, whereas this epiglottis will be made up of this elastic cartilage. Just remember. Yeah, correct. Yeah, correct. KP Chaudhary, you are getting it correct. Lokesh, correct. Yeah, Raja Rajeshwari is correct. Fine. With this understanding, we'll move on to our next part. Fine. Just about few joints, you need to just remember. If they ask you any of the joints which is present in the central axis, means just remember the central axis. If there is any adjacent to the central axis, because this is the central bone which is sternum, and this is the center, which is the pubic symphysis. Like most of the structures or most of the joints at the center, it will be a secondary. So if it is at center, it will be secondary one. And what does its secondary signifies is that there will be a cartilage here and there will be a cartilage here. In between there is a something. So S for secondary and S for something. Okay, S for center. Fine. Or S for sound center. Fine. So it will be some fibrous material between the center. So most of this at this midline, it will be forming a secondary type of cartilaginous joint. Example is, yeah, correct. KP Chaudhary, it will be what? It is the pubic symphysis. Fine. Pubic symphysis. Fine. Next one, if you're able to see, this is the primary type of cartilage. And primary, we know there is no one in between, just a cartilaginous joint. Okay. And it will be formed adjacent to the, like there will be a means there will be joints between these sternum and the ribs. Whereas this one, just this fibrous joints, it will be forming this sutures and this gums, like gum poises joints and this sutures, they will be forming this fibrous joints. Okay, fibrous joints. fibrous joint. Just remember, like they can mark and ask you like what is the type of joints which is being present between this vertebra. Means this intervertebral discs like are near this articular fasciitis. They can ask you. Like most of them, it will be what? Yeah, correct. It will be a secondary cartilaginous joints. Fine. And just remember few joints based on the movements. Fine. Fine. On you must need to you must there is no chance of negligence that you forgot this thing. Like between the malleus and incus, which type of synovial joint is being formed? You can remember as a miss. So just remember between the malleus and incus, it will form this saddle type of joints. Okay, it is also a synovial joint. Okay, fine. It is a saddle type of joints. Okay, okay. Whereas incus and stapedius, it will form this like the questions they will ask you. We know, yeah, yeah, correct, Asutosh. Yeah, Rajeshwari. Now you are getting it correct. Rose, you are getting it correct. If you see, this there are mainly three ball and socket joints. Like will always need to remember. Yeah, now you got correct, Janvi. Like this inferior stapedial, it is a ball and socket joint. Okay, it is a ball and socket joint. You know, like there will be this glenohumeral joint and this acetabular joint, and this one, all of this three are this ball and socket joint. Just remember. Okay, fine. Yeah, nice, Rosh. Um, nice, Asutosh. You had a nice, like, good answers. Fine, keep going. This all about this anatomy. You need to remember about the main images part. Fine. With this understanding, we'll move on to just few parts of physiology. Like we won't means we won't get a deep diving. We'll just see a superficial one. Fine. And if you see in the case of physiology, we need to know about the cell junctions. If you see some sort of gaps, okay, it is what it is the gap junctions. And these junctions they will mark in the image. What they will ask you, what is the composition? This gap junctions will be made up of this type of proteins known as connexins or connexin proteins. Fine. Yeah, sure. Yeah, we'll upload this unnoted PDF without any changes will be given. Yeah. Physio. Yeah, nice emoji, Lokesh. Fine. Yeah, this will be made up of what? Connexins. Okay. This will be made up of this type of proteins known as connexins. And next one, this means these are all mostly on this adjacent borders or the lateral borders. Fine. Yeah, heart walls also there will be connections will be present. Means like it will be most means based on the cell type. This junction may be vary. Okay, fine. And next one will be this desmoglins. Like desmoglins, which will be made up of this desmoglins. We know there is a disease known as pemphigus vulgaris, which we study tomorrow. Fine, pemphigus vulgaris, which will be having this antibodies um, against this desmoglin 1 and desmoglin 10. Yeah, this desmoglins mainly it will help in this connection of this keratinocytes. Yeah, correct, correct, Rose. Like fine, it will be what? It is the desmoglin. And next one, it is the adherent. Means there are some few tight junctions and like and near to the tight junctions. This is what? Which is the adherent junctions. And this adherent junctions, it will be made up of a compound known as E-cadherin. And this if there is loss of this E-cadherin, means this can lead to this anaplastic changes. So in the case of gastric carcinoma, like in a case of diffuse gastric carcinoma, there will be loss of this E-cadherin or E-cadherin mutation. Next one is the tight junctions. And remember to grasp it tight, you need to occlude it. Fine? Yeah. Tight junction, it will be for this, like it can forms like barriers, any of these barriers and prevents this like least liking of leakage. Fine. And this will be made up of this components known as occluding. Fine. Whereas this basal layer, it will be formed by this hemidesmosomes. Hemidesmosomes. Okay. You just need to remember these things about this image. Fine. Just don't get into a deep dive. Okay, just remember these things. Fine. Next one, just a cardiac cycle. I just given for your reference. If you need anything, you can just grasp it from it. Fine. Next one, we'll ask about this JVP because till now, like most of the things, if they ask about JVP, they will give you in a history. Like for example, they can give you a history of cardiac tamponade. Like if there is any recent history of RTA, okay, recent history of any RTA, and they will give you this typical triad where there is a JVP will be increased. There will be muffled heart sounds, right? So, and there will be hypotension. And what is the name of this triad? You will see in a case of tamponade, cardiac tamponade. Could anyone answer in the comment section? Yeah, correct. It is known as what? It is known as Beck's triad. Okay, it's known as Beck's triad. And in a case of cardiac tamponade, you will able to see this absent of Y descent. So there will be absent Y descent. Okay, first like means we'll directly dive into the pathology, or like we'll get a small glimpse about this usual one, and then we'll directly dive into the pathological one. We know like A, it's because of this atrial contraction. Fine. And C, it's because of this cusp bulge. Fine. V is because of this ventricular film. Okay, just it's simple things you just need to remember. And next means you need to mostly remember about this pathological ones. If you're able to see this absent, if there is absent of this A waves, it signifies that there is no atrial contraction. In the case of atrial fibrillation, there will be no contraction. So it will be leading to this absent A waves. And if you're able to see this Canon type of A waves, where you will able to see this Canon type of A waves, like if there is any mismatch between this atria and ventricular contraction, you will able to see this type of Canon means Canon A waves. Like large A waves will be seen in a case of any stenosis conditions. Whereas if you want to see this Canon A waves, it will be seen in a case of C for C, it will be seen in a case of complete heart block. Remember, it will be seen in a case of condition known as complete heart block. So you will able to see the small A wave, and this is a big A wave, which is known as what? Canon A waves. Next one, the C wave and this V image, it will be merged together, and this CV wave will be formed during this condition known as tricuspid regurgitation. So this giant type of CV wave will be seen in a case of tricuspid regurgitation. Okay. Okay, just remember these three things. This is what you need to remember about this JVP. Fine, and if you want to remember just one more about this constrictive pericarditis, there will be deep X and deep Y. Just remember. Fine. Deep X are mostly of deep Y. Just remember. Fine. These are the things you need to remember about the JVP findings. Next one, we'll move on to this action potential or means action potential. And there is just a simple difference between there is a major difference between this SA node potential or this atrial potential and the ventricular potential. And if you know this is a single difference, you will be able to treat the means treat them arrhythmias in a much perfect manner also, and you can understand and you can answer them if they being asked. Yeah, automaticity seen in a case of SA node. Yeah, correct guys. Yeah, correct Rose. Yeah, and mm, and means it's mainly for this management and for the exam uh, solving applications. Fine. And if you see this there is a funny leaky channels in the SNO, okay, which leads to the initiation of this potential. And if you see this pre-potential phase, it will be because of the sodium ion. Just remember, it will be because of the sodium ion. Next one, if you see, next one after this pre potentiation phase, then there will be a it will be reaching this threshold stimulus, and after this reaching this threshold stimulus, it will be forming this depolarization wave curve, means depolarization curve, then there will be repolarization. Remember, the significant is that the depolarization of this atria, it will be by this calcium channel. So in the case of any atrial arrhythmias, you can try calcium channel blockers. Fine. Whereas this repolarization, it will be by this potassium channel blockers, and once there is a repolarization, it will fall below this threshold. So okay, then it will start the cycle from the A. Fine. Yeah, and one more thing is that there is no latency, because there will be no latency in the case of SN, because they will be producing these waves very mm, very fluently. Okay, so there will be no latency. Just remember these things. Next one is the zero phase. If you see this phase, it will be produced by this sodium influx. Just remember this pre-potentiation phase in the case of SA node, sodium, whereas this it will be by this depolarization by this calcium, where here the depolarization will be by this sodium. Okay. Next one, once the sodium comes in, once there is a enough number of polarization being happened, then the potassium channel will open. Fine. On this, there starts this initial phase of depolarization. Fine. Then this calcium means initially the potassium goes out. Fine. And the calcium start coming, and this leads to this phase known as plateau phase. Okay. Next, after this plateau phase, then this leads to this, and it will go to this depolarization phase by this potassium efflux. Fine, and it will return to this resting potential. Fine, or below this threshold level or sub-threshold stimulus. Okay, fine. These are the main differentiation you need to remember. Like, because this depolarization by this calcium is the most significant point you need to remember. Okay, with this understanding, we'll move on to some flow volume loops. If you see this flow volume loops, fine. In this flow volume loops, you just need, like, it's a kind of mnemonic types. You just need to memorize it. Like, this is how a normal flow volume loop, and this is what, this is the inspiration curve, and this is the expiration curve. Fine. It is the expiration curve, and based on this loop, we can tell where there is obstruction and which type of pathology is this. And we know, in the case of any restrictive lung diseases, in the case of early stages, or if there is any just any airflow obstruction or any obstructive lung diseases, the formation of the scoop over the respiratory case. So this formation of this scoop will be seen in a case of obstructive lung diseases. Could anyone tell me any of these examples of this obstructive lung diseases? And in these conditions, you will able to see this. Yeah, correct. Rajeshwari, yeah, Janvi, I was getting it correct. It will be what? It will be the COPD, which is actually what? Which is this obstructive lung disease, right? And whereas in the case of any restrictive lung disease, you'll able to see this small type of graph. The graph will be similar, whereas the graph will be looking much smaller. So it will be seen in the case of restrictive lung disease. And this most of these things you will able to identify. Whereas here comes the confusion. Like in the case of any intrathoracic obstruction or any extrathoracic obstruction, um, this um, this curve means deranges. If you see, if there is any extrathoracic obstruction, this extrathoracic obstruction it will cause flattening of this curve over this inspiratory curve. So if there is any extrathoracic obstruction, it will cause this intrathoracic or this inspiratory flattening. If there is any intrathoracic, it will lead to this um, expiratory flattening. So it will lead to this expiratory flattening, fine. And if there is any fixed obstruction, for example, if there is any fixed foreign body, this will lead to this flattening of this both inspiratory and expiratory curve. Okay, it lead to this. Yeah, fine. Means like the same is this. Intra means opposite, means I E. So if you see any intrathoracic obstruction, there is a flattening of this expiratory curve. If there is any extrathoracic, there is a flattening of this intra, means like inspiration. Just remember inspiration. If there is any fixed obstruction, it will cause flattening of this both. Okay, just remember. And the example of the fixed one, it is the foreign body obstruction. Right? Correct answer. Next one, we'll move on to the few parts of biochemistry. If you see a child who is having this features of hepatomegaly, along with features of failure to thrive and the features of repeated features of hypoglycemia, on an examination, you are able to find also increased uric acid levels. All of these features are this typical for this, yeah, like typical for this glycogen storage. Yeah, correct, Lokesh. It is the like it's most commonly it is the type 1, which is the one Gurki disease. Like so, it will be most commonly means these are the typical features of this glycogen storage diseases. And we know this glycogen storage, which is what, which is the one Gurki disease. It is due to this deficiency of this enzyme known as glucose 6 phosphatase. Fine, glucose 6 phosphatase. Yeah, just remember. Correct, Basil. Yeah, generally, yeah, we can see dual cases, but it will be more typical for this mucopolysaccharidosis. Okay, yeah, correct, RSA. And next one, it is the Pompey's disease. If you see this Pompey's disease, it will be because of this enzyme deficiency known as lysosomal alpha 1,4 glucosidase, fine, are also known as acid maltase. Yeah, fine. Yeah, um, you can remember by this mnemonic warm pump cori and make a tired. Like it's based on your convenience. You can remember like yeah, nice mnemonic by the location. Yeah, nice. Fine. If you see this pump piece, you need to just remember this second one. Second one, it mainly affects the heart. If you see glucogen storage disease along with the features of any cardiomegaly or any cardiac conditions, it will be because of this pump disease. Yeah, correct, Janvi. The other name is what? It is the acid maltase. Fine. Next one, if you see C for Coris, you just remember CD, which is the Coris disease. It is because of this debranching enzyme. Fine. Next one as the AB, which is what? Which is the Anderson disease. It's because of this branching enzyme. If there's any debranching enzyme deficiency, there is a formation of this dextrin-kines. They'll just they won't be enoughly debranched, and there will be improper deposition of this glycogen. Fine, yeah, correct. ABCD, if you remember, it is correct. Next one, MECAD is M for M, it will be a muscle glycogen phosphatase. It is due to the deficiency of this muscle glycogen phosphatase, so it will especially affect these muscles, and they will give this history of exercise intolerance. Fine. And hers, it's the hepatic one. When hers is the hepatic one, if there is any hepatic glycogen phosphorylase means deficiency, it will lead to this condition known as Hers disease. Fine. In hers, the muscles will remain unaffected. Just remember about these simple things. Fine. Next one, if you're able to see this kind of deposition over years, they're known as ochronosis. And this turning of this urine means once the urine is being exposed to this air, this urine is being turned into black color. Fine. And this turning, this phenomena and this deposition of this components in the are these pigments in the multiple cartilages and in the joint spaces and in the eyes. Which disease you will think of? Yeah, correct, Lokesh. Yeah, rock, yeah, RSR, yeah, rose. It is what? It is the alkaptonuria. It is the alkaptonuria. And we know which enzyme is responsible, which enzyme deficiency is responsible for this alkaptonuria. Yeah, guys, it is what? It is due to the deficiency of homogeneous oxidase deficiency. Okay, it is due to the deficiency of homogeneous oxidase deficiency. Okay, yeah, correct, Rose. Yeah, correct, Rock. Yeah, correct, Janvi. Yeah, fine. Yeah, you are getting it correct. And with this understanding, we'll move on to the next part. If you see this image, if you see a blonde, if you see a child with blonde hair along with more fair means like it's the child is being more white when compared to the family members and along with some features of mental retardation and this things and along with some features of sometimes features of a mousy or a musty odor of urine. What do you will think of? Yeah, yeah, guys, I'm already flooding with answers. Yeah, Lokesh, yeah, Rose, yeah, Rock, yeah, Arasar, yeah, Janvi, yeah, Basa. You are getting it correct. It is what it is the phenylketonuria. And we know this phenylketonuria is due to the deficiency of phenylalanine hydroxylase. Okay, it is due to the deficiency of phenylalanine hydroxylase. And next, if you see to detect this, just don't confuse this thing with the alkaptonuria. Means this to detect this, will use this urine samples, which is what to detect this will do this test known as ferric chloride test, which looks similar to the urine samples, but it is not the same. It is known as what? Ferric chloride test. Okay, just remember. Yeah, we also do butyrate test also. Yeah, correct, Janvi. Fine. Yeah. With this understanding, we'll move on to the next part. If you see this, the same type of features, see a more fair skin, and if you see some ocular features, okay, and if there is any absence of this melanin pigment, yeah, it's just a tyrosinase. Just remember, it is the tyrosinase. Okay, tyrosinase. Don't get confused. Yeah, guys, you are means you are not falling into trap. You are just exactly like standing where you want. Yeah, just keep going. Like just you'll be coming with flying colors. Fine. Next one, if you see about these enzymes, if you see in a case of enzymes, it means you need to remember this plots. If you see this line lever Berg plots, means you need to remember about these two things. If you see about this competitive incubation, if you see this competitive incubation, how you can remember this? That means competitive incubation, it looks like a cross. Okay, competitive incubation crosses because it crosses at the level of, yeah, correct, Lokesh. Yeah, it will be crossing at the level of Vmax. So, or half the Vmax, it will be crossing. So, the Vmax will remains the same. Okay, means if you see, if there is no incubator, if there is incubator also, the Vmax remains the same. So, we know in the case of complete incubation, the Vmax remains same, whereas Km will be increased. Fine, but Km will be increased. Okay, yeah, yeah, guys, correct. Yeah, Rose. And if you see this cross, it will be a complete incubation. Whereas if you see this in a case of non-complete incubation, the Km remains same. Okay, the Km remains same. Okay, whereas the Vmax will be decreased. Okay, Vmax will be decreased, whereas this Km remains same. So just remember one thing, which is the cross of this complete incubation. If you remember this cross, like you no need to remember about this any of the cells. Fine. Yeah, correct. Rose. Next one. If you see this image is due to the deficiency of which of the following? White hot spot. And we know this white hot spot is due to the deficiency of vitamin A. Means at which stage of this deficiency? We have this X classification, right? Yeah, is it X1A or X1 something? Arasa, just wait, have patience. We'll look into the next image. Yeah, it is X1B, it's not the X1O. Yeah, correct, Sai. You are getting it correct. Yes, to it is X1B, it's not the X1A. Yeah, yeah, Rose, yeah. Yeah, it is what it is the X1B. Just remember, it is due to this vitamin A deficiency, and this vitamin A deficiency it will be staged as X1B. It is not 11, it is X1B. Fine. And if the child is less than, if you're bringing a child who is having a similar feature, if the child is less than 1 year, so how much dose of vitamin A you will give orally? Or if it is more than or equal to 1 year, how much you will give? Yeah, just remember it is a 1 lakh and 2 lakh. Okay, it is a 1 lakh and 2 lakh dosages. Fine. If it is less than 1 year, we'll give 1 lakh. It is a oral dosage. So if there is a less than, if it is a less than 1 year, we'll give 1 lakh orally, and if there is a more than 1 year, we will give 2 lakhs. Okay, more than or equal. Okay, it's a oral dosage. Okay, don't get confused. For that, we'll give this spoons also, in which first depression will means will be measuring at the level of 1 lakh, and second will be at the level of 2 lakhs. Okay, And next one, it is what? It is the rickety rosary. This is the rickety rosary. That's what you're already previously putting with answers. Yeah, it will be given on the 0, 1 and 14th days. Yeah, guys, correct. 0, 1 and 14th days. And the vitamin A supplementation will be starting from the 9th month itself. Fine. Yeah. If there is a weight also signifies, yeah, we can give to correct, guys. You are absolutely awesome. Yeah, you are like means you are up to the mark. You are just being ready for the exam. It's just the NBE. Just need to conduct the exam as soon as possible. Fine. And if you see this recurrent rosary, it is due to the deficiency of vitamin D. And we'll study this more in depth and when we discuss in the case of pediatrics. Fine. Next one, if you see a chronic alcoholic is presenting you with features of some kind of dementia. Okay, dementia, just dementia, and he's having some um uh, and he's having some features, clinical features suggestive of heart failure. Fine. And did a CT and you will able to see this type of appearances or a cardiomegaly. Means in which of the following vitamin deficiency you will able to see this deficiency means see these features? Yeah, guys. Yeah, Rose. Yeah, Karthik. Yeah, Rock. Yeah, Lokesh. You are getting it correct. It is due to this deficiency of thiamine. Okay, thiamine deficiency lead to this kind of features. And there are two types of beriberi. Okay, beriberi. And there are two types of beriberi. One, there is wet beriberi which involves the heart, whereas this dry beriberi it will involves this CNS. Fine. It will have this involvement of the CNS. Yeah. Yeah, right. Yeah. Next one is the Cassel's necklace. Yeah, it can be seen in a case of mice eaters because of this lack of this tryptophan, and it is due to this deficiency of this niacin. Okay, niacin. Okay, and we know this if there is a niacin deficiency, it can lead to the decrease in the thiamine also because niacin forms the thiamine. Okay, like no, sorry, not the like it can be seen in a case of it's not thiamine. It can be seen in a case of tryptophan deficiency. Okay, just remember because in a case of myosin, like mice eaters, there will be a decreased means a decreased availability of this tryptophan. Okay, fine. Yeah, it will be having these features of these dermatitis, dementia, and diarrhea. Okay, the first feature will be the diarrhea. First feature will be the diarrhea, and finally it can lead to this death. And in which one of the following diseases you will able to see this eye of tiger appearance? Yeah, correct, Rock. Yeah, eye of tiger appearance. Yeah, Rose. Yeah, that is the fourth D, death. Where you will see this eye of tiger appearance. So that is all eye appearance will see in a case of CMV. Where you will able to see this in a case of MRI. Where you will see this eye of tiger appearance. Yeah, fine. If you see this eye of tiger appearance, you will be seen in a case of pantothenate kinase deficiency. Okay, just remember. Okay, okay. Pantothenate kinase deficiency. Just remember. Fine, don't get confused. Next one, if you're able to see this features of glossitis, chiliosis, and itching, this will be due to the deficiency of means like mainly due to the deficiency of vitamin B12. Fine. Okay, which is the riboflavin deficiency, whereas vitamin B3, which is the niacin deficiency, which will be presenting with this features of Cassell's necklace. Yeah, correct, Rock, correct, Rose, correct, Lokesh, correct, Sai. Yeah, you're getting it correct. Next one, in which of the following vitamin deficiency will lead to this formation of this myelomeningocele? Myelomeningocele, which of the following deficiency? It is due to the vitamin B9 deficiency, which is the folic acid deficiency. It is the folic acid deficiency. And if there is a normal female, yeah. And if you see this vitamin B9, which is the folic acid deficiency, what is the normal level of supplementation? Like how much folic acid we need to give usually? Yeah, normally we need to supplement with 400 micrograms. Whereas in a case of anemia Mukta Bharat, we used to give us a 500 mgs. Okay, just remember, normally there is no risk, we need to give us 400 micrograms. Whereas in a case of high risk patients or if there is any female with diabetes mellitus and any other things, we need to give us 4 mgs. Okay, 4 milligram we need to give. Okay, whereas in a case of anemia Mukt program, okay, in a case of anemia Mukt Bharat program, we used to give us 60 milligram of iron along with 500 micrograms of folic acid. Just remember, yeah, yeah, correct, Jani. Right, Rock and others also you are getting it correct. Yeah, correct, medic. It is what it is. Yeah, it can be 4,000 mcg means which is equal to the 4 milligrams. Fine. With this understanding, we'll move on to the next part. Okay. First, tell me, is this a normal image of an eye, or is there any significance of this image? KF rings. This is not the normal. It is the KF rings, which will be seen in a case of Wilson's disease. Wilson's disease. And we know this Wilson's disease, it is due to the mutation of which of the following genes? This will be enough. You no need to watch the previous videos. This will be enough. Yeah. It is the ATP-B7. Okay. It will be what? It is the ATP-B7. Just remember. Yeah. It is the ATP-7B. Okay. It is due to the mutation of ATP-7B. And if you're able to see, means this is due to the over deposition of this copper. Yeah, correct. Medic Neelam Srivi and Ria and RSR, you are getting it correct. And if you see this image, where you will able to see this kinky hair, means of this what is deposited? It is due to the deposition of copper deposition. Means it deposits over the Descemet's membrane. Okay, and it is also known as oculolentiform degeneration because it because it lead to this ocular features along with this chorea. Okay, and the lentiform and it also deposit into the lentiform nucleus. Yeah, in CNS and imaging you will able to see this panda sign because it won't take up the signals. Fine. And next, if you see this kinky, this spiky hairs, okay, and it is due to the deficiency of copper. What is the name of this disease known as? Yeah, correct, RSR. It is known as what? Kinky hair, which is seen in a case of Menkes disease. Right? It is due to deficiency of copper. Remember, it is due to the deficiency of copper, and this is due to this mutation over this ATP-7AG. Okay, this it is due to the ATP-7AG. Yeah, correct, Janvi, Neelam Srivi. Yeah, anonymous. Yeah, you are getting it correct. Riya also, you are getting it correct. Next one. Yeah, these are the few things you need to remember. Next one, if you see a patient which is presenting with this features of this before and after image, the features of hepatosplenomegaly, and along with this images. Yeah, I'm good, Amit. How are you? Some like now it's biochemistry going on. Next upcoming it will be the patho one. Fine. Oh, it is not cretinism. So if you see this image, and means these two images are being correlated. Okay, fine. Okay, just correlate these two images. This is what this is the crumpled tissue paper appearance. Where you will see this? Yeah, sure. Yeah, I know you. Yeah, it is what it is. What it is the Gaucher's disease. It is the Gaucher's disease. Okay, it is known as what? It is known as Gaucher's disease. Could anyone tell me what is the deficiency? Yeah, Kwashiorkor and marasmus also looks the same. Like tomorrow we'll see like how the Kwashiorkor looks like, because Kwashiorkor it will be also the belly enlargement, but it will be seen with other features also. Fine, like for example, hair features like flax sign, and there will be flaccipine dermatosis also. Fine, and this is the Gaucher's disease, which is due to the beta glucosidase deficiency. This is all about this biochemistry unit, remember. Fine. With this understanding, we'll move on to our next part. Yeah, correct, Janvi. It is what it is the beta glucosidase. Fine. With this understanding, we'll move on to the next part of pathology. Fine. After this pathology, we'll have a short break for 10 to 15 minutes. Fine. We'll be starting with the pathology, and we know initially, like there will be a normal cell, there will be a cell injury, and following this cell injury, there will be two types. There will be a reversible cell injury, and there will be irreversible cell injury. Fine. And how will you able to find? Yeah, it is what it is the bleb formation. Because of the cellular swelling, if you see this bleb formation, it is the first sign of cellular injury. Okay, fine. So initially there will be a irreversible cellular injury, means after some time this reversible will become irreversible, and if it doesn't becomes reversible, it doesn't reverse itself, it can lead to this. Thank you, Ashwin. Thank you, Ashwin. And it can lead to this irreversible cell injury. Fine. And initially there will be a bleb formation, and there will be a ribosomal detachment, and there will be the formation of nuclear clumps. These are the changes you will be able to see in a case of reversible cell injury. Fine. Yeah, Rock, there will be amorphous nucleus, amorphous deposition in the cell, but there will be means less deposition in a case of reversible, whereas in a case of irreversible cell injury, there will be significant deposition will be seen. Fine. Whereas if we move on to this irreversible cell injury, this bleb formation, this leads to the lysis of this bleb, means this cell membrane will be lysed, and there will be lysis of this nucleus also. If you are able to see, This is how this normal nucleus looks like. And initially, in a case of reversible, it leads to this clumping, and then this clumping is more prominent, and it is known as what? Pycnosis. Once it being like pycnosed, this will be broken into small fragments known as karyotexis. And once it is being broken, it's of no use. So it must be lysed. Fine. So, like if you have any doubts, like if you have any random doubts, we'll answer at the end of the session. Fine. Don't worry. Okay, all of your queries will be asked, but just have some patience. Fine. And karyolysis, it will be the end of the stage. Fine. And if you see this type of irreversible cell injury, it can lead to the either apoptosis or necrosis. Fine. Apoptosis, we know it's a programmed cell death. So, in the case of apoptosis, if you see, this will lead to this type of pattern. Like mostly, like this is a non-specific one, but apoptosis can lead to this type of pattern known as, yeah, correct. Neelam Stevie, it is known as what? It is known as step ladder pattern. And this step ladder pattern is because of that it is programmed. So it will go and cut in a particular sequences. Okay, so it will be seen in the case of apoptosis because it is a programmed cell death. Fine. And if you are able to see this smear pattern will be seen in a case of necrosis. Okay. And we know in the case of apoptosis, there will be no lysis of the cell membrane. The cell membrane will be preserved or the cell membrane will be intact. Okay, and the cell size will become small. Okay, fine. Whereas in the case of necrosis, there will be a inflammation and lysis of the cell. Fine. Inflammation and the lysis of the cell. Yeah, medic. Yeah, Janvi. Yeah, Baisla. Yeah, Rock. You are getting it correct. Yeah. And the marker of this apoptosis, it is what? It is the annexin. Annexin 5. Yeah, correct. Like do it with purpose. If you ask me, like proper images will be at least 20 or 25 will be just a image, like minimum images will be expected. Okay, minimum will be 25 and maximum can go up to 40. And so like in each of the questions, if you see, at least one means like every fourth question will be having some features of the images. Means if you study these PDFs and if you listen to these classes, you will able to understand not only the images, and you will able to understand about the descriptions of the images. If you know the description, if they given you the same thing, for example, they will be given means in questions some alcoholic patient will be given some vitamin deficiency means like cardiac enlargement will be given. So this will be pointing out toward to this image which is having shown to you as a cardiac enlargement. So this will point you towards this, and this will make you to answer this question. This can be seen in a case of thiamine deficiency. So this is how you can answer. So either they can ask you as an image or else they can ask you as a description. Okay, yeah, correct. And unless this is what, that's why we are describing it. If you just see image and I tell you this is the thing, and it won't work, it won't last for so long. So that's why I'm just describing it, which will help you to solve these questions. Fine. I think so. Your doubt is being cleared now. Next, we'll move on to the type of necrosis. If you see this type of necrosis, okay, fine. If you see this type of necrosis, if sometimes in some organs, in some places, yeah, correct, Janvi, it is what, like if you see this architecture, if it is maintained or if it is lost. Yeah, anonymous. Yeah. If you see this maintained architecture, if you see this maintained architecture, and which is seen in a case of solid organs, and the mechanism is what? It is the coagulation of proteins. And this type of necrosis is which type of necrosis? Yeah, you're welcome. Do it with purpose. Yeah, medic. Yeah, Nijay. Yeah, it is what? It is the coagulative necrosis. It is the coagulative necrosis. And this type of coagulative necrosis, okay, it's most commonly seen in the case of solid organs. Like solid organs like kidney, heart will be showing this type of necrosis. Yeah, correct, Baisla, correct, Ria. Yeah, you are getting it correct. Next, if you see this architecture in which architecture means necrosis in which architecture is being lost, you will not be able to see this architecture. This will be seen in a case of liquefactive necrosis. And we know the main mechanism it is what? It is the enzymatic digestion. It is the enzymatic digestion. Okay, just remember, it is what? It is the enzymatic digestion. Okay, don't forget. Yeah, correct, RSR, correct, Janvi. And this type of liquefactive necrosis will be seen in a case of brine or in a case of abscess formations. Okay, abscess formation. Fine. Next one, we'll see some special type of necrosis. Means in special some cases. Could you tell me what is this type of necrosis? The necrosis of the lungs, like in a specific infections or in a special infections. Caseous necrosis, also known as cheesy necrosis, which will be seen in a case of TB infection, and this will be due to the presence of mycolic acid. Mycolic acid. Some random question. What is the name of the staining method you will be using to identify this TB? AFB staining. It is what it is, the acid first staining. Okay, just remember. Next one, if you're able to see, there is a case of pancreatitis must be given. And in a case of pancreatitis, you'll be able to see this momentum which is being deposited with this small chalky white material. Okay, if you're able to see this deposition of this small chalky material, which is due to because of this enzymes which is being digesting this fat, and it is what it is, the fat necrosis. Okay, and it is pathologically seen in a case of any trauma over the high fat areas. Okay, correct Janvi, correct, do it with purpose, correct Doc Karthik. Fine, it is what it is. This fat necrosis will be seen in a case of in omentum, in a case of pancreatitis. Okay, whereas in a case of any trauma to the breast or trauma to the gluteal region, it can lead to this fat necrosis. Yeah, correct Lokesh, correct Riya. Fine. With this understanding, we'll move to few more types of necrosis. If you see, this is a blood vessel. Okay, and if you see this around this blood vessel, if there is some kind of fibrin deposition, okay, if there is some kind of fibrin deposition, which type of necrosis is this? A correct Baisla? A correct Nijay, correct Janvi, it is what it is, the fibrinoid necrosis. It is the fibrinoid necrosis. It is the fibrinoid necrosis. Fine. It is what it is, the fibrinoid necrosis. And this fibrinoid necrosis, it can be seen in a case of few diseases, especially like polyarteritis nodosa, rheumatic heart diseases. Okay, rheumatic heart diseases, and in a case of malignant hypertension also, sometimes we'll be able to see this. Fine. Yeah, pass will be pink in color. Yeah, it can take the stain. Yeah, it can be seen in a case of SLE. Yeah, correct. Mainly will be seen in a case of polyarteritis nodosa and rheumatic heart diseases. Correct, correct Nijay, correct Baisla. Fine. Next one, it is what it is, the this type of necrosis. It is known as what, dry gangrene and wet gangrene. Just remember, like there will be dry days, right, in which like liquids won't be available. Okay, yeah, in those days, the husbands will return to their family correctly. Okay, just remember, like the means just they will return to this family because they are dry. They means they know what they're happening and they know where they need to stand and what their limit is. Whereas in a case of some wet days or in which days the liquor is available, like they will be going and roaming and they will be drinking and they won't be knowing their limits and they don't know where they will go and where they will sleep. So if they're not within or if they don't know the limits, so it will be what it is, the wet gangrene. And if they know the limits, so it will be what it is, a dry gangrene. So remember, you won't see means you will be in a limit, whereas in a case of wet day, you won't be in a limit. Okay, just remember it is a mnemonic to remember if you are unable to differentiate between this dry gangrene and a wet gangrene. Okay, just remember these things. Fine. This is the case of dry gangrene of this upper limb. This is the wet gangrene. Fine. Just remember. Yeah. Yeah. Yes, I think just like few mnemonics might be you to learn because sometimes I do get some confusion, so I used to make it. So if you found it useful, you can you can make use of it in your whole life. Right? Yeah, fine. Next, we'll move on with some staining procedures. If you're able to see, there is a on one side there is a stratified squamous epithelium, and next side there is a pseudostratified columnar epithelium. Okay, and there is a in between there is a intestinalized epithelium, means there is a columnar epithelium along with goblet cells. In which of the following conditions you will be able to see this thing? Yeah, it is what, yeah, correct Janvi. It is seen in a case of Barrett's esophagus. Barrett's esophagus, and we know, yeah, correct Lokesh, yeah, correct Baisla. Like it is the columnar metaplasia along with this goblet cells, and it is what it is seen in a case of Barrett's esophagus. And we know, in the case of to identify this Barrett's esophagus, there is a presence of this goblet cells, and this goblet cell will secrete this acid mucin, and this acid mucin will be stained by this stain. What is this name of this stain? Could anyone tell me? Yeah, correct. Zoho, it is what it is, the metaplasia topic, which metaplasia, and it is what it is, the intestinal metaplasia, Alcian blue. Okay, Alcian blue, which will be staining this, acidic mucin, and it will stain this into this blue color. Fine, just remember. Yeah, correct Medinatic. Fine. Next, if you're able to see next images, we're just staining the fat. Fine. Yeah, correct Sakit. If we are staining the fat, and to remember about this fat, we know like everyone like who means like who are having the fat, like they want to lose it. So just remember, we'll use the stain known as loss stain, or because we need to lose the stain. So just remember O for oil red O. So oil red O, and next one S for Sudan black B. Okay, so this oil red O and Sudan black B will be used for this lipids known as. So they'll be staining these fats are this lipids. So just remember, these are the fat stains. Yeah, correct, Medic, Rio and Sakir and Baisla and Janvi. Yeah, you are getting it correct. Fine. Next one, if you're able to see, there are some two perinuclear pigments. Means these two perinuclear pigments, they go side by side. So we don't know like exactly how we need to differentiate. So means with grossly we cannot differentiate in a much better. So we need to stain them. Fine. And while staining, if you're able to see this perinuclear pigment means which is around the nucleus. So this perinuclear pigment. Hence, in description itself, they have given like repeated transfusion, and there is a perinuclear pigment which is being stained, and it is also refractile, and it is being stained with this stain, and it is showing blue color. Okay, what is this must be? What is this stain must be? It is what is the pearls Prussian blue. Okay, so what is this perinuclear pigment must be? Is it a lipofuscin or it is the hemosiderin? Yeah, correct, Nijay. Correct, Lokesh. Yeah, it will be what? It will be the hemosiderin. So it will be hemosiderin. It will be hemosiderin. Stained with pearls, Persian blue. Next one, if you're able to see, there is a perinuclear pigment. Yeah, no worries. There is like sometimes you will get confused. So that's why the session is the main motive of the session, because this is to means like in a description of the questions will easily guide means like will easily guide it through a wrong way. Whereas if there is an image given and the proper description, if you go along with, you will never go wrong. Okay, and if there is a perinuclear pigment, and if you baseline, it will be what? It is the lipofuscin. Lipofuscin. It is also known as what? It is also known as wear and tear pigment. Wear and tear pigment. We know this lipids will be stained with which stain? Which will be stained with the oil red. So that's why that's where we can differentiate this hemosiderin from this pigment. Fine. Next one, if you're able to see this image, okay, this is the pulse Prussian blue which is being stained this hemosiderin pigment. Okay, hemosiderin. Fine. If you're able to see this, there are two Mason stains. Which of the following Mason stains will be used to stain the Yakriti? Which of the following Mason stains will be used to stain this melanin? Could anyone answer in the comment section? Yeah. To differentiate between this hemosiderin and lipofuscin, that's what I told. Hemosiderin, it will be first thing, it will be refractile in nature. First thing, it will be refractile in nature. This is the thing. Okay, on microscope, they will be on description, they will be given, it will be refractile in nature. And on staining, it will be stained with pearls Prussian blue. Fine, it is what it is the feature of hemosiderin. Fine. Whereas in the case of lipofuscin, they will give the history of old age people. Means because this is a wear and tear pigment. Okay, so there will be history of old age people, and it will be stained with this stain which is known as oil red O. Okay, or any lipid stains like soda and black. Fine. This is the thing you need to understand. Fine. Yeah. There is this Mawson stains like correct guys. You are getting it correct. Yeah. Thank you. Thank you. Yeah. Thank you. Her name is Zoho. Like fine. Yeah. Correct. Yeah. Nijay, Janvi, Medic. Yeah. It is what it is the Mason Fontana stain. It is the Mason Fontana which is being used for staining this melanin. Okay, melanin. Fine. Next one. If you're able to see, we use one more Mason stain, which is known as what? Which is known as Mason trichrome. And this Mason trichrome will be used to stain this granulation tissue, because once there is a wound, it will be healing. Yeah, correct. Yeah, correct, Rose. Yeah, correct, Janvi. It is what it is, a Mason trichrome, which is used to differentiate this collagen along with the smooth muscles, and to differentiate between this neovascularizing new vessels. So vessels, collagens, and smooth muscles, to differentiate it, will use this Mason trichrome stain. Okay, just remember. Fine. With this understanding, we'll move on to our next part. Fine. Means there is a patient who is presenting with chronic history of chronic hypertension. Okay, chronic hypertension means on examining for some other reasons, you took some biopsy and you're able to see this blood vessels. Okay, you will able to see this blood vessels, and in this blood vessels you will able to see this some deposition of this calcium. Okay, so deposition of this calcium. Which of the following stain you will use to stain it? Which of the following stain is first used here, which will show black in color? Remember, it is not alizarin. Alizarin red, yes. Okay, so it is a alizarin red. So it will stain the calcium as red. So it's a name. So if you couldn't understand it, just read the name. It is alizarin red. So it will be what? It will stain the calcium into red color. Okay, yeah, correct. Yeah, one kosa. One means like Lokesh Baisa, Nijay. Yeah, Medicnitic. Yeah, Janvi. Yeah, you are getting it correct. It is what it is the one kosa. It is the one kosa stain. Remember, one kosa stain. Remember this one kosa stain means you can remember this V K C or K B C. Okay, VKC means this one kosa stain, it will stain this calcium into a kala color. Means it will stain the calcium into a black color. Means of the black in Hindi it is known as kala, and C for calcium. Okay, C for calcium. So it is what it is the one kosa stain which stains the calcium into black color. Okay, just remember. Next one, or else you can remember it as KBC also. Means like kosa, black, and calcium. Fine. And these are the two stains which is being used for calcium. And we know there are two types of calcification. Okay, there will be a dystrophic calcifications and there is a metastatic calcifications. We know this dystrophic calcification will be happening in dead cells or in living cells. This dystrophic calcification will be happening in a case of dead cells, and here the calcium levels will be normal. Whereas in a case of metastatic, yeah, correct, Lokesh, in the case of metastatic calcification, the calcium will be high, whereas it will be depositing into these living cells. Then it will be depositing into this living cells. Fine. Fine. And the example of this dystrophic calcification, a famous histopathological finding, it is what it is the samoma, samoma bodies. It is what it is the samoma bodies. And we know the samoma bodies will be seen in a conditions which can be remembered by this mnemonic known as PSM. Okay, so it is what it is the papillary carcinoma thyroid and serous cyst adenoma of ovary. Okay, and meningioma and mesothelioma. Mesothelioma. Yeah, correct, Lokesh. Yeah, it is the onion skinning. Yeah, correct. Yeah, it is the PSM2 or you can remember. Yeah, yeah, Ria, you are getting it correct. Fine. It is what it is seen in a case of samama body. So just remember, they can give you like it means they can describe you the features of papillary carcinoma thyroid, and they can ask you what is the type of calcification which can be seen. You can remember it's a tumor, so you will think of it as a metastatic. But it is not a metastatic. Yeah, correct, Kirti. Yeah, but means metastatic it represents few cancers. For example, in the case of RCC, you will be able to see this metastatic um, calcification, and in the case of hyperparathyroidism. Fine, hyperparathyroidism. Okay, just remember. Okay, don't get confused with this biased names of metastatic. Fine. Next one. Next one. This is the neutrophil entrapment traps. And in the case of some kind of if there is any huge sepsis or if there is any uncompensatable sepsis or any huge infection which is being going on, in those conditions, our body will use this peculiar mechanism known as and it's neutrophil entrapment traps, means in which the neutrophil lay its traps and it will grasp these microorganisms and it will kill itself. Yeah, correct, Nijay. It will kill itself and also this organism. So it is known as what? Neutrophil entrapment traps. In this unit, remember, it will be occur by this mechanism known as citrullinization. Okay, it will be formed by this mechanism known as citrullinization, and it is also known as beneficial beneficial suicide. Okay, means why it is known as beneficial suicide? Because at the end of this nets procedure, nets, yeah, like yeah, it will, yeah, it's aggravates the SLA, correct, Janvi, and it's known as beneficial suicide. And because it at the end of this thing, the neutrophil will be dying. Okay, and the neutrophil will die at the end of this. Fine. With this understanding, we'll move on to the next part. If you see this image, you will be able to see some kind of giant cell. Okay, giant cells. And if you see this giant cells, okay, means in this giant cell, if you're able to see some multiple nuclei which are arranged in a shape of horseshoe. Okay, horseshoe. In which of the following, first of all, what is the name of this giant cell? Is this a Langhans giant cell or Langerhans giant cell? Could you answer? Could you guys answer in the comment section? Yeah, Lokesh, yeah, Janvi. Yeah, remember, like Janvi, it is that's what the trap you have fallen. Yeah, Ria, you have just step means like means you have not fallen into it. It is what it is. The Langhans. Remember, that's what That's what the main motive of the session. Fine. Means they will give you, you know exactly what's the answer. But the first option will be written as Langerhans. So you will go, means you will mark and immensely you won't, I means you subconsciously won't remember also. When you come out of exam hall, you remember there is also one more option your friends will be discussing. So don't get this silly mistakes to be happen. So remember, this is the Langhans Jansel. Fine. Whereas Langerhans. Langerhans. Remember, Langer, remember as der. So Langer is seen in a case of any derma, means in skin. So it is what it is a normal antigen presenting cells, which is what it is the seen in a case of dermatology or in the skin, which is what it is known as Langerhans cells. Whereas Langerhans cells are the giant cells seen in a case of TB. Okay, don't get confused. And we know, yeah, in spinosome layer will be seen in skin, especially in the spinosome layer, we'll see this. Fine. Next one, if you see, if there is a if there's a inclusions over this inside the cell and both inside and outside the cell, okay, following an infection. What is the name of this giant cell? Yellowish Kirti, Baisla, Medignic. Don't worry, Janvi. Yeah, come back. We'll give means have a good comeback. Yeah, yeah, you are getting it correct. It is known as what? Warden Finkeldy Finkeldy giant cells. And this Warden Finkeldy giant cells, it will be seen in a case of measles. It will be seen in a case of measles. Just remember, it will be seen in a case of measles. And this measles, we know, this measles can produce a seen a symptoms known as subsclerosing panencephalitis. Just remember, measles can produce a symptoms known as subsclerosing panencephalitis. Fine. And this measles can produce a type of pneumonia. The pneumonia caused by measles, it is known as what? It is known as hex pneumonia. It's known as hex pneumonia. Fine. Next one, if you're able to see, this is a Zank smear. Remember, it is a Zank smear. Means this smears are the Zank smear. They are used in this dermatological examinations. Fine. Yeah. And in this Zank smear, you're able to see multiple nucleus. In which of the following conditions you will be able to see this multiple nucleus in a Zank smear? Could anyone answer in the comment section? Yeah, guys, it is what? You will be able to see this multinucleated giant cells. Yeah, correct, Obala. You will be able to see this multiple nucleated giant cells in a case of HSV infections. In a case of herpes simplex infections, you will be able to see this multinucleated giant cells in the Zank smear. And next, it is our favorite Olay appearance. Olay appearance. Okay? This is the Olay appearance. And there are two Olay appearances. One is how will you able to differentiate whether it is a Reed Sternberg cell or a CMV. Because they will means like some exams they will just give this image and they will ask you what is it means like what is this cell. They won't ask you even give any description of this. They won't give any descriptions of this image or the conditions. Fine. So if you're able to see this red, if you're able to see the center is red. So remember red for Reed. So red for Reed. So Reed Sternberg cell, which is seen in a case of Hodgkin's lymphoma, which will be center will be red in color. Okay. Lokesh, you are getting it correct. If you're able to see this blue color cells, will be seen in a case of this blue color cells will be seen in a case of CMV infections. Fine, CMV infections you'll be able to see this. Like they'll be giving this condition. For example, they can tell you there is a serpent means they can tell you that there is a HIV positive patients and he's presenting with some chorioretinitis and there is a pizza-pic chorioretinitis which will be caused by this CMV. Fine, yeah, it is what it is known as what eosinophilic. Correct, guys. I am getting it correct. Fine. Next one we'll move on to this chart. Means like at least they will ask like minimum one question from this chart. It will be sure. Either they will ask you as image-based questions, or they can ask you as a history, or they can ask you about a condition. Yeah, Lokesh, in HIV we will be able to see this CD4 counts which is being less. Okay, and first thing you need to think it is the means first thing you need to differentiate it is the X-linked dominant and the recessive one. If you see this X-linked dominant condition, remember who will be dominant? Like you can mimic right like a males will be it's a male dominant society, it's a male dominant society. No, it's no more. So previously even disease know it. So it's not a dominant, males are not the dominant. So the in the inheritance itself it no the dominance is the female one. So in a case of X-linked dominant diseases, they are most commonly seen in a case of female. So it is the father to all daughters. It is the father to all daughters. Yeah, correct, Basila. Yeah, correct, Kirti. Yeah, like you are getting correct. It is the dominant one. It is the female one. Fine. So, and this dominant one will be seen in a case of just few conditions. For example, Ravi. You can remember by this mnemonic as Ravi. Okay. Rett syndrome, Alport syndrome, Alport syndrome, and then vitamin D resistant rickets and incognita pigmenta. Okay, incognita pigmenta. Yeah, correct, Baisla. You are getting it correct. It is okay, fine. Next, this is what this is in the case of X-linked dominant. You can able to see, right? This is a female, okay, and this is a male, okay. If you see this image, you will able to see from this male, all of this female or this from father to all daughters will be affected. There is no son. The son will be spared here. Fine. Next one is the recessive. If females are dominant, obviously you know the males will be recessive. So here there will be a females from mother. It will be to this all the sons. There will be so no females will be affected. Okay, just remember. Fine. So it is a X-linked recessive disorder. Fine. Next one. Then first you differentiated this X-linked dominant and recessive one. Next you are going to differentiate between the autosomal recessive and the autosomal dominant. How will you differentiate? By these two things. First is this gender and this generations. Fine. Everything for everything. First of all, you thought about this gender and you segregated this the X-linked dominant and the recessive one. Next one you are going to differentiate this autosomal dominant and the recessive one. In the case of autosomal dominant number, there is no gender differentiation. There is no gender differentiation. Whereas what is the differentiation is factor is the generation. Okay. What is this generation? Is this if there is any skipping of this generation? If there is any skip, it will be what? It is autosomal recessive one. But yeah, correct, Lokesh. Or if there is any if there is no skip, it will be autosomal dominant. If you see this chart, you need to look into the families. You don't need to look into this of means who are residing near to the families or who are coming as new to the family. So just remember, if you see this is the family one. So if you see this family, the one part which is being skipped. So if it is skipped, so it will be autosomal recessive. Okay, so don't count this one because they are coming externally. Okay, so be vigilant with this because one of this FMG exam they ask this image, means which looks similar to the autosomal dominant. But if you see clearly, you'll able to see it is the family, but he's coming outside. So it is what it is, autosomal recessive one. Fine. The class will be till like around till 11 p.m. or 11:30 or like around till that time we'll close this class because okay, fine. And like pathology it's almost at this end, and next part it will be taking 1 hour 45 minutes and 2 hours around. Fine. So and we'll be taking a small break after this pathology. Fine. Fine. And could anyone tell me what is this investigation which is being done here? It is known as what? It is known as fluorescent in situ hybridization, known as fish. Okay. And this fish, yeah, correct. Senthil, it is known as what? It is known as fish. And this fish will be done, yeah, correct, Nijay? Yeah, fish sky. Yeah, it is known as fish. Yeah, correct, correct. This fish will be done for a means done for a known gene locus. Means like done in a case of gene locus which is being known, means like we know this exact location of the zone, then we do this fish. Fine, just remember. Fine. And in which of the following conditions you'll able to see this BCR ABL gene fusion? It's like the distant correlation. Yeah, means in few means in a case of karyotyping we won't able to identify this microarray and the small translocations. For those conditions we'll be able to do this fish and we'll identify it. Yeah. Correct. In which of the following conditions you'll be able to see this BCR ABL fusion? Yeah, guys, you should be much fast in answering it. It will be seen in a case of CML. Just remember, it will be seen in a case of CML and this CML in a case of this BCR ABL fusion. Okay. 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 Don't worry. Like it's a human mind will tend to forget. Don't worry. Okay. BCR ABL fusion means 9:22 translocation. Philadelphia chromosome. You must be reading, right? So it is what it is seen in a case of CML. Okay. Don't forget. Okay. So sometimes we'll get forget, but when you see because your exams are option based, you will be able to remember this option and you can see the answers in front of you. So you won't be having these issues. Okay, don't worry. For every questions, I should bring answers from next time onwards. Fine, I will try. Next, if you see this image, next will means this about this image you need to remember. Next one, if you see few syndromes like and their clinical features. Fine. If you see this image, we have to see this is what this is the Down syndrome. And if you see Down syndrome, it is due to the trisomy of 21. Fine, trisomy of 21. And if there is a trisomy of 21, we'll study this with along with a small story. If you see this trisomy of 21, means he's down. Means at the age of 21, he's down. Means he's sad. Why he's sad? Because he's single now. Means he is single now because someone broken his heart. Okay, just remember he's single and he's broken his heart. So if he's single, means he'll be written, means he'll be having ID card that he is single. How he will be having this ID card or identity card? Because it will be there will be a single simian crease in this hand. So if it is having, he will be a single. So just remember, so single simian crease, single simian crease. Why is means he's single now? Because his heart has been broken. Okay, so just imagine it as a heart and it is being broken. Okay, why it is being broken? Because he has been committed before, but someone has translocated it. Fine, yeah, hand online, that is known as simian crease, single simian crease. Because in a case of Down syndrome, you will be able to see this thing known as Robertsonian translocation. Okay, Robertsonian translocation you'll have to see in these conditions. And this heartbreaking means because Robertsonian translocated his girlfriend, so he's become single now. Fine. And then if you're able to see why his heart is broken, because he's having some endocardial endocardial cushion defect. Defect. Okay, means he's having endocardial cushion defect. Fine. And well, yeah, correct medically, it is endocardial cushion defect. So he wants to forget everything. So in the case of Down syndrome, Down syndrome, the most common cause of leukemia, it is what it is, the ALL. So he want to forget all about this events which is being happened, but he is not able to forget. So the God given him mm, some things so that he can get this pre-senile Alzheimer's. Okay, he'll be getting this most common leukemia, which is the ALL, and he'll be having this presenile Alzheimer's. And since he's single and he's so depressed, he don't want to go out, so he'll be roaming inside the room. So he'll be always wearing the sandals. So he'll be having this sandal toe. So he'll be having this sandal toe gaps. Okay, just remember these things by this mnemonic down, because Robertson translocated his girlfriend, heartbroken. Yeah, M type, it's the most common, and if it is less than 3 years, AML, it is not ALL, it is AML, M7, it is the most common one. Okay, if it is less than 3 years, if it is more than, or if they are asking most common, it will be ALL. Okay, fine. The Robertson translated his girlfriend, so his heart is broken because of endocardial cushion defect. Fine. So he want to forget all. So the most common ALL is, most common leukemia is ALL, and next he want to forget all, so we'll be having this presenile Alzheimer's. Fine. With this understanding, we'll move on to the next part. Okay, and we know, like, Down syndrome, we told it's a boy story. Now we'll just come to the story of a girl. Okay, which is what? Which is a Turner. And she's a, remember, she's a short girl. Okay, she's a short girl, and she's studying in a quite a big class, like maybe in a 10th or 11th. But she looks very short, and she looks very, means she didn't attain any minarchy, or she's lacking the secondary sexual characteristics. Okay, so since she's short, everyone started bullying him. Okay, everyone will start to call, oh, that girl is going like that. Okay, fine. Yeah, sure. Yeah, thank you, Preeti. Like, I hope so it will help you out. So, like, everyone is calling this her as O. Okay, so you just remember it is because of the 45XO. So everyone calling us O. One day she got much offended and she want to reply them now. She want to turn. So what she want to do? She want to turn. So yeah, she's IQ normal. That's why she's in school, right? Okay, her IQ will be normal. IQ will be normal. Right? She want to turn. So it's a Turner syndrome, but she's unable to turn. Why? Because she'll be having this low, means webs. So we'll be having this webbed neck. So because of this webbed neck, she's unable to turn. Okay. So, but she's not heartbroken like him. But because she's already committed with someone known as Noonan. Okay. So the male variant of this Turner syndrome, it is known as Noonan syndrome, which is due to the involvement of this chromosome number 12. Okay. And both of them, they combine, they make some streak. So why, what, in which they will be making streak? So because both of them, they will be having some cardiac conditions. As each female, she will be having this bicuspid aortic valve and the coarctation of aorta. She will be having this bicuspid aortic valve and the coarctation of aorta. And if, it's a male, so like she thinks like whatever decision he makes, it must be right. So the male, he will be having some right-sided heart lesions like pulmonary stenosis. Okay, pulmonary stenosis. And since they have, both of them, they are having this heart problems, they will be making streaks. So she'll be having a streaky ovaries. She'll be having a streaky ovaries. So remember, it's a small girl, everyone is bullying us. Oh. So she want to turn. It's a Turner syndrome, but she couldn't turn because of the web neck. And and mm, and she's committed because both of them they will be committed with the guy known as Noonan, because both of them they will be having the similar features, and as she thinks he's right, so he'll be having some right-sided heart lesions like pulmonary stenosis, but she will be having this heart lesions of bicuspid aortic valve and the coarctation of aorta, and both of them they will be having this heart condition, so they will be maintaining the streak, so she'll be having a streak ovaries. Okay, fine. This is the story in which you can remember about this Turner syndrome, right? Like this is about the Turner syndrome you can remember about. And with this understanding, I think so this thing will help you out. With this understanding, we'll move on to our next part. Okay, these are the two stories which I had for these 2 days. Fine. Yeah, thank you, Baisla. And with this understanding, we'll move on to the next part. If you're able to see the features of cleft lip, cleft palate, along with P, every P things. This will be seen in a case of Patau syndrome. Okay, and we know Patau syndrome is due to the trisomy of 13. Okay, it is due to the trisomy of 13. It is will be what? It is the Patau syndrome. Fine, and there will be a presence of this two things known as this rocker bottom foot along with this cardiac defects known as VSD. Fine. Next one, if you're able to see this Edwards syndrome, in the case of Edwards syndrome, you'll be able to see this presence of this prominent occiput known as elongated foot, and along with that, he means like in this conditions you will be able to see this. Yeah, the correct Baisla, correct 3, correct RSR, correct Nijai. This Edward will be because of trisomy 18, and there will be the same VSD will be there and same rocker bottom foot. In both of these conditions, there will be these features of rocker bottom foot will be there, and he will be having the extra harsher kidneys. And we studied before which of the following artery will prevent this ascent of this harsher kidneys. Could anyone tell me what is the name of this artery which is being responsible for preventing this ascent of this Edwardson means like ascent of this harsher kidney? Yeah, Nijay, it will be the inferior mesenteric artery. It is the inferior mesenteric artery, and we know it is at the level of L3. Remember, the correct location, correct Shomshaker, it is like correct Baisla, it is what it is the inferior mesenteric artery, it is the level of L3. Inferior mesenteric artery. Next one, if you see a male with the features of gynecomasia and along with features of small testes and features of mental retardation or decreased IQ. Okay, and these are all will be the features of 47 XXY. These are all the features of which of the following condition? Yeah, guys, correct. Yeah, Kirti. It is what it is seen in the case of Klinefelter's syndrome. Okay, just remember these are all the features of Klinefelter syndrome. Yeah, just remember. Yeah, correct. Doc Karthik. Correct. Baisla. Correct. Kirti. Fine. With this understanding, we'll move on to the next part. Fine. In the case of vasculitis, you need to remember which of the following vasculitis will be having this temporal headache, okay, and will be manifesting in most commonly in males in the old age. What is the name of this? Yeah, Rose, they will be having this tall stature. Yeah, location is what it is, the temporal arteritis. Temporal arteritis also known as giant cell arteritis. Okay, fine. And there will be a splitting of this internal elastic lamina. Means on microscopy, you will be able to see this splitting. On microscopic examination, you will be able to see this splitting of internal elastic lamina. Fine, just remember. Next, if you are able to see a correct rows, correct Ria, correct location, you are getting it, the diagnosis correct, the same. They will be giving this typical history of this the Nordic sensation felt over this temporal region, or they will give you this image. So this is the descriptive image, or else this thing they can give. Fine. And there will be a features of giant cells you'll be able to see, appreciate. And if you're able to see some of the vasculitis which is being unilateral head attack, correct? Yeah. In which you will be able to see this involvement of this aortic arch. Which of the following vasculitis will involve this aortic arch and produces this means aortic arch syndrome? Takayasu arthritis. It is known as what? It is known as Takayasu arthritis. Yeah, correct location, correct Dakarthi. This is what it is known as what? It is known as Takayasu arthritis. Fine. And if you're able to see a child, which means like child is being 5 to 15 years of age and who is presenting with more than or less than 5 years, more than 5 days of fever. Yeah, Harikayada. Yeah, it's correct. Yeah, it can be seen. Yeah, Bacilla. And the child is also presenting with fever and along with few features. For example, there is a features of conjunctivitis. There is a presence of this rash. Okay, there is a presence of this criteria known as cream criteria. Conjunctivitis, rash, and there is a erythema, and along with the edema, okay, and there is a lymphadenopathy, there is a lymphadenopathy and a mucosal involvement. This is one of the strawberry tongue. Yeah, right. Yeah, yeah, correct. Yeah, Rose. Yeah, Baisla. Yeah, Ria. Yeah, Karthi. Yeah, Niju. Yeah, you are getting it correct. Yeah, Lokesh. It is what? Yeah, Harika. It is what? It is the Kawasaki disease. Kawasaki disease. And we know for this Kawasaki disease, we use this immunoglobulin IVIG as a treatment. Okay, we'll use this IVIG as a treatment. There will be formation of this. Yeah, there will be features of this strawberry tongue. Two conditions will be able to see the strawberry tongue. One is the scarlet fever, next one is the Kawasaki disease. Fine. Whereas in the case of strawberry vagina, will be seen in the case of trichomoniasis. Okay, just correct. Yeah, yeah, we'll give high dose aspirin because they're high prone for generation of this MI and aneurysms. Fine. With this understanding, we'll move on to the next cardiology part. If you see, there is a asymmetrical, sorry, asymmetrical septal hypertrophy. Okay, along with this ventricles means left ventricle being in the shape of banana shaped ventricle, banana shaped ventricular cavity will be seen in a case of which of the following? Yeah, guys, correct. Yeah, and it will be seen in a case of HOCM. Fine, and it is due to the mutation of which of the following gene? It will be due to the mutation of beta myosin heavy chain. Okay, could anyone tell me what is the chromosome on which this gene is present in? What is the chromosome number this gene is present in? Remember, it is this beta myosin heavy chain will be present in the chromosome number 14. Fine, and fine. If there is just a hypertrophy, if there is just hypertrophy of this ventricle, we will be able to see this type of nucleus was boxcar nuclei. Boxcar nuclei will be just seen in a case of hypertrophy, just hypertrophy. Whereas in a case of hypertrophic obstructive cardiomyopathy, yeah, not Rose, it's not 23. Yeah, correct. Baisa, it is 14. Yeah, fine. Not Arun, it's not 11. It's 14. Okay, Harika, it's not 5. Okay, just don't confuse. It's 14. Okay, remember for till your life. It's HOCM, it's the chromosome number 14. Fine. If you see, since it's just a hypertrophy, it will lead to this boxcar appearance. Whereas if there is any hypertrophic obstructive cardiomyopathy, means there is a huge hypertrophy, so it will lead to this myocyte disarray. Okay, there is a haphazard deposition or haphazard proliferation or haphazard hypertrophy of this muscle leading to this type of histological features. Fine. Next one. Fine. Just remember this thing. Next one, if you're able to see this type of dilated cardiomyopathy, if there is a history of alcoholic given, or if there is any titin gene mutation, okay, titin gene mutation, this will be resulting in this type of cardiomyopathy known as dilated cardiomyopathy. Fine, yeah, correct, Harika. And in this, you'll be able to see this type of nucleus. They are known as ninja star nucleus. Ninja star nuclei. Fine, they are known as ninja star nuclei. Fine, yeah, correct. Those are correct. You are getting it correct. Fine. Next, we'll just see about few images of this infective endocarditis. You know, this means like endocarditis especially. Endocarditis, it might be of different types. If you see this type, if you see this rheumatic heart disease, mostly the vegetations will be present on the superior surface. There will be small vegetation. It's not a big one. There will be small vegetations will be present along the line of closure. So the small one they will be present on the line of closure. Whereas if you see this infective endocarditis one, yeah, correct, Baisla. If you see this infective endocarditis one, there is a large one. It is a large one, and it is a large, bulky, and it is a friable one. Means they can dislodge and can cause embolism. Okay, fine. It is they can dislodge and can cause embolism. Yeah, correct, Arun. Yeah, most common valve to be involved in the case of RH, it will be metal valve involvement. There will be initially there will be a regurgitation followed by a stenosis, and it can lead to this mouth appearance and a fish mouth appearance even. Fine. And next one is NBT, also known as mesenteric endocarditis. Means this is not because of any of the infection or any of this phenomena. It is because of this. Pathological fibrin clots formations. For example, in the case of AML, in which if there is a pathological clots or pathological fibrins and platelets being formed, this leads to the formation of NBT, also known as mesenteric endocarditis. So there also will be this small fibril vegetations, and it will be also along the line of process. So just remember, RHD and the NBT, both of them, they will be having this same features, but In RHD, it will be small lesions, whereas in the case of NBT, it will be more larger when compared to the RHD. Okay. Whereas in the case of SLE, means LSE, Liebman's endocarditis will be seen in the case of SLE. You will able to see both sides. Okay. SLE, remember, for side by side. Yeah, correct, Rose? Yeah. Liebman's endocarditis will be seen in the case of SLE. It will be seen on the both surface of this walls. Okay, just remember. This is the RHD one, and we know this RHD. There is a body known as arch of bodies can be seen. Okay, arch of bodies can be seen. Fine. And the most common valve to be involved, that is the mitral valve. Okay, mitral valve. Okay, and we know the most common organism is responsible for this infective endocarditis. It is what? It is the Staph aureus. That is the Staph aureus. Fine. With this understanding, we'll move on to the next part. You see the respiratory part. Means in asthma, there might be means, and if you're able to see this type of spirals known as Koshman spirals. This is actually what, which are this tracheal mucosal lines. Yeah, correct, Shakib. Yeah, correct, Shakib. Yeah, it is what is known as Koshman spirals, which is actually what, which is the mucosal of this trachea. Okay, fine. Yeah, crisis, which is seen in a case of asthma. Next one is this is what? What is the name of these things? Name of these crystals? Yeah, Lokesh, you're correct. Yeah, Rose, you're getting it correct. What is the name of these crystals? It's known as charcoal laden crystals. They are known as charcoal laden crystals. Okay, these are actually what they are from this eosinophils. Okay, they are actually from this eosinophils, which is made up of the galactin 10. Fine. Next one, these are the bodies known as Criolla bodies. This Criolla bodies, what is this Criolla bodies made up of? Yeah, correct, Arun, Baisla, Rose, Shakib, yeah, Ria. Yeah, these are actually what? These Criolla bodies, which are actually what? Which can look like something similar to of multinuclear giant cells in Zank's layer of HSV. Okay, but you need to see the history also, right? In rare occasions, they will just give images and they will ask. But in most of the cases, they'll be giving a proper history and they will be asking. Right? Yeah, it is what it is the epithelial mucous plus along with this epithelial cells. Yeah, correct. Acetally, yeah, it is epithelial cells. Just remember, right? It's also what Criolla bodies. Fine. Then with this understanding, we'll move on to the next part. If you see this image, in the case of sarcoidosis, you'll be able to see this type of bodies known as asteroid bodies. Okay, asteroid bodies. And along with this asteroid bodies, what is the other type of bodies you'll be able to see in the case of sarcoidosis? Yes, again, correct. Yeah, it is known as what? Schumann bodies. It is known as what? Schumann bodies. Okay, and in most of the cases of pneumoconiosis, you'll be able to see this type of bodies known as ferruginous bodies. Ferruginous bodies. Okay, because over this there will be deposition, means our body will go and deposit the iron, and we can stain this iron using the Prussian blue. So they are known as ferruginous bodies. Yeah, yeah, guys. Yeah, Rasar, Asif Ali, yeah, Rose Alifa, Alifa, you're getting it correct. And this, if there is a ferruginous bodies present, along with this, you'll be able to see this pleural plaques on gross, and also on X-ray you'll be able to see this feathery pleural plaques. Pleural plaques. All will be seen in a case of which one of the following pneumoconiosis? This three will be typical for which of the following pneumoconiosis? Yeah, remember this three of this, it will be typical for, yeah, asbestosis. It will be typical for, yeah, guys, correct, Shakib, correct it. And Rose, yeah, you're getting it right. This one is seen in a case of asbestosis, right? And remember, this asbestosis involves this base. So it involves this base of this lungs, and we'll be having this pleural lesions. And what is the most specific type of carcinoma you will be able to see in a case of asbestosis? What is the most specific one? Listen to the question carefully. Most specific. Yeah, correct, Shakib. It is known as what? Mesothelioma. Whereas most common, if they ask, it will be the bronchoalveolar cancer, also known as the adenocarcinoma. Yeah, Radhika, yeah, Arasar, you are getting it correct. It is what? It is the mesothelioma, which is the most specific one. Yeah, Lokesh, the most common is the adenocarcinoma. Yeah, Shakib, it is the adenocarcinoma, which is the most common one. Okay, fine. This understanding will move on to the tumor part of this, or the CA part of the lungs. Yeah, correct, Arun. If you're able to see this, means uninfilled deposition means in a tumor, means remember, it's not a, means in a lung tumor. Okay, it's not any other tumor. If you see this thing in a lung tumor, it will be what? It is a keratin pulse. Correct, Rose? Keratin pulse. Yeah, bacilla. Yes, Akib. Yeah, it will be seen in a case of squamous cell carcinoma. And if you're able to see this, there is alveoli, and just one side only the tumor cells are being getting deposited. So this is known as what? Butterfly on fins, also known as lipidic pattern. Will be seen in a case of which of the following conditions? Yeah, guys, remember this will be seen in a case of bronchoalveolar carcinoma. Just remember. Next, if you're able to see some kind of vessel involvement, okay, if you see a lung tumor which is being involved into the vessel and showing this blue small cells and the small cells which is being involving into this, yeah, correct, Arun, it is known as what? Azopari effect, which will be seen in a case of Azopari effect, effect, which will be seen in a case of, which will be seen in a case of small cell lung cancer. Okay, which will be seen in a case of small cell lung cancer. Just remember, fine. With this understanding, we'll move on to the kidney part. Fine. In kidney, if you're able to see, if you're able to see, means you need to differentiate a correct ria, correct basila, correct acephaly. Fine. If you're able, we need to differentiate this type of renal stones. And this renal stones, they'll be either they will be giving these features or they will be giving this images as their features. Fine. And if you see first one, if you're able to see this one, if you're able to see the cystine stones, you'll be able to see this 6 are the hexagonal crystals. And these hexagonal crystals will be seen in a case of cystine stones. Fine. Next one, if you're able to see this coffin lid, coffin lid type of cells, okay, if you're able to see this coffin lid type of cells, will means coffin lid type of crystals will be seen in, yeah, correct, Lalit Kumar. Yeah, if you're able to, in which condition you're able to see this coffin lid cells, coffin lid crystals? Yeah, guys, yeah, Mr. Shakib, it is seen in a case of stag horn calculi, which is what, which is the triple phosphate stones. Okay, could anyone tell me what is the most common organism which is being causing infection? Means infectious organism responsible for this formation of this staghorn stones or staghorn calculi? Yeah, correct. Triple phosphate stones, correct, Lalit? Yeah, it is what, it is the protease, and it will be producing this enzyme known as urease. Okay, they will be positive for urease. So, okay, fine. Yeah, Radhika, don't means like don't get confused. It's not E. coli, it's protease. Fine. Next one, if you're able to see this type of envelope type of crystals, it will be seen in a case of which of the following means, yeah, it's silent color, yeah, correct. This will be seen in the case of which type of crystals will be having this envelope shape. Yeah, remember it is the calcium oxalate dihydrate. And if you're able to see this dumbbell shaped, it will be seen in a case of calcium oxalate monohydrate. So if sometimes you'll be having confusion like which is this calcium oxalate monohydrate or calcium oxalate dihydrate. Fine, both of them are calcium crystals only. If you just remember, means if you went into college and if you staying single or if you're still single, then means what do you need to do means you need to build up your body. So if you're single, if you're mono, you need to lift the dumbbells and you need to build your body. So if you're mono, you need to lift, yeah, you need to lift the dumbbells. Or you can remember as mono is dumb, which is more meaningful. Like fine, okay, fine. And if you're single, you are building your body. Of course, you will get committed. Once you get committed, you need to have a proper communication. So in previous times, to have a proper communications, we need to send letters. Means we need to send via envelopes. So this envelope type of crystals will be sent in the case of dioxalate. So between two, you will able to communicate. So this will be okay. You can remember. Okay, to communicate, you are giving letters. Okay, just remember. Fine. And next one, this rhomboid means this rhomboid type of crystals will be seen in a case of uric acid stones. Okay, could anyone tell me is uric acid stones um, are radiolucent or they are radiopaque stones? Yeah, they are what? They are radiolucent. So they will be radiolucent in nature. So they are radiolucent stones. Right? That is this calcium oxide and stored stones. We can easily see with the image because they are radio opaque in nature. Right? Next one will come to some cars. If you see this cars, yeah, Karthi, yeah, Arun, yeah, Basila, yeah, Shakib, yeah, we're getting it correct. If you see this type of cars, means cars they are usually because of it's a normal phenomenon. Means because of the presence of proteins in the loop of Henle known as Tom Hounsfield protein. Okay, And if there is no any problem, like if just a cast means if just a proteinous cast, we won't think much. But if you in the appearance of cast, if you're able to see this muddy brown cast, muddy brown cast, in which condition you're able to see this muddy brown cast? Could anyone answer me in the chat section? Yeah, correct, Basila. In which condition you're able to see this muddy brown cast? Remember, it will be seen in a case of acute tubular necrosis. It will be seen in a case of acute tubular necrosis. And if you're able to see this WBCs, WBCs, it will be seen in a case of glomerulonephritis. Like for example, any of this nephrotic syndrome, yeah, correct, check if any of this nephrotic syndrome or nephritic syndrome will be having this WBC cause. Okay, and especially in a case of nephritic syndrome, okay, in a case of nephritic syndrome, you'll be able to see this RBC cause. Yeah, thank you, Satyam. It's nice to hear. RSR, yeah, pyelonephritis, any of these infections, it will be having this WBC cause. Fine, fine. And then WBC cause will be seen in a case of nephrotic syndrome. So, okay, and nephrotic syndrome will be able to see this features of hoo-ha. Okay, there will be hematuria, there will be oliguria, there will be hematuria, there will be oliguria, and there will be hypertension, and there will be azotemia. Just remember, these are the features. Yeah, this, yeah, Pratik Bedman, like this PDF of this session will be shared in Dr. Banu Prakash sir group once the session will be over. Yeah, correct. Yeah, glomerulonephritic, especially glomerulonephritis, especially the nephritic syndrome component will be having this RBC cause. Right? With this understanding, we'll move on to the next part. And in uncertainty means there is some certain situations you need to just see the image and you need to know whether it is a normal or abnormal one. In one of the NEET PG examinations, they asked this image, which was absolutely normal one. They just asked what is the pathology behind this. Okay, so first image, if you're able to see, this is absolutely normal glomeruli. Okay, so once you see, like don't means don't see as a answer perspective, just see and observe the images. So if there is any changes, there is no any deposition like this, any nodular glomerulosclerosis, if there is no any changes or if there is no any crescentic deposition, so it will be a normal one. So if you're able to see this, if you're able to see this nodular deposition in the case of diabetic nephropathic patient, so it will be known as what? Which lesion? Yeah, guys, correct. Someone told. Yeah, it is known as KW lesion. Okay, it is known as Kensington-Wilson's lesion. Okay, it's actually what, which is a nodular glomerulosclerosis. Next, in which of the following condition you will be able to see this crescent shape of this glomeruli? Crescent shape, where you will be able to see? Yeah, Basila. Yeah, Mohit, Shakib, it is correct. It will be seen in a case of RPGM. Fine, it will be seen in a case of RPGM. Next, means there is a child who is presenting you with a frothy urine. Fine, it's not the urine which is being turning into black, it's a frothy urine the child is presenting with, and he is having this, there is a edema, there is a anasarca, means edema over the all over his body, means swelling all over his body, and normal microscopy you couldn't find anything, but whereas on electron microscopy you'll be able to observe these podocytes which are being fused together. Yeah, guys, you are getting it correct, Shakib and Lokesh. Means Shakib, Lokesh, yeah, initially you are means getting it. Don't get confused. Like it's a edema, means edema and frothy urine means there is a protein being lost. Means it's a nephrotic syndrome. So the most common cause of nephrotic syndrome in a children, it will be what? It is the minimal change disease. And in electron microscopy of the minimal change disease, you'll be able to see this appearance known as effacement of podocytes. Okay, effacement of the podocytes, and we know this minimal change disease will be having this excellent response to the steroids. Okay, yeah, Pratik, yeah, RSR, Radhika, Basila, Shakib, yeah, yeah, nice answers. Fine, I'm just like I'm in a blue blow right now. Like you're getting it correct with most of the questions, so don't worry. Fine, and the patient is presenting with features of fever, hematuria, and a flank mass. Okay, and means all of these things are the triad of which of the following? You know, yeah, guys, yeah, these three, they're known as two-lead triad, which is seen in a case of RCC. And we know the most common cause of RCC, correct, Shakib, it will be, it is what? It is the clear cell variant of clear cell. You'll able to see the cells are completely clear. So it is what? It is the correct, Karthik, the correct Basila, it is what? It is the clear cell carcinoma of the RCC, clear cell variant of the RCC, and which is being associated with the syndrome known as von Hippel-Lindau syndrome. Okay, it will be associated with the syndrome known as von Hippel-Lindau syndrome, and it will be having the involvement of chromosome number 3. Take it just a moment. Fine. With this understanding, we'll move on to the next image. In the case of there is a features of this RCC, along with this, there is the appearance of this plant cell appearance. Which of the following RCC will be having this plant cell appearance? Yeah, Ritikriya. Yes, Shakib, yeah, you are getting it correct. It will be seen in a case of chromophore RCC. Fine, you will be seeing this plant cell appearance in a case of chromophore RCC. Fine, just remember these things. With this understanding, we'll move on to the next part. If you see this J image, if there is a chronic diarrhea along with features of malabsorption, and then duodenal biopsy, you will be able to see this PAS positive macrophages. PAS positive macrophages. Fine. What is the diagnosis of this condition? In which condition you are able to see this PAS positive macrophages on the lamina propria? Yeah, correct, Shakib. It is seen in a case of Whipple's disease. It will be seen in a case of Whipple's disease. Fine. Where in which you will be able to see this. Yeah, correct. Now, it's not ulcerative colitis, it's not celiac. Like, let me clarify you, because this macrophages, they will be eating this Treponema whippleyi bacteria. So, when this bacteria inside this macrophages, they will uptake this pastine, okay, and they will turn pink in color. Fine. They will uptake the pastine and they will turn pink in color, and this will be exclusively seen in a case of Treponema whippleyi. Okay. Whereas, means like, whereas if you're able to see, there must be villi, but if you're able to see, there is a atrophy of the villus. There is a atrophy of villus along with the scripts which is being, yeah, thank you. Yeah, there is a crypt hyperplasia. Okay, there is a crypt hyperplasia, and this both of these features will be seen in a case of which condition? Yeah, correct, Shakib. And Dr. Karthik, it is the celiac disease. Okay, celiac disease, and we know the celiac disease will be having some association with this gluten. So we'll avoid this bro in diet. So okay, so we'll avoid this bro in diet. Fine. Yeah, correct, Radhika. Yeah, it is the celiac disease. Fine. And the dermatological variant will study in the upcoming sessions, which is what is the dermatitis herpetiformis. Fine. Yeah, Basila, yeah, Karthik. Fine. With this understanding, we'll move on to the next part. This is where you'll be able to see this last time you answered, right? Crypt abscess. In which means in some conditions, you'll be able to see this crypt abscess along with some of the features of bloody diarrhea. Yeah, I forgot, like there is a presence of anti-tissue transglutaminase antibodies along with they will be positive for anti-endomysial antibodies. Endomysial antibodies. Yeah, correct, Siraj. Yeah, correct. We need to avoid the bro. Okay, if you're able to see this image, you'll be able to see this presence of this crypt abscess along with this continuous involvement with clinical features of bloody diarrhea. With the clinical features of bloody diarrhea, and the most common part to be involved is rectum. And this all of this following, along with this formation of the small pseudopolyps. Okay, will be seen in a case of which condition? Yeah, lead pipe appearance. Yeah, will be seen. Yeah, correct, Shakib. Yeah, Lokesh. Yeah, like, yeah, Karthik. Yeah, it will be seen in a case of ulcerative colitis. Okay, we'll be able to see this bloody diarrhea. Fine, and there will be a lead pipe appearance because of this loss of hastrations. Fine, and if you're able to see this formation of strictures, and there will be means the cobblestone is not shown here, but there is a means since there is a skip lesions, strictures, skip lesions, cobblestone mucosa, along with the fistulas will be seen in a case of this is Crohn's disease. Fine, granuloma formation also in a case of caseating granuloma will be seen in a case of thank you, dopamine. Will be seen in a case of Crohn's disease. Fine. This will be seen in a case of Crohn's disease. And could anyone tell me? Yeah, the most common site will be the terminal ileum, and the most common site will be terminal ileum. What is the most structure which is to be spared in a case of Crohn's disease? Could anyone tell me? It will be what? It will be the rectum, and the antibody which is being responsible. Yeah, correct, correct, Lalit and RSR, and the antibody which is being responsible will be the anti-Saccharomyces cerevisiae antibody. Fine, just remember it, the ASCA antibodies. Fine. With this understanding, we'll move on to our next part. If you see this type of arborizing, arborizing polyp. In which of the following conditions you will be able to see this arborizing polyp? Yeah, correct. You will be seeing in this condition in case of Peutz-Jeghers syndrome. Could anyone tell me what is the gene which is being mutated in the case of Peutz-Jeghers syndrome? And this arborizing polyps, it also will be in the case of Peutz-Jeghers syndrome. It will be also, yeah, Shubham. Yeah, you are means and Shakib. Yeah, means your top notch. Like it is what it is the STK11 gene. Fine. And this arborizing polyp, it will be always also having this mucosal deposition or mucosal hyperpigmentation known as lentigenes. Fine. In which of the following condition you will able to see this onion peel appearance of this bile ducts? In which of the following condition you will able to see this onion peel appearance of this bile ducts? Yeah, guys. Yeah, Shakib, it is correct. It is what is the primary sclerosing cholangitis. And we know ulcerative colitis can be associated with this primary sclerosing cholangitis because both of them they show this same P ANCA positivity. Whereas we know vaginous can show both C ANCA and P ANCA positivity. Fine. C ANCA, P ANCA positivity, but most common it is the C ANCA part. Okay, fine. Yeah, correct, Rock, correct Nidhi, correct Basila, correct Lalit, correct Shakib, correct Siraj. Fine. Yeah, that's correct, Arun. Yeah, fine. With this, we'll move on to the some part of the CNS. Means if you're able to see this type of flame cells or this kind of flame kind of appearance, which is known as what? Neurofibrillary tangles. It's actually made up of these tau proteins. It will be seen in the case of Alzheimer's disease. There is the same Alzheimer's disease having one more feature known as Hirana bodies. No, no, Nigri bodies, it's a different one. Nigri bodies, like it means it also having this similar picture, but it will be there will be history given and it will be seen in a case of cerebellum. Okay, it will be near to the Purkinje cells. You will be able to see. Fine, and this Hirana bodies also will be seen in a case of which is made up of actin, which also will be seen in a case of Alzheimer's disease. Fine, and which of the conditions today we studied? We had this regional Alzheimer's. With this understanding, we'll move on to the next part. If you're able to see, yeah, correct, Shakib, yeah, correct, Lokesh, yeah, correct, Arasa, yeah, if you're able to see this image in which we'll able to see there is a butterfly like glioma, there is a butterfly like glioma, because of this involvement of this corpus callosum. Okay. What is the thing you will think of? Ya Shakib, Ya Meher, Ya Shubham, Ya Radhika, Ya Rock. It is what it is seen in a case of. Ya Basila, it will be seen in a case of glioblastoma. Glioblastoma. And we know it is due to the wild type mutation of this isocitrate dehydrogenase. Okay, it is due to the isocitrate dehydrogenase wild type mutation. And it is the this glioblastoma multiforme. It is a yeah, Lokesh, yeah, correct. Yeah, Rapunzel zone. Yeah, it will be a grade 4 tumor. It is a grade 4 brain tumor. Okay, so it is a one of the malignant one. Fine. Just see. Next one, if you're able to see this one, this is what? This is a pink. This is a white. If you see the center, it is a pink. Just remember this pink roses means like if you see means like it's just a male oriented study, so females don't get offended. So if you see males like if you see some rosettes which are having pink in the inside means it is what it is pseudo rosettes. Fine. And these are being compared with men. Why it is being compared with men? Because males will be having means like males will be having in their heart as females. So, but okay, so the males will be having in their heart which is females, and females they like the color pink. So females will having pink color in their heart, and this like males will be having this pink color in their heart, and this will be known as this pseudorosets. It's also known as Homer right pseudorosets. Fine. Yash, yeah, Lalit, yeah, Shubham, yeah, thank you. Yeah, fine. And this will be seen in the case of pseudorosets, and this will be seen in a case of three conditions like medulloblastoma, Ewing sarcoma, and neuroblastoma. Fine. Yeah, that is the RB gene localization. Yeah, correct, Lalit. Fine. Next, it is the white. If you're able to see the transparent one, the white one, it is what? It is the true rosette, which will be seen in a case of retinoblastoma. Okay, which will be seen in a case of 13q14. Fine. It is the local is the 13q14. Fine. Which is true rosette, which is also known as Flexner Wintersteiner, also known as just remember as Flexner white or white, which is means center if it is white, so it will be a two rosette. So it will be seen in a case of retinoblastoma. Fine. It is due to the RB gene mutation. Fine? Just remember these things. This understanding will move on to the next part. Be able to see this palisading of this nuclei to the one side. Okay? Palisading of nucleus along with the two zones which is having this antennae A, which is antennae B, which is having less number of cells, and antennae A, which is having a lot of cells. Yeah, Asif Ali, yeah, Rock, you are getting it correct. It is known as what? Vestibular schwannoma. That's known as previously known as acoustic neuroma. Fine. And okay. And this vestibular schwannoma will show this antennae A and antennae B areas along with okay verrucae bodies. Verrucae bodies. Just remember. Fine. And yeah, correct. Arun, yeah. Acoustic neuroma. It is also known as acoustic neuroma. Yeah. It can be associated with this NF2. Okay, NF2. Okay, the Nismi tumors. And if you're able to see this fried egg appearance, along with this chicken wire calcifications. In which condition you will able to see this one? Yeah. In MRI, you will able to see this ice cream cone appearance. In which condition you will able to see this fried egg appearance along with this chicken wire calcifications or at the cerebellum? It will be seen in a case of which tumor? Means mostly at the level of cerebellum. It will be seen in, means it will be due to which tumor? Yeah, oh yeah, that's correct. Oligodendroglioma. Yeah, that's the previous one. It is seen in a case of pilocytic astrocytoma. Astrocytoma, just tumor. Yeah, it is most commonly seen in a case of children. Yeah, correct. Ria, Shakib, and Asif Ali. Yeah, Basila. Yeah, fine. Yeah, Radhika. Just tumor. Fine. This understanding will move on to the blood path. Fine. If you're able to see in the case of bone marrow biopsy, we'll use this types of needle. If you're able to see this a screw at the side, it is known as Salah needle. So if you're able to see a screw at the side, it is known as Salah needle. And if you're able to see this type of needle, it is known as Jamshidi needle. It is known as Jamshidi needle. And if you are not able to appreciate any screw, and it is just made up of these two are made up of steel, okay? And if you not able to appreciate the side screw, which is in a straight in the screw kind of thing, it is in a straight position. It is known as what? Klima needle. It is known as what? Klima needle. Okay, just remember. Yeah, Ria, yeah, Rock, yeah, Basila, correct. And in a case of peripheral smear, if any peripheral smear is given, if you're able to see this yellow kind of granules, this yellow kind of granules, just remember it will be typical for this eosinophils. It will be typical for this eosinophils. If they give any image and if they contain these yellow granules, it will be eosinophils. Fine? Don't be confused with that. Next, if you're able to see a child who is having these features of hepatosplenomegaly or mainly splenomegaly along with the features of chipmunk faces along with undiagnosed, you're able to see this microscopic, you think of thalassemia. And we know in the case of Mainzer index, thalassemia will be having Mainzer index less than 30. Fine. Next, if you're able to appreciate this type of blister cells are bite cells along with this stain showing this Heinz bodies. Means actually Rosenthal fibers, they are actually normal fibers. Means it's in normally it's appear in our brain. Means like it will be normally deposited. Whereas in the case of pilocytic astroma, it will be deposited in a fashion so that we can see. Okay. So no need to remember much about it. Fine. Like no need to go in depth about it. Just remember this small concept that like Rosenthal fibers, like in those pattern will be seen in a case of astrocytoma. Okay. Fine. Heinz bodies will be seen in a case of G6PD. Fine. Yeah, bite cells, then these things will be seen in a case of G6PD deficiency. And next, if you're able to see this macroovulocytes along with this hypersegmented neutrophils. This macroovulocytes along with hypersegmented neutrophils will be features of this vitamin B12 deficiency anemia. This is a type of megaloblastic anemia. And this will also, you also able to see one more type of bodies known as Howell-Jolly bodies. Howell-Jolly bodies. Yeah, Somesh, yeah, Basila, yeah, you are getting it correct. It is a type of megaloblastic anemia which is due to the vitamin B12 deficiency. Fine. And next, then, just a minute. And next, in the same condition, you will be able to see this type of rings known as Cabot rings. Cabot rings also seen in a case of vitamin B12 deficiency and also in a case of sometimes in a case of splenectomy. Yeah, correct, Ria? Correct, Arasa. Fine. And next, you will be able to see this type of ringed sideroblast. Ringed sideroblast means like around this around this RBCs or this around this RBCs, you will able to see this deposition of this iron. So it will be seen it will be known as ringed sideroblast. Yeah. Okay, fine. And this will be seen in a case of myelodysplastic syndrome. It will be seen in a case of myelodysplastic syndrome. Just remember. Fine. Yeah. And this same knuckle hyperpigmentation. Knuckle hyperpigmentation also seen in a case of vitamin B12 deficiency. Just remember these things. Yeah. Yeah, guys. Yeah, Ria. Yeah, Ranjan. Yeah, Rose. Yeah, means there are two different entities. Means if you see this Heinz bodies, means if you see a case of G6PD deficiency, there is a deficiency of this enzyme in this NADPH. Means there is a this deficiency of this enzyme lead to the deficiency of NADPH. So if there is a deficiency of this, there will be huge free radicals because this NADPH NADH they will convert this free radicals and they will absorb it. If there is no free radical scavenger, there will be huge free radicals and they will come and eat up this hemoglobin and they lead to this deposition as a hemoglobin debris. Fine. So it will be what? This will be manifest Heinz bodies. This will be seen in a case of any reticulocyte staining. You will able to see appreciate this Heinz bodies. Whereas this Howell jelly bodies you will be able to see in a case of normal Romanowski stain. Okay. This is how you are able to see. You will able to differentiate this Heinz bodies from this Howell jelly bodies. Fine. I think so. This you are able to differentiate. It's known as Flexner-Wintestiner rosette. Remember, Flexner-Wintestiner rosette is not a, it's a true rosette. Fine. Whereas Homorite pseudo rosette. Remember, Homorite pseudo rosette is a pseudo rosette. Whereas Flexner-Wintestiner rosette it's a true rosette. Fine. Yeah, in G6PD there will be a history of drug intake. Just remember. Fine. And this is how this normal cell develops. And with this, we'll move to the next part. Be able to see there is a all lineage. It means if there is a hyperproliferation of if there is any hyperproliferation of all this lineage, and on examination you will able to see this type of rods known as R rods. You will able to see. Okay, and this will be typical for AML, and this R rods will be typically seen in a case of AML M3. It's actually what which is the PML RARA fusion. Yeah, guys, correct. It's not CML Lalit, it is AML. Fine. Yeah, it is R rods. Correct, Ranjan. It is the R rods, which is what? Which is the PML RARA fusion, which will be the 1517, which is the 1517 fusion. That's remember. Fine. And fine, this is the R rods. And next, if you're able to see this type of just lymphocytes. Okay, it's just the lymphocytes which are being showing this appearance known as schoolgirl or a convent girl appearance, and a child is having the features of fever along with bone pain. This will be typical for this ALL. Okay, this will be typical for this ALL. Remember, this is a child, so it will be a features will be seen in a case of ALL. Fine. Whereas if you're able to see this type of smudge cells, which is due to the absence of vimentin. Okay, and if there is a smudge cell which is due to this absence of vimentin, if they while preparing the slides, if they burst, it will lead to this formation of smudge cell will be seen in a case of CLL, which also you can see there is a uniform. So this also will be the lymphocytes. Fine, just remember. So yeah, Lalit, yeah, you are getting it correct. In the case of CML, you will be able to see 920. Yeah, garden party appearance means in the case of AML or CML, because in the case of AML or CML, mostly all of the lineages will be overgrown. So there will be all of the lineages overgrown. So it will show this garden party appearance. Whereas this ALL will show this schoolgirl or the convent girl appearance. Fine. And mainly garden party will be seen in the case of CLL. Just remember. Fine. And in the case of AML M4 or any type of myelomonoblastic and AML M4 and M5 monoblastic and monocytic, both of them, they will show this gum hypertrophy. Okay, they will show this condition known as gum hypertrophy, and they also may show this one more condition known as leukemia cutis. Just remember, it is known as leukemia cutis. Okay, just remember. Yes, yeah, Lalit. Next, if you able to see this type of clover leaf or some kind of cerebriform appearance, also known as Sézary cells. This will be seen in a case of which of the following condition? Which will be seen in a case of Sézary syndrome, which is actually what? It's a T cell type of non-Hodgkin's lymphoma. Fine? Yeah. And if you're able to see this, yeah, correct. Yeah, AML M7, it is the most common type which is being seen, means like our most common, most specific type which is being seen in a case of Down syndrome who is less than 3 years. Remember, Down syndrome with less than 3 years, you will think of AML M7. Okay, fine. This is what this is the starry sky appearance. Starry sky appearance which will be seen in a case of Burkitt's lymphoma. Okay, Burkitt's lymphoma. Just remember. Fine. Next, if you're able to see this type of hairy cells, chloroma seen in a case of M2. Okay, don't confuse chloroma seen in a case of M2. Fine. And this is what this is the hairy cells which will be seen in a case of hairy cell leukemia. Okay, leukemia. This is actually a B type of non-Hodgkin's lymphoma. Just remember. Okay, and most commonly seen in boys. Fine. Fine. Right, they'll be TRAPS positive. Yeah, correct, guys. They'll be TRAP positive, and there'll be annexin A1 positive also. There will be a annexin A1 positive. Fine. Whereas annexin 5 positive will be seen in a case of process. Fine. With this understanding, we'll move on to the few more questions in few more images in pathology. If you're able to see this both, yeah, grape-shaped inclusions will be known as what? Mulberry are the mode cells. Okay, grape-shaped one, they are known as mulberry are the mode cells. Or if you're able to see this intranuclear inclusions, they are known as what? They are known as this Dutcher bodies. They are known as Dutcher bodies. And yeah, and serum electrophoresis, you will be able to see this M spike. Okay, M spike will be seen in a case of multiple myeloma. Okay, multiple myeloma. Whereas in a case of just for your reminder, I just brought this image. In the case of nephrotic syndrome, okay, nephrotic syndrome, all of these proteins will be decreased. When usual, all of this following will be decreased except one protein, which is this alpha 2 will be increased. Okay, this is the protein, means this is the pattern will be seen in a case of nephrotic syndrome, whereas this one will be seen in a case of multiple myeloma. Fine, yeah, and it will lead to this amyloid light chain deposition. Fine, amyloid light chain deposition. There will be different flame cells will be seen, and there will be Dutcher bodies also. Yeah, guys, correct. Yeah, yeah, Ravat, you are getting it correct. Yeah, Arun. Yeah, correct. And if you are able to see this type of appearance in which there is a central blood vessels and followed by this tumor cells, and there is a blood vessel in the center. Okay, and there is a gap after it between this tissue. Okay, fine. This tissue. So this will be seen in a case of which of the following tumor? First of all, what is this type of body known as? Could anyone guide me through? What is the name of this bodies, and in which tumor you will be able to see? They are known as Schiller dual bodies. Remember, they are not means this is the Schiller dual bodies. It's not granular cell. It is seen in a case of yolk sac cell tumors. Okay, fine. It is Schiller dual bodies. Yeah, of course you are getting it correct. It is known as Schiller dual bodies, which will be seen in a case of yolk sac. Yeah. If you're able to see this image, you'll be able to see this type of staining, which is known as gram staining. And in gram staining, you need to remember just a few things. One is that the gram positive bacteria. The positive bacteria, positive will be purple in color, fine. Whereas negative will means we know means like red will be a negative, right? So just remember, negative one will be red in color, fine. Negative one will be red in color. Next is that means the staining steps. If you see the staining steps, initially means we'll add a blue dye, because since the peptidoglycan layer of this gram positive bacteria it's thick, so it can take up this blue dye and it will never leave. Whereas this gram negative bacteria, it will just take and leave. So initially we'll add a blue dye, then we'll undergo this iron treatment, then we'll add a decolorizer, then we'll add a counter stain as safranin. Fine. So remember, there is a mnemonic by a PM faculty known as come in and stain. Fine. Come in and stain. So initially the first stain will be the crystal violet. Fine. The first stain will be the crystal violet, and the last one will be the safranin stain. Fine. Just remember these things. Fine. With this understanding, we'll move on to the next part. If you see this staining, this is used to identify the Mycobacterium tubercular bacillus, which is known as Zeal Nielsen staining, which is also known as acid fast staining. fine, which is also known as acid fast chaining. And in a case of acid fast chaining, we'll do these things in a reverse manner. Whereas this one here, the carbon fuchsin stain, which is actually what? Which is a red stain or the pink stain, will add in the first in the first go. Whereas last will add the blue stain. Fine. Whereas in last will add the blue stain. Just remember these things. And here we'll use this sulfuric acid. So in between we'll use this sulfuric acid like H2SO4. Okay. So means there will stabilize with iodine. Okay. Here will stabilize and then we'll treat it with sulfuric acid. Then will stain with methylene blue. Fine. And this is how a zeal stain looks like. Fine. With this understanding, we'll move on to the next part. If you see this image, in this image, you need to remember just few things. One is that if there is in a conjugated pili, if there is a pili formation, then the genome will be transferred through this pili known as conjugation. Whereas if there is any bacteriophage involvement, so it is known as transduction. So remember, if there is any bacteriophage involvement, it will be known as transduction. Whereas if it is taking from outside, it is known as just transformation. Yes, Sveta, yes, Somesh, it is correct. If there is any bacteriophage, it is known as transduction. Okay, this is the thing which is being repeatedly tested. So just don't forget it. Fine. Next, if you see this image, in this image you will be able to see they are testing some antibiotic sensitivity. Fine. In this antibiotic sensitivity, we'll use this type of thing known as diffusion method known as Kirby-Boyer disk diffusion method. Just remember, Kirby-Boyer disk diffusion method. Fine, we'll use to know this antibiotic sensitivity. And if antibiotic sensitivity is sensitive, then no organism will grow closer to it. Whereas if it is resistant, the organism will grow closer to it. Just remember, if they will given us what is the name of this disk diffusion method, it is known as Kirby-Boyer disk diffusion method. Fine. With this understanding, we'll move on to the next part. If you see a history in which it is given, the organism shows golden colonies on nutrient agar. Along with this test, in which you will be able to see this gas bubbles present, which is the catalase test positive along with this coagulase positive. Okay, coagulase positive. What is the organism you will think of? Yes, Somesh, what is the organism you will think of? Yeah, means if there is a organism which is producing golden yellow colonies on this nutrient agar, means then you will think of Staph aureus. Means aureus, aura means it is a gold, so it is the Staph aureus, which is the catalase and coagulase, both of it is positive. And we know it is a Lokesh, Baisla, and it is the most common cause of skin and soft tissue infection, and it is the most common cause of endocarditis. We studied endocarditis, and it is also most common cause for osteomyelitis, except in case of sickle cell anemia. We know sickle cell anemia it will be caused by the salmonella. And there are two types of coagulase positive. This is known as tube coagulase and this is known as slide coagulase. Okay, slide coagulase. Just you need to know just these things. Fine. If you know these things, these are the better things. Means these are the most things you need to know. Fine. That's it. With this understanding, we'll move on to the next part. If you see on this blood agar, if you're able to see this complete hemolysis, it is known as beta hemolysis. If you're able to see the half hemolysis, it is known as half. Remember alpha. Okay, so it is known as alpha hemolysis. Okay, whereas if there is a no or very minimal hemolysis, it is known as what? It is known as gamma hemolysis. So mainly we'll discuss about this alpha and beta hemolysis. There is organisms which are classified as group A beta hemolytics. Okay, in group A beta hemolytic organisms. Could anyone tell me what is the example of this organism? Yeah, Somesh. Yeah, Baisla. An example of group A beta hemolytic organism? Yeah, it can lead to PSGN. It can lead to rheumatic heart disease, rheumatic fever. What is the organism we are talking about, Radhika? Yeah, Divya Pooja. Yeah, it is a type 3 hypersensitivity reaction. Yeah, Divya, yeah. which organism we are talking about? We are talking about this Streptococcus pyogenes. Okay, Streptococcus pyogenes. Just remember, we are talking about this organism known as Streptococcus pyogenes. Yeah, correct, Somesh. Fine. And in the same, if you're able to see in the same, if you see this group B, then there will be organism known as Streptococcus agalacticae. Okay, agalacticae. And this Streptococcus agalacticae will show this special type of test positivity. Yeah, they can show this catalysm and they will show this type of positivity known as camp test positive. There will be camp test positive. Yeah, correct, Pratik. Yeah, they will show this camp test positive. Okay, fine. These are about the beta hemolytics, which we need to know, which has been repeatedly tested in the exam. Next, if you see, next one, if you see this alpha hemolytics, like there might be the organism which is occurs in a diplococci and it is capsulated, diplococci and it is capsulated, and it is the most common cause of community acquired pneumonia. What is the organism which we are talking about? Diplococci and means yeah correct, Patrick. It is what it is the Streptococcus pneumoniae. Okay, pneumonia. And okay, and it also produces this carom coin colonies. Carom coin colonies. Okay, just remember, it also produces this. Yeah, correct, Lokesh. It also produces this carom coin colonies. Yeah, correct, Divya. Then we also have, there is also one streptococci which is known as Streptococcus viridans. And remember, this Streptococcus viridans they are the most common cause of subacute bacterial endocarditis. Just remember this one point about this organism known as Streptococcus viridans, which causes this subacute bacterial endocarditis. Fine. With this understanding, we'll move on to the next part. If you see, there is an organism which causes this type of HR and which shows medusa head colonies on culture and also shows this string of pearls appearance, and it also shows this inverted filtry appearance. Inverted filtry appearance on stab culture. What is the organism you will think of? Yeah, snake. It is what it is, the Bacillus anthrax. What is the Bacillus anthrax? Remember about this Bacillus anthrax. Remember, it is also this capsulated organism, but it is, we know, it is made up of it is made up of glycopeptide capsule, and means it will be differentiated from other capsules. And we know this anthrax, it is a aerobic organism, so it will grow more on the upper surface. But it will grow more on the upper surface. So remember this organism. You remember a small girl who is being decorated or being dressed for this Halloween. She's having this having this appearance of a witch. Okay, witch, and in which head she's having this Medusa head appearance, and then she's wearing a skirt which is of this inverted filtry appearance. And if if she's a witch who is dressed as, then she'll be having means she'll be old witch, right? So she'll be having some sticks. So remember, we'll show this appearance known as bamboo stick appearance because of this presence of this central spores. Okay, because and it is a spore-laden organisms, and since she's a witch, she need to tell some mantra. So she'll be having this string of pearls, means in her hand. Okay, she'll be having a string of pearls in her hand. Yeah, correct, Divya. And then means she's just for Halloween, right? So she need to collect some candies. So this candy she is collecting in a plate. So remember, so it will be calculated in a plate media. Okay, plate media, and it is aerobic in nature. Just remember these things. Will be sorted about this Bacillus anthrax. Fine. Next, if you see this image, in which you will be able to see this terminal spores, and which is being cultured in this Robertson cooked meat media, and which is a drumstick. Terminal spores which is showing this drumstick appearance, and it is more of anaerobic and aerobic, and it is showing filtry appearance. Since it is anaerobic, it will grow more on this lower surface. Okay, so it is a filtry appearance and stab culture. What do you think of? Yeah, guys. Yeah. With this understanding, we'll move on to the next part. If you see this image, you will be able to see this Chinese letter pattern, Chinese letter pattern, along with this formation of these granules. What is the name of these granules known as? Berbic granules. Yeah, correct, Radhika. And, and it is being cultured in this low plus serum slope. Yeah, it is what it is known as what? Corynebacterium diphtheria. It is what it is the Corynebacterium diphtheria. Okay. And it also has one more specific culture media. What is the name of this? Yeah, it is also known as Walton granules. It is known as what? It is stained with Albert stain. Okay. It is stained with Albert stain. And it is having this media known as potassium telluride agar. Telluride agar. Okay, just made this made up of this telluride agar. Next, it is being stained with this Albert stain for this metachromatic granules. Okay, or this volatile granules. Fine. Yeah, it leads to the formation of this pseudomembrane formation. Fine. Next, you'll be able to see this type of test which is being performed. Yeah, correct. Unisol gaming and which is being used to detect the toxin. So it is known as what? It is known as which test? It is known as ALX gel precipitation test. Fine. Yeah, correct. So much it is known as ALX test. Correct. Fine. With this understanding, we'll move on to the next part. A child or anyone, a child who is presenting with features of meningitis along with this rash. What is the organism you will think of the causative? What is the causative organism you will think of? Meningitis along with the rash. You have full moonlight. Yeah, it is what? It is the Neisseria meningitis. It is the Neisseria meningitis. And we know if you're able to appreciate gram negative means red color. So it will be a pink color. So if you're able to appreciate the pink color gram negative organism, okay, which is the Neisseria gonorrhea. Okay, Neisseria gonorrhea. Fine, it is the Neisseria gonorrhea. Fine. And next, if you see this Neisseria gonorrhea, it is having this perihepatic adhesions. Okay, perihepatic adhesion leading to this string of violin sign. String of violin. Okay, which is what is the name of this syndrome known as? Yeah, it is a divide. It can lead to complication of this PID of Neisseria gonorrhea. What is this name of this syndrome known as? What is it? Yeah, correct. Unisol. It is known as Fitzhugh-Curtis syndrome. It's known as Fitzhugh-Curtis syndrome. Just remember. Fine. With this understanding, we'll move on to the next part. We are able to see organism which is gamma in shape and having flagella and showing shooting star motility, shooting star or darting motility along with positive string test. What is this organism? What you will think of? Yeah, guys. Yeah, I'm getting correct answers. It is what? It is the Patrichria, Lokesh. It is what? It is the Vibrio cholera. And Vibrio cholera, we know it is a salt-loving organism. So since it's a salt-loving, so it can be stained, means it can be cultured in this TCBS agar, and in TCBS agar, it will show this yellow colonies. Okay, yellow colonies. Just remember, is okay, fine. And this by this yellow colonies, we can differentiate this Vibrio cholera from this Vibrio parahemolyticus. Just remember, fine. Yeah, you are getting it's yellow color. Yeah, full moon light, correct. Yeah, you are now getting it correct. Fine. Next, you saw a case which is being come with the features of this kind of appearance of the skin, and pressing you will able to see here this means air bubbles which are bursting, or some kind of air presence or crepitus presence. What you will think of? You will think of a condition known as gas gangrene, and this gas gangrene will be caused by Clostridium perfringens. Yeah, correct, Lokesh. Yeah, correct, Riya, Divya. Correct. Yeah, it is known as perfringens. Achha, it is known as Clostridium perfringens, and it will show three features. They are known as, remember, as superstar NTR. So they will show this Naegele's reaction, which means like it will show the stromy fermentation on the litmus milk. It will show, and yeah, and T for they will show this target hemolysis, and they will show this test known as reverse cam test positive. Reverse cam test positive. Yeah, correct, Lokesh. Yeah, correct, Divya. Correct, you are getting it correct. It is known as reverse cam test positive. And there is also one more features of this Corynebacterium. Okay. No, sorry, it's not Corynebacterium. There is one more feature of this Clostridium. Okay, which causes this diarrhea after antibiotic usage. And on examination, you're able to see this formation of the pseudo membranes over it. So, what you will think of? It is known as pseudomembranous colitis. Pseudomembranous colitis, which will be caused by this. It will be caused by which organism? Clostridium difficile. Okay, Clostridium difficile. Under microscopy, you will be able to see this volcano type of eruptions. You'll be able to see this volcano eruption. Okay. Yeah, correct, Patrick and Ria. Correct, you are getting it correct. Next, we'll move on to the next part. If you're able to see this type of agar, which is known as buffered charcoal yeast agar. Fine. Yeah, it means full moon, right? This is the antibiotic associated diarrhea, especially from the second generation cephalosporins. Fine. You'll be able to see this by BCYE agar means which will be culturable for this Legionella. Okay, in case of Legionella, it will be features with atypical pneumonia along with features of diarrhea. Atypical pneumonia and diarrhea. Fine, just remember this thing. Next, this is the McConaughey agar which is used to differentiate this lactose fermenters. Lactose fermenters. Fine. And then you will be able to see here there is a typical example of a lactose fermentation in which you will be able to see this pink colonies. Colonies, okay, which will be seen in a case means which is also a lactose fermenting bacilli which shows this typical yeah, means Legionella caused by this AC vents. Yeah, thank you for remembering. This is the AC vents. Okay, like this type of pink colonies will be produced by this Klebsiella pneumonia. Okay, Klebsiella pneumonia. Just remember. Fine. Yeah, Divya. Yeah, Brescia, you are getting it correct. Fine. This understanding will move on to the next part. If you're able to see what is this type of what is this microscopy first of all? Could anyone guide me through it? What is the name of this microscopic microscopy? Leave about proteus. Yeah, this is a proteus. Fine. This is proteus. Okay. What is this microscopy? It is what it is the dark field microscopy. It is known as what? Dark field microscopy. It is what it is the dark field microscopy. In which you are able to see this type of curved or this type of organisms, which is the means which is showing this corkscrew type of motility, which is what? Yeah, correct, full moonlight, correct, Ravat, and correct, Somesh. Fine, correct, Ria. Fine. So it is what it is the Spirochids family, Spirochids, and one of them is the Treponema pallidum, which causes the syphilis. Fine, just remember these things. Fine. Next, if you're able to see, this is the protease, and what is the name of what type of motility does this protease shows? Yeah, guys, what type of motility does it shows? It shows this swarming motility. And if 2 to 3 species of this protease they come together, okay, fine. Yeah, guys. Yeah, wow, Radhika, yeah, like last of answers, Sveta, Hasanar, and Somesh and Divya. You are getting it correct. And if you're able to see 2 to 3 species, they are come and colliding each other. It is known as what? Dines phenomena. Which is also seen in a case of protease. Fine. Next. For Pseudomonas, we have this culture means while culturing on the nutrient agar, it produces 2 types of pigments. One of them is this pyorubin, next one is the pyocyanin. Cyanin, it produces this blue color pigments, whereas rubin, it produces the red color pigments. And we know it is the most common cause. Of bacterial corneal ulcer. Okay, it is the most common cause of bacterial corneal ulcer. And we know if it is a bacterial corneal ulcer, this will be a single ulcer with uniform border. Okay, just remember, yeah, you will be able to see this thing, which is this hypopia. Yeah, that's awesome. Like we're having this eagle eyes, yeah. Fine. Yeah. With this understanding, we'll move on to the next part. We're able to see this mycology means like mycology. It will be an easy kick for you because they will ask either the staining techniques or they will give the typical history. They won't go in depth. They will never go in depth, and they will ask something else. Fine. So in the case of mycology, there are few staining techniques you need to know. One of them is this. This is the fluorescent stain which is used in the case of mycology. This is what this is known as chalcofluor white. It's known as chalcofluor white stain. Then, if you know any of this culture morphology can be known by this stain known as lactophenol cotton blue. Okay, lactophenol cotton blue, and this will be showing this features known as means this is the lactophenol cotton blue. That's why it's blue in color. Fine. Next, yeah, correct. Yeah, means SJ, it is the culture media Lokesh, correct. And Somesh, yeah, it is the lactophenol cotton blue staining. Yeah, correct. Aditya, yeah, Patrick and Ria, Pooja, yeah, we're getting it correct. Fine. And you will able to see this microconidias which are being moving upwards. Okay. So this is what if you know means if there is a smoke, it will fumes up. So if something is fuming out, remember it is what it is the Aspergillus fumigatus. Okay, Aspergillus fumigatus. Yeah, correct anonymous Zozo. Fine. Next, if you're able to see this type of blackish colonies, if you're able to see this type of blackish colonies on a Steburos dextrose agar, this is the SG agar, which is the most common agar which is being used to cultivate the fungal organisms. Fine. And this is what this is the Aspergillus niger. Fine. Next, if you're able to see a silver stain which is being used to stain this fungi, what you will think of? Yeah, anonymous Zozo. Yeah, it is what? It is the Gomari methamphetamine silver stain. Okay. And in the case of Gomari methamphetamine silver stain, if you're able to see, there is a acute branching along with septate. It is what? It is the Aspergillus. It is what is the Aspergillus. Fine. Or else, if, yeah, you are feuding with answers. Yeah, Divya, Priya, yeah, full moon light, Radhika, Divya. Yeah, guys, yeah, you are getting it correct. Yeah, acute angular branching around the 45 degrees. And we know if it is acute angle, everything will be by this denoted by this mnemonic of A. And if you flip through this A, it will known as V. So the drug of choice will be what the drug which is be used to treat. It will be the what? It will be the voriconazole. Okay, it is the voriconazole. Fine. Next one, if you are able to see this type of broad base, if a fungi with a broad base along with this 90-degree branching, broad base with 90-degree branching, what do you will think of? Yeah, Lokesh, yeah, Divya, it is what? Yeah, Rose, Alfia, it is what? It is the mucormycosis. It is the mucormycosis. Fine. And this fungus we can also stain with pastime. Fine. With this, we'll move on to the next part. If in a Severus dextrose agar, if you're able to see this type of white creamy colonies, what you will think of? What is the organism you will think of? Yeah, Patrick. Yeah, Roself. Yeah, it is what? It is the Candida. It is the Candida you will think of. Fine. And if you're able to see this tender, boggy swelling. Yeah, fine. Yeah. And if you're able to see this same, this phenomena in which if you're able to see this formation of the germ tube, if there is a tennis racket size type of granules will be seen in a case of Langerhans histiocytosis will be the birds like big Birberg granules. Fine, just remember. Fine. This is what this is the germ tube formation which is also known as Raynaud's phenomena. Fine, this is also known as Raynaud's phenomena. Next, if you able to see this spaghetti and meatball appearance, which of the following conditions you are able to see the spaghetti and meatball appearance and this Seborrheic dextrose agar showing this fried egg appearance on Seborrheic dextrose agar. Yeah, it will be seen in a case of sporotrichosis. It will be seen in a case of Malassezia furfur, also known as Tinea versicolor. Okay, fine. It's also known as Tinea versicolor. Fine. Just remember. Next one, we'll move on to the part of Manu. Yeah, it is Tinea versicolor. Yeah, it's correct. Fine. Next, we'll move on to the next part, which is this dimorphic fungus. Dimorphic fungus. You know this mnemonic, like body heat perfectly changes shape. Okay. B for blastomycosis, H for histoplasma. Cold is mold. Yeah, 25 degree. If it is a cold, so it will be the mold. Yeah, guys, correct. The one more P is what? It is the Penicillium marnefi. Fine. Next one is what? C for coccidioidomycosis. Coccidioidomycosis. Next one is the sporotrichosis. Take a sporotrichs. Fine. Yeah, guys, correct. Yeah, Patrick, Priya, Divya, you are getting it correct. Fine. And if you see, fine. And if you see, if you see this type of barrel-shaped arthrospores along with this spores, small spores inside this one, like if you make the C a large spherule and a small spores inside it, it will be what? It will be the coccidioidomycosis. Okay, it is the coccidioidomycosis. It is also known as valley fever and desert rheumatism. Desert rheumatism. Just remember, fine. Just remember these 2 points. Next, if you're able to see this pilot wheel or Mickey Mouse appearance, where you will able to see? Yeah, east with endospores, correct? Yeah, pilot wheel or the Mickey Mouse appearance, where you will able to see? Where you able to appreciate this appearance? Yeah, it will be seen in the case of paracoccidioidomycosis. Okay, fine. Next, if you're able to see this image, in which you will be able to see this kind of broomstick kind of appearance of this organism along with this red pigmentation and culturing with pigmentation on SDA. In which of the following conditions you will be able to see this? Yeah, correct. Correct, Nijay. It is what it will be seen in a case of Penicillium marnafi. Just remember, means just remember in a home, like like our mother used to take broomsticks for 3 reasons. One is to clean, the other is to beat us, and next is to beat the rats in the no blank. Sorry, I forgot. Fine. Okay. I will. Sorry, I means I forgot this. I will text the team to share you as soon as possible, and I will share you the unlimited PDF as early as I could. Okay. Sorry, example. Fine. Okay. The reservoir for this Penicillium marnifi, it is what? It is the bamboo rats. It is the bamboo rats. Fine. Next, if you are able to see this type of tuberculate spores, it will be seen in a case of which disease? It will be seen in a case of which disease? A tuberculate macroconidia. Where you will be able to see? And the histoplasmosis will be able to. It is also known as Darling's disease, also known as Ohio's disease, also known as Cave's disease, and it is being spread by the bats. Just remember, yeah, correct, Beatrix, yeah, correct, Mia, Vijay, fine. Then if you're able to see this type of rosette formation, following a traumatic, means following a trauma, and there is a means like subcutaneous nodules which is in the lymphatic, means in the line of lymphatics. What do you think of? Yeah, you will think of sporotrichosis. What is the name of the phenomena you will be able to see in a case of sporotrichosis, guys? Rose Nijay. Yeah, guys, yeah, correct. Lymphatic spread. The phenomena known as splendid Hopley phenomena. Okay, fine. Yeah, you will be able to see this one more bodies, but it's not shown here. It is known as asteroid bodies. Okay, asteroid bodies. Fine. And if you're able to see this kind of budding yeast kind of, yeah, it is also known as rose gardener's disease. Yeah, correct, Rose. Yeah, Manu, Divya, you are getting it correct. And if you're able to see this budding yeast kind of appearance, budding yeast or this figure of 8, okay, this will be seen in the case of blastomycosis. Okay, blastomycosis. Next, a simple question like, is histoplasmosis is a dimorphic fungi? Yeah, correct, Manu. Correct, Patrick. Yeah, B looks like 8. Yeah, correct. Yeah, B looks like 8 also. You can remember. No, it's not a dimorphic fungus. Remember, chromoblastomycosis, it's not a dimorphic fungus, whereas histoplasma is a dimorphic fungus. Just remember. Fine. Okay. Don't get confused. Chromoblastomycosis, copper medullary bodies or copper bending bodies, also known as sclerotic bodies. Okay, then if you're able to see some kind of multiple discharging sinuses on foot, What you will think of? Which disease you will think of? Yeah, Madura foot. Yeah, war deletions. Yeah, Aditya, correct. What you will think of? Yeah, you will think of Madura mycetoma or mycetoma foot, in which there are two types of mycetoma. There might be a U, which is because of fungus, and there is a actinomycetoma, which is because of this bacteria, which is actinomycetes. A correct FMG aspirant, correct Radhika, correct Aditya, correct Omkar, correct Lalit and full moonlight. Fine. Next, if you're able to see, if you're able to see if you're able to see this type of appearance on the nose, and there is a history of pan bathing means 2 days back, and along with this, you will able to see this type of small spores inside. What you will think of? Is it what it is the rhinosporidiasis? Sporidiasis. Okay, and it is most commonly seen in the coastal regions of Tamil Nadu and Pondicherry. And next, if you're able to see this, what is this microscope? It is Rhinosporidium seaberry, right? Just remember, yeah, that's correct. This is a India ink stain, which is a negative stain. Okay, in which we'll able to see appreciate which of the following organism, which is what it is the Cryptococcus. Okay, which is the Cryptococcus. Okay, and can cause meningitis. Okay, you can cause Cryptococcus meningitis. Yeah, for capsule, we'll use this negative stain, are also known as India ink stain. And if you're able to appreciate some kind of ping pong or crushed ping pong ball appearance, crushed ping pong ball appearance. Okay, if you're able to see this, appreciate this crushed ping pong ball appearance and a Kumari with a min silver stain of a bronchoalveolar lavage, what you will think of? You will think of PCP pneumonia or pneumocystis jirovecii. Okay, pneumocystis jirovecii. Just remember these two things. Next we'll move on to few parasitology images. And yeah, correct, Riya Divya. Yeah, correct. If you're able to see this type of flask-shaped ulcer, along with this anchovy sauce appearance, sauce pus. Be seen in a case of, yeah, be seen in a case of which condition? Will be seen in a case of, yeah, Nijay, we are getting incorrect. It is seen in a case of entamoeba histolytica. Yeah, correct. FMG aspirant, Divya, Riya, full moonlight, and Aditya. Rose, you are getting incorrect. This histolytica. Fine, just remember. And for treatment, we'll use this metronidazole. Yeah, correct, Harjit. Fine. Next, if you're able to see this image, in which there is a falling leaf motility, and there is a like kind of angry man. Okay. Yeah. Thank you from the aspirant. It's boost me up. Fine. If you're able to see this type of falling leaf motility, also known as, also in Hindi, you can tell it as Giradia. Okay. So remember Giardia, Giradia. So remember Giardia will show this falling leaf motility. Fine. Yeah, angry looking man. Fine. Then if you're able to see this type of twitching motility, and there is a history of strawberry vagina, what you will think of? Yeah, monkey. Yeah, 8 flagellus. Yeah, correct. FMG aspirant. Yeah, akin snake. Yeah, it will be seen in a case of Trichomonas vaginalis. Trichomonas vaginalis. And for treatment, we'll give that say metronidazole. Fine, just remember. Next, which is the only parasite which is being having the flagellas? Yeah, correct. Aditya, Rose, Jivya, FMG aspirant. Yes, Lalit. Yeah, Johnson. Yeah, correct. Right, is what it is the Balantidium colli. It is the only protozoa which having this type of small type of flagellas. Okay, just remember. Next, if you're able to see this type of appearance, there is a history of washing contact lens in water and developed a ring-shaped ulcer. What do you think of? Yeah, it is what it is the acanthamoeba. Acanthamoeba. It is the acanthamoeba. Fine, just remember it is the acanthamoeba. Fine. Yeah, correct, Rose. Yeah, Lalit. Yeah, yeah, it's a cilia. Fine. It's cilia. Just remember. Next, if you're able to see this operculated eggs, operculated eggs. Which of the following means like most of the trematodes will be having this operculated eggs, except which of the following? Except this schistosoma. Okay, the schistosomas will be having this spines. So the schistosoma will be having the spines. So schistosoma mansoni will be having this lateral spine, whereas hematobium will be having this terminal spine. Japonicum will be having this rudimentary spine or the knob they will be having. Fine, just remember knob. Fine, yeah, guys, correct. And if you're able to see this type of polar knobs along with this polar filaments. So remember, means like old is Nana. If Nana she is wearing specs, means these are two knobs, and the specs to be connected with some rope, so it will be connected with some polar filaments. Yeah, so this will be seen in a case of H Nana. So this will be seen in a case of H Nana. Yeah, Lokesh, yeah, full moonlight, yeah, Rose, yeah, Aditya, yeah, we're getting it correct. Next, if you're able to see this type of lens shaped or lenticular shaped eggs, in which of the following conditions you'll be able to see this lens or lenticular shaped eggs? No, it's not trichura structura. Means we have means like the next slide is trichura structura. It is what it is the yeah yeah it is what the lens one it is the enterobius vermicularis. Just remember enterobius vermicularis. Fine. And next, if you're able to see this type of terminal mucus, means like mucus on this both sides, mucus on this bilateral mucal flux. Okay, and barrel shaped eggs. Barrel shaped eggs. All of these are the features of trichurus trichura. Okay, now it is trichurus trichura. Patrick, FMG aspirant, Omkar, yeah, you are getting it correct. Rose, Ravat, yeah, correct. Yeah, yeah, it's also bile stain. Fine. Next, if you're able to see this type of hooklets and the segmentation which is being formed. Okay, and this type of eggs will be seen in a case of which worms? It will be seen in a case of hookworms. Okay, just remember it is a hookworm egg. Okay, and next there are two eggs. One is a unfertilized egg and a fertilized egg. Okay, if it is an unfertilized egg, yeah, unfertilized egg which is having this roughy bumpy things, whereas this fertilized one which is can become more smooth. It is what it is. Yeah, correct, guys. You are getting it correct. Yeah, Patrick. Mm, Rawat. Yeah, you are getting it correct. It is the egg of what? Ascariasis. Ascariasis. Okay, so it is the ascariasis, unfertilized and the fertilized egg. Fine. Yeah, Dimple Patel. Yeah, Aditya, you are getting it correct. Next, we'll move on to few more parasites and we'll conclude with microbiology. Fine. If you're able to see if there is a history of if there is a HIV patient presenting with diarrhea. Fine. And an acid fast staining, we'll be able to see this acid fast positive organisms. Fine. Fine. Yeah. Zil-Nielsen staining. The means you have been done and in which you will be able to see a 4 to 8 micrometer of organism. It will be suggesting of which of the following organism. It will be showing the you'll be think of cryptosporidium. Remember, crypto is so small. So cryptocurrency they will be either invisible or they'll be so small. So remember, cryptosporidium it is the very smallest one. So it will be 4 to 8 in nature. Whereas cyclospora it will be 8 to 10 in nature. And both are C. Remember, C means it's a complete ring. Okay, so it will be a complete ring in nature. Whereas isospora, if you make this I, you can make into a somewhat oval shape. So oval shape it will be a isospora. Whereas others two they will be a round in nature. Okay, just remember this point. Fine. I think so. It would help you. Okay, Patrick. Okay, no. Okay, Rose. Yeah, fine. With this, we'll move to the next point. If we, in a case of Plasmodium, most of the Plasmodium species they will be having this single ring, whereas eh, whereas this Plasmodium falciparum will be having this multiple rings. Fine. Along with this gametocyte of the Plasmodium, yeah, headphones, the col forms. Fine. Yeah, this is a ring forms. Fine. Then gametocyte you'll be able to see this banana shaped gametocytes to be seen in a case of Plasmodium falciparum. Means like in this image, it's the only one you need to differentiate. Fine. Yeah, banana and falciparum and multiple banana. Remember. Fine. Next, if you're able to see the single rings along with this Maltese cross appearance. This both of these are the features of which of the following? Yeah, this will be seen in the case of babesiosis. Babesiosis. Yeah, animal, rubber, FMG aspirant, rose. Yeah, we're getting it correct. Fine. This will be seen in the case of babesiosis. Fine. And if you see a child who is having this skin skin lesions along with the history of fever. Fine. So it will be what? It is a case of Kala-Azar. Okay. And this will be a case of cutaneous leishmaniasis. Okay. This will be a case of cutaneous leishmaniasis. Fine. Okay. Which is also known as post Kala-Azar dermal leishmaniasis. Fine. Yeah. It will be spread by the sandfly, and two drugs will be used, miltefosine and liposomal amphotericin B. Fine. Whereas in case of this, we'll be able to see this type of bodies known as LD bodies. LD bodies will be seen. Fine. And for diagnosing Kala-Azar, okay. And for this, we'll be able to see this LD bodies. Fine. Just two drugs will be able to use. One is miltefosine and another one is liposomal amphotericin B. Fine. Just yeah. And for diagnosing, we'll use this ARC39 antigen. Yeah, guys. Yeah. Correct. FMG aspirant and moonlight. Yeah, correct. Yeah, Aditya, you are getting it correct. Yeah. This is all about the microbiology. Then we'll do with more faster with the PSM and FMT. Okay. And we'll finish up around like around 12:30. Fine. This will be the aim for us. And just stay connected. If you are feeling sleepy, just lay in your beds and just go through this, because this will be very important for your exams, because your 1 mark can change your life from in to out. Fine. That's it. Yeah. Multi-person it will use for this cutaneous leishmaniasis. Fine. Next, we'll move on to the preventive and social medicine. Like, yeah, Lokesh, yeah, sure. Yeah. If you're able to see, there are two types of cohort studies. Means if you're going retrospectively, it is known as retrospective cohort study. Means in both of this, means we'll be starting with the conference boosts. Yeah, sure, yeah. Yeah, from the aspirant. Yeah, fine. Means both of the means how will you able to differentiate from cohort from the case control? It will be based on the exposure. Means in both of this retrospective and prospective, you'll be starting from the exposure. Fine. Retrospective, you go back. Fine. Whereas in the case of prospective cohort, you will be means you will go along with the time. Fine. And in a case of case control, you will just take a history. Fine. You will just take a history and you will know about it. Fine. In the case of cohort study, you will able to get the incidence. Cohort, you will able to get the incidence. Okay. RR and the population relative risk and the population attributable risk. Whereas in the case of case control, means in a case control study, means we'll just go and find the exposure. Means we'll just take a history and we'll go and find the exposure. Whereas in a case of retrospective cohort, like means we don't know yet the disease is origined or not, but we know the exposure and these things. So we'll go back, means we'll take this exposure and we'll trace back to the disease. Fine. That is the main difference. Okay. I think so. This will start you out. Next, if you see this case control, you will just get this odds ratio. Okay, but you won't get any prevalence. Fine. You're welcome, Rose. Fine. Next, this is the same case control study. Means you will just get the odds ratio. You won't get any incidence, any prevalence. Whereas this cross-sectional study, also known as snapshot study, in which you will get this prevalence. Fine. In which you will get the prevalence. And case control will use for rare diseases. Fine. And the most famous is what? It is the Framingham heart study. The case control, it is also known as the cross product ratio. Correct. Okay. Yeah, guys. And in this late time, you need to just know means about this. Yeah, snapshot. In this, you need to just know about this late time. Late time means after the means like actually it will be the before appearance of the symptoms to the usual time of diagnosis. It is what it is, the late time. Fine. It is the before appearance of the symptoms to this usual time of diagnosis. It is known as what? Late time. Just they will ask sometimes this definition, and they will give this A pointer and C pointer, and they will ask you what is this. Fine. You just need to have a orientation about it. Fine. Next one, will go and look into the type of epidemics and endemics. Fine. If you're able to see, there is all of these cases will be under this single incubation period, and there is a rapid rise and rapid fall. What is this one? What is this? This is what? This is a single point source epidemic. This is a single point source epidemic. Example is Staph aureus food poisoning. Food poisoning. Fine. And if you're able to see multiple peaks, the same source. And when the source is being means being resolved, and the disease starts decreasing, and with multiple incubation period. This will be seen in a case of single source, multiple or common source, multiple exposure. Okay, okay. Then, if you're able to see, means what is the means endemic means if there is a constant presence of a disease. Yeah, example is this. Means example for this is typhoid Mary, or contaminated well, or a milkman delivering milk to all of these villages. Fine, a single milkman. Fine. If there is endemic means there is a constant presence of a disease. Whereas if there is any epidemic means there is a SD plus 2. Like if there is a usual plus more than 2 cases. Okay, SD plus 2 of this standard deviation. So it will be known as epidemic. Just remember. Next, if you are able to see, this is what this is the ILR. Iceland refrigerators should be kept at the level of PHC, and we know in the middle will keep this TD vaccines, and it will tell the efficacy of this Iceland refrigerator or this maintenance of the cold chain. Next one, on downside will keep this heat sensitive vaccines like OPV, MR, JE. Fine. Whereas in upside we'll able to keep this diluents and then hepatitis B and the pentavalent vaccines. Fine. Next, if you're able to see this type of vaccines, means these are the vaccine vial monitors. Means if there is a single use vial vaccines, means the vaccines which won't follow this open vial policy. For example, this MR vaccine, like Mera Rota Hua Bacha, means like MR vaccine and Rota vaccine and COVID vaccine. This all of this they won't follow this vaccine vial policy. Okay, yeah, fine. They won't follow this open vial policy. So for them, the vaccine vial monitor will be kept on the lid. Fine. Whereas if there is any multi-use vials, like for example, polio, pentavalent, or hepatitis B, they will be where the VVM will be kept at the side of this. Fine. Fine. Just remember this. If this VVM, if the color of this inner is lighter, then we can use it. If it is same or if it is darker, we won't use it. Fine. Like means the heat. Just remember this heat sensitive vaccines will be kept at the downstage. For example, OPV, MR, JE, BCG, and Rota, they are heat sensitive. Fine. Whereas this one, they are all freeze sensitive. Just remember. Okay. Yeah. And this is what? This is the dial thermometer. And this is what? This is the vaccine carrier. Fine. And this is the ice packs. And in ice packs, you can keep two vaccine vials. Okay. You can keep 2 vaccine vials. Next one. Things like recently there is a increased trend of correct FMGE aspirant. And recently there is an increased trend of asking questions about this demographic graphs. Fine. So just try to understand it. In the case of stage 1, means in the case of stage 1, there will be both birth rate and a death rate. Means imagine, means when a country which is being formed or which is hugely developed, there will be initial stages, there will be a huge birth rate and death rate. Once with evolution, with advancement of these medical techniques, okay, the death rate will tend to decrease, whereas this birth rate will remain more. Fine. Whereas the birth rate will remain more. Okay. Whereas at the end of stage 2, if you're able to see, the death rate will be declining. So you will able to see this maximum gap. You'll able to see between the death rate and the birth rate. Fine. Whereas this means this demographic graph will start constricting from the stage 3. Fine. And because since there is a development, the birth rate means because of this inflation, the birth rate also will become decreased. So at stage 4, both of them will become low, whereas still the birth rate will be more than the death rate. Whereas in stage 5, it will be inverse. Stage 5, there will be a less birth rate, in which means less birth rate and death rate, whereas this birth rate will be less than compared to the death rate. Just remember, India said the stage 3. Okay, so maximum gap is at the level of late stage of stage 2, and stage 3 the demographic gap start decreasing, and stage 4 there is a reversal. Fine. These are the three things you need to remember about this graphs. Fine. If you see, then let's move on to some instruments. If you see, this is the inflantometer. Next, if you see this scale, this is known as what? Salter's scale. Next, if you see this image, this is what? This is the Shakey's tape. So Shakey's tape, which is used to measure the mid-arm circumference. Yeah, this inflantometer will, yeah, correct. Yeah, we can use just for till 2 years. Herpendon calipers, which will use to measure the skin fold thickness. Skin fold thickness. Fine. Next, we'll move on to this type of things. In the case of in schools, we'll use this type of bench known as minus type desks. So in schools, we'll use this type of desk known as minus type of desks. Fine. And we'll use one urinal for 60 children and one toilet for 100 children. Okay, children. Okay, just remember. Fine. Yeah, we'll use this minus type of desks. Fine. Next, a few instruments. This is the Kata thermometer. This is used to measure this low air velocity. This is the globe. This is used to measure this mean radiant heat. Next one, it is the what? What is this instrument? Sling psychrometer. Okay, this is known as sling psychrometer. Yeah, Lokesh, yeah, FMGE aspirant. It is what? It is the sling psychrometer, which is used to measure this humidity. Yeah, Rose, correct. Yeah, and this is what? This is the Horax apparatus. Horax apparatus is used to measure this chlorine demand. Okay, chlorine demand. Yeah, correct, Aditya. Fine. And if you use this for chlorine demand, fine, then means the component which is being used is the starch iodide. Means the chemical is the starch iodide. Starch iodide. Fine. This is the fluoroscope. Okay, it's not fluorine, it's chlorine demand. Fine. Just remember, don't confuse. Pari, it is the chlorine. Okay, chlorine. Okay, this is the fluoroscope which is used to know how much level of chlorine is there. Fine. This is to measure how much is needed. Fine. Next, if you see, this is known as sociogram, which is being used, which is being drawn in a case of, this is the sociogram which is being drawn in a case of focused group discussions. Okay. Next, this is known as panel discussions. It's done in TVs. Okay, fine. So there is, yeah, correct. Pratpati, correct Rose, correct Lokesh. Yeah. So there is a no set order or set speech. Okay. And next, it is what? It is the demonstration. It's the demonstration of ORS. Yeah, correct. Moonlight, Ria, and Pratpati. Fine. Next, if you're able to see this, this is known as letharism, and this is being caused by this plant known as Lathyrus sativus. Yeah, Pari. It's known as Lathyrus sativus, and it is due to the toxin known as BOA. Okay, BOA. Just remember these two things. Fine. Yeah, it is lead to this neuroletharism. Next, if you're able to see this plant is known as Argemon mexicana, and it is adulterated with mustard oil. As it is adulterated with this mustard oil, this can lead to which of the following conditions? It is not yellow oleander. Will show you this yellow oleander. Means it's not yellow oleander. Just see, okay? Just see, it's like this kind of petals. Okay, I will show you the yellow oleander in just 5 more minutes. Like in means after 5 minutes. Fine. Just remember. Fine. Yeah, the toxin is the sanguinarine. It leads to epidemic dropsy. Fine. And this is what this plant is known as crotalaria. And this crotalaria, it's not Boa Aditya. It is what? It is the sanguinarine. Okay. If you are watching this video in a much faster, just click the like button. Fine. Okay, crotalaria can lead to endemic ascites. Okay, it will lead to this endemic ascites. Fine. Next one, if you're able to see this toxin which affecting the nuts, which is what? Which is the aflatoxin. Aflatoxin, and this aflatoxin can lead to heart disease. Fine. Yeah, aflatoxin causing this peanuts and walnuts and can lead to this HCC. Yeah, correct location FMG aspirant Ria, Radhika and Rose. Yeah, correct. So this will understand to this few vectors. If you're able to see, this is the female Anopheles mosquito. And if you see this female Anopheles mosquito, it is a sophisticated mosquito. Yeah, correct, Pariria. It is what it is, the sophisticated mosquito. Why it is sophisticated mosquito? Because it is breeds in a clean water, and it will lay eggs alone and will lie parallel to water surface. Okay, these are the things. Yeah, there will be no siphon tube, and it will so that it will lay the eggs parallel to it. Fine. So, fine. Fine. Whereas others you can be able to see this Simon tube presence. Okay, siphon tube presence. Fine. Next, this is the female Anopheles mosquito. We know this leads to the causage of malaria. Fine. Next one, if you're able to see, this is what? This is the tiger mosquito, or also known as Aedes aegypti. And it's also known as which mosquito? Yeah, guys. Yeah, full moonlight. Yeah, Radhika. This one is what? Shameless mosquito. Shameless mosquito. And it will lead to the formation of, like, causing a few diseases. You can be remembered by this mnemonic of dry chickens, dry chickens, like dengue, Rift Valley fever, yellow fever, chikungunya, and Zika virus. Okay, just remember. Fine. It's not chicken pox; it is chikungunya. Okay. Okay, Rose. Just correct it. Okay, fine. Like maybe it came as mistake. Fine. And if you're able to see this type of hunchbacks, if you're able to see this type of hunchback, hunchback. See, yeah, don't worry. Like, yeah, just there are few diseases you need to remember. Like, for example, in a case of Anopheles, you need to remember about this um, mm, malaria. Whereas most of the diseases will be this Aedes aegypti. Fine. Yeah, you're welcome, Rose. Fine. And if you see this hunchback, you just remember the singers. Okay, means mainly the yeah, mainly the mm, hip hop singers. If you see these hip hop singers, they won't sit and or stand like a normal one. They will just having this hunchback and they will sit like this. So they will be having this hunchback. So remember, and they will ask why, who, what. So means in Hindi, why means it is Q. So it is known as what? Culex mosquito. You know what is the Culex mosquito? And like just for this mnemonic sake, so okay. Um, just for this mnemonic sake, so they'll be dirty. So they will breed in a dirty water. And if you see other singers, they will come alone and they will sing. Whereas this rap singers and they won't come alone, they won't sing. Okay, they will come in a clusters. Okay, so they will lay eggs. Okay, they will lay eggs in a cluster, so they will come in a clusters. Just remember, fine. Yeah, they will breed in a paddy fields also, and this culex can results in the Japanese encephalitis. Fine, and also this culex can cause us this filariasis. Fine, this culex and the next one, which is the Mansonia, which will lay eggs on the roots of this Mansonia plant, can cause filariasis. Okay, these two things, like filariasis will be caused by this culex and also by this Mansonia. Fine. Remember this Mansonia will be, remember man will be having a long legs. Fine. And the seawater plants, these are Mansonia plants. Fine, they will be having this long legs. Fine, just remember. Next, if you're able to see this head, it is known as what? Heart tick. Head present, then remember it is a heart tick. And if it is a heart tick, then there will be, remember this T will be present everywhere. If it is a heart tick disease, it will be tick T, then tick encephalitis, tick hemorrhagic fever, and tularemia. All of this will be having this T. Okay, fine. Then if you're unable to locate this head, then it will be what? This will be the soft tick. And soft tick can be removed, means the disease will be remembered by this mnemonic known as QRS. Yeah, I forgot. Like there is a one more disease. Thank you for more, like it also will causes a disease known as Kaizenor forex disease in India. Fine, just remember this things. Fine. No, it is not also caused by Anopheles. Only Culex and the Mansonia will causes this filariasis. Fine. Okay, Mithu Kumar. This QRS means soft tick will causes Q fever and relapsing fever. by the soft tick. Okay, remember, soft tick causes Q fever and relapsing fever. Then if you move on, if you're able to see this louse, here we be able to see this louse, remember, my instead of pert means keeping this louse as a pert, remember, pert. Okay, so P for tuberculosis, E for epidemic typhus, R for relapsing fever, and T for trench fever. Okay, T for trench fever. Okay, remember this, guys, the correct location. Then if you're able to see this, guys, guy known as ridgewood bug, which causes this Chagas disease, also known as American trypanosoma virus. Fine. Next one, this is the sandfly, which causes this. This is known as Calazar, also known as visceral leishmaniasis. Yeah, correct location, correct party. Fine. Then if you're able to see this organism known as Ratflia, which is responsible for this condition known as bubonic plague and endemic typhus. Remember, this louse which causes epidemic typhus, whereas this guy, this Ratflia causes this endemic typhus. Okay, so don't get confused. Okay, they will ask you which of the following organism or this vector will lead to this formation of this endemic typhus and epidemic typhus. Okay, so don't get confused here. Fine. With this understanding, we'll move on to the next part. If you see this image, okay, how will you remember these things? Like yellow means, if you know Hindi, like it's better to understand. So if you know this putty plaster will go into pila. Okay, means putty means or any of this putty means any of these bandages or any of these plasters or any of these gauze pieces which are soaked with this body fluids, it will go into the pila means yellow. So it will go into the yellow one. Whereas red means red rubber or recyclable plastics will go into this red one. Red, recyclable and rubber. Okay. And the white translucer container, it will be have means it will be used for the disposal of this blade and scalpels. Okay, any sharp objects. Okay. Then blue, it will be for this broken glass. Blue for the broken glass. Just remember, glass and the metallic implants will go into the blue. Okay. Next, if you come, this is how a disaster management works. Initially, there will be a disaster. Followed by this, there will be a response. And once there is a proper response, we'll do a proper rehabilitation. Followed by, there is a prevention and mitigation. And there will be prepared for the next disaster. This is the disaster management cycle. And this is the management, means this is the logo of this disaster management in India. And the nodal office, just remember, nodal office is at district level. And the chairperson is our Narendra Modi ji, which is the PM. Okay, PM is the chairperson. And this is how this triage works. And you'll be able to see this is triage which is being happening in lifetime. Fine. Okay, fine. In which red, Pari, it is the PM. Yeah, location, it is the nodal office at the level of district level. If you see this red one means they need the urgent care. Okay. Yellow means they need some delayed care. Yellow means they can walk. They are ambulatory patients. Means black means they are like less preferred because they are moribund patients. Moribund are these dead patients. Fine. Next, able to see this is how a normal standard deviation looks like. Fine. This is how a normal standard deviation looks like. Normal standard deviation curve, which is a in which mean equal to median equal to mode. Fine. Then it is a bell-shaped curve. It is a bell-shaped one. Next, if you see the SD is means like if the standard deviation is 1, there will be the 68% of cases will be within it. Okay, 68%. If the standard deviation is 2, then there will be around 95%. If there is a standard deviation of 3, there will be around 98%. Fine. Just remember, 90% of cases will be present. Fine. And these are the two. Yeah, guys, you are getting it correct. Allocation. If there is a right skew, also known as positive skew. If it is a left skew, it is also known as negative skew. And how will you know median and mode? Just remember this left. If you make this L, then you need to put this like this. Means you need to turn this L into like this. If you turn like this, then this will be this. Okay, so the mode will be the highest in a case of left skewed, whereas in a case of median it is the second, and the mean will be the least value. Fine. Just remember. Here also the opposite of it. Fine. Mean, median, and mode. Fine. So here the highest value will be in a case of right, it will be the means. So just remember this, and you can able to solve the question. Fine. Next one. If you're able to see this diagram, first diagram, if you're able to see, then it is what, if you're able to see this graph means this chart which is being continuous, it is what it is, the histogram. And there is a quantitative variables and it is in frequency. Fine. It is telling about the frequency and time. So it is what it is, the histogram. Next, if you're able to see this histogram along with some line, what is this one? Is this frequency polygon or a frequency curve? Yeah, correct. FMG aspirant, full moonlight, Ravath and location Pari. Yeah, it's just 12. Like we have few 30 more minutes left. Like we'll be done and we'll be going home happily that we revise this many subjects. Fine. Yeah, correct. Yeah, correct. Ria, it is what it is, the frequency polygon. It is what it is, the frequency polygon. And next, if you're able to see the same histogram, means above which there is a curve which is being drawn. Yeah, it is what it is, the frequency curve. Just remember, it is the frequency curve. Next, if you're able to see this type of graphs, means this type of charts which are being separated. Okay, separated. Okay, and it is what it is, the and it's the bar chart. It is the bar chart. Fine, and it is in which the qualitative variable is given. Fine, qualitative variable is given, and there might be different charts. There might be a component bar chart also, and there might be a multiple. Okay, just remember there might be a multiple. And yeah, yes, only it is the bar chart. And if you're able to see a diagram in which there is a progression with time, means like you are telling about this trends of events. You are telling about this trends of event with passage of time, and you will be able to see this dip. And if you're able to see this dip, it will be what? It will be a full moonlight and Riya Pari. It is what it is, the line diagram. Fine, it is the line diagram. And if you're able to see a graph which is cumulative, means which is adding on, adding on, adding on, and which is not seeing any dip. It is not seeing any dip. Then it is what it is, the cumulative polygon, means like 2 plus 2 equal to 4. So it will start at 4. Then if it is 4 plus 0, it will remain as 4, but it won't dip down. Fine, just remember these things. Fine. This understanding will move on to the next part. You see this image which is scattered along the median line. So it is what it is, the scatter diagram. Okay, and this is the pie chart. Okay, and next, if you're able to see these numbers written in this manner for easy segregation, it is known as what? Stem and it is known as stem and leaf plot. Okay. Okay, guys. Then, if you're able to see this type of funnel type of appearance, so it is what it is, the funnel graph. It is known as what? Funnel graph. Next, if you're able to see this box along with this whiskers, box and whiskers. What is this diagram known as? Yeah, full moonlight. Yeah, correct, Ria. Yeah, it is what it is, the. It is known as box and whisker plot. And this is what? This is the forest plot which is being used for this meta-analysis. Yeah, correct, Pari. Fine, correct, Ria. Next, if you're able to see, there are few diseases in which, like during COVID times, like most of the cases they were subclinical. Okay, fine. So there are few diseases which shows, like most of the diseases which shows this subclinical manifestation, but only few they won't show this phenomenon known as iceberg phenomenon, in which there will be no invisible cases or carriers. So it will be what? So it will be remembered by this mnemonic known as MTR. There will be measles, tetanus, and rubella. Not rubella, it is rabies. Fine. You know, tetanus and rabies, they're highly mortal in nature. So just remember. Fine. Just remember these things. So there will be no subclinical cases. Either they'll be present and they won't be present. Fine. Just remember. Okay. And next, if you're able to see this type of maculopapular rash, and you will able to see the spots. What do you will think of? Which disease is this? Which disease is this, guys? It is what this is, the measles. What is the name of this spot known as? Yeah, it is what it is, the Koplik spot. It is known as what? Koplik spots. Fine. In which of the following diseases you will be able to see this rashes of this all stages? In which of the following diseases you will be able to see this rashes of all stages? Yeah, it can lead to FSP, measles. Yeah. And in which disease you will be able to see these rashes of all stages? It will be seen in a case of chicken pox. Remember, it will be in the case of chicken pox. And we know if there is a meningitis along with rash, yeah, yeah, sure, yeah, yeah, correct. Thank you, FMG aspirant, for this kind note. Like, means if there is a measles, there will be features of CCC, like cough, coryza, conjunctivitis, will be given in the questions. Fine. And if you able to see this type of rashes along with meningitis, we already studied. It will be what? It is the Neisseria meningitis. Fine, it is the Neisseria meningitis. Not means like meningitis means it is Neisseria meningitis means gonorrhea means there will be a purulent discharge given. Fine, don't get confused. And if you're able to see, this is what this is the step wells. The step wells being means used as a mode of transmission in a disease known as Guinea. Okay, and it is because of this stem cells are banned in India. And pig is a amplifying host for which of the following disease? For the Japanese encephalitis. And this is for just image the disease is being spread by monkeys. It is what it is there. Yeah, dracunculosis, which is also known as Guinea worms. Yeah, fine. Yeah, dracunculosis. With this understanding, we'll move on to the next part. Like, this is the logo of this Suraksha clinic, in which sexually transmitted infection and RTA are being treated with kids. Okay, which has given us syndromic management. Fine. And to remember these kids, you can remember as great girls wear red, blue. Great girls wear bright red, yellow bags. Okay, just remember. If you see this, remember, yeah, FMG aspirant, yeah. If you see this mnemonic, gray, first one, great is for the gray. So first, for any urethral discharge, we'll start giving the gray. Fine, we'll start with the gray. Fine. Once we're done with the gray, then we'll move on to this. Next one is the green. Okay. Next one will be the white, because and blue. All of this will be giving. Green will give for vaginitis, whereas white, blue, and red will be giving for this. Will giving for which of the following things? Yeah, remember this gray words, because you will be getting confusing with this GG word. So great girls. So if you remember this first word, it means if you are getting confusion, then it will be easy enough for you. Fine. Then red one. All of these three things will be for this ulcers. Whereas first one will be the penicillin sensitive one. Next one will be the penicillin resistance. Next one will be for the viral or the genital herb ulcers. Fine. Next one, yellow. Remember, low for lower abdominal pain. Fine. And bags for this, black for bubus. Okay, bubus. Just remember. Next, if you see, these are the rule of halves, which is being used for this. Yeah. Next, welcome, Mary. Fine. If you're able to see this rule of halves, which is being used for this hypertension, then this is what? This is the tracking phenomena, which is also seen in a case of hypertension. Next, this is what? This is the National Health Mission, fine, in which you're able to see this son and a family with a child. Fine. Next, if you able to give this PMJ, which provides insurance of 5 lakhs, and there is no limit on family members. This is the National Tuberculosis Program logo, and this is the DOTS program. Okay, direct observation means program. And next, there is an online portal known as Nikshay portal. Fine, Nikshay portal, yeah, Nikshay portal program. Then you will be able to see this logo of ICDS. Okay, and the heart of ICDS, it is what it is, the Anganwadi workers. Fine, and Nikshay, it is the online TV one. There is also known as Nischai, which is the pregnancy testing kits. Right? And there is this is for this Pradhan Mantri Jan Dhan Yojana. Means if there is Dhan means like if there is a rupee symbol in between, it is what? Jan Dhan Yojana. Just remember. Next, this is what this midday meals has been replaced as Poshan Abhiyan. Just remember. Next one, if there is a family planning, just remember, if you want to plan, it will be in a triangle in fashion. Fine. Next one, it is what? This is the JSSK, which provides free diagnosis, drugs, delivery, diet, and free blood transfusion, and delivery services for mother and children. Fine. Then there will be NBCC, and this newborn stabilization unit also. Just remember, this is the Janani Sisu Suraksha Karika. Fine. Then there is a program known as Suman, in which every night there will be a means camp by this both private and the government practitioners. Fine. Next one is the Anemia Mukt Bharat, means initially means for children, means for initial infants. The tablets will be of pink in color. Okay, because these infants and these small children, the mother will decide the tablet. So so just remember, if the favorite color of this mother will be pink, so they will be having this pink bottles or the small pink tablets. Fine. Next, if the boy means if they grown, if they become boys, they will choose their favorite color, which is the blue. Okay, which is this adolescent are the children's. Then there is red for this pregnant, means adolescent, lactating and non-lactating females. Fine. And for them the composition will be 60 milligram of iron plus 500 microgram of folic acid. Just remember. Fine. Yeah, there is a strategy known as 6 into 6 into 6 strategy by this anemia mukt program. Fine. No, 6 into 6, it is a huge one, like so we won't, means because we have a lot to cover, like we'll cover next. Okay, next session, don't worry. Okay, just remember, it's 6 into 6 means 6 strategies will be there, 6 beneficiaries will be there, like infants, females and adolescents, and 6 methodologies are implemented. Okay, just they will ask this thing. Fine. Next, this is the national vector program, vector borne disease control program. Fine. Means you will be able to see this mosquito, and the most common is the malaria, and most common viral is the dengue. Fine. And this is the national AIDS control program. Okay. Next one, if you are able to see this lotus, it is the national leprosy program. Fine. Next one, if you are able to see this is the mission Indradhanush. Okay, this is the mission Indradhanush. Okay, this is the mission Indradhanush, by which 7 vaccine preventable diseases are being prevented. Okay, next there is also known as scheme Indradhanush, which is being used for this. In a case of ESI hospital, there will be a 7 color bedsheets and 7 days. But initially there were 7 days, and there was different phases of this mission Indradhanush was being launched, which includes this later on vaccines also. Fine. Next, we had the switch program for polio vaccine. Okay, in which trivalent polio has been converted into the divalent or bivalent polio. Fine. And we know this is the logo for this blindness control, and the most common cause of blindness, it is the cataract. Right. And if you're able to see this flower on this hands, okay, this is the national program for prevention of control of non-communicable diseases like cancer and diabetes. Fine. This is our favorite app, which is the Arogya Setu app. Fine. Yeah, correct, Pari, it is the cataract. And if we are able to see this sun, we are able to see this sun here also in iodine, means iodine intensification program. Okay, fine. In which 2 levels of iodine intensification will be done. Means at factory level, it will be at 30 ppm, whereas at consumer level, it must be at to fulfill the must requirement of 15 ppm. Just remember, fine. And this is the logo of the national health insurance. Okay, just remember one more logo. Yeah, the Corona Arogya Setu. Okay. Next one, if you're able to see, this is the logo of the ESI. And in ESI, if you're able to see, means the employer pays higher of point, means they will pay the highest stream of 3.25%, whereas employee pays 0.75%. Just remember, 0.75%. Okay, yeah, correct. This is the ESI. Next, you're able to see, this is the IDSP program, in which 3 forms being used: the syndromic form, and the presumptive diagnosis form, and lab confirmed. Means syndromically, initially they will be treated, then they means by this healthcare workers, then they will be treated by the medicals or the doctors by this presumptive diagnosis, and then there will be a lab confirmed diagnosis, after which the exact treatment will be provided. Fine. And Ujala, it is against this female trafficking, and Ujala, it is the LED lights, and Ujjvala, it is the cylinders. Okay, don't get confused with this the terms. Fine. Next, it is the logo of this Ayush, which is depicting this leaves. Fine. And next, it is the NRGA, which is providing this non-skillful works. Fine. Fine, non-skillful works. And there is this program known as Lakshya, which is used for maintaining this labor room quality. Don't forget. Okay. And next, it is the Ma initiative for breastfeeding. Okay, is for labor room quality. Fine. Next, it is the food and safety standards in India. Fine. And this is also this award known as Collective Award, which is for this regeneration of this public health services. Okay. And these are the things you need to know about this PSM. And we'll have a means we have short of time and we have few more slides left. So we'll start with the like forensic medicine. We'll complete in another 20 minutes and we'll go home. Fine. Fine. If you see this is a classical case of hanging. The hanging might be of two types. If there is a complete hanging, the foot will be hanging above. If there is a foot touching below, it is the partial hanging. Okay. And next, if you're able to see this in a case of hanging, this knot will be compressing the. Yeah, sure. The link will be shared. Don't worry. Fine. Okay. Yeah. And yeah, there is a hangman's fracture, which is known as what C2. The fracture of C2 means fracture and dislocation. Okay, which is actually what spondylolisthesis of this C2 over C3. Okay, and if you're able to see, this knot will be compressing the yeah, that is the typical knot. If this knot compressing this sympathetic chain, then this leads to this symptoms known as ipsilateral dilation of this pupil along with this opening of the eye. So it is known as what? It is known as la fascia sympathetic. Okay, and in hanging, the means the knot will be, means if you see, this ligature will be of having three features. One, it will be the ligature mark will be incomplete, and it will be oblique. Okay, and it will be suprathyroid. Okay, and it will be of suprathyroid. There's three features. Next one, there are few methods of homicides. This is known as what? Throttling. And in throttling, you will be able to see this type of bruises known as six-penny bruises. Okay, and we know we see this copper penny bodies. Yeah, same side knot. Yeah, correct. Yeah, and we see this copper penny bodies in which condition? Yeah, the answer, guys. We see this copper penny bodies in a case of chromoblastomycosis. Fine, and this is what this is known as mugging. Okay, this is known as mugging. If someone uses elbow, yeah, that's nice. That's nice. Rose and Radhika, fine. Yeah, yeah. FMG aspirants, yeah, they're still making it happen. Fine. And there are few other methods. This if there is a ligature is being used, it is known as ligature strangulation. And if it is iron collar is being applied, it is known as garrotling, also known as Spanish windlass techniques. Yeah, correct, Rose. Yeah, yeah. In strangulation, you'll be able to see this complete ligature mark. Okay, and it will be a straight one. Okay, and it will be infrathyroid. Okay, just remember. Yeah, Spain may. Yeah, and then if you're able to, yeah, this will be is done in Spain. Yeah, and next, if the neck is constricted between the two bamboo stick, it is known as Banstola. Okay, and there are few other methods. If we are just obstructing the airway with pillows or with the pinching with hands and obstructing the nose and the face, it is known as what? It is known as smothering. This is what it is, the smothering. And in a case of any bricks fell off an or if when someone bit, acute sitting killing. Yeah. Next one, if someone is sitting, means or if there is some parts have been fallen and causing some traumatic asphyxia, it is what it is known as traumatic asphyxia. And there will be able to see a face known as fascia accomotica. Means you will to see there is a color of this skin, and this is because of this congestion, the face and this over here, there will be Yeah, there will be a contusions will be present. Yeah, correct. And this lacerations over the slits will be present in a case of smothering. Fine. Traumatic accident means, yeah, traumatic asphyxia can be accidental, can be even homicidal. Fine. And if you're able to see this discoloration over here, it is known as faciae ecchymotic. Fine. And next, if this combination of this both, it is known as barking. Okay, barking. Fine. Next, this is how a person chokes, and for this we'll use this Hamlet's maneuver. Fine. Next one, this is known as what? Positional asphyxia. Next, if you're able to see, in a case of in a case of drowning, you will be able to see this lungs which is being filled with fluids, which is known as what? Emphysema aqueous. Next one, if you're able to see this goosebumps appearance known as cutis ancedera, and this is known as what? Washer woman's hand. All of these things will be seen in a case of hanging. Fine. Yeah, we'll be able to see these small hemorrhages, also known as Poltoff's hemorrhages. Yeah, cutis ancerinus. This was washer woman's hand. And next, while drowning, they may clench something, and it will remain as rigorous. So it is known as what? Cadaveric spasm. Cadaveric spasm. Just remember. Fine. Yeah. Yeah. Correct. Pari correct. FMG aspirants correct. Radhika correct. Rose. Yeah. Then if you're able to see, this is postmortem signs. Initial there will be deposition in the fashion of triangle. It is known as tachinoia sclerotica. Next one, it is this cattle trucking of the retinal vessels. It is known as what? Which sign? Yeah, Kynes cross. It is what? It is known as what? It's known as Kevorkian sign. It is known as Kevorkian sign. So it is the retinal vessels. Okay. Yeah, correct. FMG aspirants. Yeah, Shubham. Yeah, it is correct. Fine. Next, it is what? It is the rigor mortis. Initially, there will be a primary relaxation. Then there will be this rigor phase. Rigor mortis. Then there will be secondary relaxation. Fine. Just remember. And it also follows a few rules like distance rules, rule of 12. Just remember as things. Fine. Facts. Next, if you're able to see, this is what? This is the post-mortem lividity or staining. Fine. And just in it means, and it will be get fixed by 8 hours. And just remember a few things about it. You will see this cherry red in which condition? Yeah, it is also known as suggelation. Cherry red. Cherry red will be seen in which condition? Yeah, anonymous. Yeah, FMG. Yeah, aspirant. Back via. Yeah, Shubham. Yeah, it is seen in a case of carbon monoxide poisoning. Whereas the cyanide will show brick red appearance. Brick red appearance. Okay, brick red appearance of. Yeah, means in the case of CRAO and Tay-Sachs, you will able to see this this one cherry red spot. Fine, just remember this cherry red spots. That is a different one. Fine. Whereas whereas yeah, CRAO, there is a if there is a branch retinal artery occlusions, there will be also the cattle tracking. Okay, but this is a different one. This is a this is what this is a post-mortem science. Just remember. Fine. A nice correlation means if you're able to correlate this way, you won't forget, because these are the easily confusable stuffs. Okay, that's nice you are getting it here, so that others also get means others also getting clear. Right. And this is known as what? Gray waves, also known as adipose formation, which will be happen in a case of warm and moist climate. Okay. Next, this is what? This is the mummification, which will happen in a hot and humid climates. And what is this sign? What is this? Because of this, yeah, there is no odorless. Yeah, correct. What is this of this? What is this sign? It is H2S, means gas the being deposited over this chest wall. It is known as what? Yeah, correct. It is gas. It is the marbling. Yeah, because of this Clostridium welchii, the preferences, and this marbling, it will take around 36 hours. Okay. Correct, Shubham and Pari. Fine. And there are few types of incision you need to know. This is the most commonly performed, which is the eye incision, in which some trachea will take every organs in a single go. And this is what? This is our Y type of incision. This is the modified Y. This is what? This is the modified Y. Modified Y. And if you do some, if you use some radiological methods, okay, just remember, like from axilla you are starting, it is the Y incision, and axilla you are coming to this the Ziffy process, then you are extending, it is Y, whereas you are starting near to the mastoid process, and you are means you are coming into the neck, and you are starting from this um, sternal notch, it will be a modified Y. Which one? What is X? X will be, we will be doing in a case of police custody, means in which most of this let is being used. Fine. Which I want to explain from just as aspirant. This one, this is the I-shaped incision. Usually we'll do a single incision, fine, and we'll take the all organs. Okay. For example, in few conditions, means we need to preserve. Means for example, if in a case of some hanging or any homicidal things, we'll use this Y. Means we'll use this type of incision. Fine. If there is any chest trauma, we'll use this type of incision known as modified Y. We'll start from the axilla. We'll go to this xiphoid process, and they will extend down. Okay. Yeah, there are different types also, but yeah, in inverted Y we perform this, but the most common run are these three. And next, in few cases, what we'll do is we'll start from this mastoid process, and we'll come into this sternal notch, and we'll start extend from here. Fine. At the end, here it will be the extension, but here it will be the different changes. Fine. And okay. And next, it is what if you use any radiological methods, it is known as biopsy. Okay, it is known as biopsy, and the X incision will be used in a case of custodial death. Custodial death. Okay, which I didn't brought. Okay, it is seen in the case of custodial death. You're welcome. Fine. Next, the human identification. The even in means identical twins, it will be different. This is fingerprint. The fingerprints. Fine. The most common one is the loop one. So love, wife, and children. Fine. So the most common one is the loops are the most common one. Then holes, then arch, then composite. Okay, this is the whole one. This is like this whole one, and this is the loop, and this is the arch. Okay, this is how this arch. Right. This is how you need to identify. Superimposition, and by which you are bringing a photo of a dead person. सर जी आपकी कॉलेज से हाँ अच्छा सही है ओके हरी हरी nice to see you here. And if you're able to see this rugose, it is known as what? Rugoscopy. And next one, if you're able to see this lip print, it is known as what? Cilioscopy. And there is also one more method here. If you're able to see this pores, it is known as poroscopy. Poroscopy. And for fingerprints, we need to need 10 to 12 points. Just remember, we need to need 10 to 12 points. Yeah. Yeah, correct, Pari and Rose. It is what is cilioscopy. And if you're able to see this tattoos in a normal person, it's okay. They will use it up, or else they will do this lymph node biopsy. Okay, because near to the nearby lymph nodes, these pigments will be deposited. Fine, or we can use this ultraviolet rays to notice it. Fine. Next, to differentiate these cuts. Fine. If you're able to see, this male will be having this. This is the male skull. Will be having this narrow pubic angle. Okay, this is the narrow pubic angle. Okay, and there is a sulcus in female. There is a presence of this sulcus known as, yeah, there will be a wide in female. Obviously, if it is narrow, it will be wide. Nice roast. There will be a wide pubic angle, and this is what, this is the pre-auricular sulcus. Auricular sulcus, which will be present in females. Okay, present in females. Just remember. Next, this sciatic notch will be deep in males, whereas here broad in females. Just remember. Yeah. Thank you, Anonymous Zoho. It's give me more motivations, like to do more sessions with you guys. Okay, thank you. Fine, and these are the types by which you can able to differentiate female. Female means you can get a conclusion whether the body is a male or a female. Fine, and the most means like the maximum sex differentiation creation will be, yeah, most identified. The maximum of this sex differentiation will be, yeah, thank you, Shubham. Yeah, most of this sexual differentiation maximum score we can do with this pelvic bones. Fine. Next one, if you're able to see this type of pink, crystals. Remember, pink crystals will be seen in a of because of hemins of this blood will be seen in a case of Nagayamas test or Nagayamas reagent. If you're able to see these brown crystals are this type of brown rhombic crystals. Remember, means men in a break they used to go to the means tea means they will get this tea breaks to get a puff. So okay, just remember if they get a puff, they used to get this tea means for tea break they will go. So remember, brown crystals just used for semen. Okay, so obviously men. Okay, then it will be uses this brown. It will be having this brown crystals, and it will be it's known as what take man's. Just remember, tea is brown in color and it be consumed by the men. Okay, just remember. Yeah. Okay, this is a kind of mnemonic you can remember to get it through. Fine. Yeah, Nagayamas test it's a pink crystal which is used to identify these human crystals. Correct? Yeah, Lokesh. Next, if you're able to see this yellow, remember why you will able to see this mark this from this glass which is being used in this bars. So if you see in bars, we'll get this beer, wine, and any other means like not wine. Okay. Yeah. Barbados yellow crystals. Yeah. You can remember in bar you will get this beer which is yellow in color. So bar beer which is yellow in color. So it is a Barbados crystal. Barbados says there will be yellow crystals. Fine. And it is also the semen crystals. Fine. Just remember. Yellow it is also for the semen. Fine. If you're able to see, this is what this is the aconite. Okay. And aconite it is also known as metazar means sweet poison. Means if you want to remember about this sweet poison, you just remember about their ex. Okay, fine. Means why it is X? Because she's X because she or he is X because they broken your heart. Okay, they broken your heart. Okay, so it is a cardiac poison. Okay, and as it is broken your heart, then when you see them again, means you will be having this cunning eyes, and which will be like dilating. Means there will be a repeated constriction and dilation. So it will be known as Hippar's sign. Okay, Hippar's sign. And you know, means why is the eggs are known as sweet poisons? Okay, because they are sweet until unless it's yours, and once you had broke up, they turn as a poisons to you. Fine, just remember. Fine, the same with me. So it's like same with this thing also. It is also a cardiac poison. Fine, yeah. Fine. If you see this cardiac poison, this is the yellow area. That is that time we studied right, like rose that we saw it. That is what that is the mustard oil or alternate. That is not the oleander. This is save him. He's speaking facts. Yeah, maybe. Yeah, sure. Yeah, okay. This is the cardiac person. This is the yellow oleander. Fine. Whereas this one, that is the Argemon mexicana. Okay, just don't confuse with this plants. Fine. It's a cardiac poison, and it will increases the potassium law means like potassium in the blood, and it causes cardiac arrhythmia. Okay, cardiac arrhythmias. Right. This is the yellow oleander. Fine. Next one you will be able to see. This is the common cobra. Common cobra will be having the specs. Fine. Next one, if you're able to see this band, they are known as kite, right? And both of them they will be neurotoxic. They will be neurotoxic in nature. अगर if something is swimming with is having this fins, it is what it is a hydropediae. Hence it is a snake, so it will be a musculotoxic. And if you're able to see this sharp kind of yeah, correct. Pari, Lokesh, FMGE aspirant, Shugam, Rose. Yeah, you are getting it correct. If you're able to see this V kind of head or a triangle kind of shape, it will be known as what? It is the viper. It is a vasculotoxic. It's the vasculotoxic one. Fine. Next one, if you're able to see, this is the Datura, also known as thorn apple. Okay, will causes this all deep things, dry eyes, dry mouth, and also there's a dilation of this pupil. Dilation of pupil. Okay, it's also known as Yamitash, Anonymous. No, ganja is the next one. Fine. Next one, and this one, the active principle is what? It is the hyoscine. Okay, hyoscine. Okay, just remember hyoscine. Fine, and it is a roadside or a rail side poison. Just remember. Fine. Next one, this is our favorite marijuana, or also known as ganja, and the active component here it is the yeah, sure. Like in marijuana, you will be getting this running amok. Okay, run amok. Okay, yeah, sure. Yeah, fine. Next, this is what this is the snorting of cocaine. Okay, and you will see this phenomenon known as magnets. Yeah, more. Yeah, this is what this is the magnets phenomenon. Okay, it can lead to this bugs itching known as magnets phenomenon. Fine. Yeah, that's what. Like, that's the truth, right? That's what. Yeah, you can use this mixture known as या हो गया बस लाइक जब बोलोगी तब खत्म हो जाएगा लेकिन बस 5-4 मिनट है खत्म कर देंगे फिर चले जाएंगे ठीक है yeah there are means like if you ask me each questions like I can tell for a huge minutes like there are parts most of the parts being used but the most concentrated part in the marijuana plant it is the oil okay hash oil means that this they will tell okay that tomorrow the same time 7:30 fine and if you ask the leaves, the most commonly means like in as a ganja, they will use this thing flowers without seeds and this stems they have this less content. Okay, just remember these things. The main component you need to remember is this tetrahydrocannabinol. Fine. Next one, if you're able to see, this is this Brutonian lines. Brutonian lines. Fine. Next one, in this Brutonian lines, along with this mm, stripling of RBCs will be seen in a case of which poisoning? Yeah, correct, guys. Flowering plants, no, the flowers of this plant. These marijuana plants will be having these flowers and they will be used as ganja. Usual ganja is the flower one. Okay. This will be used in the case of correct. It is used in the case of lead poisoning. Okay. And there will be a means they will use this fine. It will go and inhibit the ALA dehydrogenase and phenolchylidase. There are two enzymes. Fine. And if you found a poisoning along with the hair loss, it is what? It is the thallium poisoning. And green color urine you will be seeing in of phenol or carbolic acid poisoning. Okay. Carbolic acid poisoning. Okay. That's stronger. Next, if you're able to see this raindrop pigmentation along with blackfoot, along with measles lines, all of these things they are seen in a case of which poisoning? Yeah, guys, yeah. Can do dusting, only the stomach, yeah. We can do, yeah, correct, guys. Yeah, we can do in the case of carbolic poisoning, we can do gastric lavage. Fine. This is the case of arsenic. And it mimics cholera. Fine. Next one, if you're able to see, this is what this is the Abrus precatorius, which is used as a sui poison. Okay, sui needle poison. Okay, which can mimic the viper bite. Fine, viper bite. Okay, this is what this is the semicarpus anacardium. Anacardium, also known as marking nut, which is being used in forensic for producing artificial bruise. Artificial bruise. Okay, artificial bruise. Fine. Next one, this is what this is the resinus communis, which inhibit this 60S ribosomes. Just remember this. Yeah. Semicarpus anacardium, it is also known as, yeah, it will produce this compound known as bilavinol. Yeah. It inhibit 60S ribosome. Okay, ribosome. Fine. Next, this is what this is the Strychnus maxvomica, which is a spinal poison. Okay, which will produces the symptoms which similar to tetanus. Fine. Next one, this is the calotropis, which is used for artificial bruise along with abortion stick. And this is what this is the poppy plant, which produces which one? Opium. Yeah, Opistoponus. Posting will be done by seen in a case of tetanus and also in Strychnus maxvomica, opium. And when in opium there will be a pinpoint pupil. Yeah, Dejanta calotropis. Yeah, this is the name of this calotropis. Right, correct. And there are few methods. Just we saw it is the snorting. And if you apply any to any cloth or anything, and if you just smell it off, it is known as huffing. And if you just put some chemicals in the block and um, and take in, it is known as bagging. Okay. Next one, this is known as what? Skin popping. And this is known as what? Chasing the dragon. Chasing the dragon means once you lit up and then feeling nostalgic. Don't worry. Once you lit up and you will chase the smoke, it is known as chasing the dragon. Fine. Next one, there are few torture methods like, okay. And this is what this is on slapping the ears. It is known as telephono. Okay. And food, it is known as phalanga. And there and and there will be a wet submarine, and there will be applying the plastic covers. It is known as dry submarine. Okay, just remember these things. Next one, this is known as parrot preach. Each this is known as to make them to strong for a long time, stand for a long time. It is known as L plankton. Next one, if the neck, hand, and the leg they are tied together, it is known as what? Incarto, something like. Let's just go and check this like spellings. Fine. Only this spelling. Fine. Next one, this is known as what? Sahas. Fine. This one is Sahas. Next one, this is what? This is the vitriolage. Okay. And we know what is the section we use for this vitriolage? What is the IPC section? Yeah, it is the acid bond A, B. I am making you easy. A for B for attempt, A for attack. What is the section you will use? Just remember 3 2s are 6. So 326A and 326B we will use for vitriolage. Fine. Just remember, don't forget. Next one, this is what this is the peeping tom, and which is what? Which is scotologia. Yeah, guys, correct. Deepika Pudukona. Yeah. If you see this peeping tom means like it is also known as scotologia, means yeah, it can be punished by 354C. Means if you are seeing, it can be punished by the C. Fine. Next one, it is known as what? Exhibitionism. Exhibitionism. Okay. And it means if they're having, if they're in for this inanimate objects, it is known as fetishism. Fetishism. Fine. Next one is this few operation. Last one is the trauma part, and once we done, will be done for the day. Fine. If you see, this is the aberration, and this is a grace aberration. Next, it is the pattern aberration, and this is what this is a pattern along with pressure. Okay, pressure aberration. Okay, pattern along with this pressure. Yeah, this is a mosquito bite. Okay, a bit larger mosquito bite. Okay, nothing else. Fine. Then this is what if in a case of hanging, you will able to see this pressure and pattern bite both you will able to see. Like mostly, just remember pressure aberration. Who are doing suicide, they will be under pressure, so they will be do. So this is what this is the pressure aberration. Okay. Okay, pressure aberration. This is a pattern aberration. Fine. Just remember. Next one, if you're able to see, this is what this is the bruise or this confusion. And next, if you're able to see, this is what this is the ectopic bruise. If there is ACF fracture, it will lead to this ice known as Raccoon ice. And next, it is known as what? If there is a middle canal fossa fracture, it leads to this battery sign. Okay, battery sign. Yeah, correct, Mr. Alpha. Yeah, correct, Shubhamagar. Next one, this is the laceration. To see over the bony prominences, any blunt objects, they can cause an injury, which leads to this like some lacerated tissue, and along with this incise looking lacerations, just remember it is what? It is the laceration. Next one is the degloving injury. Degloving injury. Fine. Next one, this is what? This is the incision. This is the incision. And if there is a huge number of cuts over this forearms, it is what? It is known as yeah, correct. Dimple, Lokesh, Radhika, Rose, and Anonymous. Yeah, fine. This is what is known as hesitational cuts. Hesitational cuts, which will be seen in case of borderline personality disorders. And there are two types of defense zones. There will be active defense zone and there is a passive defense zone. Means if you are means if you are actively um, defensing, means you will get over this means flexor aspects. If you are passively, you are going just someone in attacking, you will get this passive defense. So this is active one and this is the passive one. Okay, just remember. Just being asked in last FMGE exam. Fine. And next, it is known as harakiri or seppuku, which has been like previously done in Japan's. Fine. Yeah, flexor is active. Mm, extensor is passive. Fine, just remember. Fine. Okay, and full penetration can be known by this mark known as mark of this Hildgard. Okay, just remember. And if there is a double-edged sword, okay, or any knife, it will produces this type of markings over two side. And if it just a single edge, so it will produce on the only one side. Other side it will be like kind of curved one. Okay, fine. Yeah, death there will be a because there will be a huge blood loss, so there will be a hypovolemia and the patient will be dead. Fine. Next one, this is the Pons fracture. Okay, this is the depressed fracture. Means of this child skull which is being so soft, so it will be like a kind of ping pong ball, also known as Pons fracture. This is what next one. This is the depressed fracture, also known as fracture alla signatura. Means the fracture will be telling which weapon which is being cast. Means like mostly it will be the hammer, so it will show this pattern of the hammer. So it is known as fracture alla signatura. A small part of the bone is missing. It is known as what? Gutter fracture. First one, it is known as what? Gutter fracture. Yeah, Dimple. Yeah, Lokesh. Yeah, keep hammering. Went wrong. Wow, like it's like yeah, it was a nice joke. By the way, fine. Like yeah, yeah. Next one, yeah, your favorite. Like it is what it is. The EDH. It is a idli shaped hemorrhage. Remember idli shaped hemorrhage. It is our lenticular shaped hemorrhage. Who will makes the idli better? Or the best of the soft idli? It is the mama. Okay, so just remember ma. So remember ma. So middle meningeal artery is responsible for bleeding in a case of EDH. And initially means initial few days also we don't care about mother. And later means before marriage we will just roam around the mother to get us married. And once we get married, we won't take care of mother. Like this is the usual scenario. So this is the same as lucid interval. So just remember it is the lucid interval. Okay. Since there are few facts just to tell as a story you can remember. Fine. The lucid interval will be seen in a case of EDH. Again, he's speaking facts. Yeah, that's true. Yeah, fine. And then we know this EDH. This will be middle meningeal artery will be coming where this foramen which we saw today. It's the foramen of spinosa. Fine. Next one it is the crescent shaped hemorrhage. It will be what? This is the subdural hemorrhage. Next one, this is what? This is the subarachnoid hemorrhage, which shows this thunderclap hemorrhage. Next one, this is what? This is the intracranial hemorrhage showing the putamen bleeding. Fine. Fine. And just in bullet entry wounds, just you need to know a few things. Means if you can see this blackish, blackish over this entry wound, and there will be a singeing of hair. There will be a singeing, and there will be a small tattooing, blackening because of this fire burn powder. Then there will be a tattooing because of this unburned powder, and there will be a singeing because of this. Yeah, we are in blanket watching a session. Yeah, once done with the session, I will go inside the blanket. Fine, and we'll do this tattoo means, and there will be a tattooing. Fine, and after this, there will be a bullet entry wound, and there will be a aberration collar, and there will be a grease collar. Okay, these are all the points of this entry wound. Fine, entry wound. Fine, and if there is a close. Okay, if you see this thing, means if there is a stellate shaped wound, means it will be because of this close or the contact, especially the contact shock. Okay, it's because of the contact shock. Okay, fine, contact shock. Just remember. And this is the difference between the entry and the exit one. Means entry it's just like this, and in eversion there means on exit one there will be eversion of this margin. So you'll be able to appreciate this a version of these margins. Okay, entry will be small, whereas exit will be big. Okay, so just remember how we are entering into our medical, like we came as a small persons. When we became a doctor, like once you are done with the FMG, you'll become a big. It means like a, you are good to tell, right? So that's what the same. So entry wound and the exit wound. Okay. Next, if you see this type of wounds known as sparrow. Close and contact means just I will tell you the difference. Means contact means this is contact means this is a contact. So the gunpowder means like gunpowder and the fire and the bullet, everything will be deposited inside. So there will be a full blow. So if there is a full blow, it will show this cruciate type of wounds. Fine. Whereas in a case of close means it's not it's contact. Close means this. Okay, so here if you shoot means you will be able to see this aberration color, grease color, you will be able to see the singeing, and you will be able to everything tattooing on the outside. Okay, not inside. Fine. And next one is the near, in which you will means in which step by step is going backward. Fine. Yeah, fine. Next, this is the sparrow foot marks, which will be seen in the case of windshield injury. Next one, this is the hyperextension and hyperflexion injury because of this. What is the name of this thing? What is this called as, guys? What is the name of this syndrome? Yeah, this one is what? Yeah, correct location is known as whiplash syndrome. This one is whiplash syndrome. Next one, if someone is wearing seat belts after bombing in sea. Yeah, this is the seat belt sign. Okay, the most common to be injured is the mesentery. Okay. Okay, longitudinal tear over the mesentery. Just remember. Fine. Yeah, guys. Yeah, alpha Kausalya and the Kansik Rose. I were getting it correct. Fine. And there is just few things left. Just I think so one or two more slides. Then we'll go back. Like go home. When if you see this vehicle hitting over the man, means mostly on the lateral condyle of the tibia there will be a fracture. It is known as bumper fracture, which is actually what primary impact injury. Next, once he's hit by a car, he will fall over the bonnet, and once he fall, he will get injury over any other places, which is a secondary impact injury. Once he fall over the bonnet, then he fall over the ground. Once he fall over the ground, which leads to this tertiary injuries or this secondary injuries. Means this is secondary impact injuries. This will be the secondary injuries. Okay, fine. Yeah, this is the bumper fracture. This is the tibia fracture. This is the tibia fracture. Means especially the lateral condyle of the tibia. Fine. Lateral condyle of tibia. Just remember. Fine. Next, the blast injuries. Like, okay, blast injuries. In a case of primary blast injury, the damage only because of the primary waves. Means the most common organ to be damaged is the tympanic membrane. Secondary, it's because of this Marshall's triad known as Marshall's triad, which is known as ACL. Means there will be a means the small flying projectiles, they will come and hit you. So there will be aberration, contusion, and laceration. So aberration, contusion, and laceration. Fine. Next one is the tertiary. Means this will make you'll go and bombard in MCA, right? So tertiary means is you are displacing somewhere and you are falling lead to this skeletal muscle fracture or something. Fine. This is the tertiary injuries. Fine. Next one it is this lightning burns, also known as, it shows this flower pattern known as arborizing pattern. Arborizing pattern, also known as Lichtenberg pattern. Okay, and these are all seen in a case of, no, obviously means we cannot do much. Don't worry, like things will happen, like good things will happen. Just keep hope for next few more days, like keep going. Okay, and if you're able to touch a small voltage areas, you lead to this type of bone known as jewel bones. Okay, jewel bones. Fine. And if there is high voltage, it leads to this bone known as crocodile bones. Crocodile bones. Fine. Next next this bones, this means in this you just need to differentiate between the superficial partial and the deep partial. Superficial partial, you will be able to see this formation of the blisters and there will be a huge pain. Whereas in the case of deep partial, there will be a relatively less painer and there will be just like mostly Nani, like tomorrow, like we'll hope so, like admit card will be released and you will know, means you will get a good, means like you will get the centers which you wanted. Fine. And means and deep partial you will just get this pinprick sensation. So just these are the two differentiating features you need to know. Fine. or else others will be no superficial, will be just erythema and there will be painful, fine. And in full thickness, everything will be involved, including the hypodermis, right? Yeah, there will be means in deep partial, there will be a wound contraction will be more when compared to this. And this Wallace rule of 9, mm, and for adults we know, but for in children, just remember, instead of 9, it is multiplied as 2, which is 18. Okay, here we have 18, but here we have just 14 here, fine. Whereas others, most of the things they are same, fine. That's it. We reduced here and we just added here, fine. It's the Wallace rule of 9, like last slide and before the last slide, fine. And if you're able to see this baby which is being hit by their parents or their caretakers, this is the battered baby syndrome. Okay, and there will be this small fracture over this metaphyseal, so they are known as what? Bucket handle fracture. And you will able to see there is a multiple fractures at multiple stages of healing. Multiple fracture at multiple stage of healing. Okay, and you able to, okay, these are about this features of this battered baby syndrome, and you will able to see this butterfly bruise. Okay, butterfly bruise, fine, because they will use to pinch, right? Once they pinch, they will get this type of bruise known as butterfly bruises, fine. Next, if you're able to see this sign which is known as Spalding sign, which is seen in a case of intrauterine death, and the first sign will be the presence of air in large vessels known as Roberts sign. Okay, Roberts sign. To identify the stillbirth, we'll use this test, means floating test known as Bruslow's second life is in which if the baby is swallowed, then the stomach should float. Okay, because the stomach also will be having some airs, right? This is the Bruslow's second life test. Okay, yeah. With the same note, we'll move on to our parts. And finally, like just before addressing this session, let me tell you, like, for to whom this session might be helpful. Like, fine. Yeah, don't worry, anonymous. Don't be scared. Okay, just cool. You are answering so good means you have done a good preparation. Just keep going for a few more days. Like you'll be coming with flying colors. Fine. No, it won't be postponed. Don't worry. No, I didn't told it will be postponed. Postponed. Yeah, today will be the last session. Yeah, there will be no postponement. That's what I also want this to be like happening as soon as possible. Okay, so don't worry, just keep on going. Okay, there will be no means like because FMG it won't get postponed. Okay, you can think about any other exams, but FMG it won't be. Yeah, sure. Like don't worry, we'll meet. Sure, we'll meet for meet again. Okay, don't worry, anonymous. Like fine, and this session will be helpful for those who will be preparing for the first time because they will be knowing like what are the things they need to know about these images, and this part are most important things they might be preparing for the exam. And second one, like these are those peoples like who will be so who will be scared of these exams, and they'll be having this mindset what to do in the meantime, like whatever I'm studying it's not getting in. For those it's like a relaxing kind of session, you can watch and you can enjoy it, and meanwhile you can learn a bit, fine, you can learn a bit, fine. Then there is also the third kind of people like who already studied everything and who are just chilling out, and for them also it will be a confidence booster session. Okay, you can also attend the sessions and it will be helpful for you, fine. So revise nahi ho pa raha hai, like no, don't worry, like whatever you have done, like just go. If you're not unable to remember anything, just go superficially, like just flip through the pages. If you just flip through the pages, it will be enough. Okay, it doesn't, you don't need to do this proper revisions. Now you need to do this flip through revisions or the superficial revisions. Okay, fine. Then with this note, I will start our today's session, fine. If you're able to see, this is the first image. Like if you're able to see this first image, then you will be able to address that this there are multiple muscles which will be responsible, which will be yeah, which will be given in these images, or sometimes they will ask you what is the name of this image, like muscle which won't be cut during this episiotomy. Could anyone tell me which of the following muscles won't be cut during this episiotomy? Just remember there are different types of muscles you'll be doing, means different types of muscles in the pelvis. And from this you need to remember just few more things, like if you do a episiotomy, the episiotomy will be the cut from here. fine. And if you do cut from here, you will be able to see this, you will be cutting this muscle known as bulbospongiasis. But if you see this muscle, which is what, which is this ischio-cavernous, this ischio-cavernous will be spared. Like in most of the times, this ischio-cavernous will be spared. Okay, so don't get confused. Fine. And means, and we'll talk about this episiotomy in a more concise manner during the subsequent slides. Fine. And then if you're able to see this, all of this, most of these perineal muscles, they will come and attach to this structure. It is known as what? Perineal body. Fine. Then if you're able to see these structures, means this is what, this is our urethra and this is our vaginal opening. And then if you do a episiotomy, means initially it will be cutting this vaginal mucosa, then it will be cutting this muscle, which is what, which is this bulbospongiosus. And just remember this one point about this structure, which is what, which is this ischio-cavernous, it won't be cut during this episiotomy. Fine. Just remember these things. And all of this muscle, sir, hit the mic. Nice joke, but then how you will able to hear? Like you will be hearing my peristalsis, not my voices. Fine. Then all of this superficial transverse muscle and also the deep transverse perineal muscles, all of them, they will come and join at this level of this perineal body. Just remember. Fine. And this is the only one point you need to remember about this image. Next, if you're able to see, there is a swelling over this vulva. Swelling over this vulva. The patient is presenting with a painful swelling over the vulva, and just a superficial examination, we will be able to identify this swelling. What is the name of this cyst was? What will be this cyst? Yeah, correct, anonymous. It is what? It is the Bartholin cyst. And for Bartholin cyst, we know it can go into the repeated inflammation and infection. So we'll do this marsupialization. Means we'll do, yeah, correct, anonymous. We'll do this marsupialization. Okay. Whereas if you're able to appreciate, this is also a type of cyst, but if it is of more deep in origin, and you will means means, and you will be means and doing the PV examination, you will able to feel this cyst in a more deeper structures. So if you're able to do this, feel this structure in a more deeper part, it will be what will be known as what? It is the Gartner's cyst. Okay, Gartner's cyst, which is actually what? Which is a cyst which will be the remnant from this embryogenetic parts like mesonephric duct. Okay, just remember. Fine. This is how you will able to differentiate these two. Then there is a patient who is been presenting to you. Means at a 17 years, a female is presenting with features of amenorrhea, which is what, which is the primary type of amenorrhea, and she's having cyclical abdominal pain, and along with this, yeah, so along with this cyclical abdominal pain, yeah, correct, Glintz, correct, anonymous, correct, Kansick. For cyclical abdominal pain, she will be presenting with. And on examination, you'll be able to see this bulge out. You'll be able to see this bulging of this hymen. And this will be what? This will be what? This will be the imperforate hymen. Imperforate hymen. And for this imperforate hymen, we use this type of incision known as cruciate type of incision. Fine. We'll use this type of incision known as cruciate type of incision. Just remember. Correct answer? Correct. Yeah. There will be a bluish hue or a bluish bulging membrane. Fine. Yeah. Correct, Anil. Fine. With this understanding, we'll move on to the next part. Be able to see this one. What is the name of this cannula? What is the name of this cannula? Yeah. It can cause endometriosis, but in a later part of life. Fine. What is this name of this cannula? Cannula. What is this name of this cannula? Yeah, correct, guys. It is what it is known as was Leach Wilkinson cannula. And we'll use this Leach Wilkinson cannula for an investigation known as hysterosalpingography. Fine. And this is how it does it done. Okay, fine. Yeah, correct. Glimpse Anchal Bisa, location kinds. Fine. Yeah, don't worry. Like we have means today we'll study more instruments so that you won't be means you will have a clarity like which things will be asked and like what you would know about it. Fine. And means we'll use this in we'll use this cannula for this investigation known as hysterosalpingography. And during this hysterosalpingography, you will be able to see if there is a just like uterus, it will be like means like the counter of the uterus must be like this. Whereas if you're able to see appreciate just a one uterus, what will you think of? What is the name of this thing? Yeah, this will help you in NEET PG also. Yeah, correct. Yeah, it will be what it is known as what unique cornuvate uterus. It will be what it is the unique carnivate uterus. Yeah, correct, guys. And this is how this unique carnivate looks like, because um because both of because uterus, it will be formed from the two ducts and it need to join medially. If it doesn't, if one duct, if it regress, the only one will form, which lead to this formation of this unique carnivate uterus. Fine. Next. Yeah, yeah, correct, Anil. Next, if you're able to see this type of arc formation, and it is what it is known as what, arcuate uterus. It is known as arcuate uterus. Fine. And we know the most common type of Mullerian anomaly, it will be what? It is the septate uterus. Okay, it is the septate uterus. And means like most on ultrasound and on the most of the investigation, the septate uterus and the bicarnate uterus, both of them, they look similar. But if you're able to see, if the distance between them, if it is more than 4 centimeter, means it will be what? It will be the bicarnate uterus. It will be the bicarnate uterus. Fine. If it is less than 4 centimeter, it will be the septate uterus. And then, if you're able to see, for this bicarnate uterus, we'll use this method, means we'll use this method as a treatment known as Strassman metroplasty. Fine. Whereas in a case of septate uterus, we'll do what? Hysteroscopic septal resection. Fine. Hysteroscopic septal resection. Okay, just remember this. Fine. Yeah, the angle will be more pronounced in the case of bicarnate uterus, where it will be less in the case of septate uterus. Yeah, correct answer. Fine. With this understanding, we'll move on to the next part. If a HSD image which shows this type of beaded type of, the beads are the beaded type of fallopian tube. This beaded fallopian tube will be seen in a case of which condition? Fine. And we know this type of TB, it won't spread by a sexual intercourse, it will be spread by a this hematogenous part. Hematogenous. Okay, just remember hematogenous. Fine. And there will be different types of unnoted PDF. I already shared them. Like if possible, they will share you back, or else will give you the unnoted one. Fine. Next one, if you're able to see, there is a filling defects. And there is a history of like any procedures, for example, suction and evacuation, or like mostly of DNE, like dilatation and curettage. Like dilatation and curettage, any history, then it will be suggestive of what? This will be suggestive of Asherman syndrome. Yeah, because of this excessive curettage, because we need to stop this curettage when you're able to see this grating sound, or when there is a formation of bubbles. If you keep on doing this, you will go and damage the basal layer. This will lead to this formation of adhesions known as overzealous curettage. Yeah, correct. Like walking like more, means more more consciously. Fine. And with this understanding, we'll move on to the next part. If you see a female who is having these features of irregular menstruality, irregular periods, along with these features of this acanthosis nigricans, along with this feature of this sting of pearls, along with this central stroma. Okay, central stroma. Okay, if there is a two of these features, or if there is any both ultrasound feature or any hormonal feature, it will be suggestive of this PCOS. Yeah, it is the criteria which we use for this PCOS. It is known as what? Rotterdam's criteria. Okay, because at least any of these two will be present, either any biochemical changes or any hirsutum like androgenic changes, along with this, means with or without this ultrasonic changes, like any two. Fine, it is what it is, the Rotterdam's criteria. And could anyone tell me what is the drug which we use to treat the infertility in the case of PCOS? Yeah, Stanley-Whittle syndrome, also known as, correct, Lokesh? Like what is the name of this drug which we use for infertility in a case of, yeah, correct, it is what it is, the drug which we use for infertility. Okay, it is what it is, the letrozole. Yeah, correct. Previously we used clomiphene citrate, but now we use this letrozole. Okay, Akash. Yeah, we need to treat symptomatically also, correct, Anshul. Yeah, largely just remember, previously we used to use clomiphene citrate, but now we are using the letrozole. Fine. And next we can do one more procedure in a case of PCOS, because there will be a thick stroma formation known as laparoscopic ovarian drilling. Okay, laparoscopic ovarian drilling. Okay. Yeah, correct. The Anil. Yeah, that is the pathophysiology. Correct. Yeah, Lokesh, it is one of the complications. And if you're able to see the same, means around the same kind of appearance, but in history they will be given like there is she's in treatment for infertility. Okay, infertility, and she have been administered with this HCG. What is this syndrome? Like means there is no any different now, there is no any differentiation between the NEET and FMG. Like the pattern will be the same, but just the negative mark is the difference. Okay, so don't worry, just keep on hammering, you will be coming with flying colors. Okay, don't worry. Fine, this is the ovarian hyperstimulation syndrome. Okay, this is what it is, the ovarian hyperstimulation syndrome. A correct amal, correct anil, correct lokesh, baisla, uh, lashini and glimpse answer. Yeah, we're getting it correct. Next, if you're able to see, if there is a patient who is presenting with the features of infertility along with increased or this progressive dysmenorrhea, okay, along with this dyspareunia, on an examination, on a laparoscopy examination, fine, and like yeah, there will be more than 9 follicles, correct, yeah, on an examination you will be able to see this gunpowder or this bond powder deposition, or you will be able to see this chocolate cyst. It will be suggestive of which of the following conditions? Next, if you're able to see means if they ask you what is the most common site, of endometriosis, okay, most common site, it will be what? It is the ovary. Yeah, it can be associated with the mutations also, correct. Fine. It is the most common site. They will ask. Then it will be the ovary. Correct, FMG aspirant. Next, if you're able to move on, then if you're able to see some irregular means if there is some irregularities of this uterus, irregularly enlarged uterus, which is more than or equal to, or more than means are more than 14 weeks, okay, or more than 14 weeks or any weeks, okay, which is irregular in nature, it will be what? It means along with this features of dysmenorrhea, along with some other features, like then it will be suggestive of which one? No, it's more than 14 weeks, like because we know adenomyosis, it is, if it is, it must be less than 14 weeks, right? If it is more than or any weeks, fine, this will be suggestive of this fibroids. Okay, and we know fibroids, the most common degeneration it will undergo, it is what? It is the hyaline degeneration. Okay, it is the hyaline degeneration, and like least commonly it will undergo this carcinomatous changes, and in old age it can undergo this calcification. This is what? This is the calcification of this fibroid. Fine, fine. Yeah, figure classification we use. Yeah, whereas in this type of, if there is a pregnant lady who is having these features of this painful, means the fibroids which are getting aggravated, which are getting painful during the time of pregnancy, because they will undergo this type of degeneration known as red degeneration. Okay, and what we do this conservative management. Yeah, correct, Anil, correct, Kansak, correct. Yeah, fine. Next, if you're able to see, there is a symmetrical, means this is how this differentiate between this fibroids and this adenomyosis. If there is any symmetrical enlargement of this uterus, because here the endometrium will go on deposit inside the myometrium. Presence of endometrium into this myometrium. Fine. And this is what? This is the adenomyosis. There will be a symmetrical enlargement. Okay, there will be a symmetrical enlargement with this. Sir, we didn't get yesterday PDF. No, I think so. It's shared in your group. Just check it out, because I already shared, like yesterday night only it has been shared. Okay, just check. Yeah, fine. Yeah, there will be on pathological examination, you're able to see this leaks of myometrial blood, and on ultrasonography, you'll be able to see this dash and dot appearance. Fine. And just check Unisol, like check your groups. Fine. Okay. And if it will be a symmetrical enlargement, which is not more than or equal to 14 weeks. Okay, just remember. Next, if you're able to see some kind of uterine mass, which will be having, yeah, which will be having a feeding vessel. Okay, if it is having a feeding vessel, then it will be suggestive of the endometrial polyp. Okay, it will be suggestive of endometrial polyp. Okay, fine. Then we'll move on to few infections. If you're able to see this type of strawberry vagina, means this is what? This is strawberry cervix, along with, if there is any greeny frothy discharge, it will be suggestive of which of the following condition? It will be suggestive of this. What? This is what? This is the trichomoniasis. And we know trichomoniasis, it produces which type of motility? Yeah, correct, Ria. It produces what? It produces this twitching motility. It produces this twitching motility, and to treat we'll use this metronidazole. Okay, we'll use this metronidazole. And if you're able to see this type of cells, means there is a lactobacillus which are being adherent to the epithelial cell, it will be what? Yeah, correct, doctor. Correct, Lashini. Correct, Zevi. And Johnson, correct answer. Yeah, correct. Then this is what? This is known as what? This is known as clue cells. Clue cells, fine. And this is what? This is the diagnosis. What? This is the bacterial vaginosis. Fine. And for this also we'll use this metronidazole. Fine. Yeah, correct, Johnson. Fine. If you're able to see, there is this abundant lactobacilli which is being adherent to this um, epithelial cells. Fine. And next, if you're able to see this cardioid discharge, cardioid discharge, cardioid discharge, what do you will think of? Okay, okay, sorry. Then I will just cross check with them once the session is once we get a break. I will just cross check with them. Okay, don't worry. Yeah, in Candida we'll be able to get this cardioid discharge. Okay, cardioid discharge will be seen in a case of candidiasis. Candidiasis. Fine, just remember. Fine. Next, if you're able to see this type of verrucous growth or this warty lesions which are huge, what you will think of? What is the diagnosis you will think of? Yeah, guys. Yeah, no, it is condyloma acuminata. Just remember, FMG aspirant, it is acuminata. Fine. Yeah, yeah, correct, Patrick. It will be seen in a case of HPV infections. Fine, especially of 6 and 11. Okay, HPV of 6 and 11. Next, if you're able to see some solid, means if there is no verrucous, if there is some kind of solid like masses, okay, like a nodular masses, then you will think of this condyloma lata. Okay, condyloma lata. And we know this condyloma lata, it will be seen in a case of, which infection? It will be seen in a case of secondary syphilis. Yeah, correct. Zivi? Yeah, correct. Yeah. No, that is HPV 16, 18. It is what it leads to this cervical cancer. Whereas, okay, just remember. Whereas this condyloma acuminata, it will be by this 6 and 11. Fine. Yeah, correct. Anil. Correct, Johnson. Correct, Correct, John. Yeah, we're getting it correct. Next, if you're able to see this, yesterday also we saw, means if you see this violin string appearance of this perihepatic adhesions, it will be seen in a case of which condition? It will be seen in a condition known as Fitzhugh cutis syndrome. Okay, then we'll move to some pregnancy changes. If you're able to see this type of appearance, which is known as what? A black line running over the means running over the abdomen. What do you think of? Yeah, it is what? It is not linea alba. Means see, it's a black line. So it will be what? It is a. If you're able to see this, means black line means the side one, it will be a white. Okay, it will be like more post pregnancy. So it will be what? Yeah, it will be what? It is the linea nigra. Okay, linea nigra. If you're able to see nearby one which is white, which is the alba. Fine. If you're able to see this black one, it will be the linea nigra. Okay, just remember. Yeah, correct neuroxin. The next one will be what? It is known as what? Cholasma. Okay, and is the facial changes in the pregnancy. Fine. Next, if you're able to see this type of bluish or this violet discolorization over the cervix and the vaginal wall. It is, what is the name of this sign known as? Yeah, guys, what is the name of this sign known as? This is known as what? This is known as Chadwick sign. This is known as Chadwick sign. Just remember, it is known as what? Chadwick sign. Okay. Yeah, correct, Ria. It is known as what? Chadwick sign. Next, if you're able to move on, means you need to know about this twinnings. Fine, yeah, correct, Johnson's correct, Zivi. Okay. If you're able to move on, you'll be able to see this type of twinnings. Okay. Just a minute, guys. This image, like, means this is what how this twinning happens. Fine, yeah, Ria, yeah, Sharma, you are getting it correct. Yeah, these are the two signs. Like, fine, before that, you just remember how this twinning happens, like how this dichorionic diamniotic and this other twins are being formed. If you are able to see, if there is a separation before the third day, and then it will be what? It will result in the dichorionic diamniotic twins. Like, for example, you are meeting for your first friend in a cafe. Okay, then initially you don't know them. Okay, then you will start talking. Then once you start talking, then you know them. So on the first day, if you're both of you are getting coffee or any things, you will be paying separately. So remember, if it is first 3 days, it will be a dichorionic diamniotic twins. And later on, you know, like when after 3 days you or 4 days you are seeing them in continuous, then means one will pay and other they will think, okay, it's not good to pay with the stranger, so he will send off. So the payment will be a single, but actually he will return back. So it will be a monochorionic diamniotic twins. But after eighth day, you become this thick friends and you know who will be having the money. So the money one will paying. He'll be paying. So after 8th day, the who will be having this money, he'll be paying it off. So after 8th day, it will be a monochorionic and monoamniotic pregnancy. Whereas after 14th day, it will be what? It will be the conjoined ones. You will become more and more close friends. Just remember these things so that you will be able to answer this questions is being asked in exams. Next, you will be able to see this type of twinnings. Fine. Yeah, most common type of this conjoint ones, it will be what? It is the sarcophagus type. Fine. Next, you will be able to see this type of sign. Means this is what? This is known as what? Lambda sign. Okay, this is known as what? Lambda sign. And this lambda sign, you can remember by this mnemonic known as, uh, okay, yeah, lambda sign also known as twin peak sign. Okay, fine. You can remember by this mnemonic known as moti or also known as laddu. Okay, means if you call, if someone is chubby, you will call them means lovely known as moti or laddu. Fine, just remember. Yeah, correct. Yeah, correct, Govindraj. Yeah, if you're able to see, so it is known as, if you see this lambda sign, L for lambda sign will be seen in a case of dichorionic diamniotic pregnancy. Fine. Whereas next sign, if you're able to see this small thin, so it will be what? It is this T sign. It will be seen in a case of monochorionic pregnancy. So remember it as moti laddu. So monochorionic pregnancy, it will be having this T sign. Okay, just remember. Yeah, correct, Baseline. Yeah, correct, Riya. Then we'll move on to the types of placenta. If you're able to see this type of placenta, why it is important is that everyone has their own significance. Yeah, fine. If you're able to see this type, if there is a placenta, if there is a main placenta, along with this, if you're able to see a small secondary lobe, okay, are also known as succensurate placenta. Fine. This will be what? This is the succensurate placenta. And we know if there is any presence of this succensurate lobe, they may present you with PPH. Fine. Yeah, correct, Kansik, correct, Riya. So they can present you with PPH. Fine. They mostly have secondary PPH. Okay, so we need to remove this placenta very carefully and we need to examine them very carefully. Fine. Next, if you're able to see this premature separation, if you're able to see this cord should be separated here. But if there is any premature separation of this cords before joining to this placenta, then it can lead to this velamentous insertion of cord. And if there is any velamentous insertion of this cord, it can lead to this vasa previa. Fine, it lead to this vasa previa. Okay, now don't confuse it with Battledore. Fine, and marginal. Just glimpse. We'll just wait. I'll show you the Battledore one. If you're able to see this, this is the marginal. Means if there is around this margin, this is what, this is the Battledore placenta. But if you're able to see this umbilical cord, it is attached to the placenta till the end. But here it is being separated prematurely. So this is how this Battledore placenta looks like. And if there is if there is a if there is in a margin, if there is in a thick margins, so it will be what? It will be the, yeah, sure, Shubham. You will get the PDF for sure. Like I will just communicate with them in the break, and you will get this PDF for sure. Okay, don't worry. Fine. And if there is the thickened margins, it will be what? It is the circummarginate placenta. And if you're able to see this type of thickening, this is known as what? This is known as circumvallate placenta. Means if instead of over, means ending here, if it is ending near to that or in the middle, it is known as what? Circumvallate placenta. Okay, yeah, correct, Ria, correct, Johnson. Fine. Okay, don't take stress about the PDF. Like you will get for sure. Like I don't know where the glitch is. I will ask them and I will share you as soon as possible. Okay, don't worry. Fine. And next, you will able to see this type of manure. And what is this name of this manures? Yeah, they are known as what? Leopard's manure. And then first, you will able to feel this fundus. If you are able to feel this fundus, you will able to know which part is the presenting. Means if you are able to see this small irregularities, means the baby's sacral lesions and the limbs in the fundus part, means the head is in the downside, so it is a cephalic presentation. Next, this, then you will need to know this lie, means whether the lie is a longitudinal one or the transverse one or the oblique one. So you will keep this hands on the side and you will able to see what is the lie. You will able to locate the lie. Yeah, correct, Shubham, Baisla, correct, Rose. Yeah, yeah, first one is known as fundal grip, second one is known as lateral grip. Fine. And you will know this type of lie. If it is parallel, means if it is parallel to this female pelvis, it will be what? It will be a longitudinal lie. If it is being if it is perpendicular, then it will be a transverse lie. Fine. Then you will able to see this type of grip. What is the name of this grip? This is known as Pavlik's grip. Okay, just remember this is known as Pavlik's grip. Next one, to see this engagement, okay, whether the head is engaged or not, we'll use this grip which is known as pelvic grip. Okay, pelvic grip, or this fourth leopard grip. Fine, or this fourth leopard maneuver, which we'll use to see whether it is engaged or not. If it is engaged, your hands won't meet up. If it is engaged, your hands won't meet up, or if it doesn't engage, your hands will meet up. Just remember these things. This is how you will able to differentiate this different types of leopards maneuver. Fine. With this understanding, we'll move on to the parts of or the types of female pelvis. If you're able to see, this is how this normal oval shaped female pelvis, which is the gynecoid type, which is the most common type also. Fine, it is the most common type also. Next, if you're able to see this type of this heart shaped pelvis or this triangular shaped pelvis, it is known as what? It is what it is the correct Ross, it is the most common type, it is the gynecoid. It is what it is the android pelvis. And we know this android pelvis can lead to this one type of complication known as deep transverse arrest. Okay, it can lead to this complication known as deep transverse arrest. Next, if you're able to see this flat pelvis, it is known as what? It is known as platypod pelvis. If there is any flat pelvis, it is known as platypod pelvis. Okay, fine. And if you're able to see this vertically, epidiametrally over this type of pelvis, it will be known as anthropoid pelvis. And you will be able to see a typical type of delivery in a case of anthropoid pelvis. It is known as what? It is known as phase 2 pubis delivery. Phase 2 pubis delivery. Fine. Yeah, correct. Yeah, there will be a persistent occipito-posterior. Yeah, correct. Correct, Govindraj. Yeah, and that can lead to this deep transverse arrest. Yeah, yeah, correct, Rose. Yeah. And next, if you're able to see this only one, this is this the in normal patients, you'll be able to see this two wings of this the two ala of the sacrum. If you're able to see if there is one wing of this ala or one ala is absent, so it is which type of pelvis? What is the name of this pelvis known as? Or if there is any one ala absent, it is known as which pelvis? Yeah, it is known as which pelvis? Yeah, correct, Govindraj. Then all others expecting your answers? Yeah, it is known as what? Nuggles pelvis. Whereas if both of them are absent, if two of them are absent, it is known as what? Robert's pelvis. It is known as Robert's pelvis. Just remember. Fine. Next, we'll move on to the next part. Like this is how this episiotomy which is being done. Usually, before we used to do this midline episiotomy. Now, mm, yeah, yeah, correct, Govindraj. Correct, Hasanar. Fine. If you're able to see, means there are two types of episiotomy. There is a medial episiotomy and there is a mediolateral episiotomy, fine, or the middle episiotomy and the mediolateral episiotomy. Now the most commonly done is the mediolateral episiotomy, because if you do middle episiotomy, means for extension we cannot do more extension. If we do more extension, there will be a perineal tear and there will be involvement of this anus also. So to prevent this, we'll use this mediolateral episiotomy. Yeah, correct, Kansik, correct, Govindraj, correct, Lokesh and Ria. Yeah, correct. Yeah, in medial lateral there is a no risk of rectal injury, and we can extend it as more as J or a T. Okay, just remember. Okay, more as J and T. Fine. And the disadvantage is that there is a more blood leaks. Fine. And if you means if you didn't do this episiotomy, means, or if you didn't do this episiotomy on time, fine, then there will be a this can lead to this complication known as perineal tears. Okay, perineal tears. And this perineal tears, it is of different degree. If you're able to see, just this vaginal mucosa, it's being turned, means if this toning of this vaginal mucosa, it will be what? It will be the first degree. Correct, Rose? Yeah, correct. Correct initial. Correct. It's correct. Yeah. Then second means in a case of second degree, we are able to see this vaginal mucosa. Along with this, there is a tone in the perineal membranes or perineal muscles. If there will be a toning of this perineal muscles. And in a case of third degree, there will be involvement of this anal sphincter. Fine. If there is an involvement of this anal sphincter, this third degree is of two types, A and B. If there is a less than 50% involvement, it is of A. If it is more than 50% involvement, it will be as 3B. Fine. And if there is any mucosa of this rectum which is being involved, then it will be classified as the fourth degree one. Okay, just remember, it will be classified as the fourth degree one. Okay, these are the four. Yeah, correct, Baisla. Correct, Priyanka. Yeah, fine. These are different types of perineal tears. You need to remember. A, less than 50%. B, which is of more than 50%. Fine. Next one is able to see, these are the movements which are being happening during the case of normal labor. Fine. In the case of normal labor, initially there will be a formation of this bag of membranes. Once the bag of membrane is being formed, then the head will start descend down. Once the head start descend down, then it will go under this rotation. Okay. Once then it will go under this internal rotation, and once there is an internal rotation, the baby will come under, means come outside by this complete flexion. Okay. complete extension. Once it comes into this extension, it will goes this procedure known as restitution, in which previously which is dead did the internal rotation, now it will being relieved by this external rotation. Then there will be delivery of this anterior shoulder, and finally there will be a delivery of this posterior shoulder. Okay, this is how this normal delivery occurs. Fine, yeah, can say. And if you're able to see, once the baby is being delivered, okay, then means once this anterior shoulder of this baby delivers, then we'll perform this active management. There are active management in this third stage of labor, in which we'll give what? We'll give this oxytocin. Okay, oxytocin. Just remember, we'll give this oxytocin. Fine. And once the oxytocin, yeah, correct, Rose. Once the oxytocin is given, then we'll do this cord clamping, and along with this we'll remove this placenta. Fine. And this placenta can be removed by, yeah, it's given as IM, like, fine, it's given as IM. Then this placenta can be removed by two methods. Like, if there is any central separation, if there is a lateroplacental cord and the central separation occurs first, then it is known as Schulet's method. Then it is known as what? Schulet's method. And if the separation starts from the side, it is known as Matthews-Duncan's method. It is known as Matthews-Duncan's method. Yeah, Krishna Rawat, yeah, you are a kind Rawat, you are exactly prescribing the dose itself, correct? Yeah, that's correct. Fine. Correct, Baisla. And there are two methods, Schulet's and the Duncan's method. Then sometimes, in sometimes the shoulder, the baby will not unable to deliver its shoulder. Fine. Because, for example, if there is any macrosomic baby, fine. Or if there is any, like, mostly if there is any macrosomic baby, if the shoulder is not able to deliver, then it can lead to a condition known as shoulder dystocia. Fine. Shoulder dystocia. Fine. And if there is any shoulder dystocia, what we'll do is we'll do two maneuvers. One is known as Meg-Roberts maneuver. If this maneuver fails, then we'll move on to the next maneuver. Means we'll bring the patient to the corner of the table, and we'll flex their hip, and we'll give this suprapubic pressure. Fine. Yeah, suprapubic pressure. Just remember, we'll do this maneuver known as, first we'll do this Meg-Roberts maneuver to deliver this anterior shoulder. Fine. And if this thing fails, then what we'll do is, how this baby came out, means then we will rotate and we'll keep this head inside. So okay, we'll push the head inside, and we'll do this maneuver known as Zavanelli maneuvers. Okay, we'll do this maneuver known as Zavanelli maneuver. We'll do this maneuver known as Zavanelli maneuver, and we'll undergo the C-section. Okay, C-section. Okay, this is one of the this is done in a case of shoulder dystocia, in a case of macrosomic baby. And next, if you're able to see, if there is a breech baby and you deliver till the chest, okay, or you deliver till this umbilicus, then the hair, then to deliver this head, you will use this maneuver known as Mauricio Snelly Weep maneuver, in which you will just put your fingers into the mouth, and you will do the malaflexion, and you will take out the baby. So this is known as what? This is known as Mauricio Snelly Weep maneuver. Okay, just remember this maneuver. It will be a, just remember, smile, because we smile with mouth, and here we'll put our fingers into the mouth. Just remember. Fine. We'll able to remember this. Then if the head is not coming, and this whole till the shoulder is being delivered, then we'll do this maneuver known as or techniques known as, yeah, there is a malar flexion and shoulder flexion. Yeah, correct, guys. If you're able to do this, in a arc fashion, we'll use this. We'll deliver this baby in a arc fashion known as Burn-Marshall techniques. Okay, Burn-Marshall's technique. Okay, we'll do this techniques known as Burn-Marshall's techniques. Yeah, correct, Rosalifa. Next, if you're able to see, means if it is a still baby is not, means if previously, if in a case of breech, if the baby is not delivering, then we can do one more maneuver, in which we'll rotate the baby of this will hold the trunk, and we'll rotate the baby. It is known as what? It is known as Lovset's maneuver. Okay, it is known as Lovset's maneuver. Okay, just remember, it is known as Lovset's maneuver. And to deliver that, in a case of any extended breech, okay, yeah, correct, Rose. Yeah, full moon. This is what? This is the Pinnuts. This is the Pinnuts method. Okay, in which if there is any extended breech, you want to deliver this legs, then you will go inside, and you will just flex the leg. You will keep a finger on the popliteal fossa, and you will flex, and you will bring the leg out. So it is known as what? Pinnuts maneuver. Okay, these are the maneuvers, which is means, like, because they can be given image as an image, and they will ask. Fine. Yeah, hi Anikit. Fine. And you will able to see, this is where there is a premature separation of this cord, like, because there is a premature separation of this cord, and this cord, this is what? This is the velamentous velamentous insertion, and this can lead to vasoprevia. Okay, vasoprevia. And remember, in the case of vasoprevia, the blood will be from this baby. Fine. Okay, don't forget. Yeah, correct, Rose. It can lead to this vasoprevia. Fine. With this understanding, we'll move on to the next part. Next, if you're able to see, okay, means if the placenta is low lying, if the placenta is low lying, it can result into the huge blood loss. Okay, okay. So this, if the placenta might be mostly in a superior aspect. If it is towards the cervical os, it will be what? It will be either it can be low lying or it can be covering the os complete or partially. So it is what? It is the placenta previa. Okay. Okay, we'll consider them from the marginal. So if this touching this margin, so it is what? It is the marginal placenta previa. Okay, or if just obstructing half of the os, so it is what? It is the partial placenta previa. And if it is completely obstructing, it is what? It is the complete placenta previa. And we know, in a case of placenta previa, we won't do this. We won't go for a normal labor. We'll do cesarean section. Right? In a case of partial or complete placenta previa, just remember. Okay, we'll do elective cesarean section, or if there is an emergency, we'll do this cesarean section even. Fine. And then normally this placenta will be like this, and because of this presence of this membrane known as a correct location, correct Baisla. If there is any presence, because of this presence of a membrane known as Nitabux membrane, Nitabux membrane. Fine. And if there is any absence of this Nitabux membrane, this placenta can go more deeper, and it can result into this three condition known as AIP, known as accreta, increta, and percreta. Okay, accreta, increta, and percreta. Yeah, and one of this, like the most common cause, it is what? It is the previous history of placenta previa. Okay, so remember, the placenta previa, it's one of the complication. It can result in um, this one, which is this morbidly adherent placenta. Just remember. Okay, so previous history of placenta previa, and or if there's any previous history of any morbidly adherent placenta, or sometimes it can happen because of this previous history of LSCS. Okay, just remember, this can lead to this morbidly adherent placenta known as accreta, increta, and percreta. Okay, yeah, yeah, thanks. Yeah, correct, Rose. Correct, Larshini. Yeah, you are getting it correct. Then if you're able to see, if there is a pregnant female around the 20 to 25 weeks, if she's coming with a tender abdomen, if she's coming with a tender abdomen along with this pallor out of proportion. Okay, pallor out of proportion. Okay, okay, and a tender and tense abdomen, this will be because of this condition known as, what is this condition? Yeah, it is the next one is the cavalier. Yeah, correct. Yeah, correct, Rose. Yeah, it is what it is. It is seen in a case of abruptio placenta. Okay, it is seen in a case of abruptio placenta. Okay, because are the premature separation of this placenta, and it's of two types. Either she can come with this pervaginal bleeding present, or she can come without any PV bleeding, which is known as what? It is known as concealed variety, or it is known as what? Revealed type of placenta, means an abruptio placenta. And sometimes this abruptio placenta can go and invade this myometrium. This is lead to this type of uterus. A correct Priya and Priyanka. Yeah, a correct cons, correct full mean, like it can lead to this type of uterus known as cavalier uterus. Okay, cavalier uterus. Okay, just remember, it can lead to this uterus known as cavalier uterus. And we know, like mostly if there is any case of abruptio placenta, if the abruptio placenta will go with normal vaginal delivery. Right? Okay, only if the fetus is in distress, will go for cesarean section. Otherwise, will go for normal vaginal delivery. Fine. And if there is any DIC also, will control the DIC and will go for normal delivery. Okay, if there is any fetus distress, or if there is any maternal means or more morbidity, and those situations will go for LSCs. Just remember. Fine. Next, if you are able to see, if a female who is presenting with more second trimester abortion, a correct Baisla? Yeah, if you're able to see a female who is having this more second trimester abortion, and on scanning, you'll be able to see the length of cervix, it is less than 2.5 centimeter. Fine. Length of is less than 2.5 centimeter. What is the name of this procedure you will do? Or the name of this circulage you will do? It is what it is known as what? McDonald's What is the name of this circlage? Yeah, guys. Yeah, it is what it is, the McDonald's circlage. Fine. Which will be seen in which will be done in a case of incompetent cervix. Okay. Next, we are able to see this type of suture. Means in a case of PPH, okay, in a case of PPH, we'll start with oxytocin, then we'll go for methogen. If there is any contraindication for this methogen, we'll use carbaprost, and if nothing helps, we can go for arterial ligation. If this also fails, or previously, or if there is no limited setup, or resource limited settings, we'll use this type of sutures known as B-Lynch sutures. Yeah, correct, Priyanka, Ria, and Baisla and Rose, you are getting it correct. It is known as what? B-Lynch suture. Okay, it is the B-Lynch suture which we will use for PPH. Yeah, correct, Ria. Next, if you are able to see this in ultrasonography, you will be able to see this snowstorm kind of appearance. Snowstorm appearance. Along with this, if you are able to see this type of small grape nodules, what you will think of? Yeah, correct, full moonlight. It is known as what? Yeah, identiform mole. Yeah, correct, Rose. Correct, Rajeshwari. Fine. The correct, Ravat. It is what it is, the moles. So it is what it is, the molar pregnancy. And there will be two types of moles. It is completely mole. It will be what? It is a complete mole. And if there is a mole along with this fetal part, it will be what? It is a fetus. It will be what? It is a partial mole. Fine. It is a partial mole. Okay. And in the case of the partial mole, just remember the chromosome number will be 69XX. Okay. XXX or XXY. Just remember. Fine. Whereas here XXY mostly, and here if you see this complete mole, it will be 46XX. Remember, like there will be less likely to have a XY part. Fine. Yeah, partial it will be, just remember, if you flip this P, it will be 6. If you flip this 6, it will be 9. So it will be a 69. Just remember, if you are getting confusion with it. Fine. Yeah, correct for moonlight. Like most commonly in a case of complete molar pregnancy, it will be what? It will be the 46XX type. Fine. Because mostly it will be from the maternal origin. Okay, there will be no like male counterpart. Fine, just remember. With this understanding, we'll move on to the next part. If you're able to see, this is what how this WHO partograph looks like. Okay, where we monitor this, yes, cervical dilation along with this horse. Fine, where we also monitor this fetal heart rate. Fine, fetal heart rate, and we'll do this CTG. Dip or the tip of this fetal heart rate deceleration along coincides with this means contraction, then it will be what it is known as what? Yearly deceleration. And we know this yearly deceleration, it is an absolutely normal one. Okay, it is an absolutely normal one, which will be because of this head compression. It will be because of this head compression. Fine. And if you're able to see, if there's a uterine contraction, and if the fetal deceleration, it will be followed by this contraction, it will be known as what? It is the late deceleration. Remember, if someone died, if someone died, we call them as late. So remember, so if late means the baby is in a, some difficult situation, or baby is gonna die. So it's because of this. Remember, like baby is gonna die. So because of this uteroplacental insufficiency. So just remember, so the most serious one, it will be the late deceleration, which leads to this uteroplacental insufficiency. Fine. Remember. Yeah, we need to check for 15 seconds, and usually like there will be 5 to 15 boxes, or 5 to 15 increase in the heart rate, or there is a 5 times of B2 bit variability we need to check. Fine, just remember. Next, if you are able to see this variable type of deceleration, means there is no coincidence with this contractions. It will be seen in a case of umbilical cord compression. It will be seen in a case of umbilical cord compression. Just remember. Next, this is how this means this is how this CTG is being recorded. If you're able to see, this is the uterus probe, which is used to know this tone of this uterus. Next are these contractions of this uterus known as, okay, topography. Next, this is what? This is the probe which is used to hear the fetal heart rate. Okay, yeah, correct, Rose. Next, if you're able to, we'll move on to a few contraceptive methods. If you're able to see, this type of method means in which the beats are used to calculate the days. Okay, what is the name of this method? Yeah, beats method, or it is also known as which method? Yeah, guys, waiting for your answers. It is known as which method? Otherwise also known as, yeah, correct. It is also known as Tirumala method. It is also known as Tirumala method. Okay, fine. Okay, it is one of the type of natural contraceptive methods. Next, if you're able to see this, how this male condoms looks like, and male condoms will be provided from the government, or branded as from the government as the name of Nirod. Okay, Next, if you're able to see, this is how this female condoms looks like. And if you're able to see this female condom, it will be having this two rings. The male condom will be having a one ring, whereas this female condom will be having this two rings. And this female condoms, like there are FC2 types of condoms which will be given by this government for free of cost for this commercial sex workers. Fine? Yeah, correct, Govindaraj. Yeah, Larshini Govindaraj. Yeah, correct. Yeah, and this FC2 types of female condoms will be provided to this commercial sex workers. Okay, especially for the females. Fine. Yeah, correct, Priyanka. And next, if you're able to see this type of cap, it is known as what? It is the Dutch cap, also known as diaphragmatic cap. The one of this most problematic thing in the case of diaphragmatic cap is that mm, it must be fitted by this physician. So it will be a difficult one, and it should be removed because to prevent this any bacterial contamination or prevent this toxic shock syndrome. Yeah, correct, Kans. Fine. And next, if you're able to see this type of like just checking this cervical mucus, okay, type of cervical mucus thickness. Okay, this method is known as checking the cervix mucus known as Billings method. Fine, it is known as the Billings method. Just remember, it's known as Billings method. Next, if you're able to move on to the next part, you can see some oral contraceptive pills, and this oral contraceptive pills, okay, oral contraceptive pills will be given by this government in the two variants. One, it is known as Mala N and Mala D. Okay, remember Mala N for no money. Okay, okay, D for dollar, and it is paid. So remember, it is a paid one, it is a free one, and both of them they will be containing this 3 microgram of ethinyl estradiol and 150 microgram of the progesterone. Just remember. Then for this, yeah, we'll be having this ethyl estradiol and the levonorgestrel. Okay, just remember. Fine. If you're able to see this image, you'll be able to see that there are white color tablets and black color tablets. And these white color tablets, they are the hormone tablets. Whereas this black color tablets, they are actually what? They are this iron tablets. So we need to start taking. Means we need to counsel the patient. They should start taking from this white tablets, and they need to continue. Okay, and continue till this whole cycle. And in the last 7 days, they need to take this iron tablets. Okay, iron tablets. Okay, just remember the white one will be the hormone tablets, whereas this black one which is will the iron tablets. Okay, just remember. Fine. Next one, if you able to see this type of injections, okay, which is branded as Antara, which will be made up of this medroxyprogesterone acetate. Okay, it will be given as an injection. Okay, which will be given as once in a 3 months. Once in a 3 months. Okay, just remember, it will be given as once in a 3 months. Next, if you able to see this brand, which is branded as Chaya. Previously, it is known as Saheli. Okay, now it is branded as Chaya, which will be having this common known as Senchromafene. Okay, Senchromafene. Fine. Which is the Senchromafene, which is and the component is what it is the ormilaxafine, which is a means for initial first 3 months, it should be taken twice a week. For the next three, like once a week. Just remember, once a week from the after 3 months, whereas before 3 months it should be taken twice a week. Just remember, it will be written here also. You can able to see. Fine. Next, if you're able to see, there are few intrauterine devices. If you're able to see these first generation devices, they will just mainly act by this foreign body reaction. Okay, and this is what? This is the Lippel's loop. Okay, this is what? It is the Lippel's loop. Next, if you're able to see this copper windings on these arms also. Correct? If you're able to see this copper windings on the arms, it will be what? It is the 380A. Fine? Because you will be able to see this copper windings on the arms also. Fine, and it will be for having this CUT 380A, and it will be having this lifespan for 10 years. Fine, it will be having this lifespan for 10 years. Yeah, correct, Baisla? Yeah, correct, thanks. Correct, Priyanka. Next, we will be able to see this is this multi-load 375, and it can be kept for how many years? It can be kept for 5 years. Just remember, it can be kept for 5 years. Next one, this is the Myrina. Okay, this is the Myrina. Okay, and this Myrina, the whole composition, it is what? It is the, and it's a 52 milligrams, whereas it releases every day, it releases 20 micrograms. Just remember, it is made up of 52 micrograms, whereas every day it releases 20 micrograms. Fine. And for tubal ligation, we use this type of procedure. Okay, we'll use this type of procedure, which is known as what? modified modified polymer- polymerase technique. We'll use this method known as modified polymerase techniques. Next, there's also this type of implants. You'll be able to see 1, 2, 3, 4, 5, and 6. 6 stylistic capsules are being subdermally implanted. Okay, fine. Yeah, means you can keep it, means like Mirena, it can be like up to 5 years, but they'll tell, but mostly it will be up to 3 years. Yeah, correct. It is the 3 years of Mirena. Just remember. Fine. And if you're able to see the 6 stylistic capsules, which is implanted into the subdermis, it is known as what? It is the Norplan. It is the Norplan. Just remember. Fine. Okay. With this understanding, we'll move on to the next part. If you're able to see this one, it's used to collect the samples from the ectocervix. It is what it is, the eye spatula. Eye spatula. And if you want to take from the endocervix, you will use this second one, which is what? Which is the cytobrush or this endobrush. So this cytobrush. Okay. And the last one, if you're able to see this one single one, which can take from this endocervix also, ectocervix also, and from the transition zone also. It is what? It is the cytobroom. Okay. Just remember, broom brooms everything. So broom brooms everything. Okay. So cytobroom, it can take from ectocervix, endocervix, and also from the transition zone. Yeah, correct, Ria. Fine. Then if you're able to see on application of acetic acid, if there is any color changes, this method is what it is known as visual inspection under acetic acid. If there is any malignancy, it will coagulate, or it will make use of this acetic acid. So we can screen for malignancy using this visual inspection under acetic acid, and it is a screening tool which will be more cost effective in nature. Then if you are able to see this type of test in which a Q-tip is being inserted into the bladder, okay, and we tell the patient to cough. Okay, if there is a mobility, if there is a large mobility, and if there is any pulsated release of this urine, this will be because of this. Or if there is any release of this urine after this any increased abdominal pressure, it will be what? It is the stress urinary incontinence. Okay, it is the stress urinary incontinence, and the test is what? It is the Q-tip test. Okay, yeah, means we use this VAA and the cytobrush to rule out this CA cervix. Correct. Next, if you're able to see, means to know this type of fistulas, whether if they are from this ureter, or is it from this bladder, or is it from this urethra. Okay, fine. If we means first we will use to dye, means first what we will do is that we'll fill this bladder with this blue color dye. Okay, if the first one, if it is being soaked just by the urine, not by this blue color, then it will be what? It will be the ureterovaginal. If the first one is being soaked by the blue color one, then it will be what? It is the vesicovaginal fistula. Okay, vesicovaginal fistula. Okay, then or if the third one, if it is being soaked by this either urine or from the dye, it will be what? It is the ureterovaginal fistula. Okay, remember the most common cause for this vesicovaginal fistula, it is what is the most common cause in India. It is what? It is the obstructed labor. Okay, remember, it is what? It is the most common cause. It will be the obstructed labor. Fine. These are the things you need to remember about this type of test, and in case of fistulas. Fine. Next, we'll move on to this part. Okay, if you're able to see this, they are used in a case of abortions or MTP. Okay, abortions are MTP, or we'll call it as more popular as medical termination of pregnancies. Fine. For this, initially, this is how this menstrual regulation. This is how this menstrual regulation syringe looks like. Fine. This is how this menstrual regulation syringe looks like. The next one, it is what? It is the manual vacuum aspiration syringe. Okay. Okay. And it can develop up to the pressure of 600 to 660 millimeter Hg of pressure, and it can hold up to 60 ml of fetal contents. Okay, and it can hold up to 60 ml. Next, for this syringing, we'll use this type of cannula. Based on this, the size will be decided based on the week of pregnancy. So it will be what? What is the name? It will be what? It is the Karman's cannula. Okay, it is known as what? Karman's cannula. Will use based on the gestational age of the fetus. Fine. Yeah, means like mostly the volume, it will be of around 60 ml, and the pressure will be maintained from 600 to 660. Fine, just remember. Fine. It is known as Carbon's cannula. This is what the next one, the cannula which we attach, it is known as what? Is the Carbon's cannula. Next, if you were to move few instruments, like who all have instruments, you can see it through. If you are able to see this non-traumatic type of scissors, they are what? They are this episiotomy scissors. Right? What they are? What they are? This episiotomy, because they are really having this blunt edges to be non-traumatic. Next, this is what? This is the Hegas dilator. These Hegas dilators are used to pass inside the cervix to know how much it is being dilated. So, in a case of incompetent cervix, we can use this and we can diagnose the condition of incompetent cervix. Fine. Next one, if you are able to see this type of cup, it will be seen in a case of ovum forceps. Okay, to take this fetal tissue during suction or during dilatation and curettage. Okay, we'll use this and we'll take the tissues. Fine. Next one, it is the uterine curate. Okay, during this dilatation and evacuation, we'll curate the uterus with this. Okay. Next, it is what? It is the cuscous vaginal speculum, which will be what? Which will be the self-retraining. Okay, it will be self-retaining cuscous vaginal speculum. Fine. Next one, it will be what? Yeah, ovum holding forceps, it won't be having a lock. Correct. Kinds. Next one, this is what? This is the valcellum forceps, which used to grasp the cervix during any procedures. Fine. Next, you need to remember about this few forceps. Yeah, there's also one more image. I'll just add on. This type of perineally curved blades, it will be seen in a case of Pepper's forceps. Okay, if you're able to see this small pelvic curve, if you're able to see this small pelvic curve, it will be seen in a case of Kellan's forceps. So, if you're able to see this distinct perineal curve, it will be seen in a case of Pepper's forceps, whereas this small pelvic curve, it will be seen in a case of Kellan's forceps. Fine. Next one, you need to know about this outlet forceps. This is how this outlet forceps looks like. If you're able to differentiate these three types of forceps, it will be means like most of them they will be asked within these three types of forceps. Okay, so just don't forget about this orientations of this forceps. Fine. Next, if you're able to see this type of retractor which is being used during the cesarean section, what is this name of this retractor? Yeah, moonlight. Yeah, we'll see this outlet forceps also. Yeah, Baisla. Yeah, it is known as what? Known as Dine's retractor. It is known as what? Dine's retractor, which will use to prevent any bladder injuries. Fine. Yeah, it means all look the same. Just see this curviness of this blade, okay, and this blade and this outlet forceps. You are able to see this distal blades. Okay, no, you try to differentiate. It means if you're not able to remember this, just try to see in the morning times. Okay, you'll be able to identify the differences. Fine. And next, this is how this Sims speculum looks like. Sims speculum looks like. Fine. With this understanding, we are concluding this obstetrics and gynecology. We are moving on to this. Yeah, it's the sim speculum. We are moving on to this pediatrics. And in pediatrics, it will be done in a few minutes only, like because there are few slides or few images which are being asked repeatedly. Fine. You're able to see what is this? This is what? This is an incubator. This is what? This is an incubator. And in incubator, you need to know the mechanism of heat gain and heat loss. If we see incubation, in the case of incubator, the mechanism of heat gain, it will be what? Absgyno. Yeah, it's done by Isla, finally. Yeah, it's in a NICU setup. Yeah, it's incubator. Yeah, no, next one I will show you the warmer. First one, it is the incubator. Fine. The mechanism of gain, it will be what? It will be by this method known as convection. By this convection. Okay. Whereas the mechanism of heat loss, it will be by this radiation. Okay. Next one, it is the radiant warmer. It is the radiant warmer. Okay. And this main mechanism of heat gain, the heat gain, it will be by this thing known as radiation, and loss here it will be by this convection. Okay, convection. Next, you will be able to see this therapy in which the baby's eyes and this scrotal regions are being covered. It will be what? What is this thing? It is known as phototherapy. It is known as phototherapy. And we know the most common mechanism of this phototherapy, it is what? Mechanism of phototherapy is what? It is the most common mechanism by it to act. It is what is known as what? Structural isomerization. Structural isomerization. It will convert this lumirubin, means like bilirubin, into this variant known as lumirubin. Okay, bilirubin into means unconjugated bilirubin into this lumirubin. Okay, remember. Okay. Yeah. Means there will be, yeah, there will be a structural isomerization also, there will be a optical also, but mainly it will be the structural isomerization. Just remember. This is how this neonatal resuscitation which is being done, and we know it will be for in a case of neonatal resuscitation, like there will be a three chest compression and a one breath. Okay, 3:1. It is done in a ratio of 3:1. Just remember. And mostly in a case of infants or newborns will use around 250 ml of, will use amber bag which is of 250 ml. Like cans 30 is to 2, sorry, 30 is to 2, it will be for the adults. Just remember. Fine. For adults it is 30 is to 2. Whereas in the case of infants and children, it will be a 3:1. Fine. And next, there are some transient conditions you need to remember of. Fine. Yeah, correct. Full moonlight. Yeah, you are getting it correct. In in a case of, there will be few transient conditions. This is known as what? Erythema, toxica. And next, if you are able to see some this type of pustules, it is known as pustular melanosis. Pustular melanosis. Okay. And this one, if you are able to see this type of appearance, which is, what is this one? No, milia I will show you. It's not milia. Don't confuse it with milia. Fine. Yeah. Third one, it is not hemangioma. Hemangioma means it's a benign blood accumulation, benign blood neoplasm. Okay, fine. So it will be a bulging out, means it won't be a flat like this. Okay, it will be bulging out. Fine. So this is a kind of stain. Okay, yeah. Means it's around the port vein, but it is known as what? It is known as salmon patch. It is what? It is known as salmon patch. You'll be able to see this port vein stain in a case of, that is a different one that is we see in a case of Sturge syndrome. Whereas this is known as salmon's patch, also known as stalk bite, also known as angel's kiss. Okay, they will have this multiple names for the same thing. It is known as what? Salmon patch. Just remember. Next, you're able to see this type of acne kind of appearance known as neonatal acne. Okay, and then if you're able to see this type of appearances of this type of small lesion over this palate, it is known as what? Epstein piles. It is known as Epstein piles. Just remember, it is known as Epstein piles. Fine. With this understanding, we'll move on to the next part. If you're able to, for identification of this gestational age, we'll use this type of sign. Known as, this type of sign is known as scarf sign. Okay, scarf sign, because we use the system known as extended Ballard scoring for to know this exact gestational age of this child. So in which a part is this scarf sign. Fine. Next, this is what? This is known as was Palladai feeding. Okay, Palladai feeding. This is which is being done here, and there is also one more type of feeding which is known as Katori spoon feeding. Okay, just remember. Fine. Yeah. Then this is how this NG tube, nasogastric tube, which we use if the gut, if the initially, means if it is less than 28 weeks, we'll use total parental nutrition, because there will be an immature gut itself. So we'll give total parental nutrition. If it is around 28 to 32 weeks, the gut will be mature, but the swelling reflex won't be developed properly. So at those moments, we'll use this between 28 to 2 weeks. Okay, we'll use this NG tubes. Whereas around the 34 weeks, the baby knows swallowing, but the rooting reflex, because when they touches this nipples, means around this, when they touches this nipples around this 34 weeks, there will be no rooting reflex. Means the baby won't turn, and they won't start sucking. So we use this type of feeding known as Palladai feeding around this 34 weeks. Okay, if it is more than 34 weeks, the baby can feed itself, because the rooting reflex will be developed. Okay, so don't worry. Fine. With this understanding, we'll move on to this next part. Yesterday also we saw this. This is what this is known as Shakir stick. It is known as Shakir stick. Next, if you're able to see this type of fluid accumulation in the lobar fissures, or this fissure sign called this sun ray appearance. Sun ray appearance. Were you able to see the sun ray appearance? The correct full moonlight, correct location. Were you able to see the sunlight appearance? Yeah, guys. This will be seen in a case of condition known as transient tachypnea of newborn. Means like most commonly it is seen in a case of cesarean section delivery, because in a case of normal vaginal delivery, the baby's chest will be pressed, and whatever the fluid inside the lungs, it will be come out. Okay. Yeah, correct by slide, it is the TTP. Fine. And if you're able to see this kind of white out, or this GGO, or this white out lung fields, it will be seen in a case of respiratory distress syndrome. Okay, it will be seen in a case of respiratory distress syndrome. Correct full moonlight. Next, if you're able to see a baby which is being, or the newborn which is being recently delivered, and if you're able to see this type of scaphoid abdomen, okay, along with some respiratory distress. And an image, you'll be able to see this type of, yeah, hyaline membrane disease, it is also known as, yeah, correct. The respiratory distress syndrome, it is also known as hyaline membrane disease. And if you're able to see this type of mm, mm, bubble of shadows inside the thoracic cavity, it will be what? It is the, yeah, correct, Gopinath, it is known as what? Congenital diaphragmatic hernia. And we know the most common type of this congenital diaphragmatic hernia, it is what? It is known as what? It is the Bock Delix type of, it is the box Delix type of hernia. Okay, it is the most common type. It is most commonly at the left posterior membrane defect. Okay, just remember. Yeah, correct. Hence Bisla full moon light. Yeah, correct location, correctly area. Yeah, it is what it is, the box Delix one. Next, if you able to see this type of, if an infant or a newborn which is being um, is being feeded by this from the external sources for a long time, okay, or aggressive formula feeding, it can result into this condition known as nectarizing enterocolitis. And in nectarizing enterocolitis, you need to remember these two signs, okay. In these two stages, like 2A and 2B. 2A, it will be having this gas, means it will be having this gas in between the bowel lobes, okay. Yeah, Morganglis will be the anterior and right. Yeah, correct. Full moon light. Yeah, correct location, correct Gopinath. And if you're able to see, mm, this gas in between this bowel loop, it is known as what? It is the, it is stage this NEC stage 2A, whereas stage 2B, there will be presence of gas inside this, like portal vein. There will be presence of gas in the portal vein. Okay, just one more. And next, some cardiological malformations. If you able to see this figure of 8 or the snowman appearance, this will be seen in a case of which condition? Yeah, correct. Rian full moonlight. Yeah, this figure of 8 of snowman appearance, it will be seen in a case of, correct, Ravat and Ria. It is what? It is the TAPVC, like mostly of a supracardiac variant of TAPVC. Next, if you are able to see this type of egg on string appearance, will be seen in a case of which condition? Yeah, it will be seen in a case of transposition of great arteries. Next, if you are able to see this type of formation of three appearance, or this three appearance, and along with this notching of the ribs. This will be seen in a case of, this will be seen in a case of coarctation of aorta. Okay, notching of ribs will be seen in a case of coarctation of correct. Yeah, correct Khan. Yeah, correct Baisla. Yeah, correct Kants. Fine. Next, if you able to see this type of boot-shaped heart, it will be seen in a case of tetralogy of Fallot. And remember, the severity of this tetralogy of Fallot, it will be decided by which of the following? It will be decided by this pulmonary stenosis. It will be decided by this pulmonary stenosis. Okay. Yeah, correct Baisla. It is the boot-shaped heart. Okay. Yeah, car in boot. Yeah, correct Lokesh. Yeah, correct Gopinath. Correct Baisla. Fine. Next, we'll move on to the next part. If you're able to see this open box appearance, okay, this will be seen in a case of Epstein anomaly, and most commonly they will be associated with pre association with this lithium intake. Okay, lithium intake during pregnancy. Yeah, correct. Correct full moonlight and correct Ria and Baisla. Yeah, correct. Fine. That is lithium. Next, if you're able to see this type of, next, if you're able to see this type of um, anterior neuropore defects, where there is any absence of this clavarium, it is what? It is the anencephaly. Anencephaly. Okay, it is due to this failure of closure of this anterior neuropore. Next, we are able to see some mass at the sacral region. It will be what? It is the, it is the sacrococcygeal. It is the sacrococcygeal teratoma. It is the sacrococcygeal teratoma. Yeah, correct Gopinath. Yeah, correct location. Dr. Khan. Yeah, it's correct. Next, if you're able to see, yeah, it's not encephaly, Dr. Khan. It is anencephaly. Right. Next, if you're able to see, there is an absence of this neck. If there is any absence of neck, it is known as what? Absence of neck, it is known as anencephaly. It is known as anencephaly. Just remember, it is known as anencephaly. Yeah, correct. Now it's correct, Dr. Khan. Yeah, yeah, correct. Then we'll move on to some part. If you're able to see a child who is presenting with a history of chronic diarrhea, and along with you will able to see some history of chronic diarrhea. Okay, along with this, you will able to see rash along this orifices, and there is a acrodermatitis also. And dermatitis along this hands. What you will think of? Yeah, it is think of, don't confuse it with impetigo and hand foot mouth disease. It is what? It is our classical. It is what? The classical zinc deficiency. Acrodermatitis. So classical zinc deficiency. What is this disease known as? Guys, what is this disease? The name itself tells it is known as acrodermatitis, acrodermatitis enteropathica. Okay, okay, it's known as acrodermatitis enteropathica. Correct, full moonlight and Nitin. Okay, and next if you're able to see a child who is sitting in a lateral, and this child belly, you will be able to see some edema. So if you draw this K, you will be able to draw this edema, belly edema. So if you're able to see this belly edema along with this flaky paint dermatose, flaky paint dermatosis along with the sign known as flag sign. Okay, flag sign means there is a alternate black and white, alternate black and white kind of appearance, which is known as flag sign, which will be seen in a case of kwashiorkor. So all of these things will be seen in a case of kwashiorkor. Okay, remember, yeah, kwashiorkor, it's mainly a protein deficiency. Correct, Lokesh Baisla. And next, in a case of, we know in a case of marasmus, there will be a baggy point appearances. Okay, there will be monkey faces. Just remember, fine. Next, when we look on to this deficiency, it means most of these things you need to differentiate from the X-ray. They'll give it this child with the X-ray is this features of these three classical features, which are known as CSF features. Okay, there will be a cupping. You'll be able to see this formation of this cup, which is known as cupping. Next, if you're able to see, there is a splaying, there is a splaying, and there is a fraying also. So, if you're able to see this cupping, splaying, and this fraying, all of this will be seen in a case of which condition? All of this will be seen in a case of rickets. All of this will be seen in a case of rickets. Yeah, correct, Gopinath, Baisla, and full moonlight, and Kans, Ria, you are getting it correct. It is due to the deficiency of vitamin D leading to this rickets. Okay, correct. Next, we are able to see this type of ring formation. This type of ring formation, and there is some periosteal hemorrhages. Periosteal hemorrhages mimicking a pseudo paralysis, and you will able to see this white line of fruncles. Means you will able to see this type of lines known as white line of fruncles. All of this will be seen in a case of scurvy. Okay, all of this will be seen in a case of scurvy, which is due to this vitamin C deficiency. Fine. Ring epiphysis is known as Wimberger's ring, and next it is known as it will be having this white line of fruncles. Okay, yeah, correct, Nitin. Sai, yeah, correct, you're back. Yeah, correct, Baisla and Khan. Yeah, it will be seen in the case of scurvy, which is due to this vitamin C deficiency, because we know vitamin C helps in this collagenation. Fine. With this understanding, we'll move on to the next part. If you're able to see, there is this formation of these milestones. Okay, initially, these milestones, they will progress from the in a cephalocaudal progression. Fine. Okay, in a cephalocaudal means they will start from this head and they will go and they will progress towards the toe. Fine. And initially, if you're able to see, initially the child will start to hold his neck. Okay, it is known as neck holding. It will be come around. It will come around this 3 months. Okay, the neck holding will be around the 3 months. Next, if you're able to see, once it's hold the neck, it will try to roll over. Next, remember, on 6 months it try to sit. Okay, on 6 months, 6 yes for yes, it will sit, but it doesn't sit simply. It will be sits. It sits with support. It sits with support. Okay, whereas around the 8 months, 8 months it will be sitting without support. 9 months it will be standing. Once it sits without support, of 9 months it will be standing. It will be standing without support, and 12 months means sorry, it will 9 months it will be standing with support, and around 12 months it will be standing without support. Once it start standing without support, okay, around the 12 months it will start walking, but around 15 months it will be start walking alone, because it will initially around 12 months it will be standing without support but walks with some kind of support, whereas 15 months it will walks without support. Remember, 18 months it will start running. Okay, it will be start running around 18 months, so it will be running at 8 months. Okay, 18 months. Okay, and 2 months it will go up and down by this 2 feet. Okay, with 2 feet it will go up and down. Fine. And around 3 years it will go alternate feet just upstairs, means it can keep 1 feet here, 1 feet down. Okay, around 3 years, but it will be just going upstairs. It don't know how to come back. Around 4 years it will, means it can come down with alternate foot, and you can see around 4 years, if you draw this 4, it's like standing in one leg, or also known as hopping. So around 4 years it will be a hopping. So just remember, in this part, say in this case, 6 months it will be a sit with support, 9 months sitting without support, and 12 months it will be means 9 months there will be a standing with support, and 12 months there will be a standing without support. Fine. Next, if you're able to see this fine motor milestones, around this 4 months there will be this bind dexterous grasp. Okay, 4 months there will be a bidextrous graft. Yeah, correct, Baisla? Yeah, around 6 months there will be a S for S. It will be a unidextrous, means single hand, so it will be a unidextrous grasp. And around 9 months there will be immature grafts, and 12 months it need to cut the cake. So it need to cut the cake, so it will have this mature pincer grasp. Okay. Yeah, there will be two things, craveling and creeping. So craveling comes first, followed by this creeping. Yeah, correct, guys. Fine. Next, around 18 months, it will start scribbling, okay, and it will draw some lines. And around 15 months, it build two blocks, and around from 18 months, it build three blocks, and whatever it is, whatever the next upcoming year, you can multiply with three. So around 2 years, it will build a blocks of 6 blocks. Fine. Just remember these few things, and we know there are few drawings it can make. Around 3 years, it can draw a face, okay, and years. So remember, around 3 years, it can draw a circle. Then on the neck, it will be a cross. So around 4 years, it can draw a cross, and around 4.5 years, it can draw a rectangle, and around 5 years, it can make a skirt. So it is around 5 years, it can draw a triangle, and around the 6 years, it can draw this rhomboids. Okay, just remember. Yeah, correct side, like around 4 years, it will make this cross. Okay, just remember. Next, if you're able to see, in the case of social milestones, you just remember at 3 months, it will recognize this mother, and 6 months, yes for yes, it will be a stranger anxiety. Okay, it will be having the stranger anxiety, and 9 months, it will be waving the bye bye. Okay, and 9 months, it will be waving this bye bye. Okay, and 18 months, it will do this thing known as domestic mimicry, or copying the tasks of these parents. Okay, just remember. Okay, these are the things you need to know. Next, if you know about this language milestones, around 3 months it will cooes. 3 months it will be producing this cooing sound. Fine. And 6 months it will be a single, so monosyllables. S for S, it will produces this single or this monosyllables. And 9 months it produces this bisyllables. 12 months it can speak 1 to 2 words. Okay, like bisyllables like mama, papa. Okay, and 18 months it produces it can tell 8 to 10 words, and around 3 years it can know three things, their name, gender, and age. Fine. And 4 years they can tell you story. Remember, if four people, if they unite together, if you see four people means who are sitting together, then they will make some stories. So remember, at 4 years it can make some stories. And if you don't unable to remember all these things, it's okay. Fine, you just remember these three things, like which is being repeatedly tested. Fine. If you see a 6 year child, okay, means like, sorry, 6 months, 6 months, fine. Remember, yes for S. If 6 month child, it is a single child. Remember, if someone is single, okay, single means it need to support. It means he should be having a support to sit. So remember, means he uses one hand to support and sit. Okay, so 6 months if single, so it will be sits with support. Okay, and if it is sitting with support with one hand, only one hand will be free. So it will uses this mobile phone, means or he or she will uses this mobile phone using only one hand. So she will be having this unidextrous grasp. Okay, as she is single, she or he, they won't talk to their boyfriend or girlfriend. So they will be talking to these two peoples who are what? Who are this ma and pa. So they will tell this monosyllable. They will use this monosyllable words. Okay, just remember they will use this monosyllable words. And if they go to the family, like because after sometimes everyone, if someone comes new, they will come ask about their child's marriage. So he'll be having this anxiety known as far as they will be having this stranger anxiety. Okay, they'll be having this stranger anxiety. These are the things you need to remember about this 6 months. Next, if you're able to see this 3 years, if you see this 3 years, remember this it 3 for C, it copies a circle, okay, and it can write a tricycle, okay, tricycle, and it know three things. It know three things, which is what? Which is this age, name, and gender. Okay, age, name, and gender. Next one, it is the 18 months. If they will ask this 18 months, okay, remember 18 months, we know around 18 years we'll get free from everything. So we'll get free from our home. So remember, in our home, like we'll be living within a particular limit. So means there is a drawn limit. So if there is a drawn limit means someone need to draw. So if means at 18 months the child able to draw a line, okay, or the draw a limit, and at 18 months it will crosses the line by running. So at 18 months it will runs, okay, at 18 months it will runs, fine. And if it runs out of the home, it need to do some tasks, either it need to study, then it need to work, and it need to take care of herself, okay, or he or she, they need to take care of themselves, fine. So if they come they need to means around 2 to 3 pages it will turn, and it will study around 18 months. Next it will go and build blocks. It can build blocks of 3, okay, it can build blocks of 3, and it can do a thing known as washing, like it can mimic their parents, like washing clothes, like washing the dishes, known as domestic mimicry. It can do around 18 months, it can do a thing known as domestic mimicry, okay, domestic mimicry. Just remember these things, okay. These are the milestones which are being repeatedly tested, so don't forget these things, and don't forget about this motor milestones and a grass motor milestones and the fine one, okay. These are the things they're asking in a more recent patterns, fine. Next, with this understanding we'll move on to this ophthalmology part, fine. Once ophthalmology and ENT done, we'll have a short break, fine. And most probably we'll conclude this session today on time around 12:15 to 12:30, fine. If you see this image, okay, this is what is this chart? It is used to assess this visual acuity. Yeah, correct, Baisla. Yeah, okay, okay, Somesh, okay, Sai, fine. If you see this image, it is what? It is the Snellen's chart. And what is this next chart? It's already written. It is what? It is the ETDRS chart, which is the most specific one, because you can able to see this angulations of this letters. So it is what? It is the ETDRS chart. Next, if you want to means do this visual acuity, you will go for these two charts. Whereas if you want to know this contrast sensitivity, then you will be able to do this chart. You need to use this chart known as Pelly-Robson chart. Pelly-Robson chart. Okay. Okay, there are also some other types of chart for visual acuity. For example, if some uneducated people are there, then we'll use this type of C known as landlord's rings. Okay, okay, landlord's rings also we will use, and then for children we'll use this pictures type of uh, charts. Okay, just remember. Okay, and this contrast sensitivity is being tested by this chart known as Pelly-Robson chart. Fine. Next, this is for color vision. We'll use this type of charts known as Ishihara chart. Okay. Yeah, Allen chart will use this picture which is being used for this children's. A correct Ravat. Fine. And this was what Ishihara chart. Ishihara chart. Okay. Means like either there will be written as letters we need to identify, or else they will ask us to identify this pattern, means where it starts and where it's going ends. Okay. This is also Ishihara chart. Okay. Just remember. Next, if you able to see few instruments, in ophthalmology, we'll use few instruments. Initially, whenever the patient comes, initially we'll make them to sit in this system known as biomicroscope. Okay, biomicroscope. Okay, which is known as what? Slit lamp biomicroscope. So known as slit lamp biomicroscope. Fine. And we know, yeah, Ishihara is for color blindness, and we know this slit lamp examination uses this slit type of rays, and we'll check mostly from this starting from this outer eyelashes to this anterior chamber. We can use this, means anterior chamber to even the posterior chamber. We can able to visualize using this slit lamp, using its normal magnifications. Whereas to see this posterior part or this more defined posterior chamber, we'll use this 90D lens. So posterior part of this posterior chamber, to see this posterior chamber or the posterior part, will use this 90D lens. Next, if you're able to see, we'll attach a, then if you're able to see, okay, don't believe in this, don't worry, like the study, like exam will be happen on time. Okay, don't worry, don't get biased. Fine. Next one, if you're able to see, yeah, don't worry, like don't means like don't believe in those things, like don't worry, your exam won't get postponed, like you will be having this exam on time. Okay, just prepare yourself for it. Okay, don't worry. Fine. This is the Goldman applyation tonometry. Okay, it is the Goldman applyation tonometry. Okay, which is the gold standard tonometry method. Fine. Next one, this is the direct tonometry, means like direct ophthalmoscope. in which you will able to see this 15 times magnified view of central retina. Okay, central retina. Okay, and this one will produces this. Which type of image does it produces? Yeah, adult card will be issued on 15. It will produces this virtual, erect, and the magnified image. Okay. Next one you will be able to see this is what this is the indirect ophthalmoscope. This is how this indirect ophthalmoscope looks like. Fine. And for this indirect ophthalmoscope, we use this plus 20D mirror. Fine. And it produces 5 times magnifications. And with this, we'll able to means the patient will be at this arm length of the arm length. Fine. And it will be a and here you will able to see this inverted images. Fine, you will able to see this inverted but this real images, real and magnified image, a correct size, correct bisla. Fine, you will able to see in the case of indirect ophthalmoscope, and you will able to see this borders of this retina, which is known as what, ora serrata. Fine, next this is what, this is the gonioscope, which is used to know this angle of this eye, to know whether this angle is open, to differentiate between this open angle glaucoma and this closed angle one. Yeah, correct. Yeah, correct location. It is the gonioscope. It is especially what it is a 1, 2, 3, 4. It is a 4-mirror gonioscope. Okay, just remember it is a 4-mirror gonioscope. Next, if you able to see some other methods for eye measurement, this is what this is known as was tonopin. Okay, which is used for irregular corneas. Irregular corneas. Fine. Next, you able to see this is what this is known as what, rebound. This rebound tonometry, it will be used for this rebound tonometry. It will be used for self use. Okay, self measuring. Now, next, you able to see this Placido's disc. Yeah, correct, Somesh and Baisla. Lokesh, yeah, correct. You are getting it correct. Next, you able to see this one. This one is Placido disc, which is means which is used to see this corneal curvature. Corneal curvature. Okay. Yeah, correct. Location, it is used to see this corneal curvature. Next, if you will be able to see this test, which is used to see this tear breakout time, it is not Schimmer's test. Schimmer's test, which is used to identify this dry eye. Fine. Yeah, correct, guys. Next, this is a stain which is also used for this Sika, means the dry eyes, which is this rose Bengal stain. Okay, rose Bengal stain. Okay, it is known as what, rose Bengal stain. Yeah, correct, Gopinath, correct, Somesh, correct, Baislas. It is what it is the previous one, it is the Schimmer's test. Next, we are able to see this image. Okay, this image, in which if the patient is complaining or coming with some history of any trauma to the eye or any aberrations or something, some sand has been went into his eyes. So on OPD basis, you will able to just do a stain on a fluorescent stain, and you will able to see this aberration marks. So in a case of slit lamp, you can be able to see this. To appreciate this type of corneal aberration, you will be able to see, you will use this test known as fluorescent test. You will be able to do this stain known as fluorescent stain, and you will be able to see this corneal aberrations for this corneal aberrations. Fine, just remember. Yeah, correct, Khan. Next, these are these muscles of this eye. Like there are 7 extraocular muscles. Okay, there are medial rectus, lateral rectus, superior and inferior rectus, whereas lateral rectus will be supplied by this 6th cranial nerve, and there will be inferior oblique and superior oblique by this 4th cranial nerve, whereas others will be supplied by this 3rd cranial nerve. Fine, and there is also one more muscle known as levator palpebrae superiors. Fine, yeah, correct, Gopinath, Lokesh, Baisla. Yeah, correct. Fine, and if you able to see, the patient is unable to abduct the eye. If there is no abduction, then means the patient will be typically presenting, and history they will be given as like eye in and face out. Eye in and face out position. This eye in and face out position will be seen in a case of 6th nerve palsy. Okay, 6th nerve palsy. Okay, which is what, this is the LR palsy. Okay, so will be seen in a case of canal nerve 6th palsy. Yeah, correct, Sai. Correct, Gopinath. Correct, Lokesh. Correct, Khan, and correct. Fine. Next, if you're able to see, means this eyeball which is being rotated out on the lower aspect. Okay, and the patient also having these features of ptosis. As he is having these features of ptosis, then that only the examiner is lifting his eye. Okay, eyelid. So it will be this due to this involvement of which cranial nerve? Yes, Somesh, correct. Yeah, Khan. Yeah, yes, I. It is what, this is the involvement of 3rd cranial nerve. It is the involvement of this 3rd cranial nerve. Okay. Whereas remember, in the case of fourth cranial nerve, like there will be, it will produce this less pronounced symptoms, and this eye will be moved towards the inner side, and the patient will be there. The history there will mention the patient unable to do, means unable to go up and down in this using the, or having some difficulties in using the staircase. Okay, there will be mention of this. Yeah, correct, Khan Baisla, Gopinath. Yeah, correct. Then if you are able to see this kind of, if you're able to see, to identify this trophias, as a squint, you will do this type of test known as Hirschberg test, where you will able to identify this based on the location of this reflection. Fine. If it is away, it will be what? It will be the esotropia. If it is towards, it will be what? It is the exotropia. Means it will be the opposite one. Okay. Fine. Yeah, correct. Location and the Khan. With this understanding, we'll move on to the next part. Okay. So you're able to see this type of cobblestone papillae. Along with this spots around this limbus known as Horner Tanter spots. Along with this there is a features of ropey discharge. What you will think of? Yeah, correct. Gopinath Lokesh, yeah, Sai, yeah, Baisla. It will be something you will think of this vernal keratoconjunctivitis. And we know this vernal keratoconjunctivitis, it is a which type of hypersensitivity reaction? Yeah, can be seen. It is a which type of hypersensitivity reactions? Yeah, guys, answer. Yeah, it is what? It is the type 4 hypersensitivity reaction. No, sorry, it is not type 4, it is the type 1 hypersensitivity reaction. Yeah, Somesh. Yeah, it is not type 2, it is type 1. Yeah, Lokesh, it is correct. It is what? It is the type 1 hypersensitivity reaction. Next, if you are able to see this type of pits, which are known as Herbert's pits, and this line is known as Alts line, and then there is a Sago grain follicles. Sago grain follicles. All of these things they are seen in a case of which condition? They will be seen in a case of, correct, they will be seen in a case of trachoma. Okay, they will be seen in a case of trachoma. Remember, they will be seen in a case of trachoma. Yeah, correct. Sai, yeah, Lokesh. Yeah, correct. Yeah, we'll use this histo classifications starting from the follicles. Fine. Yeah. Yeah, correct, Praveen. It is the trachoma. Next, if you're able to see this formation of this Flickton nodules. Flickton nodules. It is what? It is the Flectonular conjunctivitis, which is what? Which is the deposition of this TB basically, or this superficial reaction of this TB, which is what? Which comes under this type 4 hypersensitivity reaction. Next. Okay. Yeah, safe strategy will use. Yeah, correct, Praveen. Next, if you're able to see this type of elastotic degeneration. Okay, elastotic degeneration of the conjunctiva. This will be seen in case of which of the following condition? Yeah, correct, Baisla. Yeah, correct, Gopinath. It is what? It is known as what? Pterygium. Yeah, it is on the nasal aspect. Yeah, correct. Yeah, for a more accurate answer. Yeah, and if you're able to see some kind of iron deposition over this pterygium, it is known as Stoker's line. It is known as Stoker's. In the stomach, it is known as Stoker's line, and this pterygium can result in the production of irregular astigmatism. It can produce this irregular type of astigmatism. Next, if you're able to see this type of ring-shaped ulcers, along with this means there is a history of contact lens users. What you will think of? Who is used to wash this contact lens on the water? What you will think of? Which disease you will think of? Yeah, correct. Sai, it will think of acanthamoeba keratitis. Acanthamoeba keratitis. Okay, you will think of acanthamoeba keratitis. Next. Okay. And if you're able to see a single ulcer, if you're able to single well-defined ulcer, yeah, correct, Gopinath. Yeah, correct. Yeah, for treatment of this pterygium, we'll use this conjunctival grafting. Fine. Yeah, it is mainly because of this bacterial. It is because of this bacterial corneal ulcer. Okay, and the most common cause of this bacterial corneal ulcer, it is what? It is the Pseudomonas. It is the Pseudomonas. Fine. Next, if you're able to see this fuzzy margin, along with this formation of this is a big one. There is a formation of this fuzzy margin, along with this formation of this satellite nodules. Okay, this will be along with, there is a history of, yeah, characteristic, yeah, there is a history of which trauma with vegetative matter. This will be seen in a case of which of the following? Yeah, it will be seen in a case of fungal corneal ulcer. Yeah, correct. Yeah, Sai. Yeah, Gopinath. Yeah, Kainz. Yeah, Baisla. Yeah, Praveen. Yeah, Dr. Khan. Yeah, Somesh. This is a fungal corneal ulcer, and you will be able to see this type of deposition or this collection known as hypopia. Okay, hypopia. Okay, collection of this pus. This is known as hypopia. Next, if you are able to see this type of dendritic, dendritic type of corneal ulcer, this will be seen in a case of which of the following? Dendritic, yeah, it is a dendritic ulcer, correct location. It is because of any viral, especially of HSV origin. Like mostly of HSV will cause this viral type of keratitis or viral corneal ulcers. Okay, just remember. Yeah, correct. Yeah, there will be decreased corneal sensation, so they will close this eyes, and when they open, there will be a huge trauma to this cornea. Fine. Yeah, correct. Baisla, Sai, and Kans. Fine. Yeah, cobalt. Yeah, correct. Yeah, this is the cobalt filter. Means when you use the slit lamp, there will be different types of filters. Okay, we'll use this filter known as cobalt filter. Okay, this is being asked in recent INSET exam. Fine. Next, if you're able to see this type of sign, which is seen on looking downwards. What is this sign known as? What is this sign known as? Yeah, guys. Yeah, the diagnosis you just made, it is what it is the keratoconus. Conus, what is this sign is known as? Yeah, it is known as what? It is known as, yeah, correct, Gopinath, Kainz, and Somesh, Ruchika. It is what it is known as what? Munsens. It's known as Munsens. Okay. And we know in the case of keratoconus, there will be a excessive curvature of this cornea. And this will lead to this production of this type of striae known as, what is the name of this striae we will able to see here? It's not Wilson. Remember we saw Wilson on yesterday's session, right? It is keratoconus. This produces which type of striae? This produces this Vox striae. Remember, it is a correct location produces this Vox striae. Okay, just if you flip this from this type of conus, and if you flip this, it will produce this Vox striae. Just remember, and there will be one more reflex will produce known as scissoring reflex. Okay, scissoring reflex, and there is, okay, just remember, it also produces one reflex known as scissoring reflex. Okay, but yeah, yeah, Dr. Khan, yes, you are getting it correct. Next, in the case of uveitis, we will able to see this collection of this capes along this triangle. What is the name of this triangle known as? It is known as arch triangle. It is known as arch triangle. Okay, it is known as arch triangle. This collection of this capes, it is known as what? Arch triangle. And if there is a large, if there is any granulomatous uveitis, it can produce this type of large capes known as, yeah, correct. It is correct. It is known as what? It is known as mutton fat capes. It is known as mutton fat capes. Yeah, Lokesh. Yeah, it is what it is the arch line. Yeah. Yeah, there is two types of iris nodules you will be able to see, which is actually not shown here. There are Basacus and Copis nodules. Okay, fine. Next, if you are able to see on healing this uveitis, if there is any iritis or iridocyclitis, it produces this type of pupil, which is known as festooned pupil. Okay, it is known as what? Festooned pupil. Fine. And yeah, thank you, Afzal Malik. Yeah, I hope you are enjoying it. Yeah, fine. Yeah, this capes they will be seen in a case of anti-uveitis. Fine. And next, if you're able to see this type of like headlight in a fog appearance, this headlight in a fog appearance will be seen in a case of toxoplasmosis. It will be seen in a case of toxoplasmosis. Just remember, it is in the case of toxoplasmosis. And yeah, this anti-uveitis, it is most commonly associated with this ankylosing spondylitis, which is what, which can be associated with this which is associated with this ankylosing spondylitis, which is is having this HLA association of HLA B27. Okay, just remember. And this positivitis, just by this toxoplasma, will produce this appearance known as headlight in the fox appearance. Yeah, correct, Somesh. Yeah, correct, Kaist. Yeah, correct, Dr. Khan. Next, if you're able to see, if there is any cyclitis or iritis which is being healed, it can produce two complications. It can lead to this formation of synechi. If it attaches to this posterior part, which is this lens, it can lead to this condition known as posterior synechi. Okay, this posterior synechi can attach to this lens. It can result to this condition known as secondary cataract or this complicated cataract. Fine, it can result into this cataract known as complicated cataract, which is because of this diseases. Fine. Next, if you're able to see, come to this types of cataract, you will see this type of whitish around this whitish hue. You will be able to see this type of cataract, which is what? Which is the mature cataract. And once this mature, it can become this hypermature cataract. And this hypermature cataracts are two types. Okay, this is what this inner cortex which is being liquefied. Okay, so that this nucleus which is being fallen down, it is what it is the Morgagnian type of hypermature cataract. This is known as what? Morgagnion's cataract. Fine. And if you're able to see this type of cataract, this forming this having this maximum type of visual handicap, it is what it is the posterior subcapsular cataract, which will be having this maximum visual handicap. Understand? Next, we are able to see this type of snowflake. Yeah, Gopinath, yeah, Somesh, yeah, Sai, yeah. It can lead to this phagolytic glaucoma. Phagolytic glaucoma. Yeah, correct. Okay. Yeah. Yeah, yeah, Lokesh. Yeah, thanks. It is what is the snowflake cataract. Okay. It will be seen in the case of diabetes mellitus. Next, this is what? This is the Christmas tree cataract, which will be seen in the case of myotonic dystrophy. Next, if you're able to see this cataract, this is the sunflower cataract. Okay. Which will be seen in the case of Wilson's disease. Yeah, correct. Praveen, correct. Thanks. This is the rosette cataract. Rosette cataract, which will be seen in the case of blunt trauma. Okay, blunt trauma. Remember. Next, if you're able to see this ectopia lentis, okay, if you see this ectopia lentis means dislocation of the lens because of this improper formation of this holding filaments. Yeah, wow. Thank you for this nice description, Somesh. Yeah, correct, correct, Gopinath. And next, if you're able to see this ectopia lentis and the superior-temporal, which will be seen in the case of Marfan syndrome. Okay, it will be seen in the case of Marfan syndrome. Fine. Yeah, correct, Gopinath. Next, and during this cataract surgery, we need to stain the capsule. So we'll use this stain known as tryptan blue, and we'll use this forceps known as we'll do this procedure known as capsulorhexis. For this, we'll use this forceps known as capsulorhexis forceps. Okay, just remember. Yeah, Dr. Khan, yeah, you are getting it correct. Next, if you're able to means we need to differentiate this cortex from the nucleus. So for that, will do this thing known as hydrodissection. Okay, hydrodissection to differentiate this cortex from the nucleus. Correct? Yeah. Next, if you're able to see, means to differentiate this part of this nucleus, we'll use this procedure known as hydrodelineation, in which you're able to see this glow. This glow will be seen in a case of hydrodelineation. Okay, try to differentiate this hydrodelineation from this hydrodissection. Okay, just remember, delineation means done in nucleus. Delineation means done in nucleus. Whereas dissection, it will be done from the capsule to the nucleus. Okay, just remember. Okay, don't get confused. Next, this after cataract surgery, there might be few complications. This is known as what? Erschling pulse. This rings formation known as Somers rings. This is what this both of them, there will be this complication known as secondary cataract, also known as postcapsular opacification. Okay, posterior capsular opacification. Next, sometimes you will able to see this accumulation of fluid inside this macula known as macular edema, known as Irwin gas syndrome. Okay, Irwin gas syndrome. Next, there are two types of IOL, means type of posterior chamber IOL will place. There will be a unifocal type, and there can be a multifocal type. There can be a unifocal one, or there can be a multifocal one. Yeah, correct, Somesh. Yeah, correct. Yeah, in a case of phaco surgery, we'll use this foldable IOL. Yeah, correct, Dr. Khan. Next, if you're able to see, these are the exudates. If you're able to see this type of hard exudates, will be seen in a case of non-proliferative diabetic retinopathy, and you will be able to see this kind of neovascularization, which will be seen in a case of proliferative diabetic retinopathy. And for this neovascularization, we'll use this. Yeah, correct. Sri Sai, CR we are having in upcoming slides. Ruchika, just wait. Fine. In the case of proliferative diabetic retinopathy, you will be able to see this kind of neovascularization, and for this, there is a factor which is being responsible known as VEGF, vascular endothelial growth factor. To against this, we'll use this drug known as bevacizumab and ranibizumab. Okay, just remember these two drugs are remembered as bevafarani. Fine. Next, this is the soft exudates. which will be seen in a case of hypertension. Okay, for this type of neovascularization, yeah, a characteristic will use this type of procedure known as panretinal photocoagulation. Okay, we'll do this procedure known as panretinal photocoagulation. Fine. Next one, you are you are waiting for this image, right? This is what it is. It is the cherry red spot, which will be seen in a case of CR VFO. Fine. You will able to see this tomato splash appearance. You will able to see this tomato splash appearance in case of CR Vivo. Okay, this is what this is the pizza pie appearance. Yeah, yeah, they are ophthalmic emergency. Yeah, CRAO, it is an ophthalmic emergency, correct? Yeah, correct, Sai Khan. Yeah, you are including with the answers. Yeah, Praveen and Ruchika. Yeah, it can be associated with some other diseases like Tay Sachs, name and pick. Okay, this cherry red spot, so it is non-specific one. Then this pizza pie type of retinitis will be seen in the case of CMV retinitis. It will be seen in the case of CMV retinitis. Fine. Next one, if you are able to see this pale optic disc along with this retinal pigmentation. Okay, this will be seen in a case of retinitis pigmentosa. Okay, retinitis pigmentosa. Fine, it will be seen in a case of retinitis pigmentosa. Yeah, it will be because of this CMV retinitis, which is because of a viral infection post HIV patients most commonly seen. It will be at the level of CD4 count less than 50. So to treat this, we'll use a drug known as valganciclovir. Okay, or ganciclovir. Okay, just remember. Yeah, correct, Gopinath. In the case of retinitis pigmentosa, we'll use this. We'll see this classical findings. Fine. Next, if you able to see this, if you able to see this retinal calcification, retinal calcifications will be typical for this retinoblastoma. Okay, just remember it will be typical for this retinoblastoma. Okay, yeah, correct, Dr. Khan. And next, if you are able to see this buphtalmos, along with these features of photophobia, blepharospasm, along with features of um, continuous lacrimation. Okay, all of this thing will be seen in a case of congenital glaucoma. All will be seen in a case of congenital glaucoma. Yeah, yeah, Dr. Khan, correct. Yeah, Rose. Yeah, it is the increased lacrimation will be seen in a case of congenital glaucoma. And we know in a case of glaucoma, the cup to disc ratio initially there will be around, it will be around 0.3. If it is more than 0.3, around more than 0.7. Okay, it will consider as this is a optic changes because of glaucoma. Fine, just remember. Then if you're able to see this streamy hard cornea along with vertically oval pupil, which will be seen in a case of angle closure glaucoma. This will be seen in a case of angle closure glaucoma. Yeah, correct? Yeah. Yeah, it will be more than 0.7. And for this angle closure glaucoma, we'll do this procedure known as laser iridotomy. Okay? Okay? To relieve this pressure. Fine? Okay, guys? For this optic changes, they'll be preceded, means they'll be later on, they'll be having this visual field defects. Initially, there is a blind spot, and initially around this, there will be development of this paracentral scotoma. Initially, there will be development of this paracentral scotoma. Yeah, that will be because of this anterior shallow chamber, the angle closure glaucoma will happens. Right? There will be a paracentral scotoma followed by this nasal stepping. Okay, this one is nasal stepping. Around this nasal side, there will be stepping, and there will be a formation of this arcuate scotoma followed by this Bajoran scotoma, extended Bajoran scotoma. Fine, and there will be a tunneling of this vision, and then last there will be a complete vision loss, and last there will be a complete vision loss. Yeah, Rose. Yeah, yeah, correct. Initially there will be arcuate, they can extend as double arcuate. Yeah, correct. The last to be the most resistant, it will be the temporal field. Fine, that's why able to see this temporal field is least affected, whereas this nasal stepping is the first one to be affected. Fine. Next, if you're able to see this child who is having this increased lacrimation, okay, increased lacrimation, and you will able to see this type of plaques. It will be due to this congenital dacrocystitis. Okay, congenital dacrocystitis. Okay, due to this congenital dacrocystitis, most commonly due to this nasolacrimal duct obstruction, most common at this valve of Hasnath. Okay, most commonly at this gall of Hasnath. Yeah, correct, Somesh. Yeah, yeah, correct. Yeah, correct, Lokesh. Fine. And we know initially we'll tell them to do massage, and if it is relieved, it's okay. If not, we'll do on first year and 1 year, and after 1 year, we'll do what we'll do. We'll do syringing first or the probing first. Yeah, initially we'll do syringing followed by this probing. So okay, so after 1 year we'll do syringing, and after 3 years we'll do this probing, and the final one it will be the means it will be the definitive surgery. If it is doesn't heal, it will do this definitive surgery and make it open into the middle meatus instead of inferior meatus. Fine, and this is the chronic dacrocystitis. Fine. Next, if you're able to see this thing due to this inflammation, it is known as what? Style, also known as external hordeolum. Fine. Next, if you're able to see this inner swelling, it is known as what? It is the internal hordeolum. And we know external is because of this gland of Zeiss involvement, whereas here it is because of this Meibomian gland involvement. Meibomian gland involvement. Yeah. Yeah, Rose, it is a style and it will be painful. Yeah, correct, guys. Next, if you're able to see this chronic one, it is the what? It is what? It is the calizion. Okay. And this is what? This is the calizion clamp. Okay. And this is what? This is the calizion scoop which we are using to scoop out. Okay. Which is using to scoop out the contact. Fine. Yeah. It will be away from the lid margins. So it will be away from the lid margins, while it will be at the level of lid margins. Fine. Next, we will be able to see there are two things, which is what? If the lid is everted, it is known as ectropion. Okay. For which we do this Zomnesky procedure. And if it is turned inwards, it is known as what? Entropy. This is ectropion. Okay. Just remember these two things. Fine. Next, this is what? This is the thyroid ophthalmopathy. Thyroid ophthalmopathy. And remember, this is in a case of thyroid ophthalmopathy. Yeah, correct, summation Baisla. Yeah, it is most common as the Graves' disease. And in the case of thyroid ophthalmopathy, the first muscle to be involved, it is the inferior rectus. The most common muscle to be involved, it is the inferior rectus. And we know, okay, the most common one, it is the inferior rectus. And there are different signs, okay, different signs, the Darlimpel signs. Darlimpel sign. Fine. And next, if you're able to see this teardrop sign, fine, this teardrop sign will be seen in the case of orbital floor fracture. Okay, orbital floor fracture, and they'll be having these features of dye features. Fine, there will be a diplopia. There will be a infraorbital anesthesia, following by this means eyeball they will go inside, so there will be a inophthalmos. Because why there is a diplopia? It's because correct, Gopinath, Rose, Baisla, Somesh. Yeah, why there is diplopia? Because the inferior apex it will be trapped. Fine. Next, we'll come on to few other pupillary signs. If there is a constricted irregular pupil, okay, constricted irregular pupil, okay, which will be positive, means which will be positive for this like accommodation reflex, means accommodation reflex positive and the pupillary reflex absent. It is what? It will be suggestive of which of the following people? It's just a light showing. It is what? It's which type of people which will be having this constricted and irregular people. It is what? Yeah, correct, guys. It is known as what? It is the Aril Robertson people. Yeah, fine. It is what? It is the Aril Robertson people. And next, if you're able to see, this people, you will be able to see there is a enlargement, means there is a dilation. Okay, this type of people, it is having this dilation. It is known as what? Unilateral dilation. Unilateral followed by a viral infection. It is what? It is which people? It is known as what? Pupil. Remember, Aedes pupil. It is seen in ladies. Okay, and this is what? This is the Aril Robinson pupil. Okay, next one. Okay, if there is a relative afferent pupillary defect, it will be seen in a case of optic neuritis. Fine. And if you're able to see this kind of small ptosis, yeah, Aedes ladies, yeah, correct, guys. Aedes will be seen in ladies, correct. initial gaming, if you're able to see this ptosis, and if you're able to see this constriction of the eyes, this meiosis, okay, and if there is also anhydrosis, it will be seen in a case of Harness syndrome. It will be seen in a case of Harness syndrome. Just remember, it will be seen in a case of myasthenia gravis. It will be bilateral, but here, if you're able to see, it is a unilateral one, so it will be typical for this Harness syndrome, and you will be able to appreciate this is a normal people, this is a constricted people, so it is a meiotic people. Okay, just remember. Okay, don't get confused. Those, neurogenic. It is the third one. Next, in this image, you'll be able to appreciate this visual field defect. In this, you just need to know just one, like one or two only, which is you need to differentiate. If you're able to see, if there is any lesion at this optic chiasma, it will produces this heteronymous type of anopia. Heteronymous anopia, which is known as what? So, which is a bitemporal heteronymous hemianopia. Just remember, it is a bitemporal and heteronymous, not the homonymous. Whereas others, it will produces this homonymous defects. Fine. This macula means if there is any occipital lobe involvement, if there is any occipital lobe involvement, it will produce this macula sparing type of visual field defect. Fine. Guys, hope you are getting it correct. And this is what, if there is any superior quadri anopsia, it is also known as pie in the sky, which will be seen in a case of temporal lobe involvement, which is the damage to this temporal lobe fibers. Whereas this one, pie in the floor, will be seen in a case of parietal lobe, parietal fibers damaged. Okay, just remember. Correct base law, Lokesh, you are getting it correct. Fine. Yeah. Next, if you're able to see, if both of this thing, if both of this light, if they are falling into the same axis, then it is just a myopia. But if there is two different axes, if they are falling, then it will lead to this type of visual field defect. They are known as what? They are known as astigmatism. Okay, they are known as astigmatism. Fine. And there are few other visual means there are few other defects. Like for example, in the case of myopia, which type of lens we use? Yeah, guys, which type of lens will use in the case of myopia? Concave lens or a convex lens? Yeah, myopia, we know it is a nearsightedness. Fine. Okay, for this we need to make this race, means like we know we will see just the near one, we won't, means we'll see just the, like it is known as nearsightedness because, and we use this concave lens so that to spread this waves which are being formed, means coming from the far, okay, from the far part, means from this far vision which are the lights coming, we will use this concave lens and will make them to diverge. So we'll use this concave lens in the case of myopia, whereas we'll use this convex lens in the case of hypermetropia or hyperopia. Okay, just remember. And if there is any change in the axis, so it will be known as astigmatism. Okay, there are different types of astigmatism. There might be a simple one, there might be a complex one. A correct Basel and Rose? Yeah, correct. Fine. With this understanding, we'll move on to the ENT part, and after ENT, we'll take a break. Fine. Fine. This will be means will be more 10 minutes, like around 10 to 15 minutes. We'll take the ENT and we'll have a break from 10 o'clock. Fine. And in here, in external ear, yeah, okay, yeah, kinds. In external, you need to know this nerve supply. Nerve supply means if you hold your ear like this, means if you hold your ear like this, means this anterior part and the posterior part and this angle of this mandible, all of these three, it will be supplied by this nerve which is known as greater auricular nerve. Okay, this lobule, it will be supplied by this greater auricular nerve. Just remember, and this angle of this mandible, it will be supplied by this greater auricular nerve. Okay, the posterior surface, it will be supplied by this lesser occipital nerve, and here the anterior superior part of this pinna, it will be supplied by this auriculotemporal nerve. Okay, whereas this near to this external auditory canal, it will be supplied by this branches of this 10th cranial nerve. Okay, these are the things you need to know about this nerve supply. Next, if you are able to see, this is how this otoscope looks like. Means until like ophthalmoscope with a different magnifications, this otoscope, it will be having a single magnification. Just remember. Fine. And we know it's our external auditory canal, it's not a straight canal, so we need to, yeah, correct. Yeah, correct, guys. Like no, it's not GAN. It's auriculotemporal nerve which is being damaged during this parotid surgery. Okay. Like, yeah. Okay, just remember. And next, yeah, gan also can be get damaged. Like that's why they will tell like during shavage, during shaving, he won't able to feel these sensations over this angle of mandible. Okay, fine. Yeah, we need to means so for otoscopic examinations, we need to pull this ear upwards and outwards. Okay, just remember we need to pull this ear upwards and outwards. Fine. Next, we'll move on to some external ear conditions. Fine. Yeah. Yeah, there is also syndrome known as in which if there is an involvement of this ATN, it can lead to this cross innervation. Okay, and it can lead to the syndrome known as freeze syndrome. Fine. Yeah. Yeah. Correct. Correct. Yeah, correct. Rawat. Fine. If you're able to see this type of ear, it is known as what? It is known as cauliflower ear. Okay, cauliflower ear, which is actually what it is the because of this repeated trauma, it will lead to this pinna perichondritis. Yeah, perichondritis. Okay, fine. Next one, if you're able to see just this inflammation over this ear, it is what? It is the otitis externa. Okay, and if you're able to see this otitis externa along with this formation, of this mycotic or this mycotic air inside, it is what? It is the otomycosis. Okay, if there is any external otitis externa along with this otomycosis, it is known as what? It is known as Singapore ear. It is known as Singapore ear. Okay, it is also known as Swimmer's ear. Okay, whereas this exostosis, it is exostosis, it will lead to this type of ear known as surfer's ear. It will lead to this ear known as surfer's ear. Next, if you are able to see this thing, there is a chronic ear discharge along with this formation of this granuloma, and there is a history of diabetic patients. So this is what? This is which type? What is the name of this otitis externa? Yeah, guys, it is known as malignant otitis externa. And the causative organism, it is what? It is what? It is the Pseudomonas. It is the Pseudomonas. Fine. Yeah, guys. Yeah, Baisla. Yeah, Rose, you are getting it correct. Next, if you see, this is how this normal tympanic membrane appears, and this is the normal cone of light. And we know in right ear, it will be at the level of 5 o'clock position. It will be level of 5 o'clock position. Okay, fine. Next, if you able to see, this is the retractor tympanic membrane, how it looks like. Next, this is the tympanic membrane perforation, like mostly because of this chronic CSOM. Yeah, 5 at the level of right at the level of 5 o'clock, left at the level of 7 o'clock position. Correct, Lokesh? Fine. Next, we will to see this irregular perforation of the tympanic membrane along with this some bleeds. So it will be representing of traumatic tympanic membrane rupture, and management will use do this conservative management. Next, we'll insert this type of for any of this in a case of ASOM or in some conditions of glue ear, we'll use this instrument which is known as what? Which is the grommet. Okay, we'll insert this thing known as grommet. Fine. Next, if you're able to see in the case of ASOM, if there is an accumulation of this pus and it will produce this type of bulging out tympanic membrane known as, along with this visible vessels, it is known as what? Cartwheel appearance seen in the case of ASOM. And next, this is what? This is the tympanic membrane perforation. Okay, and leading to this means and starting of this ossicular getting eroded. Fine. Yeah, acute SOM. Correct, Rose. Fine. Next, you are able to see this white mass begin this intact tympanic membrane. This will be seen in a case of congenital cholesteatoma. This will be seen in a case of congenital cholesteatoma. Next, you are able to see this flamingo pink sign. Flamingo pink. It is known as what? Schwartz sign, and it will be seen in a case of otosclerosis. It will be seen in a case of which condition? It will be seen in a case of otosclerosis, and this represents the presence of an active disease. Okay, if it is there is an active disease, we can give sodium fluoride and we can treat the patient. Okay, correct Basila and correct Rose. Fine. And next, you need to know just few things. This is how this normal ossicles looks, because sometimes they will ask you some most basic questions. This is how this stapes looks, and this is how this malus looks, and this is how this incus looks. Okay, Incus will be having this broad one. So remember, that is the incus. Okay, don't get confused. Yeah, in a case of otosclerosis, you will get this AS type of cough. We'll see in upcoming slides there. Fine. Next, if you're able to see, if there's any, just half of this ossicles are being eroded, we'll use this partial ossicular uh, prosthesis. Fine. Whereas if there's complete erosion, we'll use this total prosthesis, which is known as TOR prosthesis. Fine. Next, we'll do this type of, yeah, means like malleus incus, it will be from this first arch, which is they are known as like Meckel's cartilage, whereas stapes, it will be from the second arch. Fine. Don't get confused. Yeah, correct, Rose. Fine. Next one, if you're able to see this type of tympanic membranes, like if you just replace this tympanic membrane, it is known as myringoplasty, it is the type 1. Whereas in type 2 and type 3, there will be some ossicular damages. Okay, type 2 and type 3, there will be ossicular damages. You need to remember about this type 3. In type 3, okay, you will go and place this tympanic membrane or this tympanic membrane graft into this, directly into the footprint of this stapes. Fine. Fine. You just remember about this type 3 one. Okay, this will be enough for your exams. Okay, fine. If you're able to see this fluid levels along with this air bubbles, means behind this tympanic membrane, in which one of the following conditions you'll be able to see this type of tympanic membrane findings? Serous otitis media, also known as glue. Okay, glue. Fine. Okay. Next, you'll be able to see some curves. Fine. Some curves will be, means like pure tone audiometry, we'll be able to see. If there is, this is how this normal PTA graph looks like, and if there is any gap between this air conduction and bone conduction, it will be known as what? Yeah, correct. Mahir brother, you are correct. This is what, this is known as what? AB gap, which is seen in a case of conductive hearing loss. Fine. And if you're able to see, deep in this both BC curve and AC curve, it will be what? It will be the sensory neural hearing loss. And if there is a dip at the level of 4000 Hz, it's because of this, especially because of this type of known as noise induced hearing loss. Because of this noise induced hearing loss, it's also a type of sensory neural hearing loss. Yeah, correct, Rose. There will be no AB gap. But if you're able to see, means there is a AB gap and there is a decrease in like AC and BC also. So this will be seen in a case of mixed type of hearing loss. This will be seen in a case of mixed type of hearing loss. And if you're able to see just a dip in this bone conduction curve at 2000 Hz, it is known as which notch? It is known as Cohat's notch, which will be seen in a case of otosclerosis. It will be seen in a case of otosclerosis. Okay. Yeah, correct, Basila. Yeah, noise is hearing loss. It is at the 4000 Hz, known as Boyer's notch. Okay, it is known as Boyer's notch. Okay. Yeah, correct. Rose, it is known as Cohat's. This one is known as Cohat's notch. Next, this is how this normal curve appears. Okay, this is how a normal curve. Okay, okay. If you're able to see this, how this normal curve appears, whereas in a case of otosclerosis, this will produce a small curve. This will produce the small type of curve. So this is what this is seen in a case of AS type of graph, which is seen in a case of otosclerosis. Next, if you see any ossicular disruption, this ossicular disruption produces this type of distant curve. This distant curve, it will be produces by this. This distant curve will be produces by the ossicular disruption, or like if there is any dislocation of these ossicles. Next, if you are able to see this type of normal A curve, which is around this, means which is shifted to the left side, it will be seen in a case of, which is known as the type C curve, which is will be seen in a case of eustachian tubal obstruction or any retracted tympanic membrane. Fine. Next, if you are able to see this type of flat curve, which is known as what? Which is known as type B graph, which will be seen in a case of if there is any fluid accumulation in a conditions like glue here. Fine. And this is what? This is the type C curve, which will be seen in a case of retracted tympanic membrane or any eustachian tubal obstruction. Fine. And next, for child, yeah, okay, congratulations, means like all the best for your first attempt, Mayur. Okay, don't worry, like you will come with flying colors, and everyone who will be means attempting the sessions, like I will be always wishing you to have a success ahead. Like I'm coming out with flying colors in this upcoming FMG exam. Okay, don't lose hope. Like it's just a few more days ahead. Like okay, don't think that everything is getting forgotten, means you are forgetting everything. Don't worry, everything will be stored in your subconscious mind. It will help you out in the exams. Fine, don't worry. Fine. There are two tests we'll used to do. Like this is the BERA. Okay, this is known as what? BERA. Okay, brainstem. Yeah, correct. Okay, Somesh. Yeah, yeah, nice to hear from you. Fine, this is what this is the BERA, which is the diagnostic tool or this confirmatory test for any um, hearing loss in infants. Fine, we can use this screening tool known as auto acoustic emissions also. Fine, just also remember. But this is the BERA one, and just remember this BERA charts. Just remember about this fifth, which is the more prominent curve, which is be produced by this lateral lemniscus. Yeah, yeah, I remember you so much. Fine, and in the case of BPPV, in the case of BPPV, you will be able to do this two maneuver. Okay, one is known as this Dix haplex maneuver, which consisting of these two parts. Okay, it will be having these two parts, which will be used for this diagnosis. Okay, Dix will be used for this diagnosis. Okay, next one, which is this Epley's maneuver. Okay, Epley's maneuver, which consisting of 5 steps. Yeah, correct. FMG aspirant, it will be consisting of five steps, and those correct, it will be consisting of 5 steps, and it will be used for this treatment. Okay, for the management. Okay, just remember. Next, if you will to see, this is the ironed out mastoid, which will be seen in a case of mastoiditis. Okay, it will be seen in a case of mastoiditis. Okay. Next, you will be able to see, means this is the HRCT, which will be saying the same, means in the case of mastoiditis, you will be able to see this fluid accumulation, yeah, which will be showing this acute mastoiditis. Correct Ross, correct Baisla. Fine. And you will be able to see this contrast enhanced MRI, which is this gadolinium enhanced MRI, showing this ice cream cone. Okay, ice cream cone appearance. Fine. This will be seen in a case of acoustic means like vestibular schwannoma, also known as acoustic neuroma. Okay, and if it is bilateral, it is most commonly seen in a case of NF2. It will be associated with this NF2. Just remember. Fine. Yeah, guys. Then we'll move on to few instruments. Fine. If you're able to see, this is known as what? Seagull's speculum. It is known as what? Seagull's speculum, which we'll use to know this test known as seagullization. Next, this is known as what? This is known as this Jobson harness probe. Okay, this is known as what? Jobson Horny probe. Okay, which is used to remove any foreign bodies, which is used to remove any foreign bodies in the EAC. Fine. Yeah, the most common cause of mastoiditis, it will be what? It will be infection which is being tracking from the CSOM. Okay, it is the most common cause of mastoiditis. Okay. Next one, there are two forceps you need to remember. If it is a straight one, it will be what? It will be the Walsum forceps. If it is a curved one, it is known as what? Ash forceps. Okay, and Walsum's forceps it will use for this nasal bone reduction, whereas this Walsum forceps will use for will use for this cartilaginous part. Fine. Like there is no any specific organisms. Mostly the mixture of organisms. Like mostly it can be a like pseudomonas origin. Okay, I'll just confirm in the break and I will let you know, Rose. Fine, but like what I remember is it is most commonly pseudomonas family. Once I will confirm and I will let you know. Fine. Then this is what this is. If you're able to see this type of electrode which is being placed in the brainstem, it is what it is known as what? Auditory brainstem implant. Fine. This is known as what? Auditory brainstem implant. Next, if you're able to see, this is the laryngoscope which we are using, which is the McIntosh type of laryngoscope. Next, this is the indirect laryngoscopic mirror, we are used to do for, which we are doing for this indirect laryngoscope. Fine. And we know indirect laryngoscopy, with indirect laryngoscope, we will not able to appreciate few structures like below the vocal cord and this anterior commissure, and below this epiglottis and this anterior commissure of this epiglottis. Just remember a few things. Fine. Next, this is what? This is which process? This is known as what? Bloom-Singer prosthesis. And this is what? This is the electrolarynx. Fine. And this is what? This is the BAHA, bone anchored hearing aid. Okay, this is the BAHA, which is known as bone anchored hearing aid. If there is an EAC atresia, you will be able to see there is no external acoustic canal. So if there is an EAC atresia, it is the indication for BAHA. Yeah, correct, Somesh. Fine. Then we'll move on to the larynx. If you're able to see, this is how this normal larynx looks like. Fine. If you're able to see this type of nodules, bilateral nodules, Okay, bilateral nodules between this anterior one third and the posterior two third. It will be known as what? It is the vocal nodules, also known as singers or screamers nodules. Fine. It is also known as singers or the screamers nodule. Next, if you are able to see this unilateral one, if you are able to see this unilateral one, it is what? It is the vocal polyp. It is the vocal polyp. Just remember, it is the vocal polyp. Fine. Next, if you are able to see this omega shaped epiglottis, which will be seen in a case of laryngomalacia. Laryngomalacia. Next, if you are able to see this mouse nibbled appearance, mouse nibbled appearance of vocal cord will be seen in a case of TB epiglottis. Okay. Next one. This is what? This is the respiratory papillomatosis. Fine. Yeah, it will be between this anterior one third and the posterior two third. Just remember. Fine. And this is this. Sometimes they will mark you this part, and they can ask you what is the means there is a fish bone which is being stuck over here, and which of the following nerve can be injured. Okay. Fine. The location will be mostly same. The nodules and the polyps location will be same. Whereas this nodules will be bilateral, whereas polyp will be unilateral in nature. Fine. And the most common nerve which is being injured here, it will be the internal laryngeal nerve. It will be the internal laryngeal nerve. Okay. Just remember these things. Fine. Next, if you're able to see, if you're able to see this type of, there is a history of he's having by occupation. He's a trumpet blower. On examination, there is a lateral extension. You will able to see some kind of air collection, and on pressing, you will able to see this like air which is being exiting, known as by sign positive. This will be seen in a case of which condition? This will be seen in a case of laryngoscale. This will be seen in a case of laryngoscale. Okay, and we know there is a correct somesh, correct lokesh, correct bisla. It is the laryngoscale. And next, we are able to see within this muscle, which is this thyropharyngeus and this cricopharyngeus. Okay, between this thyropharyngeus and the cricopharyngeus, there is an area known as clearance area or clearance dehiscence. And this clearance area or clearance dehiscence, it can lead to this outpoaching structure known as Zenker's diverticulum. Okay, correct Praveen, and correct Baisla, correct Lokesh. Fine. Next, we'll move on to this phases. We'll able to see this typical phases where you will able to see this pinched nose, and there is a mouth breathing along with this pinched nose will be seen in a case of adenoid hypertrophy. Fine. Where else you will able to see this frog face deformity. Frog face deformity in a case of juvenile nasopharyngeal angiofibroma. Yeah, correct Logesh, Praveen, correct Neerpal. Fine. Yeah, it will be seen in a case of juvenile nasopharyngeal angiofibroma. And the artery which is being responsible, it is the sphenopalatine artery. Fine. And if you are able to see this anterior bowing of posterior wall of maxilla, it will be seen in a case of the same juvenile nasopharyngeal angiofibroma. Just remember, it is known as what? It is known as Holman-Miller sign. Okay. Yeah, correct Neerpal and correct Praveen and correct Lokesh. Fine. Next, you are able to see if there is any uvula which is being having this edema, it is known as what? Quincke's disease. Whereas if there is any abscess if there is any abscess and which is being peritonsal abscess which is being pushing this tonsil towards the opposite side, it is known as quinsy. Okay, it is known as what? It is known as quinsy. Next, if you are able to see, there is an abscess inside, and along with this abscess, yeah, correct Praveen, correct Baisla, and along with this abscess, there is an outward swelling, and if there is any swelling inside abscess cavity and outside, this if there is two cavities, it will be what? It will be the parapharyngeal abscess. If there is any swelling inside and outside, it will be parapharyngeal abscess, and we know in a case of parapharyngeal abscess, the uvula will be in the midline. It won't be shifting to the opposite side. Fine. Next, if you are able to see, if there is any increase in this retropharyngeal shadow, it will be seen in a case of this increasing in this prevertebral shadow. It will be seen in a case of retropharyngeal abscess. It will be seen in a case of retropharyngeal abscess. Just remember. Fine. Next, if you are able to see this, just the below mandibular swelling, the correct location by Isla. If you are able to see this below mandibular swelling, it will be seen in a case of Ludwig's Ludwig's angina. Okay, it will be seen in the case of Ludwig's angina. Fine, just remember these things. Yeah, Quincy and Quincy, they are different. That's why just note like brought to your point. Quincy, remember, Quincy, it is a peritonsillar abscess. Whereas Quincke disease, you'll able to see this this uvula edema, it is what it is the Quincke's disease. Okay, okay. The small changes, like small changes, will bring you a big drastic changes in your exam performance. So just don't forget these simple things. Okay, Rose? Fine. Next, if you're able to see this external nose, which is looking like a potato. So, or this also known as potato tumor. That is what it is. Which nose? It is due to which one? Yeah, it is what it is. It is due to the blockage of this ducts, which is leading to this condition known as rhinophyma. Okay. Next, if you are able to see this image, in which you will able to see this wide, roomy nasal cavity, along with this formation of this crusts. It will be seen in a case of which condition? Yeah, guys. Yeah, blockage in this sebaceous ducts. Yeah, correct. Praveen, Rose alpha. It is seen in a case of atrophic rhinitis. It is in the case of atrophic rhinitis, yeah, correct. And this part is atrophic rhinitis. We'll do this operation known as modified Young surgery. Fine. This combination of this both deformation of this external nose, it is seen in the case of rhinoscleroma. Okay, and there you will able to see this type of cells on these bodies. Okay, this they are known as, yeah, atrophic rhinitis. We won't use a single drug. Okay, we'll use this. Will you give this cal means like sodium bicarbonate, and this other means nutritious contents known as alkaline nasal douching. Okay, we'll do this procedure and we'll give nutrition to this mucosal layer and we'll make them grow. Okay, and so we won't give a particular drug. Okay, and we'll do this surgery known as modified Young's operation, in which will just means will close one nose and will promote less airflow through this, so that it will get healed much easier. Okay, just remember. And if there is a history of trauma, and if you're able to see, this type of septal swelling, there is a history of trauma along with the septal swelling. Okay, this is what this is due to the septal blood collections. Okay, yeah, sodium bicarbonate, sodium biborate. What? Okay, this is the septal hematoma, and we know in the case of septal hematoma, we need to do immediate aspiration of it, and if we means yesterday also we saw this is the rhinosporidiasis. Sporidiasis. What? Okay, yeah, correct, Rosalpha, correct, Baisla. Fine. Next, if you're able to see this image, yep, yeah, something is falling from this maxillary cavity, and on posterior nasal rhinoscopy, you'll be able to see some kind of mass. It will be what? It is the antroconal polyp. Okay, antroconal polyp, mostly it will be single. Okay, next, and an anti-rhinoscopy. This is what? This is the anti-rhinoscopy. Okay, and this is what? This is the pseudicum speculum. This is pseudicum speculum, which is used for anti-rhinoscopy. And an anti-rhinoscopy, if you're able to see this multiple polyps, which will be seen in a case of ethmoidal polyp. Okay, and this is how this nasopharyngeal carcinoma looks like. Okay, what is the origin of this nasopharyngeal carcinoma? A quick answer, guys. A quick check. Yeah, it is the fossa of Rosenmuller. Yeah, correct, Rose. It is the fossa of Rosenmuller. Okay, Rosenmuller. Then just remember this triad you will be able to see here. Fine. Anti-social should be known as fossa of Rosenmuller. Next, it is this type of fracture which are known as this Leaford's fracture. Remember this Leaford's fracture, you just remember this Leaford type 1 means it will be separating this palate from the superior structure. So type 1, you just keep your one hand, it is the type 1 fracture. For this type 2 fracture, you just join these two hands and make this triangle. So if there is this type of fracture, if there is a triangular fraction, it is the Leaford's type 2. Whereas type 3, it is the craniofacial distension. So okay, it is the type 1, type 2 and the type 3. Okay, fine. And this is next one, it is the nasal bone fracture. This is the nasal bone fracture. Next one, if you're able to see, this is the nasal septal fracture. There are two types of nasal septal fracture. One is what? One is the jawway fracture. Next one is the chevrolet fracture. This chevrolet fracture, it is the vertical fracture, whereas this jawway fracture, it is a horizontal fracture. Okay, fine. This is known as what? This the jawway, it is this horizontal fracture, whereas this chevrolet fracture, which is the vertical fracture. Okay. Yeah, type 2 and type 3. Yeah, correct, Somesh. There is a type 2 and type 3. It can be associated with this feature known as traumatic CSF rhinorrhea. Fine. Next one, on base of this, okay, at the floor of this orbit, you will able to see this type of cells. Okay, there are some added cells to this paranasal sinuses. They are known as what? They are known as this Heller cells. Okay, on the floor it is known as what? Heller cells. And or if it is relation to this optic nerve, it is known as Onodi cells. If it is in relation to this optic nerve. Okay, and there are few views you need to remember. If you're able to see this closed mouth along with this view, it is known as what? It is known as what? Water's view. Just to keep this water inside, you need to close the mouth. This is the closed mouth. It is known as water's view. If it is an open mouth, it is known as Pierce view. Okay. And if it is occipitomental view, it is what? It is what? It is which one? Which is it is known as Caldwell's view. It is known as what? Caldwell's view. Okay, it is known as Caldwell's view. Fine. Next, we'll move on to this. Just two more slides. Then we are done with the ENT. But then we'll have a good break. Fine. Yeah. Second one, it is the Caldwell. It is the Caldwell one. Fine. Next, if you're able to see this thumbprint appearance, okay, thumb appearance on a lateral chest, on a lateral spine X-ray. Along with this lateral neck X-ray, along with this there is a rising sun sign. All of this will be suggestive of which of the following conditions? Yeah, Lokesh, it will be suggestive of acute epiglottitis. Okay. Next one. This is what? This is the steeple sign. This is the steeple sign which will be seen in a case of croup or tracheobronchiolitis. Tracheobronchiolitis. Okay, this will be seen in a case of tracheobronchiolitis. Fine. Next one, you need to remember about this tracheostomy tube. Okay, this tracheostomy tube, if you're able to see, just you need to differentiate between these two tubes known as Jackson and this Fuell's tube. If you're able to see this Fuell's tube, it will be having this F type or this splitted one. So this Fuell's tube, it will be a flitted one and it will be having the two components, whereas this Jackson will be having this three components and it will be a complete tube. Okay. Next, these are the two types of plastic PVC tracheostomy tubes. This is the uncuffed one and this is the cuffed one. Fine. Next one. Remember this foreign bodies. Remember this esophagus. Remember, if you write this esophagus in this anterior view, you'll able to see this AP view. You'll able to see this complete coin. Okay, complete coin. It will be seen in the case of AP view. Fine. Whereas in the case of trachea, you will able to see this formation of slit. Yeah. Cuffed is better than uncuffed. Means like it's based on the scenarios. For example, if it is a child, will prefer this uncuffed one. Fine. Whereas in adults, will use this cuffed one. Fine. Just remember. And one more thing is that for any chronicity, means like for any chronicity, we'll use this cuffed one. Fine. And this cuffed one, it will prevent this aspiration also. Yeah, correct, Rokesh. Yeah, Praveen and Somesh. Fine. Next one. If there is a patient who is presenting with this features of this vesicular eruption of this rashes along with this facial palsy, what you will think of? What is this condition you will think of? Yeah, guys. Yeah, Somesh. It is what? It is a classical feature of Ramsay-Hunt syndrome. It is a classical feature of Ramsay-Hunt syndrome. Next, this is the line which is known as Owen's line, which is being used for which of the following? Yeah, this is due to the seventh nerve, cranial nerve palsy. This Owen line, which will be used for this identification, for this prognosis of this maxillary carcinoma. Okay. To know this prognosis, we'll draw a line from this medial epicanthus to this angle. Okay. Okay. So this line is known as Ongen's line, which is used for this identification or this prognosis for this maxillary cancer. Okay. Maxillary cancer prognosis. Okay. Yeah, upper will be poor because it will be involving the structures like more sensitive structures of the eye. low one will be the having a good prognosis. Yeah, correct, Somesh. Correct, Praveen. Okay, fine. And now we'll be having a break after this simple thing. Okay. Now till now means for this last 6 or 7 months you have been preparing for this exam day. On this exam day, don't get panic. Have a calm mindset, because if you have a calm mindset, you will be halfway ahead. Means like your half battle has been won. So have a calm mindset, and for this rest of the few days, just revise superficially. Don't grab up multiple things and don't give much stress. Okay, and be have a calm mindset. Okay, and you'll be absolutely coming with flying colors. Okay, and now it's exactly 10:15. We'll meet up at 10:30. Yeah, sure. Like the previous PDF, I will share in a break. Fine. Do you need this PDF in break? Because actually I don't have the access in the group to post. That's the issue. Yes, Sujata. Means previous, I will tell them to post now. Fine. Means it will be around till 12:30. Fine. Yeah. It will be till 12:30. Like more 2 hours. If you see this anatomy of the skin, and you need to know about this few layers of the skin. Fine. Means in the basal layer, means in the basal layer we know there is this cell which is known as melanocyte. Okay. Okay, and this melanocytes will be spreading their means dendrites along with this keratinocytes. Okay, and we know they'll be arranged in the yeah, let's get sunburn. Yeah, Lokesh, yeah. Yeah, and if you see this keratinocytes and melanocyte, there will be one melanocytes for each 36 keratinocyte. Okay, just remember one melanocyte will be for this each 36 keratinocyte. Fine. And we know we studied this Langerhans cell, remember? Langerhans cells, Langer for der. So Langerhans cell will be seen in a case of derma in dermis, which is a means like epidermis, which is a normal cell. Okay. Well, whereas we know Langhans cell, which is seen in a case of TB, they are horseshoe shaped multinucleated giant cells. Okay. Fine. This itself clear, I know. Yeah. Next one, yeah, Lokesh, yeah, you are identifying the next image. It is what is this? Tennis tennis racket shaped granules, which are known as Berber granules, which are seen inside this Langerhans cell. So, if there is any Langerhans cell histiocytosis, we'll be able to see the abundance deposition of these granules. Okay, that's it. That we need to differentiate. Fine. And there is one of the marker. It is what it is. This CD107A. Okay. Sorry, no, sorry. CD1A and CD207. Okay, these are the two markers you need to remember about this Langerhans cell histiocytosis, are which it shows this Langerhans cells. Okay, with this understanding, we'll move on to the next part. Okay, and if you see, if there are few primary skin lesions and there are few secondary skin lesions. Okay, the primary skin lesions include include this nodules. Means if there is any there are two things. One is this known as papules, next one is known as nodules. If it is less than 5 centimeter and raised structure, it is known as papules. If it is more than 0.5 centimeter or if it is more than 0.5 centimeters and is raised, it is known as nodule. Means like more than 0.5 and raised, it is known as what? Nodule. If it is less than 0.5 and it is raised, it is known as papule. Okay. And if it is less than 0.5 centimeter and it is a flat lesion and a pigmented lesion, it is known as patch. Whereas if it is more, it is known as like less, it is known as macule. More, if it is known as patch. Okay, just remember. Okay. And if there is any pus inside, it is known as pustules. Okay, if there is any pus present, it is known as pustules. And we know wheals which are seen in a case of any allergic conditions, and it will resolve by its own. Okay. Then there are some other conditions, like if you see some pinpoint bleedings. Okay, they are known as pinpoint bleedings. They are known as petechiae. Okay. Whereas if there is any aggregations of this petechiae, it will lead to the formation of purpura. Okay. This is purpura. Yeah, correct, Baisla. Next, if you'll see, there are some scaling lesions. There are some secondary lesions which include the scales. Okay. If you are able to see this fish scales, this type of fish scales will be seen in case of which condition? Yeah, Baisla. This is seen in case of which condition? We'll be able to see this fish type of scales. Remember, this will be seen in a case of ichthyosis vulgaris. This will be seen in a case of ichthyosis vulgaris. Fine. Next, if you're able to see this Greasy, greasy scales. Yeah, yeah, correct. Neuroxin. If you see this greasy scales, okay, and the scalp, which will be demonstrating this seborrheic dermatitis. Okay, seborrheic dermatitis. Next, if you see some micaceous scales, okay, if you see some micaceous scales, this type of micaceous scales, it will be seen in a case of psoriasis. Okay, yeah, correct. Yeah, correct, Lokesh. The seborrheic type of skulls, yeah, greasy skulls will be seen in a case of seborrheic dermatitis. Correct. Yeah. Mica skulls will be seen in a case of psoriasis. Fine. Next, some nail pathologists will look up. If you're able to see, if you're able to see this type of nails, this what it is the clubbing. Okay, this one is what clubbing. Next, if you're able to see this type of spoon shaped, okay, spoon shaped nails, which is also known as what? Coilonacia. Coilonychia, okay, which is also known as spoon-shaped nails, okay, which will be seen in a case of any iron deficiency anemia, and it is also associated with some other syndrome like Catterson-Pelly syndrome, okay, just remember. Yeah, correct. Yeah, it is associated with this iron deficiency anemia and the post cricoidal webs, okay, this can be associated. Next, if you're able to see this kind of ridge, okay, it is known as what? It is known as lines. It is known as lines. Okay, it is known as lines, and these lines are specific for which of the following diseases? A location neuroxin, a Baisla. The answer for this question. This is what? This is seen in a case of hand, foot, and mouth disease. This will be seen in a case of hand, foot, mouth disease. Fine. Next, if you're able to see this kind of whitish lines, it is known as niche lines. It will be seen in a case of not lead poisoning. It will be seen in a case of arsenic poisoning. Okay, arsenic poisoning. Just remember, it is seen in a case of arsenic poisoning. Okay, yeah, correct, Baisla. Next, if you're able to see this type of degeneration, it is what? It is the pterygium. Okay, next, this is what? This is the pitting. This is the pitting. This is the pitting of nails. There might be a regular pitting, there might be irregular pitting. Regular will be seen in case of alopecia areata, whereas irregular will be seen in a case of psoriasis. Fine. Next, if you're able to see this type of half and half nails, they are known as Lindsay nails. They are known as what? Lindsay nails. They are known as what? Which nails? They are known as Lindsay nails. Yeah, Lokesh, correct. Yeah. Next, if you're able to see this type of sign, they are known as what? Oil drop sign. They are this type of sign known as oil drop sign, which will be typical for psoriasis. This oil drop sign will be seen in a case of psoriasis. Fine. Yes. With this understanding, we'll move on to the next part. If you're able to see, there are two types of effluvium, like anagen effluvium and tilagen effluvium. This tilagen, it is also known as tension effluvium, where you will get tens when someone is pregnant. So, in a case of pregnancy or in case of any chronic illness, okay, in such conditions, you will be able to see this type of effluvium known as tinagen effluvium, okay, whereas, okay, after any chronic disease or any diseases, fine. Whereas in the case of anagen effluvium, it will be after this chemotherapy. After this chemotherapy, you will be able to see this type of effluvium known as anagen effluvium. Fine. And there are, you know, alopecia areata. And if you're able to see, if there is any case of alopecia areata, means there will be a patchy hair loss along with this exclamatory mark. So there will be a patchy hair loss. Okay, along with there will be a patchy hair loss along with a exclamatory mark sign of the hairs. Okay, just remember these points about this alopecia areata, and it is a autoimmune disease. Fine. And whereas others, like trichotillomania, because of this excessive hair pulling or this obsessive hair pulling disorders, okay, there will be a female pattern, there will be a central hair loss, whereas male pattern, there will be a side recession. Okay, just remember these things about this hair loss. Fine. Next, with this about this hair loss, we'll move on to some other conditions. Fine. And if you're able to see blockage of this apocrine sweat glands, we know there are two types of sweat glands, eccrine and apocrine, means eccrine sweat glands and apocrine sweat glands. If there is any blockage of this apocrine sweat glands, they can lead to this type of disease. Okay, apocrine sweat glands, they can lead to this type of disease. What is the name of this disease? This is known as Fox-Fordyce disease. Fine. And if there is any block along with this suppurative infection along with interconnecting sinuses, This will be seen in a case of, this will be seen in a case of, what is the name of this condition? It will be, yeah, correct, Lokesh, rose alpha. Yeah, trichobazar, maybe there in a case of trichotillomania, correct? Yeah, this type of separate infection along with interconnecting sinuses will be seen in a case of condition known as hydradenitis, adenitis suppurativa. Okay, and these are the ectopic sebaceous glands on the lips. They are known as Fordyce spots. They are known as Fordyce spots. Fine. And if there is any blockage of this eccrine glands, it is known as what? This is known as milia. Okay, this is known as milia. Okay, don't confuse this milia with this pustular melanosis. Okay, just remember that. Fine. With this understanding, we'll move on to the next part. Few investigations you need to remember. This is what this. If you're using a glass slide, yeah, Vaisla. If you're using a glass slide and if you're pressing and you are seeing the changes, so this is what this is known as what? This is known as diascopic. Okay. Next, if you're able to if you're able to see some kind of multinucleated giant cells in a smear taken around this dermatological lesion, so it is what? Yeah, correct, Rosalipha, Alphia. So it is what? It is the multinucleated giant cells. Okay, it is the multinucleated giant cells, and the investigation which is being done here, it is the Zank smear. It is the Zank smear. Fine. Next, if you're able to see, this is what, which test? This is known as what? Patch test, which is done for allergic contact dermatitis. And next one, this is what? This is the wood lamp examination. Okay, this is what? This is the, yeah, correct, location Baisla. Yeah, correct, Rose. And this is what? This is the wood lamp examination, which is means which is being used to see the characteristics. Fine. For example, in a case of erythasma, you know, in a case of erythrasma, it will show which type of one? It will be a coral red color, whereas vitiligo will show which will show milky white. Okay, milky white. Okay, just remember vitiligo will show milky white. Fine. Yeah, correct. Fine. Next, if you're able to see this on traumatic regions, if there is startage of these eruptions, this is known as what? This is known as what? Kobness phenomena. This is known as Kobness phenomena. Okay, fine. Yeah, correct, Rose. Next, if you're able to see, if you apply some tangential pressure, if the bulla ruptures, so it is known as what? Nikolsky sign. Okay, Nikolsky sign. And this Nikolsky sign will be seen in a case of Pemphigus vulgaris and pemphigoid. Okay, and pemphigoid disorders. Fine. Next one, this is known as Abse Hansen sign, which is also known as bulla spread sign. Means if you apply some tangential pressure, the bulla will keep on spreading. So it is known as Abse Hansen sign, also known as bulla spread sign. Okay, just remember. Next, if you're able to see some pigmentary disorders, okay, hyperpigmentary disorders especially. Yeah, correct, Rose and Vaisla. Next, if you're able to see, this is what? This is known as what? Melasma. And we already saw in a case of pregnancy, if there is same melasmatic changes, it is known as what? Cholasma. Okay, chiasma will pronounce it as. Fine. Next, if you're able to see this kind of hypertrichosis, it is known as what? Becker's nevus. Fine. If you're able to see this type of blackish nevus, which is from the birth, it is known as congenital melanotic nevus. Fine. And this is what? This is the, if there is an ophthalmic involvement, it is what? Yeah, correct, Rose and Baisla. It is known as what? It is known as nevus of Ota. Okay. And if there is any involvement of this around the supraclavicular region, just a hyperpigmentation, it will be what? Nevus of Ito. Okay. This is what? It is the nevus of Ito. Okay. Guys. Next, we saw yesterday also, like this is what? This is the albinism child, and they'll be having this oculocutaneous albinism features, and it is due to this deficiency of which enzyme? It is due to the deficiency of, yeah, Lokesh, it is due to the deficiency of tyrosinase. Okay, tyrosinase. Next, this is what? This is the vitiligo. Okay, and if there is any some hypopigmentation like a vitiligo along with this forelock, okay, white forelock, it is what? It is the piebaldism. Okay, it is what? It is the piebaldism. Next, it is what? It is the contact leukoderma. It is the contact leukoderma due to bindi. Okay, due to this bindi, there is a contact leukoderma. Yeah, this piebaldism which was seen in Indira Gandhi. Yeah, it is due to this chemical known as PTBA. Fine. And this is what? This is the hair dye. Hair dye, it is due to this chemical known as PTBC. Okay, PTBC. Okay, just remember. Okay, hair dye, it is due to the chemical known as PTBC, and you will able to see this hypopigmentation over here. Fine. Next, this is what it is few disorders. Like for example, yeah, if you are able to see this type of parakeratosis and hyperkeratosis, presence of the nucleus along with hyperkeratosis, it is known as parakeratosis and hyperkeratosis of this corneal layer. Okay, along with this neutrophils, neutrophils of this dermal papillae. Okay, and 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 there is a presence of this silvery micaceous scales. Okay, especially on the external surface. All of this they are features of psoriasis. Okay, and if it is if there is a psoriasis which is occurring in the pregnancy, pustula psoriasis of the pregnancy, it is known as which disease? Yeah, guys, answer. A quick responses for this question. The psoriasis or the pustula psoriasis which is being happening in the pregnancy, it is known as what? Remember, it is known as what? It is known as impetigo herpetiformis. Yeah, sure. Yeah, like these are the important images and points. Okay, just remember. Yeah, it is known as impetigo herpetiformis. Fine. And remember, it will psoriasis involves this extensor surface and will be having this silvery white micaceous scales. And if there is any raindrop, like it is known as guttate psoriasis. Guttate psoriasis. And once you remove the scale, if there is any bleeding, after removing the scales, it is known as what? What is the name of this sign? It is known as Aspitz sign. Aspitz sign. Okay. Next, if you are able to see lake of pus are also known as pustula psoriasis. It is known as what? Von Zumbuchki reaction. Von Zumbuchki reaction. It is known as what? Von Zumbuchki reaction. Just remember. Fine. Yeah, correct. Lokesh Baisla and Rosalfia. Fine. Next, if you means mostly we studied the psoriasis will involve this external surface. If it involves this in like this flexor surface, so fine. Is it okay? Is it okay, Baisla? Is it fine now? Yeah, I think so. Yes. Then, like if it is occurs on the flexor surface, it is known as what? It is known as what? Inverse psoriasis. Psoriasis. If there is some kind of red complete body which is being turned, yeah, okay, fine. Yeah. Then this is what? This is the inverse psoriasis. Next one, this is what? This is known as erythrodermic psoriasis. Okay, this is what? This is the erythrodermic psoriasis. Next, this psoriasis will lead to this type of arthropathy, which is what? Which is the psoriatic arthritis, which involves mainly the DIP joint, which is known as what? Which is known as this pencil in cup deformity, and for this treatment we'll use this methotrexate. Remember, only one disease will use this. Will use the steroid in the case of psoriasis. Okay, like especially in the case of pustula psoriasis of the pregnancy, we'll use the steroids. Whereas in other cases, we'll use this immunomodulators and the methotrexate. Okay, remember. Yeah, correct location, Rosalfia. Yeah, we're getting it correct. Next, if you will see this white lacy pattern on the oral cavity, along with this purpular plaques which are pruritic in nature, and this flexor surfaces. Okay, this will be a features of, it means like there is also this polygonal in shape. This will be features of lichen planus. Okay, lichen planus. Okay, and you'll able to see this thing known as pterygium. Okay, you'll able to see this thing known as pterygium. Next, in lichen planus, you want to remember about this bodies known as severe bodies. You'll able to see this type of bodies in lichen planus known as severe bodies, and it involves the flexor surfaces. Fine. And next, if there is a ball, if a claw catching this ball appearance, it is seen in a case of condition known as small pin-shaped lesion known as lichen niditis. It is known as lichen niditis. Okay, remember. Fine. Next, if you are able to see this type of inverted or the field tree appearance or the Christmas tree appearance, and along with that, if you are able to see this type of rings, which are also known as patches, known as mother's patches, where you will able to see mother's patches with one drop rings and the correlate scales of the cigarette pepper scales, where you will able to see? Yeah, guys, it is known as pityriasis rosea. Okay, you will able to see in a case of pityriasis rosea. Just remember. Fine. Next, if you are able to see, if a young male who is, yeah, if there is a young male who is having these features of this flaccid bulla, under examinations you will able to see this suprabasilar split. You will able to see this suprabasilar split showing this row of tombstone appearance. This along with these features of oral lesions. This will be suggested of which of the following? If there is a flaccid bulla, oral lesions, and suprabasilar split, and the direct immunofluorescence shows this fish net appearance. Okay, and there is a presence of these oral lesions. What you will think of? You will think of pemphigus vulgaris. Okay, if there is only just the skin lesions, okay, it will be you will think of pemphigus foliaceus. Okay, you will think of pemphigus foliaceus because it's a flaccid bulla. It's not a tense bulla. You will be able to appreciate, right? This is a flaccid bulla, and this one it is a tense bulla. Okay, remember. And fisted pattern and the flaccid bulla, all of these are these typical features for pemphigus type of disorders. Remember, if you are vulgar enough, means if you give some vulgar words by your mouth. So just remember, we use vulgar words by your mouth. So oral cavity involvement, it will be seen in a case of pemphigus vulgaris. Okay, pemphigus vulgaris, fine. And if there is no oral cavity, only skin involvement, it will be seen in a case of pemphigus foliaceus. And if you are able to see a tense bulla on a old age or a elderly patient, okay, and on immunofluorescence you will able to see a linear pattern, okay, linear pattern of IgE G deposition. It will be seen in a case of bullous pemphigoid. Okay, it will be seen in the case of bullous pemphigoid. Fine. Then, okay, then if you are able to see a linear IgA deposition, it is seen in a case of linear IgA disease. And then if you are able to see this only along this papillary tip, okay, you will able to see this immunofluorescence. This will be seen in a case of which conditions? Yeah, Rose, yeah, we're getting it correct. Yeah, Baisla, it is what it is seen in a case of dermatitis herpetiformis. It is seen in a case of dermatitis herpetiformis. Fine. Next, we'll move on to some other conditions. In a case of, this is a case of TB, in which what is the type of the nodules you will be able to see in a case of dioscopy? Yeah, what is the name of the nodules you will be able to see in dioscopy? Yeah, Kalibai, yeah, Baisla. I will be able to see this apple green nodules or apple jelly nodules, especially apple jelly nodules are seen in a case of, yeah, it is seen in a case of TB. Okay, TB of the skin. And if there is a TB of the lymph node and it is forming a sinuses and it being ruptured to the outside, so it is known as what? It is known as scrofuloderma. It is known as scrofuloderma. Just remember. Yeah, correct, Baisla. Fine. Next, this is what? This is the, if you are able to see this along all over these flexural surfaces, so there is some red lesions, red telangiectatic lesions, and which aggravates on taking a coffee or a caffeine or any hot shower. So it is what? It is the acne rosacea. Okay, and there are different forms of acne, right? And this is what the typical one. It is what? It is the formation of comedones. Okay, there is a formation of this comedones. Fine, and we know, yeah, and we know the most severe form, it is the nodulo. This is what? This is the severe form. It is the nodulocystic acne. Okay, and we can use oral isotretinoin in a case of acne. Fine. Yeah, this is the comedones. Okay, are the blackheads, are the open blackheads. Fine. And in for this acne, we'll use this type of therapy, which is known as PUVA therapy. Okay, we use this type of therapy known as UVA radiation. We'll use this for psoriasis known as PUVA therapy. Yeah, correct, Rose. Correct, Baisla. Fine. With this understanding, we'll move on to the next part. If you're able to see this child which is having this type of dermatitis, what it is? The atopic dermatitis. This is what it is, the atopic dermatitis. And this is the cradle cap, which is also seen in a case of atopic dermatitis. And if you're able to see some kind of dryness over this hands because of this repeated detergent use, it is what? It is the allergic contact dermatitis. It is the allergic contact dermatitis. Okay, and the most common cause, it is what? It is the lichen. Okay, whereas if Whereas if you ask some metal, means the most common metal is the nickel. Okay. Whereas what is the most common cause? It will be the detergent. Okay. And if you're able to see after, yeah, correct, Baisla. After after scratching with a blunting object, if you're able to see some kind of hyperpigmentation, it is known as what? Diarrhea sign. It is known as diarrhea sign, and it is seen in a case of Atricaria pigmentosa. Yeah, correct, Rose. It is the most common one. It is the detergent. Fine. Diarrhea sign. It is what? It is seen in a case of Atricaria pigmentosa. Okay, pigmentosa. Fine. Just remember. Next, we saw this means this is what this is the sarcopsis scabby, and it produces a special type of lesions which are known as what? Which are known as burrows. Okay, and for treatment we'll use 5% permethrin. Okay, and next, if the scab is which is involved on a bedridden patients, it is known as what? It can cause a means like a very severe form. It is known as, yeah, correct, Lokesh. It can form a severe type of scab is known as Norwegian scabies. Norwegian scabies. Fine. Next, if you're able to see, this is the loves we studied yesterday. The loves that is spurt or the pet. Okay, out of which P stands for this pediculosis. Okay, pediculosis. Just remember. Okay, and there is also one more thing known as, yeah, correct, Basila. Correct, Lokesh. Yeah, correct. Yeah, you're just remembering the mnemonic. That's very awesome. Fine. And if you're able to see this kind of parts which can causes this pediculosis corporis. Okay. So, okay, means it involves this body parts. Fine. Pet again means like it's a mnemonic for this louse. Okay. This is a pediculosis. Okay, next it is for epidemic typhus and for lapsing fever and T for French fever. Okay, just remember these things. Fine. These are the four diseases which are being caused by this louse. Fine. Next one. If you're able to see, if you're unable to see this line of demarcation after this, after the infection, it is what? It is the cellulitis. If you're able to differentiate, it will be what? It is the erysipelas. And we know this cellulitis, it can involve the subcutaneous tissue, and this air is lacking the subcutaneous tissue, subcutaneous fat, so it won't spread to this air. Okay, just remember these things. Fine. And if it is just a single one, it is known as what? It is known as furuncle. Remember, it is F1. In the case of F1 race, the F1 cars will be means used by only one single person. Okay, whereas in the case of normal carbuncle, normal cars, the carbuncle, it will be having this multiple openings or multiple inflammation of the multiple follicles. Fine. Carbuncle involves multiple follicles. Okay, just remember. Fine. Next. Fine. This is what? These are all the tinea disorders. Fine. If this is what? This is tinea capitis. This is cruris. Tinea cruris. This is what? Tinea pedis. And this is what? This is the tinea versicolor. Okay, versicolor. We'll be able to see this hypopigmentary patches. So what is the tinea versicolor? And we know tinea versicolor, which shows this. Yeah, correct. Lokesh rose. It is what it will show this spaghetti and meatball appearance. Fine. Next, if means if there is a two persons who are presenting you with some hypopigmentary patches over the face. Okay, and if one which is being associated with hypopigmentary patch along with these features of hypoanesthesia, okay, this will be suggestive of leprosy. Okay, and mostly it will be a old age people, means like a younger or the adults. Whereas if it is a child who is presenting with this hypopigmentary patches along with the scaly lesions, so it is what? It is will be what? It is known as pityriasis alba. Okay, because it will be lead to this scales. So scaling leads to this pityriasis alba. So just remember. Yeah, correct. Yeah, correct, Baisla. Fine. It is the leprosy part. Fine. Next we'll come to this some kind of STIs. Fine. This is what? This is the features of this secondary syphilis. Next, if you're able to see some kind of ulcer which is being painful, if any painful ulcer, it will be the most, one of the most common cause of this painful ulcer, it will be what? It will be the chancroid. Okay, it is the chancroid. Okay, this chancroid, and it will be caused by this Haemophilus ducre. Okay, just remember hemophilus do cry because of this painful. Yeah, Rose, yeah, Lokesh, yeah, Basil. Okay, fine. Next, if you're able to see this red beefy ulcer, it will be seen in a case of donovenosis. It will be seen in a case of donovenosis. Fine. And this will be seen in a case of donovenosis. And if you're able to see this kind of buboes, it is being formed, it will be seen in a case of lymphogranuloma venereum, which will be caused by this chlamydia. Okay, okay, caused by this chlamydia. Just remember, yeah, means painless. They are this LSD is painless. Okay, lymphogranuloma venereum. Okay, syphilis and donovenous, they are painless. Whereas this only one, which is this one, which is chancre. Why he's crying? Because of dew cry, which is causing this chancre. Fine. This is the mnemonic you will be able to remember. Fine. We know this linear involvement along this along this lymphatics. It will be what? It is the sporotrichosis, and this is what? This is the mycetoma with discharging sinuses. Fine. This is the discharging sinuses. Okay. With this understanding, we'll move on to the next part. If you're able to see this umbilicated papules, it will be what? It is the molluscum contagiosum. Okay. Contagiosum. Fine. Okay, fine. These are the simple warts. These are the warty lesions. Fine. Then, if you're able to see this around the lips, there is an involvement of means there is a formation of this grouped vesicles, which will be mimicking what? Which is because of which of the following organism? Yeah, Baisla, yeah, Lokesh, yeah, Rose. It is what? Yeah, this will be by this HPV and this will be by this HSV. Okay, they are this grouped or cluster vesicles. Fine. And if you're able to see different types of rashes on the different stages. Okay, different types of rash. It will be seen in a case of chickenpox. Okay, and this one is having this dermatomal spread. It will be seen in a case of shingles. Okay, and if you're able to see infection in which the skin is peeling out, it is what? It is the staphylococcal scalded skin syndrome. Okay, and here also the Nichols kind will be positive, means around the pseudo positive. Fine. Yeah, this shingles will be caused by this herpes zoster. For treatment of the pain, we'll use this gabapentin or pregabalin, whereas for this virus, we'll use this acyclovir. Yeah, Lokesh. Yeah, Neurexin. Yeah, Baisla and Rose. Yeah, we're getting it correct. Fine. Next, if you're able to see this pigmentary lesions, it is what? It is the incognitia pigmenti. Okay. Initially, there will be a vesicular pigments. Fine. Then there will be a verrucous, or it starts with verrucous, then vesicular. Then there will be a hyperpigmentation followed by this hypopigmentation. Fine. Next, if you're able to see some kind of rashes and photosensitivity, this will be seen in a case of xeroderma pigmentosa. Okay, this will be seen in a case of xeroderma pigmentosa. Yeah, Rose, it is correct. And could anyone tell me what is the defect which leads to the xeroderma pigmentosa? Yeah, guys, it is what? It is what? It is the nucleotide excision repair defect. Okay, nucleotide excision repair defect. Fine. Next, if you're able to see this, what? It is the same Salmon patch. Okay. Next one, this is what? This is the collodion baby, or also known as X-linked ichthyosis. Okay, X-linked ichthyosis. Okay, yeah, guys, you are getting it correct. Yeah. Next, if you're able to see this type of ichthyosis, it is what? It is known as Harlequin ichthyosis. Okay, it is known as Harlequin ichthyosis. Yeah, yeah, Lokesh, Rose, and Baisla. It is what? It is the Harlequin ichthyosis. Next, if you're able to see this sign known as shawl sign, along with this Gotron papules. Okay, both of these things they will be seen in a case of dermatomyositis. Will be seen in a case of dermatomyositis. Which of the following? Which of the following? Could you please write in a single questions? I just missed your comments. Yeah, Ashwin, it is correct. It is what? It is the dermatomyositis. Fine. Next, if you are able to see this melanoma. This melanoma, it is a pigmentary lesion. Along with this, there will be a yeah, sure, I will tell you. Just wait a minute. Like there will be a pigmentation, there will be asymmetry, and there will be means, and these are the features for this melanoma. And there will be positive for HMB45 and S100 positivity. And we know basal cell carcinoma, there will be a ulcer along with telangiectasia. We know it is also known as a rodent ulcer. Fine. Next one, this is the squamous cell carcinoma, which shows this keratin pulse. Fine. keratin pulse. Okay, just remember. Next, this in the case of HIV positive patient, if you're able to see this type of cancer, which is what? This is the Kaposis sarcoma. It is the Kaposis sarcoma. Fine. Next. Your question is this: how will you be able to differentiate this harlequin ichthyosis and this lamellar ichthyosis? Lamellar ichthyosis, you will be able to see the major difference. Like you will be able to see there is a membrane, means it looks like some kind of membrane being covered over the baby. It is also known as collodion baby. So it is what it is. Collodion baby. It is what it is, the X-linked ichthyosis. Whereas this harlequin ichthyosis, there will be more drying. Means because of this drying, you will be able to even see the fissures. So this is how you will be able to differentiate this harlequin ichthyosis from this lamellar ichthyosis. Fine. Harlequin ichthyosis from this collodion baby. Fine. Right. So this helps you. Next, you will see some few features of some neurotics, means like syndromes. Fine. This is what this is, the cafe aureate spots, which will be seen in a case of NF1. Next one, this is what? This is the adenoma sebaceum, which will be seen in a case of which condition? Yeah, it will be seen in a case of tuberous sclerosis, and there is also known as Ashley macules, and this is what? This is the Chagrin patch. All of this following will be seen in a case of tuberous sclerosis. Fine. All of this following will be seen in a case of tuberous sclerosis. Basal cell carcinoma, it is the most common because it occurs because of sun exposure. So just remember, basal cell carcinoma, it is the most common one. Fine. Yeah. Yes, only it is the NF. Fine. And these are all the features of tuberous sclerosis. With that, we are completed with this dermatology. Then we are moving towards the surgery part. Fine. Surgery is the bigger chunk. If surgery is done, then we have the shorter one, which is the ortho. And if time permits, we'll do this anesthesia one also. Fine. Yeah, fine. If you're able to see this type of PUD orange, okay. And what is the pathology behind this PUD orange? It is due to the blockage of which of the following structure? Yeah, this PUD orange, it is due to this blockage of this subdermal lymphatics. Okay, and it will be staged as, because whatever changes in the B means bar stages, it will be seen outside. So it will be, yeah, correct, locus. It will be staged as T4B. So B for bar, any ulceration of this PUD orange, it will be staged as T4B. Yeah, correct, Mankish. Fine. Next, if you're able to see, this is what this is, the nipple retraction. If you're able to see, this nipple will be attached to these ducts. Okay. If there is any ductal involvement of any of this cancer, it will lead to this retraction of these nipples. Okay. So this is what this is, the retraction of nipples. Okay. And we know there is some circumferential ligaments known as Cooper's ligament. So if there is any damage to Cooper's ligament damage will present as dimpling or puckering. Okay, will damage us, will show us as dimpling or puckering. Okay, means by the formation of dimples or puckering. Yeah, correct, Rose. Yeah, correct. Then if you're able to see this enlarged, and means like swollen or enlarged breast along with some red enlarged breast along with, means like along with some redness on the features of inflammation, this will be suggestive of inflammatory breast cancer. And could anyone tell me what is the name of this staging you will give for this inflammatory breast cancer? What is the stage of this inflammatory breast cancer? Yeah, guys, think. Yeah, it is staged as, it will be staged as T4D. Remember this one, PUD orange, it is a T4B. It's not T5, it's T4D. Remember, it is T5D. Fine. Next, if there is any distortion of this nipple structure, it will be seen in a case of Paget's disease of nipple. And remember, for diagnosing this inflammatory breast cancer and Paget's disease, there is, means we don't need to have a definitive lump to make a diagnosis, whereas without lump also we can make a diagnosis of this Paget's disease and this inflammatory breast cancer. Fine. Next, if you're able to see this enlarged, like massively enlarged breast, means this bosulated appearance along with this some irregular borders. Okay, this irregular borders, it will be seen in a case of tumor known as cystosarcoma phylloides. Okay, it will be seen in a condition known as cystosarcoma phylloides. Okay, just remember. Yeah, close. Yeah, by slow you are getting it correct. Next, if you're able to see this type of popcorn calcification will be seen in the case of which condition? Yeah, guys, it will be seen in the case of, correct, it will be seen in the case of which condition? In the case of fibroadenoma. Fine. And if you're able to see, okay, if you're able to see this type of microcalcifications, this type of microcalcifications, this microcalcifications will be seen in a case of ductal carcinoma in situ, right? Any are mostly in the case of ductal carcinoma. Next, if you see this type of pattern, which is known as Indian file pattern, Indian file pattern will be seen in a case of lobular carcinoma. Yeah, Rajeshwari, yeah, Rose, you are getting it correct. Fine. And next, for post breast cancer surgery, we'll use this type of flap. We'll use this type of flap known as tram flap. Okay, transverse rectus abdominis flap. Okay, before means like it is the most commonly used. Okay, most commonly used. Whereas the disadvantage is that we are taking muscle along with it. So now we are most preferring is that we are preferring is that we don't need to involve this muscular structure. So we are taking a flap known as deep inferior DIP flap known as deep inferior epigastric flap without this taking these muscles. Yeah, correct. Rose and Baisla, correct. Yeah. Next, what are the complications can happen after the mastectomy? Fine. If the initial complication will be means after any means you are able to see there is some lump which is being already excised or recently excised or some procedure which is being done. There might be collection of this fluids which is known as what? Seroma. Seroma collection. Okay, seroma collection. Okay, because if there is any serous fluid collection, it prevents this healing of this edges of this wound. Fine. Next, if you're able to see, if you're able to see, this is what? This is known as what? This is known as winging of scapula. Okay, due to the involvement of long thoracic nerve. Long thoracic nerve. Fine. Winging of scapula. Next, we are coming to the next part. If you're able to see, initially there might be a lymphedema. Then, after means especially they will give you a typical history 10.5 years after CA breast surgery. After CA breast surgery, means after 10.5 years, means you will able to see some kind of lymphedema. Okay, prolonged lymphedema. What is this name of resulting into a tumor known as lymphangiosarcoma? What is the name of this syndrome? Stewart Treves syndrome. Okay, just remember. Fine. Next, if you're able to see, there is a swelling in the neck. Okay, there is a swelling in the neck which moves with deglutination and protruding the tongue. Okay, this will be a feature of which of the following? This will be a feature of thyroglossal cyst. Okay, yeah, Somesh, you are getting it correct. Fine. If there is just a cyst, it's okay. But sometimes what will happen is this cyst can become inflamed and can connect to the outside structure. So this can lead to this formation of thyroglossal fistula. Okay, and for the treatment of this thyroglossal fistula, we'll use the surgery known as cyst trunk operation. Fine. And next means along this passage of yeah, correct, Rose, Somesh and Baisla. Yeah, Lokesh, yeah, correct. Yeah. And if you're able to see along this tongue and along this course of this thyroid, means sometimes this thyroid won't descend down. So this leads to this formation of this ectopic thyroid. Okay, ectopic thyroid. Okay, ectopic thyroid gland, and the most common site it will be what? It is the sublingual one. It is the sublingual one. Okay, whereas the most common site of this thyroglossal cyst it will be what? It is the subhyoid. It is the subhyoid one. Next, if there is a swelling around the superior border of this sternocleidomastoid. Yeah, it will be what? Yeah, correct, Bharat. It is what? It is the sublingual one. Previous one. Okay, this is what? This is the what is this thing? Yeah, guys. Yeah, Rose. It is what? It is the branchial cyst. Yeah, correct. Next, if you are able to see this radioactive uptake studies, the malignancies they will usually take this, they won't uptake, so they will become as cold nodule. Yeah, yeah, Murari, yeah, we're getting it correct. Yeah, Lokesh, yeah, correct. Yeah, Rose, this is what this is mostly the malignancy. They won't take this cold nodule. I say they won't take this cold nodule as uptake. Fine. Next, if you're able to see this image, in which you are able to see this formation of this samoma bodies. Samoma bodies. Okay. In which of the following condition you are able to see this samoma bodies? Which of the following? Cancer, and also you are also able to see the same cancer. You are able to see this orphan and nuclei, and this both of these things. Yeah, correct. We know. We remember this mnemonic as TSM. Both of these things will be seen in a case of papillary carcinoma of thyroid. Next, if you want to differentiate between the follicular adenoma and carcinoma, we need to do biopsy, and we know follicular carcinoma. Okay, there will be a, means it will spread this follicular cancer. It should involve this capsule. It should be having this capsular involvement along with this involvement of blood vessels. Fine. Next, if you're able to see this white color lesions, it is what it is the sorry, it is the leukoplakia. The red one, it is the erythroplakia. Yeah, guys. Yeah, yeah, Rose. Yeah, correct. Yeah, Rajesh is very correct. Yeah. Next, if you're able to see, there is a mucus extravasation cyst in the floor of mouth. It is what? It is the ranula. It is the ranula, and it also will be showing this brilliant transluminance. Fine. It will be trans-illuminate in nature. Fine. Yeah, correct. Rose, Baisla, and the Morarai, correct. Then, if you're able to see this type of esophagus, it will be seen in a case of Candida. And if you're able to see this type of tracheal ring formation inside the esophagus, yeah, if there is swelling here also in neck, it is known as plunging ranula. Yeah, correct. Thank you for remembering, Rose. Yeah, it is the Candida. Yeah, correct, Rajeshwari. Fine. If you're able to see the next one, if there is a formation of this multiple constricted rings known as trachealization of the esophagus, it is known as what? Eosinophilic esophagitis. Fine. And if you're able to see this type of serpentigenous ulcer, okay, it will be seen in a case of HSV infection. And if you're able to see this kind of punched out ulcer, it will be seen in a case of CMV. Fine, it will be seen in a case of CMV. Yeah, eosinophilitis, correct. Like how everything is going on. I hope everything is going good. Yeah, guys, it is the serpentigenous ulcer. Next, if you're able to see the single constriction, it is known as what? Shadsky ring. Okay, and it will produce a typical type of dysphagia known as episodic dysphagia. It produces this episodic dysphagia. Okay, remember, means on eating a large chunk, they will be having this dysphagia. Next, if you're able to see this type of bird beak appearance will be seen in a case of achalasia cardia. Okay, it will be seen in a case of achalasia cardia. Fine. Is this discussions? Yeah, like genetic images where there are few genetic we have been already discussed in the previous sessions. You can go through it. Fine. In the pathology part, especially. Fine. Next, yeah, this is the bird beak appearance, and if you're able to see this shouldering along with some irregularities, okay, and this rat tail shouldering means irregularity shouldering along with this rat tail appearance will be seen in a case of carcinoma esophagus. Okay, will be seen in a case of carcinoma esophagus. Yeah, correct, Rose. Correct, by Islam. Fine. Next, this is the esophageal manometry. Fine. And if you're able to see this type of filling defects inside the esophagus, fine, this will be seen in a case of esophageal varices. This will be seen in a case of esophageal varices. Okay. Yeah, guys, remember these things. Fine. With this understanding, we'll move on to the next one. Yeah, it's not stricture, it is the esophageal varices. Alphia. Fine. Next, if you're able to see this condition in which the baby will be presenting around the 21st day, it's not the first week or the first 3 days, it will be comes around after third week. Okay, and in third week, the baby will be presenting with vomiting. Okay, there will be projectile vomiting, and there will be features of hypokalemic, hypochloremic, metabolic alkalosis. On an examination, you will be able to see this type of appearances. On Barham's follow, you will be able to see this type of mushroom sign and this double tracking sign. It will be seen in a case of infantile hypertrophic pyloric stenosis, and you will be able to see this olive shaped mass. Yeah, guys, that's absolutely awesome. And location is not Hirschsprung disease. Hirschsprung disease, it will be a means it will be a means around this rectum we'll be able to see this thing. But here it is this IHPS. Fine. Yeah, Manasas formation, like, yeah, Lohesh. Yeah, now you got correct. Yeah, correct. Yeah, Rose, you are getting it correct. Fine. This is in a case of infantile hypertrophic pyloric stenosis. And we do this type of Nissen's fundoplications. This Nissen fundoplications will be done in a case of GRD. It will be done in a case of GRD. Okay, fine. Yeah, you'll be able to see in the mass, you will be able to see this. There is a movement from left to the right side. Fine. Yeah, thank you for remembering. Next, if you're able to see this double bubble appearance, will be seen in a case of duodenal atresia. Okay, whereas this triple bubble will be seen in a case of jejunal. Okay, whereas if you see some multiple bubble loops which are centrally placed and are dilated, it will be seen in a case of ileal atresia. Yeah, Lokesh, yeah, Murari, yeah, Alfia, correct. Fine, yeah, correct. Yeah, Baisla. Next, if you're able to see this type of cerebriform rugae, this cerebriform rugae will be seen in a case of this cerebriform rugae will be seen in a case of Meniere's disease. Meniere's disease, remember. Okay, this is the Meniere's disease. Right. Next, in a case of CS stomach, you'll be able to see these two typical features. Around this umbilical, there is a superficial lymphatic deposition of this metastatic tumor, which is known as Sister Mary Joseph nodule. Next, on the right dot, left supraclavicular. Can you see about? Yeah, Meniere's disease is just this. I think it's because of this TNF alpha overactivity. We'll able to see this rugae, which is being means hypertrophy, and it will shows like a cerebrum, like a brain. Okay, yeah, you will be able to get this PDF from this description link. There is a group known as Dr. Banu Prakash Sir group. Okay, in which you will be able to get this PDF once the session is over. Fine. Next, you will be able to see this supraclavicular lymph node, which is being enlarged, which is known as what? This is actually what Witcher's lymph node, which is known as Crozier's sign. Okay. Yeah, correct, guys. It is known as the previous one. It is known as Sister Mary Joseph nodules. No, Sister Mary Joseph nodules. Fine. Next, if you are able to see, there is a passage of this red color stools or this red jellies stools along with side. You will be able to see when you palpate the right iliac fossa. There is an empty right iliac fossa because the empty right iliac fossa. On examination, on ultrasound, you will be able to see this target sign, pseudo kidney sign. Okay, and on gross, you will be able to see this appearance. What is this thing is? Yeah, location it is what? Yeah, it is not Meckel's diverticulum. The next one it is the Meckel's diverticulum. Fine. This is the intussusception. It is the intussusception. It is the intussusception. Okay, it is the intussusception, and the most common site. Yeah, there will be a class sign can be seen. There will be a spring sign can be seen. Okay, yeah, the most common site it will be what? It is the ileo. It is the ileocolic. Means it is the ileocolic. It's not ileocecal. It is the most common. It is the ileocolic. Okay, it is the ileocolic. It is the most common part to be involved. Next, the most common pulling force it will be by this kind of pair patch nodes or this Meckel's diverticulum. Just remember, fine. And we know the one after administration of one of the following vaccine, this it can produce this is a side effect. Yeah, Kavita, yeah, Somesh, you are getting it correct. What is the name of this vaccine which is we use in like which can cause intussusception as a side effect? It is what it is the rotaviral vaccine. Rotaviral vaccine can cause this as a side effect. Just remember. Yeah, yeah, correct. Mahatesh Soni, yeah, correct. Rose, yeah, Somesh, yeah, Gopinath, yeah, Kavita, yeah, it's correct. Yeah, Manasa. And next, if you're able to see some extra added bubble structures, okay, around 2 inch means around this 2 means which follows this 2% rule. This will be what? This will be the Meckel's diverticulum. Okay, Meckel's diverticulum, and we know, and it will be the most common content. It is what? It is the gastric mucosa. So we'll use this technetium 99 per technete scan. Yeah, correct, guys. Correct, Kavita, Mahesh, Lokesh, Anjumara. Yeah, correct. And means we know this Meckel's diverticulum. It is due to this persistence of this vitello-intestinal duct. There is a persistence of vitello-intestinal duct. Fine. Yeah. Yeah, guys. Next, if you see this cobblestone appearance, we already discussed in the patho, cobblestone appearance along with this string sign of contour. String sign of contour. Yeah. Session kab tak hai? It will be for more 45 minutes to 45 minutes. Yeah. We are going in a right track, so it will be finishing in another 45 minutes, guys. Fine. And this will be these are the features of which of the following disease? It will be the features of Crohn's disease, and we know Crohn's disease it will be having the associations of fistula and stricture formation. Okay, stricture formation. Just remember fistula, and along with this, there is a formation of the strictures. Fine. Next, if you are able to see, yeah, guys, yeah, Murari, yeah, you are getting it correct. Next, if you are able to see, there is a formation of this pseudopolyps. Pseudopolyps, and very minima, you will be able to see this type of colon, lead type colon, and there is a loss of ostrations. You will be able to see in which conditions? Yeah, Yeah, Somesh, it is what? It is the ulcerative colitis. Okay, it is the ulcerative colitis. And yesterday we studied ulcerative colitis. We have this antibody, which is what? Which is the PNK, whereas here we'll have this is ASCA antibodies. Fine, just remember. Yeah, guys. Yeah, Dr. Khan. Yeah, Anjumara. They were getting it correct. Fine. Next, if you move on, if you're able to see this air under diaphragm, this air under diaphragm will be seen in a case of will be seen in case of inlet pump. There is no heart stations. If there is any heart stations, means there should be normal heart stations. But in case of lead pipe, there will be no heart station. Just remember. Fine. Ya Lokesh, Kavita, Anjumara, ya Manasa, ya Kavita, ya Ashish, ya Murari, you are getting it correct. It is the air under diaphragm sign, which is seen in a case of perforations. For this case of pneumoperitoneum. Fine, pneumoperitoneum. And for this, we need to do adequate IV fluids along with this. Yeah, you're welcome, anonymous Zozo. Like along with this IV fluid resuscitation, we need to go for emergency laparotomy. Fine. And if you're able to see this enlarged, massively enlarged colon, it is known as what? It is known as toxic megacolon. Okay, it is known as what? It is known as toxic megacolon. And if you're able to see the small outpoaching structures and on barium minima, you'll be able to see this type of, okay, this type of kind of rose thorn appearance or this comb appearance, it will be seen in a case of sawtooth, means or especially like a comb appearance or the sawtooth appearance will be seen in a case of sawtooth appearance will be seen in a case of diverticulosis. Okay, diverticulosis. Just remember. Fine. It's not hair sprung. We are up, means we yet to come for hair sprung. Okay, just have patience, guys. Okay, it is what it is, the diverticulosis. Fine. And if you're able to see, this is our hair sprung. If you're able to see, there is a tapering, means there is a constriction, there will be narrowing, which you're able to see in the case of Hirschsprung disease. Okay, and this is what? This is the Hirschsprung disease. And we know in case of Hirschsprung disease, in the case of Hirschsprung disease, it is because of this congenital aganglionosis. Fine, there will be a congenital aganglionosis. Just remember. Fine. Next, where you will be able to see this? Yeah, constrictive part is the disease, so we'll remove it. Okay, remember. Next, where you will be able to see this thumb sign in abdominal radiograph? Yeah, you will be able to see in the case of ischemic colitis. Okay, you will be able to see this thumbprint sign. Next, if you are able to see this type of pulled up cecum, this pulled up cecum, it will be seen in a case of TB. In the case of TB, you will be able to see this pulled up cecum. Remember, in TB, you will be able to see this pulled up cecum. Next, if you are able to see this apple core appearance, yeah, apple core appearance in the case of colon cancer. Yeah, guys, you are getting it correct. No, Akalisa, we won't see apple core. Just remember, it means in the case of either CA esophagus or CA colon, we'll use this, we'll see this apple core sign. Fine. Just remember, like maybe some of you are watching this video on some like few seconds or few minutes begin. Just click this live, means like live options in your video, so that you will be in a right track with this class. Fine. Next, we'll move on to the next part. If you're able to see this sort, means yeah, coffee bean sign. This will be seen in a case of sigmoid valvulus, and it also produces this type of beak known as bird beak appearance on enema. Fine. Yeah, correct. Bird beak, yeah, correct. That is barium swallow, but this is barium enema. Just remember. Fine. Next, how you will, means in image they will give you how you will differentiate between this colostomy from this ileostomy. Remember, means this is what, this is this colostomy or ileostomy. How will you think of this image? Means this is in our hospital we took this image, like we did this procedure. So like, yeah, it is what, yeah, I will tell you. Just wait a minute. Yeah, hey, it is not prolapse. Prolapse means you will able to see this much amount of content. Yeah, it is the ileostomy. Yeah, correct, Gopi. Yeah, if you see, if you make something, means in a case of ileum, we know the food material, it will be a liquid in nature. So what we'll do is, we'll make some sprout outside the abdominal wall. You'll able to see, right? We'll make some sprout outside the abdominal wall. So this is what this will be done in a case of ileostomy. And this is what, this is this loop ileostomy. Okay, this is the loop ileostomy. Just remember, fine. This is the ileostomy. Whereas in a case of colostomy, it will be exactly attached to the abdominal wall. So you won't see like a sprouting structure. You will see this like this. It will be exactly attached to the abdominal wall in the case of colostomy. Fine. Next, how will you differentiate the sigmoid valvulus from this cecal valvulus? In the case of cecal valvulus, okay, sigmoid, it will be producing this bent tube appearance of this coffee, like mainly this kidney bean, means like this will be bent tube appearance, whereas this cecal valvulus, it will be a single one. So it will produce this kidney bean shape. Okay, so remember this cecal valvulus will produce this kidney bean shape appearance. Okay, don't forget. And based on the location, because sigmoid colon is here, so it will go and tend to bend in this direction, whereas if you see the cecal valvulus, it will come and bend in this direction, so the direction also matters. Fine, this is how you will able to differentiate. Okay, next, if you're able to see this image, that, okay, this is how a rectal prolapse looks like. Okay, this is how this is also taken in our hospital. This is how this rectal prolapse. Okay, this is how this rectal prolapse looks like. Okay, fine. It's a huge rectal prolapse. Fine. They did laparotomy and means after that they pushed in, like they tried and they reinserted inside it. Fine. This is a rectal prolapse. Fine. And hemorrhoids. And hemorrhoids, you know, there are different types. Okay, there will be first degree, second degree, third degree, and fourth degree. In first degree, it's just a bleeding. Okay. Second degree, there is a bleeding plus hemorrhoids. Okay. Hemorrhoids means which is the mass will be spontaneously reduced. Spontaneously reduced. Whereas in a case of third degree, there will be along with bleeding, the mass needs manual reduction. Whereas in a case of fourth degree, there will be, it will stay outside. Yeah. Is the glycerin gas? No, actually means it was the time was questioning, so we didn't put glycerin gas. Later on, we tried with glycerin gas. Fine. Next, in a case of fourth degree, you will be able to see this. In a case of fourth degree, means there will be a prolapse. Okay, but it cannot be manually replaced. Fine, just remember. Then you will be able to see this type of fistula. Means if you are able to see this fistula, it will follow a rule known as Goodsall's rule. Okay, Goodsall's rule. Okay, yeah. This Goodsall's rule tells that whatever this fistula opens in the anterior part, they will open in this anterior aspect. Fine. Whereas this, whatever this fistula which origin from this posterior surface, they will come and open around this 6 o'clock. So they will come in a curvy linear fashion. Whereas whatever in this anterior part, it will come and open as a straight line. Fine. Next one, if you are able to see this sentinel tag sign, it will be seen in a case of fissure in ano. And remember, they will give you, means they will give in the questions, all of the following can be done in a case of fissure in ano. They will give this per-rectal examinations. Remember, per-rectal examinations will be contraindicated in a case of fissure in ano. Okay, क्विक PDF जैसे खत्म हो जाएगा सेशन है उसके बाद मिल जाएगा. ठीक है, डोंट वरी दीपा. Okay, next, if you're able to see this type of multiple sinuses which forming this abscesses, which is known as what? It is known as what? Around the coccyx region. It is what? It is the pilonodal sinuses. Okay, pilonodal sinuses. And this pilonodal sinuses, we will do this. Yeah, also known as not jumpers. It means it is known as jeepers disease. Fine, just remember. Yeah, Kalkabi means I just told the team to upload it. It will be shared to you as soon as possible. Fine, don't worry. Fine. And this is what we'll use this type of flap known as Limburg's flap. It is known as Limburg's flap. It is known as Limburg's flap. Just remember. Next. Fine. In the case of pilonodal sinuses, we'll use this rhomboid shaped flap known as Limburg flap. Yeah, Lokesh. Fine. Next, if you're able to see, means in a case of Mantell's course, which is being used for this appendicitis, we'll give this 2 points. We'll give this 2 points, just 2 things. One is for this tenderness, and next one is for this leukocytes. Okay, just remember these 2 points about this appendicitis Mantell's course. Next, if you're able to, in a case of appendicitis, you can elicit 2 signs. Okay, this is what means there are different more signs, but now have given us 2 signs. Okay, one is this obturator sign. In a case of obturator sign, you will internally rotate, means you will keep this hip in a 90-degree and you will internally rotate and it will cause pain to the patient. So it is what? It is the obturator sign. Okay, next, in a case of same appendicitis, means undoing this extension, means undoing the flexion over the hip, you will able to see, you will able to elicit pain to the patient. So it is what? It is the source test. Okay, there will be a source test and there will be a obturator sign and the source sign. Okay, it is source test and eliciting the source sign. Next, if you see this patient who is presenting with this features of this chest radiograph, which shows the appearance known as colon cutoff sign. Okay, This colon cutoff sign, it will be typical for which of the following disease? Yeah, correct. Source and updated. Yeah, Rajat. Yeah, Manasa. Yeah, Kavita. You are getting it correct. This this will be seen in a case of pancreatitis. Okay, pancreatitis. And we know the pancreatitis mostly it is a clinical diagnosis, but in a case of acute stages, we can use this CECT and we can diagnose it. Fine. Yeah, Manasa, Rajat. Yeah, Rose. You are getting it correct. Next, this is how this image of an acute pancreatitis looks like. But if there is some hemorrhages, means you see, means this is a contrast enhanced one. So you will able to see some kind of hemorrhage. So it is what it is, the hemorrhagic pancreatitis. Okay. And if there is any chronic pancreatitis, it can lead to this collection known as pseudocyst. Okay, pseudocyst. And in case of chronic pancreatitis, it can lead to this formation of this known as chain of lakes, means there is a multiple calcifications lead to this sign known as chain of lakes. Okay, then around this umbilicus you will able to see in the case of hemorrhagic, yeah, internal bleeding, yeah, correct, Dr. Khan. Yeah, in the case of hemorrhagic pancreatitis you will able to see this sign known as Cullen sign. Okay, and along the flank you will able to see this sign known as great Turner sign. Okay, these are the two signs you need to remember about this. You need to know about this pancreatitis. Fine. Next, about this hernia, like you will able to differentiate most of the hernias. Okay, the confusion arises here from this femoral to this inguinal hernia. How will you able to differentiate this femoral hernia from this inguinal hernia? Fine. Yeah, there will be a Fox sign, which if there is an inguinal discoloration, it is known as Fox sign. Okay, yeah, Raja. Fine, means you will need to differentiate between this inguinal hernia from the femoral hernia. Remember, below this inguinal ligament, you will be able to see this femoral hernia, whereas if you palpate, if it is above this inguinal ligament, it will be what? It is the inguinal hernia. Fine. And if you use mesh for this hernia repair, it is known as hernioplasty. Okay, if you use mesh, it is known as hernioplasty. Fine. Yeah, means inferior epigastric artery. It is mainly to differentiate this features of this direct and the indirect inguinal hernias. Fine. This is the hernioplasty. If just suture is being done, it is known as what? It is known as herniorrhaphy. It is known as what? It is known as herniorrhaphy. Just remember, guys. Fine. This is how this umbilical hernia, and sometimes it can go for strangulations. Okay. And in such case, yeah. In such case, we need to go for an emergency surgeries. Yeah, this mesh, it is the Prolin mesh. Fine. Next, you need to remember about this content of these two things. Okay, this is what? This is the triangle of pain, which where you know means you avoid using this cauteries. Okay. Next, it is the triangle of Doon, which is more prone for bleeding. So you will avoid clampings over this area. So in the case of triangle of pain, these pains will be mediated. Yeah, thank you, Anonymous Yoga. Like, because I'm just repeatedly seeing these images and I'm oriented with this, so um I'm just I'm just able to memorize it in a much faster manner. Fine. Which of the following you want to zoom in? Rose, could you please describe it? Fine. If you're able to see this, it includes this nerves, like include this lateral femoral nerve, like anterior means there will be a lateral femoral cutaneous nerve, and there will be anterior femoral cutaneous nerve, and there will be a femoral branch of genitofemoral nerve, and there is a femoral nerve. These are the four things that means that those are this part of this triangle of pain. Okay, so just remember, in the case of triangle of pain, we avoid cauterization. We avoid cautery. Okay. Whereas in the case of triangle of doom, we avoid clamping because there is a internal iliac veins and this internal iliac artery. Fine, just remember. Fine, like sorry, external iliac vein and the artery. Fine. Next, if able to, there are few different types of hernia you need to remember of. Fine. If there is just not the complete hernia, just a wall which is outpoaching. If just a wall is outpoaching, or this just this wall, it is what it is, the Richter's hernia. Okay, it is the Richter's hernia. If the content of this hernial sac, it will be if there is a if it is appendix. Okay, it is what it is, the Little's hernia. Fine, we know appendix is a little, so it will if it is a content, it will be a Little's hernia. Next, if it is a Muckle's diverticulum, it is what it is, Amiens hernia. Fine, or if this herniated content, if it forms some kind of W kind of shape, it is known as, if you flip this W, it will become M, it is known as Meyd's hernia. Then if you are able to see if there is a if this herniated part, if it forms the loop, it is known as cantilum hernia. Okay, these are the special type of hernia you need to remember. Okay, if there's a okay, these are the special type of hernia you need to remember of. Fine, this is the same Maynard's hernia. Fine. Next, if you're able to see there is a history of trauma patient and an evaluation, you will be able to see this deep sulcus sign. Okay, deep sulcus sign. Okay, and an ultrasonography. This is the normal one. You will be able to see this image. What is the name of this image? What is this image signifies? Yeah, you are doing e-fast. Yeah, correct. Yeah, this is the fast. Along with this two more views, which will be the e-fast. Fine. It is what it is the yeah, normal one it is the seashore sign, and this one it is the stratosphere sign. Stratosphere sign are also known as barcode sign. Okay, are also known as barcode sign. Just remember, guys. Fine. And for this pneumothorax, if it is a child, we'll put a white bore needle in the second intercostal space. Whereas if it is an adult, we'll put this needle in the fifth intercostal space in the mid axillary line. Fine. Okay, guys. Next, with this, we'll move on to the next part. We studied this same thing in the pediatrics. It is what it is the congenital diaphragmatic hernia, and this is what this is this tracheoesophageal fistula. Just remember, they will ask you this thing. Yeah, yeah, correct, Somesh, correct, Kavita. They will ask you this question: what is the most common type of tracheoesophageal fistula? Remember, the most common type it is the type C. The most common type it is the type C. Fine. Next, if you're able to see, there is a means they will give you usually means they will give a history of prolonged flight travel, after which they will be experiencing some shortness of breath. Means this will be a typical case of DVT. Okay, but if there is a large thrombus, we'll be able to remove. But if there is a small and multiple thrombus, yeah, Kavita Manasa correct, yeah, Lokesh correct. If there is a small or multiple thrombus, then in such situations, we'll means we'll use this we'll use this IVC means IVC filter. We'll use this IVC filter. Remember, we'll use this IVC filter to filter out this um, clots which is being traveled from this venous circulations of this DVT to this systemic circulations. Right? Okay. So it is a filter for DVT, and this is the Fogarty's catheter which is used for this embolectomy. Fine. Next, if you're able to see this tennis ball appearance, it will be seen in a case of which condition? It will be seen in a case of aortic dissection. Okay, it is seen in a case of aortic dissection. Whereas if there is any symmetrical, means if there is any enlargement, oh, IVC, yeah, IVC. Yeah, Sai, yeah, Lokesh, yeah, Somesh, yeah, correct, yeah, Manasa, yeah. Then if you are able to see the circumferential enlargement, it will be what? It is the aortic aneurysm. It is the aortic aneurysm. Okay, just remember, it is the aortic aneurysm. Fine. With this understanding, we'll move on to the next part. Okay, and this is the choledochal cyst, means cyst formation in the cyst, means in the biliary tree. Like mostly they will ask what is the most common type. Here the most common type it is the type 1, but they won't ask you the most common type. They will ask you this type 3. This type 3 which is being repeatedly tested, and they will ask you what is the management. Like we'll just remove this cyst, or we'll just give incision and we'll remove this. Just remember. Okay, so just remember this type 3. Okay, this is the choledochal cyst. Fine. Next, if you're able to see this strawberry gallbladder. In which condition you are able to see this strawberry gallbladder? Yeah, guys. Yeah, correct, guys. Yeah, correct. Close. Correct. Khan and Manasa. Fine. Next, if you are able to see this one, this is the water lily appearance, which will be seen in a case of hydatid cyst. Fine. Next one, it is what it is the. If you are able to see, this is not ERCP or MRCP. If you are able to see, we are just putting some tube from outside. So it is what it is the T-tube cholangiogram. It is a T-tube cholangiogram. Okay, remember it is a T-tube cholangiogram. Yeah, correct side. Fine. Next, if you see in the case of cholecystitis, will elicit this sign known as Murphy's sign. Okay, will be elicited in the case of cholecystitis. Fine. Next. Fine. If you are able to see this gallbladder wall which is being calcified, and this type of calcified gallbladder wall, it is known as what? It is known as Portian gallbladder. Okay, this is the calcified gallbladder wall, and we know this Portian gallbladder. It is in the case of ERCP, you will be able to see this endoscope. Okay, fine. First thing you will be able to see this endoscope, and next you will put dye from this pancreatic ducts. Okay, not from this CBD. Okay, you will be able to see we are putting inside the CBD, right? So you are able to see So you can delineate very perfectly. So in a case of ERCP, you will cannulate this means you will cannulate the major pancreatic duct, and there you will install the dye. Okay. Whereas here you will put inside the common bile duct, and there you will insert the dye. Okay. This is the major differences. Fine. Okay. And if you see this features of pneumobilia along with this features of small bowel obstruction and gallstones, this will be suggestive of gallstone ileus. And what is the triad you will see in the case of gallstone ileus? Yeah, guys. Yeah, we know. This triad is known as Wrigley's triad. Okay, it is known as what? It is known as Wrigley's triad. Fine. We'll see in a case of, yeah, correct psi, correct rows, and correct yeah, this gallbladder stones will produce post-acute shadow. Yeah, correct. Rows, yeah, correct. Yeah, location, yeah, we're getting it correct. Fine. Next, we'll come to this venous disorder. In case of venous disorder, they are repeatedly testing about this classification. If you see this classification, you can easily remember. Means C2 means, remember, 2 means if you keep this 2, it will form this V. So this varicose veins, it is actually what it is, the C2. Fine. If C2 it will be starting, then remember 3. 3 if you make this 3, this is the E. Means so edema. So 3 C3 it will be the edema part. Okay. And C4 there will be different parts in the C4. There will be C4A, C4B and C4C. And in this case of C4A there is a pigmentation. Fine. There will be a pigmentation in the case of C4A. Fine. Whereas in the case of C4B there will be a lipodermosclerosis. Fine. There will be a lipodermosclerosis, means you are able to see this C4 means it's actually what it is, a C4B. Okay. And C4C means there will be, if there is any radiating vessels which you are able to see, it is what it is, the C4C. Fine. Then C5 it will be a healed ulcer. C5 it is a healed ulcer. Next, if you are able to see a recurrent ulcer or non-healing ulcer, it will be a C5, C6. Okay, remember, C3 is edema, 4 has 3 components. A is pigmentation. After pigmentation, it will go for sclerosis. And C for C, there will be a corona phleboctotica, means there will be a radiation of this veins. And C5 it is a healed ulcer, and C6 it is a recurrent of this active venous ulcer. Fine, just remember. Yeah, active venous ulcer, it is the C6. Okay, fine. This understanding will move on to the next part. Means they will give this typical history of a young smoker, means who is smoking and he is presenting with this features of this hand shown below. Okay, this is what? This is a feature of Buerger's disease. Okay, like it is not Buerger, it is what? It is the Buerger's disease. It is the Buerger's. Yeah, sorry, it is the same. It is a Buerger's disease. Okay, remember this, like, so that you won't get confusion like me. So Buerger's, remember, Buerger's means if there is a U, it is the vasculitis component. Okay, if it is Berger, BER means it is just a IgA nephropathy. Remember, okay, fine. And they will means if just they given this young male along with a smoker, this clinical picture, it will tells the Buerger's disease. Whereas if they give the speeches of any alcoholic history, any coronary artery history, and if he is somewhat older age, then you need to think about atherosclerosis. Fine. Yeah, usually means in, like, if it is a Buerger's disease, yeah, Gopi, you are correct. They will ask about this. They will tell about this young male smoker. Fine. And it is a small vessel vasculitis, and this involves all of these 3 components. It involves nerves, veins, and arteries. It involves nerves, veins, and arteries get involved. Fine. And this is what? This is the Raynaud's phenomena. You will see this PCR means there will be a pallor, there will be a cyanosis, and there will be a loss, there will be a redness. Fine, just remember. Yeah. Yeah, Lokesh, correct. Yeah, Sri Sai, correct. Yeah, yes, that's awesome. Yeah, Manasa, yeah, Khan, yeah, we're getting it correct. Then we'll move on to the kidney part. If you see this kidney part, I will able to see this mouth eaten calyces or mouth eaten calyces. Okay, this will be typical for this TB of kidney. Okay, and this will be followed by this kidney known as putty kidney, and on bladder you will be able to see. Okay, and on bladder you will be able to see the small bladder which is known as what? Thimble bladder. Okay, thimble bladder. Okay, these are you need to remember about this kidney. Okay, yeah, guys, and if you are able to see this recess on this kidney and on the liver. and on the liver and kidney, if you're able to see this, you will able to see this cis, it will be what? It will be the autosomal dominant polycystic kidney disease. Remember, okay? Autosomal dominant disease, it will show cysts on the both kidneys and the liver. Whereas autosomal recessive, it will show fibrosis over it. Fine? It will show fibrosis over it. Yeah, correct, Sai? Yeah, correct. Fine? Yeah, correct, Khan. It will produce fibrosis. Fine? Next, if you're able to see some kind of penicillin cup, no, egg in cup deformity. Egg in cup deformity. It will be seen in a case of which of the following? If there is any necrosis over here, it will, or any acute tubular necrosis, okay, it will lead to this. If there is a necrosis over this kidney, okay, or if there is any papillary necrosis, it will lead to this. It will lead to this egg in a cup appearance. Fine. Next, if you're able to see this appearance, okay, of this paintbrush, of this kind of paintbrush appearance, okay, this paintbrush appearance will be seen in a case of medullary sponge kidney. It will be seen in a case of medullary sponge kidney. Just remember, guys. Fine. Next, if you're able to see this drooping lily sign, it will be seen in a case of duplication of ureter. It will be seen in a case of duplication of ureter. Okay, and this is the normal, means it is a usual renal calculi, and this is what this how this ESWL which is being done, means which will be done for less than 4 centimeter stones. If it is more than 4 centimeter, we'll do this PCNL. Okay, fine. Next, if you're able to see this air around the kidney, it is what? It is the emphysematous pyelonephritis, and we know the most common cause for this emphysematous pyelonephritis, it is what? It is the E. coli. Fine. Next, if you're able to see this type of, means broken stones. Yeah, this is the iliac source muscle. It is the iliac source muscle. Fine. This is the normal kidney stones. Okay, it is the renal calculi. Okay, which is radio opaque. Fine. Next, if you're able to see this formation of the small stones which are being collected. Okay, like a street. So this is what? This is known as what? Street of stones, also known as stain streets appearance. Also known as stain streets appearance. Okay, just remember. Fine. Next is our favorite disorder, which is the Staghorn calculi, and we know organism responsible is the Proteus, or which are any other urease producing organisms, and it will show this presence of this triple phosphate type of crystals. Okay, just remember, and it will take the shape of the kidney. Okay, and the most common stone, it is the calcium oxide. Yeah, correct, Kavita. The most common is the calcium oxide, whereas here in a Staghorn calculi, it is the triple phosphate stones. Fine. Next, if you're able to see, this is what? This is the horseshoe kidney, and we know in the case of horseshoe kidney, it will be prevented. The ascent of this horseshoe kidney will be prevented by this IMA. Yeah, correct. Sai, you already put up the answer. Correct. Yeah, correct. Disha, correct. Murari, correct. Manasa. Fine. It is the horseshoe kidneys. Next, if you're able to see this type of fish hook type of ureter, it will be seen in a case of benign prostatic hyperplasia. And if you're able to see this reverse J formation, it will be seen in a case of retrocaval ureter. It will be seen in the case of retrocaval ureters. Fine. And this is what? This is the hydroureteronephrosis. Okay, this is the case of hydroureteronephrosis. Just remember, guys. Yeah, Dr. Khan, yeah, Rose, yeah, correct. Fine. Next, if you're able to see this adder head or this cobra head appearance, it will be seen in a case of ureterosil. It will be seen in the case of ureterosil. Remember, and this, if there is any duplication of the ureter, okay, if there is any duplication of the ureter, it follows a rule known as Vegas-Mayer rule. This kind of appearance, teardrop deformity, because like after finishing your FMG, you think like you need to get rid of these books and you want to go somewhere, yeah, or make a trip to either Goa or now it's Lakshadweep, which is trending to this Lakshadweep, and you need to create some bonfire and you need to relieve your stress. Fine. And for this, imagine like you are going with your friends and you want to create a bonfire, and there is a pear tree available. So you are creating a bonfire with the pear tree. So you will able to see this pear shaped bladder. Okay, and we know bonfire, obviously there is a fire. So if you are able to see this flame sign, okay, once you met with your friends and you are done with your exams or FMG, then you will be crying with the happiness. Fine. So there will be a tear drop sign. Okay, tear drop sign. All of these things are the features of extraperitoneal bladder rupture. Okay, bladder rupture. Fine. Or whereas in a case of intraperitoneal bladder rupture, remember, if you keep on accumulating some sad stuffs inside your heart, some days it will burst and open. So if you're able to see this sunburst appearance in a case of intraperitoneal. Okay, remember. Whereas extraperitoneal, its most common cause it is the pelvic bone fracture. Okay, whereas intraperitoneal, it's because of this any blow. Okay, it's because of this any blow. Fine. Next, if you're able to see this Christmas tree, will be seen in a case of neurogenic bladder. Fine. Next, this is a huge bladder calculus. Fine. Yeah, Murari, yeah, Lalit. Yeah, it is what it is, the bladder calculus. Okay. And if you're able to see this bone forming or this sclerotic metastasis. Okay. Okay. Yeah, sclerotic metastasis along with this change in this frequency of urination, it will be seen in a case of, it is in CEA prostate. And remember, we know P for P, it involves this posterior lobe. Okay, it will involve this posterior lobe and posterior zone. Okay, and this is the procedure which we use to do for BPH. Fine. Yeah, teardrop sign also will be seen in a case of like load fracture of the orbit. Yeah, nice correlation. Yeah, prostate and breast, both of them, they will produce this spine metastasis. But remember, prostate produces this bone forming metastasis, whereas breast cancer can produce both. Okay, like, but mostly it produces the bone lytic lesions. Okay, sorry, I don't have a group, so this whatever the PDF it will be shared into the Dr. Bhanu Prakash's groups. Okay, don't worry, Dhananjay. Like, I will take care of it. I will tell them if they are awake. I will tell them to send to net. If not, till the morning you will get it. Fine. And this is the TURP procedure. Fine. It will be done for benign prostatic hyperplasia. So remember about this benign prostatic hyperplasia. Remember the mnemonic of MTB. So it will involve this median lobe and the transition zone. Okay, which is seen in a case of BPH. Okay, remember these features. Fine. You are welcome then. Next, we have this urethral injuries. The most common part of this posterior urethra which is being injured, it is the membranous urethra. Okay, membranous is the most common part to be injured in a case of posterior urethra, whereas in a case of anterurethral rupture, the most common part to be in a case of anterior urethral, it is the bulbar urethra. Okay, and you will be able to see this butterfly. You will be able to see this butterfly hematoma. Okay, butterfly hematoma. Yeah, guys. Yeah, Dhananjay. Yeah, Lokesh. Yeah, Kavita. Yeah, yeah, Rose. Yeah, Khan. Yeah, we're getting it correct. Yeah, fine. Yeah, there will be features of this blood at the tip of the meatus. Okay, in both the cases, whereas in the case of anterior, it also presents with this butterfly shaped hematoma along this penis and this scrotum. Okay, just remember. Next, this is the CA penis. Okay, okay, see, this is the CA penis. We know the most common one is the squamous cell carcinoma, and this is the Farneus gangrene. Okay, Farneus gangrene, and we know it is because of this mixed infections, both aerobic and anaerobic. Both aerobic and anaerobic causes this infection. Next, the most common congenital anomaly of this means like male urinary system. It is the hypospadiasis. Okay, it is the hypospadiasis. Fine. Next, if you're able to see, there are two conditions. One is phimosis, next one is paraphimosis. If you are unable to retract this foreskin, it is the phimosis. If the retracted foreskin causes compression of the spinal musculature, it is the paraphimosis. Okay? Okay, guys. Okay, with this understanding, we'll move on to the next part. If you're able to see this bag of worm sensations, it will be seen in a case of varicocele. Okay, and if there is a deformity known as bell clapper's deformity, usually there will be this tunica vaginalis. It will be inserted like here, but if it is inserted over above, then it will lead to this means mobile testis, means the testis will be mobile inside the scrotal cavity. So this can undergo torsion. So this is the testicular torsion which is happening because of this deformity known as bell clapper's deformity. And this testicular torsion, it can be differentiated from this. It can be differentiated from the acute epididymoarthritis. Okay, by this by this sign known as fun sign, because in epididymoarthritis this sign will be positive. Okay, whereas in a case of torsion it will be negative. Okay, just remember this. Yeah, correct, Lokesh. Fine. Next, this is the hydrocele. Okay, and the hydrocele will be transluminant in nature, and for this hydrocele we'll do this procedure like Jobulis eversion of sac. Fine. Means we'll just open the sac and we'll just close it in a opposite manner, so that whatever the fluid um, collection, it will go outside. Front test, it is what it is. This means like when the patient is coming out with pain, if you just lift up or if you support this testicles, means the patient will be having this relief in the pain, and this relief in the pain it will be seen in a case of uh, acute epididymoarthritis. Whereas in a case of testicular torsion, you are not able, you will be unable to see this relief in pain. The patient will be still complaining of pain. Okay, so if there is some resolving of pain, it is known as front test positivity. Front test will be positive in epididymoarthritis, whereas it will be negative in case of torsion. Okay, and this is the keloid scare, and this is the hypotropic scare. We know keloid, it will grow outside the wound margin, and in history they will be given, it will be persisting for more than 6 months. Okay, it is the keloid. Next, this is the sebaceous cyst, and this is the sebaceous horn. Okay, next means now like a few means like 1 years back they asked this question, like in which of the following zonal trauma you will do exploration, and you will in which of the following zone you will just do some observations. If you see first zone 1, means there are major vasculations. Okay, major vasculation. So if there is any trauma, if there is any blunt or any penetrating trauma, you will do exploration. Any of these cases you will do exploration or emergency laparotomy. Okay, whereas in the case of zone 2, okay, in the case of zone 2, if it is a blunt, means you will just do observation. If it is a penetrating, you will do emergency laparotomy. Okay, whereas in the case of zone 3, okay, if it is a blunt, okay, you will means if there is a blunt and if there is any bleeding inside, you will apply this external compression. So you will apply external compression, and if there is any penetrating, then it will what? Then it will, you need to do emergency laparotomy. Okay, just remember this, guys. Yeah, because the zone ones, it is having this vasculars like IVC and aorta will do exploration. Mainly there is also pancreas, and there are different types of ulcer. If you are able to see, means this is what around this medial malleus. If you are able to see this, this is what venous ulcer, and if you are able to see this some necrotic, it is what? It is the because of loss of blood supply. This will be the arterial ulcer. Okay, then means along the base of the foot, it will be what? It is the neuropathic or this diabetic foot. Next on the pressure zone, it will be what? Yeah, correct, Kavita, correct, Baisla. Means on the pressure zone, it is what? It is the pressure ulcer, and there is a history of bones present and ulcer present. It is what? It is the Marjolin's ulcer. It is the Marjolin's ulcer. Fine. And if you are able to see this type of stockings which is being done, or this type of device, it is what? It is the pneumatic compression device. Okay, yeah, Nitin, yeah, Rose, yeah, Kavita, yeah, Unisol Gaming, I were getting it correct. Yeah, Lalit, yeah, means this marginal ulcer can progress into this squamous cell carcinoma. Fine. This pneumatic compression device will use to prevent the formation of DVT. Yeah, correct, Baisa, Nitin, and Disha, Dr. Khan. Fine. Next, if you able to see, this is the negative pressure wound therapy, and for this will maintain the intermittent pressure, and the negative pressure will be around this minus 125. Okay, minus 125. Fine. This is the vicryl, and this is the catgut. Okay, both of them, they are observable. Okay, remember this catgut will be made from not from the catgut, it will be made from this sheep gut. Okay, then this is how this simple interrupted suture looks like, and if you take as a continuous bites, it will be a simple continuous suture, and here the difficulty will arise from this two horizontal mattress and vertical mattress. In the case of horizontal mattress, you will able to make a hutch, okay, between this line. So it will be a horizontal mattress, okay. One way you will able to remember. Next, you can remember this vertical mattress. This vertical mattress can be remembered by the correct by Isla. This vertical mattress you can remember means like first bite means like in Hindi they will tell dur se or pass se means first you will take from this distant means first bite you will take from the distant, fine, you will come along, okay, and the second bite and come along till the length or till the distant, then you will take this bite means then you will take the prick which is near and you will take near, okay. So there will be a means, so like this amount means like this, first you will prick here and you will go here and then you will take, you will come here and then you will do suchan, okay. This is what, this is the vertical matter suchan, okay. If they ask you, just do so, fine. And this is what, this is the posting suture, fine. Next they will sometimes they will ask you how will you be able to differentiate the square knot and the granny knot. Just nothing, do here just a line over here. If you are able to see both of this, both means if the same suture material is passing through this, means if you are able to see this red one will be the above on both side, yeah. Terish wiring we can use in a case of rectal prolapse, fine, yeah, we can use, or like post, like closing of any of this like gut structure which are having this means luminous structure, we will use this posting sutures, fine. Next means this is this square knot, fine. Whereas in the case of granny knot, you will able to see this is the violet which is going above in the first one, whereas second one it is the pink. So this is how this granny is knot, okay. So square knot the same will be passing, whereas granny is knot the opposite means like means in two sides there will be different suture metal will be passing, okay. This is how you are able to differentiate between this square knot and a granny knot, fine. With this understanding, we'll move on to the last part of our surgery, okay. And this is what, if you're able to see, this is what, this is the Joel's thyroid retractor. Next you are able to see this is also a retractor which is mainly used for this procedures to keep this abdominal wall to be open. And this is what, this is the proctoscope, fine. And this is also already we study, if you make N, it will look like a Doyens. So remember this Doyens retractor will look like a N. Then if it look like a question mark, it is a Diavas retractor. And if it's kind of a flat appearance, it is a Morris retractor, fine. It is a Morris retractor, okay. Yeah, Kavita, yeah, correct. Next, if you're able to see this type of appearances, okay, on the edge it will be this Alice forceps, fine, Alice forceps. Next, if you're able to see kind of thin one, it is known as what, thin means if you make L, it is a more thinner, right? So Langenbeck retractor it will be a thinner one. Next, if you're able to see this two things, it will be a bipolar cautery. If you just see the single electrode, it will be a unipolar cautery, fine. Yeah, Alice will be having the tooths, okay, just remember. Next, this is the towel clip which is used to hold this towel, like in a case of delivery or during a table, means like setting up a tray, you need a towel clip, okay. Next, in the case of needle holder, you will be able to see this depression inside. This is the needle holder, fine. Next, this is the Humbee's knife which you use for this skin graft harvesting, fine. And this is the straight artery forceps, and this is what, this is the backup forceps which is used for holding this any structures and it won't cause any trauma. For example, holding a during a pulmonized procedure, we need to hold this fallopian tubes. At this moment, we can use this backup forceps and we can hold it, fine. And this this is what are these few main instruments. Next, you can learn about this one. This is the skin stapler, okay, and this is the stapler remover, okay. Yeah, it is a skin graft, yeah, correct, Khan and Baisla. And next it is what, it is the endostapler. For example, in the case of bowels, means you are doing any bowel anastomosis, okay. After ileostomy, you need to do means ileostomy in a case of after perforation, you did ileostomy or a defunctioning colostomy, okay. After that, after some time, when the bowel heals, you need to do re-anastomosis. So for such procedures, you can use this stapler known as endostapler, right? You can use this stapler known as endostapler, okay. Okay, guys, with this understanding, we'll move on to the last slide of surgery. Okay, last slide of surgery, we have few more slide of ortho. Okay, and this is what, this is the Romovac drain. Okay, which will generate this negative pressure and it will suck the secretions. Fine. And next, if you're able to see, this is the corrugated drain, means there will be a corrugations. For example, during a hydrocell operations, you need to see this secretions to be coming out. We'll keep this corrugated drain. Okay. Next, this is what this is known as Jackson Prate drain. Okay. Okay. This also generates this negative pressure, but it will be handy in nature. Okay. Yeah. Correct. Next, this is the T tube. Okay. To check for any, for example, post cholecystectomy, to check for any trauma, to check for any bile leak, or to make any secretions, it will we use this. Yeah, we'll use this T tube. Fine, just remember, guys, because at the same time it can cut, and also at the same time it can seal also. Okay, this is the harmonic scalpel. Okay, with this understanding, we're done with the surgery part, and we are moving on with this ortho part. Like mostly will be try to finish by another 10 to 15 minutes. Fine, there is 16 more, around 16 to 17 slides in the ortho. Fine, and we'll be going in a faster flow. Like there'll be much images only. We need to grasp. Okay, fine. Yeah. Finally, yeah, Baisla. Yeah, Kavita. Fine. If you're able to see, this is the anterior dislocation. Remember, if you want to propose someone, like either a boy or a girl, okay, there is no any gender bias. You need to go and stand in front of them, and you need to open your hands, and you need to propose. So remember, if yeah, anesthesia will do it. Ruth, don't worry. Fine. Yeah. Okay, and you need to go in front, and you need to propose them. So remember this thing. So we are going anteriorly. So in the case of anterior shoulder dislocation, the arm will be abducted. Okay, the arm will be abducted and externally rotated. So the arm will be abducted plus externally rotated. Fine. This is the case of anterior shoulder dislocation. Fine. Then this is how this light bulb sign, which will be seen in a case of light bulb sign, which will be seen in a case of posterior dislocation. Fine. We were yeah, here there is also dislocation and there is also fracture. Yeah, guys. Yeah, there is a means tuberosity fracture of this humerus. Yeah, correct. Yeah, correct, Rajat. Means like I used to have this eagle eyes. Yeah, you will able to find this small details. Like I hope so. Like you will get means most of this image based questions correct in the exams. Okay. This is the posterior dislocation. Fine, and the features will be this adduction along with internal rotation. And this is the inferior dislocation, which will be which will be showing this feature known as luxatio erecta. Okay, and this, if there is any recurrent shoulder dislocation, this will lead to this two lesions, one on the humerus, another on the glenoid cavity. Means on the humerus, means on the posterior lateral aspect, and the humerus on the posterior lateral aspect, it will produce a lesion known as Hale sac. Remember, if it is on the height, it will produce on the humerus. So remember, Hale sac on the posterior lateral aspect of the humerus, whereas anterior inferior part of this glenoid cavity, it will produces this Bankart lesion. Okay, glenoid cavity, and this is the humerus part. Okay, humerus. Okay. Okay, the lower one third of the shaft of humerus fracture. It is known as there is a special name for this fracture known as Holsten Lewis fracture. Yeah, Khan, yeah, Baisla, yeah, Kavita, yeah, Lokesh. Yeah, correct. You are getting it correct. Next, for this shoulder dislocation, we use two tests known as Dugas test, means in which we'll tell the patient to touch this opposite shoulder, in which he is unable to do. It means it is a definite sign. And then we'll use this ruler, means so that means in a case of shoulder dislocation, the counter of the shoulder will be lost. So we'll use this test known as Hamilton ruler test. Just remember, fine. Yeah, a shaft axillary artery means not shaft axillary artery. Okay, shaft there will be a brachial artery, also known as profunda brachial artery, and there will be radial nerve involvement. Whereas if you see surgical kneecap fracture, there will be a axillary nerve involvement along with this posterior circumflex humeral artery involvement. Okay. Okay, don't get confused, guys. Next, if you will see, this is the supracondylar humerus fracture, and if there is any means improper healing of the supracondylar humerus fracture, it will lead to this cubitus varus deformity. It will lead to this cubitus varus deformity known as gun stock deformity. Yeah, Rose. Yeah, correct. Yeah, correct, Lokesh. And sometimes this can lead to this kind of nerve entrapments. The most common nerve which is being injured, it is the anterolateral nerve, followed by this anterolateral nerve, followed by this median nerve. Fine. Next, it can go and impinge this brachial artery. Yeah, yeah, Lokesh. Yeah, yeah, Abdul Siki. Yeah, correct. And it can means it can go and impinge this brachial artery and can cause compartment syndrome. Okay, and this compartment syndrome can be relieved by this procedure known as fasciotomy. Okay, compartment syndrome. Okay, they will be given this question. Okay, okay, about this compartment syndrome, what will be the treatment? It will be the fasciotomy. Fine. Next, if you are able to see if this muscles undergo necrosis, it will lead to this condition known as Walkman ischemic contracture. Okay, it will lead to this condition known as Walkman ischemic contracture. Yeah, Kavita, correct. Yeah, Rose, correct. Fine. Next, if you are able to see, there is a contracture of this um, means especially this ring finger. It is known as what? Dupuytren's contracture, and it is most commonly seen in a case of alcoholics. Yeah, correct. Yeah, and there's also it can be associated with one more disease known as Overman's disease, in which there will be a retroperitoneal fibrosis. Fine. Yeah, there is a trigger finger. It's a different entity. Means this is a contracture. Contracture means it will remain like this. Whereas trigger finger, it's just a inflammation of this pulley, where you try to pull. Initially, it will give resistance, but later on, it will snap and open. It will snap and open. Okay, remember. So it is what it is the trigger finger. Okay. So you try to differentiate. Means most of these things they are dynamic questions. Means you need to understand the question. The question how he is asking. Fine. It may looks like a trigger finger, but the question tells you whether or differentiates you whether this is a trigger finger or a Dupuytren's contracture. Okay. Fine. Next, this is what this is the lateral condyle of this humerus fracture. Okay, and this lateral condyle of the humerus fracture can lead to this cubitus valgus, and because of this there is a tardy ulnar no palsy. Okay, yeah, okay, Kavita, fine. Yeah, this is what, because we know this medial border, it will be transmitting this ulnar nerve. If there is a if there is a if there is a no growth over this lateral part, this medial part tend to grow, and it will lead to this tardy ulnar palsy. A correct rows, Dr. Khan and Baisla. Fine. Next, there are means in forearm you need to remember about these few fractures. One of them is the Colles fracture. If you are able to see this Colles fracture, this is this dorsal displacement of this distal fragment. It is the Colles fracture. Okay, okay, and and both of this Colles and the reverse Colles, which is Smith fracture, it is a they are extra-articular in nature. And remember, you can have this mnemonic. You know, once you meet a Virat Kohli, means who is a cricketer, once you meet, first what he will do, he will do the handshaking. Okay, he will do this handshaking. So for this treatment, he will do this handshaking cast. Okay, and after handshaking, he will go and have a dinner. So means if there is any improper healing, it lead to this dinner fork deformity. Dinner fork deformity. Okay. Yes, yeah, correct. And this Colles fracture can cause this sympathetic stimulation known as Sudex dystrophy. Okay, Sudex dystrophy, and it's one of the second most common fracture which is being occurred after push injury in a osteoporotic females. Fine, remember the most common fracture is being the vertebral fracture. Okay. Next, if you're able to see, this is what isolated ulnar fracture. It is the nightstick fracture. Only isolated ulnar fracture. Next, if you're able to see this styloid process of this radius which is being fractured, is known as what? This known as Schoffer's fracture. Okay, isolated radial styloid process. Next, if you're able to see this, first we'll come to this. Musa means if there is any upper ulnar fracture, if there is any upper ulnar fracture along with superior radio-ulnar dislocation, it will be seen in a case of which fracture? Yeah, guys, yeah, that's awesome. Yeah, Kavita, Lokesh Khan, yeah, you're absolutely blasting with answers. It is what it is, the Monteggia fracture. It is known as what it is, the Monteggia fracture. Whereas the opposite of it, if there is any radial fracture, if there is any inferior part involved, it will be what it is, the yeah, correct, Somesh. You are providing this exact descriptions. That's awesome. Yeah, it is what it is, the Galizia fracture. It is known as what? Galizia fracture. Fine. Then yesterday we saw means if this is what this is the tibial fracture. Okay, this is the tibial fracture which is most commonly seen in the case of RTA. Fine. Okay, this is the scaphoid fracture, and we know when we discussed yesterday in the case of scaphoid, nerve involves with explaining which of the following means I could get it, guys. Like in the case of Musa, like it's most commonly the PAN, posterior introsus nerve, which is being involved. Fine, fine. Yeah, scaphoid fracture. We use this correct. Somesh, we use this thing known as glass holding class cast, and this scaphoid can undergo into this avascular necrosis. And we know that there will be tenderness over this anatomical stem box. That's awesome, Kavita. Yeah, that's correct because this content of this uh, anatomical stuff box, it is the radial nerve. Correct. Yeah, yeah. Okay, yeah, correct, guys. Yeah, this is the glass holding cast. Okay, next one. If there is any extensor extensor tendon damage, okay, then this will lead to this. If there is any extensor tendon rupture, we know remember Vegas mnemonic of med. Okay, if it is what it is known as mallet finger. Okay, mallet finger there will be damage to this extensor digitorum tendon. Okay, extensor digitorum tendon. Whereas jersey finger it is the opposite. It is the flexor tendon. It is the flexor part, and both of them they will use this type of splint known as frog splint. Okay, frog splint. Fine. Next, if you're able to see this type of arthropathies, yeah, yeah, correct, Kavita Murari. Fine. If you're able to see this type of distal nodules, this distal nodules they are known as what? Harbundle nodules. Whereas this proximal nodules they are known as what? Bouchard nodules. Okay, Bouchard nodules. Both of them they will be seen in a case of osteoarthritis. Osteoarthritis. Okay, osteoarthritis. Whereas this Z deformity, Z deformity, Svanek deformity, Z deformity, Svanek deformity, and along with what is another deformity? Yeah, guys, goutness deformity. It's not gout. Gout will come back. Okay, come. Gout. It's a crystal arthropathy. It mainly involves this toe joints. Okay, don't confuse it. Okay, this is the goutness deformity. All of these things. Mm, it will be seen in a case of rheumatoid arthritis. Yeah, Kavita. Yeah, Baisla. Yeah, Rose. Lokesh. Yeah, you are getting it correct. It is the rheumatoid arthritis. Fine. And this is what this is the psoriatic arthritis, and along this you will be able to see this deformed joints over the DIP. Okay, it is what it is the psoriatic arthritis. It's psoriatic. Fine. What is the difference between osteoarthritis and rheumatoid arthritis? Yeah, means like the main difference is that both like means you can remember osteoarthritis it's a girl's favorite arthritis. No, not rheumatoid arthritis. It's a girl's favorite arthritis. Okay, why it is girl favorite? Because girls they want to apply their nail polish over this distal phalanges, so it won't involve this distal phalanges. Okay, and it involves this proximal means and it involves this um, MCP joints and the wrist joints. Okay, uh, remember. And whereas osteoporosis it will mainly involve this DLP. Okay, this is the major features which you can differentiate from this, which you can differentiate um, from the clinical features. Fine. And then there is also a few more things like osteoarthritis. It is there will be formation of the small clumps over the joints. There will be multiple mobile nodules. So it's in depth. Okay. So this is a simple thing on basic description you will be able to remember. Okay. Yeah, I think so. You got it. Like it's at the end of the day, you need to answer the question, right? They will absolutely they will tell you there is a wrist involvement and MCP involvement. There is a sparing of this distal interphalangeal joint. So you need to think of nothing. You need to just think about this rheumatoid arthritis. Okay, okay, fine. Yeah, guys. Yeah, osteophyte formation. That's absolutely awesome. Rose and Lalit, Dr. Khan. Yeah, fine. Yeah, welcome. We'll then move on to the next part. If you're able to see the same, if you want to propose anteriorly, you need to abduct and externally rotate. So remember, if there is an anterior hip dislocation, also there will be a abduction plus external rotation, whereas posterior it will be adduction plus internal rotation. Fine. This is the same one, which is where you will able to see this femur which is being adducted. Here you are able to see this femur which is being abducted. Here you will able to see there is a acid means there is a fracture of this acetabulum and this head of this femur which is being pushed inwards. It is what it is the central fracture and dislocation. Okay, dislocation of hip. Okay, remember this, guys. Okay, central fracture and dislocation of this hip. Okay. Then, if you're able to see in the case of hip fracture, we can use this type of screws known as dynamic dynamic hip screws. Okay, dynamic hip screws. Okay, this dynamic hip screws. Next, if you're able to see this, which is known as what? Means this type of prosthesis, which is having this 2O. Okay, this is known as what? Austin Moore, means 2O, 2 for Austin Moore prosthesis. Okay, fine. Yeah, correct, Rose. Yeah, it is what? Yeah, it's having this holes. It is what? It is the Austin Moore prosthesis. Fine. Next, if there is no any holes, it is what? It is the Thompson prosthesis. Fine. Yeah, guys. With this understanding, we'll move on to the next part. If you're able to see, this is the hip fracture. Okay, it is not done for hip fracture. Remember, it is done for the femur fracture. And yesterday we discussed. Okay, wow. Yeah, like you can take screenshot. Like Somesh has given some absolutely nice few comprehensions. Yeah, correct. That's awesome. Yes. Yeah, that's awesome. Fine. Then if you're able to see this application of this cast, it will go and compress this superior mesenteric artery, and this superior mesenteric artery go and compress this duodenum. Okay, and this syndrome, it is known as what? It is known as what? Cast syndrome. Okay, remember this. This is known as cast syndrome. And what is this was? What is this thing? It is the CTEV. Okay, for CT, what is the name of the splint we will use? Yeah, correct, guys. It is what? It is the Dennis Brown splint. Okay, we'll use this Dennis Brown splint for this CTV. Okay, fine, and we use this menu known as Ponseti serial manipulations. Okay, Ponseti serial manipulations. Okay, and we know it's a child, so it will play with kites. So we'll use this angle known as kites angle. Okay, and we'll use this angle known as kites angle. Fine. Next, if you're able to see, if you're able to draw the line, means this hip is outside. So it is what? It is the developmental dysplasia of this hip. Fine. And for developmental dysplasia of the hip, we'll use this harness known as Pavlik harness. And what is the name of this splint we'll use? Means like means it's not there is any age restrictions. It can be started from this 2 months as early as possible, or less than one age. We'll start this Ponseti serial manipulations. Fine. And this is what? This is known as what? This is for Pavlik harness. What is this image? It's known as what? Von Rosen splint. Okay, Von Rosen splint. Okay, and in this we do two tests known as Barlow's and Watanabe's. Fine. In the case of Barlow's test, if you're able to see, this Barlow's test. Okay, remember, if you go to a bar, if someone goes to the bar, they keep on adding. So what they will do? We'll do adding. Means we'll do adduction. When we do adduction, means after some packs, they will become saturated and they will be abducted. Means they will be abducted from this wall. So remember, so initially will cause adduction and the hip, means in the hip joint, the femur will pops and comes out. Okay, so this is the Barlow's joint. Fine. Whereas in the case of Watanabe, it will be the opposite. We'll try to abduct the joint. Okay, here we'll try to abduct one. In the case of Watanabe, we'll try to abduct. Okay, just remember this thing. Okay, or else you can remember Barlow, you will keep on adding the packs and you will be dislocated from this mold. Okay, you will try to dislocate in the case of Barlow's test, whereas you try to reposition in the case of Watanabe test. Fine. If you're able to see this pepper pot skull along with this Rugger Jersey spine, okay, along with this radial resorption over this phalanges, and there is a formation of the small brown tumor. All of this suggests which of the following conditions? Yeah, correct. Bhavnesha. It is what? It is the hyperparathyroidism. Yeah, Dr. Khan, yeah, Dr. Kavita, and Dr. Rosalfia. It is what? It is the feature of hyperparathyroidism. Fine. Next, if you are able to see this type of fish mouth vertebra will be seen in a case of osteoporosis. Okay, and if you're able to see this kind of intervertebral means calcifications of this intervertebral discs, okay, along this, it will be seen in a case of which of the following condition? It will be seen in a case of ankylosing spondylitis, and there will be a typical history of the male who is having who is having sacroiliitis and they will be unable to bend forward, and there is a features of HLA B27 association. Okay, it will be seen in the case of ankylosing spondylitis. Fine. Okay, next, if you're able to see this champagne glass pelvis along with this trident hand. Okay, both of these things will be seen in a case of achondroplasia. Okay, yeah, dagger spine, they also known as bamboo spine. Yeah, correct, guys. It is also known as bamboo spine. Okay, bamboo spine. And if there is any calcification over this anterior ligaments, it will lead to this sign known as dagger spine. Fine. And this is what? This is the, what is this one? This is what? This is the fibrous dysplasia. This is a fibrous dysplasia. Okay. Yeah, where you will able to see this shepherd crook deformity. Yeah, correct, guys. Correct, Rosalfia. Correct, Lokesh. Correct, Somesh. Guy, are getting it correct? Yeah, fine. Yeah, fine. And this is what? There are few tumors, like few malignancies we need to remember. If you're able to see, this triangle, okay, this is what? And this is what making this triangle. This is what? This is this osteosarcoma. Okay, it will show this Codman's triangle along with this presence of this appearance known as sunray appearance. Okay, and if there is this fallen leaf sign, this fallen leaf sign will be seen in a case of simple bone cyst. Fine. And if there is any multiple this bony lesions, but this growth plate, if not, it is fused. Fine. Yeah, it's not osteomyelitis, it is osteosarcoma. Okay, don't get confused. Okay, don't get sleepy. Like, we'll have another for 5 to 10 minutes, then we'll go and have a sound sleep. Okay, don't worry. Fine. And if this is what, this is not GCB. That's where the confusion is. Okay, fine. If you're able to see this growth plate, if it's unfused, it will be what? It is this aneurysmal bone cyst. Okay, it is this aneurysmal bone cyst. But whereas if this growth plate is fused, if the growth plate is fused, then it will be what? Then it will be the GCT. Okay, don't get confused, guys. Okay, this is the typical blunder we do. Okay, don't get confused. If this first, if there is any sobable kind of lesion, just see this growth plate. If it is unfused, it will be what? It will be the aneurysmal bone cyst. If it is fused, it will be the giant cell tumor. Fine. Next, if you're able to see, this is what? This is the exostosis. Fine. This is what? This is the enchondroma. Fine. This is the enchondroma. Fine. And okay, fine. And this is what? This is the, if you're able to see this some kind of nidus, it is what? It is the osteoid osteoma. This is the osteoid osteoma. Fine. Okay, guys. Fine. Next, if you're able to see, where you will be able to use this aeroplane splint, in which condition you will be able to use this aeroplane splint? Yeah, we'll use this in a case of brachial plexus injury. We will use in a case of brachial plexus injury. Fine. Next, where you will be able to see this cylindrical cast. You are asking where is Ewing sarcoma? Means in Ewing sarcoma, it's less likely visible on radiology, because you will see, means they will tell there is a, you will able to see this onion pill appearance, but it is not very prominent on radiology. So mostly the Ewing sarcoma, it will be history based, and there will be a positivity of the CD19. Okay, and it will produce this onion pill appearance. Okay, this cylindrical cast will apply on patella fracture. Okay, patella fracture. Yeah, nice, guys. Nice, Kavita. Nice, Somesh. Nice, Dr. Khan and Maruri and others, Baisa. Fine. Yeah, it is a done in a case of patella fracture. Fine. Next, this is what? This is the hanging cast for humerus fracture. This is the hanging cast for humerus fracture. Fine. Yeah, correct, Kavita. Correct, Baisa. Fine. Next, this is what? This is which splint? This is the knuckle bender splint. It is the knuckle bender splint. Okay, which will be used for? It will be used for which of the following? It will be used for this claw hand. Yeah, guys, it is used for this claw hand. Yeah, correct. It will be used for this claw hand. And this is what? This is known as what? This is what? This is the cock up splint. Yeah, Dr. Khan. Yeah, Rose, you are getting it. This is what? This is the cock up splint is used for radial nerve damage. Fine. And to identify this type of scoliosis, will means and the reason for this correlation will use this test known as Adams forward bending test. Okay, and this brace will use this known as what? Milwaukee brace. It's used for scoliosis. And remember, we'll use one more angle. What is the name of this angle we'll use for scoliosis? We'll use this. Yeah, guys, it is views. Yeah, guys, yeah, Murari, yeah, Lokesh, yeah, we will use this Cope's angle. Next, you'll be able to see this brace is known as what? Taylor's brace. This Taylor's brace will be used for TB, TB spondylopathies. So, fine. Yeah, guys, yeah, correct. Yeah, Maruri, yeah, Kavita, yeah, Somesh, yeah, you are getting in track, you are on track, fine. And the last one, it is what? It is the Jaipur foot. Okay, it is known as what? Jaipur foot. Just remember. Next, we are able to see this fixator. Okay, this is what? If it is a round, it is what? It is a, if it is a kind of flat one, then it will be a rail fixator. It will be a, yeah, right, Jaipur foot. If it's used for this, after this amputation over this ankle, we'll use this Jaipur foot. Fine. This is what? This is the rail fixator. Okay, means like a rail track, you will be able to see this track. So it is what? It is the rail fixator, whereas this one, it is the Elizarov fixator. Fine. Next, this is what? This is the tension band wiring. Okay, which can be done in a case of when there is where there is an excessive muscle pull. For example, we can do in, yeah, tension band wiring. We'll keep this KYS in the figure of 8. Okay, in the figure of 8, we'll use this KYS and we'll make this tension band to counteract this tension pull. Yeah, Bhavanish Chavan, correct. Next, the last part of this orthopedics is what? It is this image. This is what? This is the bone cutter. Okay, and this is what? This is the curate bone. Curate means which we use for this unusual bone cyst. Fine, which will use for this unusual bone cyst, means we need to do the curage known as extended curettage. Okay, because there will be multiple cavities, you cannot do a single curettage. We need to go on into each cavities and we need to do this curettage. Okay, guys. Next, this is the bone cutter, and this is what? This is the bone nibbler. This is the bone cutter, and this is the bone nibbler. Fine. Okay, if we see this straight blade, it is what? It is the Miller's type of laryngoscope, and this Miller's type of laryngoscope will use for this pediatric patients. Fine. Yeah, correct. Baisla, Rose, Kavita, Murari, Dr. Khan, and um, Chiran, Chiranjeev, and Somesh. Yeah, correct. Okay, fine. Next, if you're able to see, this is what? This is the endotracheal tube. It is the ET tube. And ET tube, you just remember, means this is the cuff. This is a cuffed ET tube. Okay. Whereas infants will use uncuffed ET tubes, whereas adults will use this cuffed part. Fine. This is what, and there is a one eye known as Murphy's eye. Okay, means which provides additional, means in means if there is any blockage to this inferior structure, means this Murphy's eye can be supportive and can produce ventilation and provide ventilation. Okay, and this cuff will be low pressure and high volume in nature. High volume. Okay, and remember the resistance of this tube. The resistance of this tube is depend on the resistance of this endotracheal tube is correct, Katri. The resistance of this will push around 10 to 15 ml, around 10 ml will push. The resistance of this endotracheal tube is based on this diameter, not the length, based on the diameter. Fine. Double lumen ET tube will be held in a case of thoracoscopic surgeries. Okay, thoracoscopic surgeries. Fine. Just remember, this is this double lumen. This is the double lumen ET tube. This double lumen ET tube, what it does is means it will inflate this two lungs separately. Means one lung will be ventilated from this and another lung will be ventilated from this. So in the case of any thoracoscopic procedure, we'll use this. In the case of any thoracoscopic procedure, we'll use this double lumen ET tube. Fine. Next, in sometimes, for example, you are doing any surgeries in the back, for example, any sebaceous cyst. Yeah, correct, Somesh. Yeah, you are coming with absolute numbers, like which will be like it is very hard to memorize. That's awesome. You are knowing this much stuffs. Yeah, fine. The size usually for adult men it will use 8 to 8.5, whereas females will use around 7 to 7.5. Fine. Yeah, correct, guys. Fine. And this is what, in the case of any surgery, we need to do in a prone position. In such surgeries like sebaceous cyst or any myelomeningocele repair, means we need to put this ET tube. If it come like this, it will kink. So we'll use this type of tube known as kink resistant. Okay, you'll be able to see, right? This is the normal one which is being kinking. This is another tube which is not able to kink. So this is what? This is the kink resistant ET tube. Okay, and once you put this ET tube, means there is a tongue, right? And you, when you give a general anesthesia, the tongue will tend to fall back. Okay, to prevent this fall back of the tongue, we'll use this airway known as Goodell's airway. Okay, Goodell's airway. Okay, whereas you want to do some simple procedures, or you want to do some daycare surgeries. In such cases, what you will do means you will do this. You will put this airway known as laryngeal mask airway. You will use this airway known as laryngeal mask airway. You just go and keep over the larynx and you just inflate. Okay, but one of the prerequisites is that means the patient should be having the NPO, because there is a high risk of aspiration in a case of LMA airways. Fine. And there is also one more version of this LMA known as LMA Prosil, in which thank you, Keshav. Proud to be have you also junior also. Thank you for attending sessions. Just keep on going. It's just a flow of motivation. It should be spread from one to another. Okay, that's it. That's the motive of the sessions. Fine. Yeah, Rose. Yeah, Chiranjeev. Yeah, Lokesh. Yeah, Baisla. Yeah, Murari. That's awesome. Fine. You're giving this exact answers which I wanted. That's really boosting my confidence. Fine. And if you're able to see this Mallam particular scoring, means if you're able to see this tip of the uvula, it is what it is the class 1. Okay, if you're unable to see this tip, but you will still able to see this uvula, soft palate and this hard palate, it will be what it is the class 2. Whereas in the case of class 3, you will just see this soft palate and hard palate. Whereas class 4, you will able to just see this hard palate. Okay, so and we know this class 3 and 4, there will be a difficult in airway. Means there will be a difficult. These are this difficult airway. And Mallam is 0. When we tell them to open the mouth, if you see this tip of epiglottis, means if 0 is this, if you see this tip of epiglottis, okay, it is what it is the Mallampati class 0. Okay, no, it's not previously, means there can be history of intubated, because of that there might be one of the reasons. Okay, but if you're able to see this tip of epiglottis, it will be what? It will be classified as Mallampati 0. Fine, that's it. Next one means we need to know about this few instruments. Fine. And then you will shift to this, means because this nasal cannula can deliver up to 0.45% or 45% of this oxygen and around 2 to 6 liters. And if the patient is still not maintaining, you can shift them into this mask known as Hansen mask or the simple mask. Okay, where you will able to deliver this FiO2 up to 0.60. Fine, and you can deliver up to 6 to 8 liters of oxygen per minute. Then, if still he is not unable to maintaining, then you can shift to this mask which is known as Venturi mask. See, this is the same mask. If you connect here, it is the normal mask. If you attach this tube, it will be a Venturi. It will become a Venturi mask. Fine, and it is based on this color coding. You will able to see this is the type of Venturi mask you will able to see, and both are the same, producing the same FiO2. Okay, but the difference is that means it will produces around 6 to 8 liters. It will give means output of 6 to 8 liters, whereas this will give around 12 liters of oxygen per minute. Fine. Next one, this is this anesthetic mask, anesthesia mask, which can give up to FiO2 up to 1 matlab means you can give up to 100% of oxygen. Fine. And with this same simple mask also we can provide this 100% of oxygen. Okay. Yeah, I will tell you. Okay, means if you add a reservoir bag to this mask, means this can even deliver up to 100, means around this 90% of oxygen. So this is what this is NRBM mask, means non-breathable mask along with this reservoir bag. Okay, this is this reservoir bag. Fine. Means how will you measure this NG tube? Means to measure this NG tube, what you will do is, means you will start with this tip of your nose, then you will go along the ear. Okay, and then you will go along this xiphisternum. Okay, means tip of the ear, means then go along this tragal pointer, and you will go till this xiphisternum. Then means then you will mark the point. Then you will put this nasogastric tube. Okay, these are the things you need to know, guys. Next, if you're able to see, this is the amber bag. Okay, this is the amber bag, which is a pediatric one. Okay, which can deliver up to 250 ml. Fine, I think so. It's yeah. Just remember, it is the amber bag which can deliver up to 250 ml of air. Okay. Then this is the rotahaler, means there will be a powder capsules. You need to crush, means you need to put, it will automatically crush, and you need to inhale. And this is the metered dose inhaler. Fine. This is the metered dose inhaler. Next one is the cannula. Okay. And cannula, I think so. You know the story. Means there will be a lava inside, which will be orange in color, followed by the soil, which is the brown in color, and no, Not only ear to sternum. This if you keep ear to sternum means it won't give you a perfect length. But means nasogastric, just remember, means just apply the simple principles. Nasogastric means you need to put into the nose and it need to go along the nasopharynx. Then it need to go into the esophagus. Then into the means then into the stomach. Fine. This is the funda. If you keep the ear means you are just measuring from here. You are not measuring this nose and into the nasopharyngeal length. This will be measured when you choose from this tip of the nose. Fine. This is you need to remember. Yeah, like someone buys like yeah, you know this much mathematics. Like I should have learned from you because like doctors they will learn less maths. Okay, less maths. Fine. Like if unable to remember this, I will just tell you a few simple tricks that you can remember. Fine. The grass will be green in color. Then there will be this plant which will be green in color and this pink flowers and along with the blue sky and a yellow sun and a purple galaxy. Fine. If you yeah correct means if you unable to know means or you are not able to in exam they asked you one question and you were remembering soil then tree then there is a flower means it will take a decade for you to get answer. So remember means 18 years you will get green flag for everything in your life. Okay, so it is a 18 years you will get a green flag. So remember it is 18 as green. And girls means girls favorite color is pink. So girls they always want to be in their sweet 20s. So 20 means girls favorite color which is the pink. Okay, if you remember these things you can remember above and below. Yeah correct so much. Yeah, again you are coming with absolute numbers. Yeah, violet which is the 26 gauge which is actually not given here. Violet which is be used for especially for the newborn. Yeah correct so much. That's awesome. Fine. Next one, if you able to see this alternate bands. Okay, bands in the needles. It is what? It is the two hoist needle. It is known as what? Two hoist needle. What is this? Yeah, yeah. You're welcome, Kavita. Means two hoist needle will be used for this epidural anesthesia. Fine. Okay. Okay. And these are these other needles like spotty and Vitakis. They are non-traumatic and they are dura separating needles. Whereas the spin keys, they are dura cutting. Okay, because they can produce this pain. Yeah, correct. Murari, Kavita, Lokesh, Baisla. Yeah, you are getting it correct. And once we given this spinal anesthesia, we'll make this position as Trendelenburgen position and reverse Trendelenburg position. For example, you want to do a lower cesarean section, then you given anesthesia, and you want to this anesthesia to be flown down and to anesthesia. Yeah, and to be anesthetized this nerve roots so that you will fill the table and keep it in a reverse Trendelenburg position. Okay, fine. Whereas this Trendelenburg position, if you keep, it can go into the cardiac tissue and it can cause bradycardia. So, okay. And this reverse Trendelenburg position, it can be kept in such surgeries where you don't need some bloodless field in the lower surfaces. Fine. Yeah, post-dural headache, it will be most common in the case of dura cutting needles like Quincus needle. Fine. Next, if you're able to see, this is this over this mucosal application or the skin application for any needle. Needle procedures will use this cream known as Emla cream, which will be made up of 25% of or 2.5% of lignocaine and 2.5% of prilocaine. Fine. Yeah, correct. Somesh Kavita, Dr. Khan and Rosalfia. Next. And this procedure, it is what? It is the IVR, intravenous regional anesthesia. For this, the systolic BB means the cuff should be inflated. The cuff inflated should be systolic plus 50 in upper limb, whereas systolic plus 100 in lower limb. Okay, this is the intravenous regional anesthesia, and this is our IV anesthetic, which is all. This is the propofol. Okay, this is the propofol. Fine. With this understanding, we'll move on to the next part. There is two more slides left. Okay, Boyle's machine, and in this you need to identify this is this vaporizers. These are this vaporizers. These are this flow meters. Next, you need to identify this one, which is what? Which is the CO2 absorber. This is how this CO2 absorber looks like. Because in most of these nerve setups, we'll use this closed circuit because the patient will breathe and the inhalational anesthetic will come back along with this carbon dioxide, and the carbon dioxide will get absorbed. Okay, once it absorbed, this carbon dioxide means mainly it will be made up of the soda lime. When it absorbs this carbon dioxide, the color of this chamber will be changed. Fine, it will be made up of soda lime. Okay, just remember it will be made up of soda lime. Next time they will show this marker and they will ask you what is this. Okay, fine. Just remember these things. Fine. This understanding will move on to the next part. Next one is the capnography. This is how this normal capnography looks like, because after doing intubation, we need to check for a few things. Okay, yeah, there will be a pigment known as phenolphthalein, which has been used in this used in CO2 observer, which turns this color into pink or around the violet, so that it will tell us this needs some replacement. Yeah, the again so much here, like the IV ray array, it's also a daycare procedure. These are all the properties of the propofol. Yeah, correct. Yeah, it can cause AIP. Yeah, correct. Yeah, it is also used for the insertion of this laryngeal mask cavity. That's correct, Somesh. And yeah, means we know, like, once the ET tube is being placed, okay, we need to know whether it is exactly in the lung, means in the trachea. So we will measure this EtCO2. Means EtCO2, it will show there will be a lice, and the curve will be of this shape. Okay, and if there is any drugs which you are giving, for example, if the patient is undergoing PPH and you are mm, mm, giving this cabergoline, means you are giving any of the drugs which causes this bronchospasm. Fine, carbapenem, for example, you are giving carbapenem which causes this bronchospasm. If there is a bronchospasm, it will produces this type of fin type of this shark fin type of grabs. Okay, and if if the patient is in anesthesia, okay, he's in general anesthesia, but now his anesthesia being means he's returning back to this normal state. Now what he can do is he can self extubate. If there is any self extubate, then this will become zero. Right? If you're doing an esophageal intubation instead of a tracheal, this curve will become flat. Okay, remember. Okay, these are the things you need to remember. Okay, yeah, fine. Yeah, if it is CO2 rebreathing, the the height of the curve, it will become increased. Fine, that's you need to know, guys. Fine, and to know this depth of anesthesia, we'll use this index known as BIS. Okay, bispectral index we'll use for know this depth of anesthesia, and also in this one of this is to know this. Um, Now means BAS, we use this monitoring of this now. Here we are monitoring this ulnar now. Okay, we are monitoring this ulnar. Fine. Next one about this anesthesia circuits. In anesthesia circuits, you need to remember just Mapleson A, D, and F, E and F. Fine. Remember A, it is for A and D for adults. A, D, U, L, T. So D and D for adults. Okay. So A and D for adults. So adult means they can do their things spontaneously. And C and D is for it is also known as brain circuit, which is for controlled ventilation. So remember, DC means D circuit is for controlled ventilation, whereas A is also known as Nagel circuit. It will be for this spontaneous ventilation in adults. Fine. Then Mapleson E, it is what it is also known as IRSTPs. Fine. Whereas Mapleson F, it is also known as means Jackson modification of this IRSTPs, and both of this E and F, they are used in a pediatric patients. Fine. Yeah, correct. A is Nagel, D is brain, F is Jackson and Reese. Yeah, correct, Somesh. Fine. Next is about the cylinders. If you're able to see, this black body with white shoulder, it will be what? It is the oxygen cylinder. Okay, and we know means oxygen. Yeah, remember, it's not 3,5, it is 2,5. Remember, the index of the oxygen, it is 2,5. Okay, because remember, means whatever the air contains two things. One is this nitrous oxide, another one is the oxygen. So nitrous oxide and this oxygen. Okay, if you see this nitrous oxide, it means both of them the posteriorly. At last, they will be having this 5. Fine. This oxygen, yeah, no problem, no problem, Murari. Fine. At last, if you're able to see, there will be having this 5. Fine. If you're able to see, oxygen, it is having this 2. So it is 2. Fine. Whereas this nitrous oxide, it is having this 3 letters, N, 2, O. So it will be having this 3. Fine. Whereas this N-Tonax will be having a special pin number known as 7, which is a mixture of, yeah, now it's a rostron. Yeah, black with white shoulder, it is oxygen. Blue with this blue, which is what? Which is Neela, which is for this nitrous oxide. Fine. And C or this cyclopropane, which is in orange in color. Fine. Yeah, correct. Yeah, that correct. Yeah. If it is a white shoulder with blue body, it will be what? It is a N-Tonax. Yeah, guys, that's awesome. Yeah, I'm really impressed with your answers. Fine. Yeah, and means for carbon dioxide, we use this gray color cylinders. Fine. Just remember, and this will be enough. Fine. And if in case of any emergency procedure, if you attempted any intubation, but this intubation fails, in such scenario, you will able to do this first procedure, which is known as what? You are doing this first procedure, which is known as cricothyroidotomy. Okay, cricothyroidotomy. Initially, we can do with needle or we can do with tubes also. Fine. Next one means the definitive management. What we can do is we can do this tracheostomy, and you can see this cuff here also. Fine. Next one. This is the last part of this anesthesia. Last slide for the day. Fine. And the CPR. CPR means if there is any protocol means CPR. First, what you need to know means what we need to know is the scene safety. Means here it is this 1 and 5. Here it is 1 and 5. Okay, just remember here it is 1 and 5. Fine. It is if it is know the CPR, first you need to check for the scene safety, because while resuscitating, if you are hidden by a means tractor or a car, means it will be a very drastic one. Someone needs to give CPR to you. So remember, first we need to see the scene safety. Then we need to check first. Next we need to check for the response. Okay. After checking the response, means if you are alone, we need to get some help. Okay. When you get some help, or means when you call for help, next, what you will do is first you need to open up the airways. Remember, first is for this airway maintenance. Fine. First, you need to open up for the airways, and you need to check for any breathing. Okay, and then you need to start compressions. Okay, first you need to maintain this open airway, so that patterned airway. Then so that he can, if he resuscitates, then he can. Yeah, first if there is no help available, yeah, you can start first help and then CPR, but first should be the scene safety. You need to, if there is an accident, if this patient is lying, if the person is lying in the middle of the road, means you cannot just go and call help, and later on you will just come and bring. First you will ensure the scene safety. Fine. And if he is responding, what is the need of help? Fine. Fine. Just remember, then we'll start this chest compressions and to breathe. Fine. In adults, just remember in adults it is what it is, the 30:2. Okay, whereas in child it will be 3:1. Fine. Okay, fine. Management of GTCS means, like, in a case of acute status epilepticus, you just turn the patient to the left lateral side. Fine. Means in adults the ratio will be 30 compressions to 2 rescue breaths, whereas in children it will be 3:2, or mainly of infants. Fine. These are all about this, and for children means for mainly of infants, will do this technique known as thumb encircling. Means we'll hold the chest and will press using our thumb. Okay, thumb encircling. Whereas in normal, means in adult patients, we'll use our palm and will give pressure. Fine. And these are all about this part for the day, and about our IBQ sessions. And just a simple saying, means just do and show to the world. Okay, just instead of saying that means saying till now, just there is few more days left. Just do better in your exams, and just show to the world that you can do it, and you can do better than anyone else in the world. Fine. Yeah, this session, if you ask me, direct images, they can come up to from minimum from 10 to anywhere between 25, and there will be descriptions, like any questions, any clinical scenarios, it will show. There will be descriptions. There will be description of these images. Fine.